All set, Madam Chair. Thank you very much. Good afternoon, everybody. We're going to start our appropriations budget hearing regarding the Human Services Agencies. And our first speaker is remote, Elena Moncada. Madam Administrator, you need a couple minutes to go through those folks. We need a couple minutes to go through the attendees to promote them. For the remotes, do you want me to do in person while you're working on that? First person's not in? Okay. Up next is Brandon Bartel. Brandon, got 3 minutes. Come on up here.
Good morning. My name is Brandon Bartel. I'm the operations manager of the Hartford Division for American Medical Response of Connecticut. AMR is the largest commercial EMS emergency medical service provider in the state. It's a critical safety net in the state's EMS system. I'd like to thank the Joint Committee on Appropriations for the opportunity to submit testimony in opposition to the section of HB 5048, which would remove $5 million of Medicaid funding that was earmarked for Medicaid rate increases to ambulance providers. Last session, members of the EMS community and other healthcare providers had come to the General Assembly and offered sobering testimony regarding the unprecedented challenges faced by Connecticut's EMS providers. Challenges that, if not corrected, will imperil an excellent but extremely fragile EMS system in Connecticut. We've explained that ambulance companies were closing because they could no longer afford to operate. We noticed that entire EMS system was reeling from a dire shortage of EMTs and paramedics, due in part to the inability to pay competitive wages. We further indicated that the combination of fewer ambulance companies and less available EMS personnel resulted in a serious gap of coverage, increased response times, and delays in transporting patients from hospitals. Finally, we pointed to the below cost of Medicaid reimbursement rates as one of the contributing factors to the current EMS crisis. In response to these challenges facing ambulance companies and other medical providers, the legislature passed Public Act 23-186, requires DSS to conduct a comprehensive Medicaid rate study, including a review of Medicaid rates for ambulance services. In addition, $5 million was added to the Medicaid budget for fiscal year 25 for the purpose of increasing Medicaid reimbursement rates for ambulance services. These were welcome first steps. Ambulance providers were hopeful that this study would result in a long-term and permanent rate reform that would raise rates to at least the cost of providing ambulance services on behalf of the state. They were also grateful for the badly needed short-term increase in Medicaid funding of $5 million, even if it was only a small Band-Aid on the statewide crisis that continues today. Explicitly, the state now wants to remove the funding increase for fiscal year 25. Instead of helping mitigate the crisis, the governor's proposal will make it worse, far worse, than the $5 million the state will save. Factoring in the federal share of Medicaid funding, the governor's proposal will reduce Medicaid funding to ambulance providers by almost $14 million. Reduction of $14 million would be devastating to our state's EMS providers who have incurred additional costs in good faith based on the financial commitment made by the state for fiscal year 25. The governor's proposed elimination of the $5 million rate increase will not only exacerbate the EMS crisis, but will also end up causing the state even more taxpayer dollars in the future. Although a small industry and relatively nominal line in the Connecticut's overall healthcare budget, ambulance providers provide a critical role in efficiently providing access to healthcare to Connecticut residents. Timely responses by fully staffed ambulance providers result in better outcomes and shorter stays in hospitals. Likewise, the availability of sufficient ambulance resources reduces delays in transporting patients from hospitals to lower cost healthcare facilities. In short, ambulance providers play a significant role in reducing healthcare costs, including those incurred by the state. I respectfully submit that the state's failure to pay a fair reimbursement rate as part of the overall plan to stabilize the crisis is a huge mistake. which will hurt the efficient provision of healthcare in Connecticut and cost Connecticut taxpayers significant dollars in the future. Ambulance providers continue to be squeezed by staggering increases in costs. In recent years, ambulance companies have witnessed historic operating costs. Although AMR is a national company and has a benefit of certain economies of scale, AMR's costs have skyrocketed. Payroll and benefits, 15.9% increase. Risk insurance, 10%.
Brandon, can you wrap it up, please?
Yes. So those increases cost us $13.6 million alone just for AMR Connecticut. The Medicaid reimbursement per transport is drastically below our cost to provide that service, about $107 below our costs. So in conclusion, I implore that this committee revise HB 5048 to maintain the $5 million Medicaid increase for ambulance services in the fiscal year 25 budget. Thank you.
Thank you very much. Up next is Jessica Schrader. She's online. Jessica, you have 3 minutes.
Thank you very much for your time. My name is Jessica Schreider, and I'm the administrator at the Fitchville Home in Basra, Connecticut. And I'm here today to support the governor's added funding for residential care homes while urging the legislature to ensure all homes receive an increase in their rates. Specifically, I want to urge you to provide funding to residential care homes for inflationary increases. So our home has a capacity for 25 residents who oftentimes are diagnosed with profound mental health diagnoses, such as bipolar and schizophrenia. Homes like ours are what help keep these individuals living dignified lives with as much independence as possible. And oftentimes we're the buffer for them going into an assisted living where they lose all independence. We provide housekeeping services, home cooked meals, nutritious snacks, as well as recreational activities for our residents. We also assist residents in connecting and communicating with providers, as well as getting transportation to these appointments, as well as opportunities out in the community that they can engage in for their physical, mental, and spiritual well-being. The pandemic took a harsh toll on homes like ours, as it wasn't often hard. It was hard sometimes to not come across staff shortages. To retain employees at our home was a challenge due to not being able to offer as competitive wages as other industries are able to offer. With non-competitive wages and a higher risk of exposure to the virus, it was a challenge to keep everything running smoothly. However, with a small core crew of dedicated workers, we were able to overcome these challenges. Now that much of the pandemic is behind us, we would like more funding in order to make our wages more competitive so that we can retain the quality of staff that we do have, as well as obtain more quality staff as needed in order to serve our residents most effectively. It is especially difficult for some of our residents to have a high turnover of staff as they begin to trust staff. And when they leave, it can make it difficult for them to build rapport with new staff, fearing that they will just also leave. Our industry strives to employ people in long-term careers so that they can establish and maintain relationships with their residents. We also have to make choices whether to save money for food costs or recreation, because our cost-based system caps year after year expenses. With prices soaring in almost every sector, we have to make some tough choices. With obesity being an epidemic in this country, we would like to help offer our residents even more nutritious meals, as many of them have diabetes and have goals of improving health. This is very challenging with all of these financial obstacles to overcome and manage. The inconsistent funding also challenges our business operations. We're constantly having to make repairs that are subject to state inspections and yet have virtually no margins to do so. Many of our facilities are old and its amenities simply outdated. Over the past 2 years, at Fitchville Home alone, we have had to replace all the flooring in residents' bedrooms, flooring replaced throughout our hallways and common areas, and paint in all residents' rooms, hallways, and common areas. Almost every month, we at least have 1 or 2 plumbing repairs needed. For this reason, we strongly support efforts to inject additional capital into residential care homes. We provide a critical service for the state and care for some of the most vulnerable people. We do this for a low cost. My home and other residential care homes throughout the state have had to get by with rates failing to keep up with costs, and yet we serve as a safety net for the frail elderly and many people with mental health diagnoses and substance abuse issues. Unlike other providers, our residents are almost all state funded, limiting our ability to cost shift and make up for low rates. Please support residential care home funding for all homes so that we can keep our great employees and pay their fair wages while they care for some of the most vulnerable in the state. Thank you for your time.
Thank you. Up next is Samantha from the Connections. Samantha? No? Up next is Maureen Amaral. Maureen Amaral. Say it again. Maureen, and if you need to accept the promotion into panelist in order to testify, if you wouldn't mind doing that, please. Up next is Lana from the Connections. Lana. Hi, Lana, you have 3 minutes.
Good afternoon. My name is Lana Apperly, and I thank you for this opportunity to tell you a little bit about myself and my time with the Connections Supportive Housing for Families program. I became involved with DCF at a hard time in my life. 2 of my children were facing a mental health crisis, and we were facing eviction from our apartment. I worked full-time while raising my children as a single parent after their father passed away while I was pregnant. My income alone was not enough to support the needs of my family, so DCF referred me to supportive housing for families. My miracle, as Joel called it, happened on June 13, 2022, and I was admitted to the program. My case manager was amazing. She never let me lose hope or get discouraged, and together we started looking for apartments, and I moved into one December 1st, 2022. Our new apartment is so much brighter, it's bigger, and it even has a new bathroom. And that program helped me with a security deposit and rent, as well as furniture and household items that we all needed, especially my kids. I continue to work full-time and also work with a supportive housing for families vocational specialist. Recently, my 2 sons have started working with the vocational specialist, exploring employment opportunities, college courses, and learning how to navigate applying to jobs online. The vocational specialist has been instrumental in assisting my family with immigration issues, providing resources, and even making phone calls on my behalf, as we are originally from Canada and First Nations. My youngest daughter continues her schooling at home, and now that I'm stably housed, my DCF case is closed, which is a great feeling. I have always believed in giving hope to people. Facing eviction, starting a new job, looking after the mental health of myself and my kids as a single parent is extremely hard and it's scary, and it's not enough time in the day. The supportive housing program provided me with financial and housing assistance I needed to keep my kids with me. But most importantly, it provided us hope. And my hope for myself and my kids is to further our schooling and one day have my youngest join us. I appreciate you giving me this opportunity to share my story and to thank you for your continued support of the Connection Supporting Housing for Families program. Thank you for your time.
Thank you, Lana. Up next is Kathy Flaherty. It's online. Kathy.
Thank you, Senator Austin and members of the Appropriations Committee. My name is Kathy Flaherty. I'm the Executive Director of Connecticut Legal Rights Project, and we provide legal services to clients who get mental health services from the Department of Mental Health and Addiction Services. And I'm here to make 3 or 4 comments on the governor's proposed budget with regard to human services, especially with regard to Husky C, which was something that this legislature fixed last session, where the income limits for Husky C were increased. And in the governor's budget proposal, he would take away virtually all of that increase. That is something that would improve access to care for people who are elderly or disabled and on Medicare and can only get certain services through Medicaid, which is the Husky C. And to have that fixed for some people, and I would encourage you all to please read the testimony of Brenda Moore when it's uploaded, because she shares her experience, and she's someone who's currently getting those benefits and someone who likely would be institutionalized if it were not for the benefits that she can receive under Medicaid. The Husky C fix would help her as of October, but if the governor's proposal were to go through, that help would then be taken away. We also are particularly concerned for older adults and caregivers who are older adults, people with disabilities who are on Medicare who get Husky A, because those people are prohibited by federal law from getting subsidies, so they're not going to get the coverage from Covered Connecticut. So the proposal to move people over, we think is very concerning because it will not result in the same coverage that people currently have. We've heard about the Medicaid rate study that came out, especially with regard to behavioral health providers. If we want to assure timely access to care, especially for mental health care in a time of what seems like permanent mental health crisis, we need to do something about those rates. We're also asking for you to consider removing the asset limits in Husky C. It is only the programs for people with disabilities that have these very low income and asset limits, and it's hurting people. It's preventing people from getting care. If we want to ensure that people don't have to go into medical debt to get needed care, we need to do something. So I appreciate your time. I know you have a lot of other people to hear from.
Thank you, Kathy. Up next is Barbara Casson.
Good afternoon, members of the committee. Thank you for the opportunity to speak with you today. My name is Barbara Casson, and I am a member of the Connecticut Association of the Deaf, and I am co-chair for the Governor's State Advisory Board for persons who are deaf, deafblind, and hard of hearing. In 2021, with monies from ARPA funding, Connecticut Association of the Deaf hired Innovi Strategies to do an in-depth survey and an analysis of a broad section of our community to identify areas of need. After reviewing this report, the advisory board created a task force to determine what should be done. This task force developed a legislative proposal to address those needs and issues. It was then submitted to the advisory board and endorsed. It was then presented to the Human Services Committee, where we await a bill number. This proposal asked for a bureau to be established under Aging and Disability Services, while ADS has other bureaus dedicated to individuals who are blind and for rehabilitation services for people who have disabilities. Nothing currently exists that focuses on the needs of those who are deaf, deafblind, and hard of hearing. Our goal for this bureau is to provide a centralized resource center, one place where people could connect to get information about available resources and supports for those who are deaf, deafblind, and hard of hearing. This bureau would provide training for entities such as police and fire departments and work with state and municipal offices to be sure that communication access is provided when an emergency announcements are being made on TV. This proactive education would ensure that captioning be provided and address the need for interpreters to always be visible on the screen. Just as right now, CTN is the perfect example. They have a dedicated box that always shows the interpreter. These are just a few ideas of what we envision would be some of the tasks and responsibilities for this bureau. I respect the time that you have given me here today. I assure you that we are eager to talk and work with you to help build back the access to services for members of our community and those who work with them. I hope when this bill reaches your committee, you will approve the funding necessary to ensure we have a bureau that can address these issues. Thank you, and please feel free to contact me.
Thank you very much. And I have one question for the community. Does this feel more inclusive to you having an interpreter?
Yes, Yes, definitely. Especially, I can look up at the screen. I know I'm on the screen, but I can also see the box for the interpreter. Historically, in an emergency or a bad storm, we have to constantly make sure that the captioning is activated and that there is an interpreter on the screen. CTN does a great job. However, when it's the media, they always pan off of the interpreter and go to whomever is speaking, and we miss that. So that continues to be an issue. But we would hope that if we had the Bureau, we would have somebody who could work closely with the governor's office and other entities to make sure that that access is always provided.
Thank you. We worked hard last year to include that funding. So thank you very much.
And we really appreciate it. Thank you.
Thank you. Up next is Kevin Watson.
Hi, members of the Appropriations Committee. My name is Dr. Kevin Watson. I'm past president and current chair of the Legislative Committee for Harford County Medical Association and member of the Connecticut State Medical Society. I thank you for the opportunity to address access to medical care. I practice pulmonary, critical care, and sleep medicine in New Britain. I have witnessed the exceptional care provided by my colleagues to the citizens of Connecticut, irrespective of their social economic class. I've also witnessed our inability to provide access to this level of excellence, secondary to the financial pressures impacting medical practices throughout the state. The current rate of Medicaid reimbursement, which at times is below 60% of the 2007 Medicare rates for many physicians, financially penalizes those providing care to our most vulnerable population. A strong physician-patient relationship is paramount to optimizing patients' lifelong care. This is an asset of community-based practices. Currently, practices must limit their Medicaid panel to maintain financial solvency. The subsequent smaller pool of physicians who can care for Medicaid patients results in longer wait times and usage of emergency departments, driving up the cost of care to the Medicaid system. Physicians strive to optimize efficiencies for the benefit of patient-centered care. Imagine operating a business without adjusting for the cost of operations. This reality challenges the existence of small neighborhood practices, resulting in consolidation. Improved patient access has tangible benefits to detecting early disease states before end organ dysfunction, such as diabetes and kidney failure, or detection of lung, colon, or breast cancer. A 2019 study looked at the expenditures of Medicaid dollars and showed that for each $10 increase in reimbursement per medical visit, there was a 1.4 increase in the probability that the Medicaid recipient visited a doctor within the last 2 weeks. Another 1% or so of that population also reported to be in very good or excellent health. With oversight and true competition, physicians in Connecticut have shown their excellence in patient care. We ask only for the ability to take care of the challenging patients without risking practices' financial viability. Overall costs have increased exponentially, magnified by the accrued debt of physicians coming out of training. Currently, Connecticut ranks 47th out of 52 states for physician retention. We should strive to keep young physicians trained in Connecticut as our future professionals, providing enhanced access to our citizens. Improving Medicaid rates will not alone rectify these problems, but certainly will move the needle in the right direction. I thank you for your time, and I'm available for questions. Thank you.
Thank you very much, Kevin. Appreciate your comments. Up next is Maureen Amirault. Maureen.
Thank you, members of the Appropriations Committee. My name is Maureen Amirault. I am from Wethersfield, and I'm speaking on behalf of wheelchair users in Connecticut. We are asking for funding to be included in the human services portion of the governor's budget, specifically under Medicaid and DSS personal line items, which has not been done so yet. These funds would be used to support the recommendations outlined in the SA 23-22 Wheelchair Task Force final report. As a wheelchair user and customer of New Motion, I know all too well about sluggish response times for repair issues and the resulting complications of repair delays. The current repair timeline consists of a multi-step process, which begins with a tech evaluation of the chair. This right now is taking 2 to 4 weeks. For some repairs, the technician could just bring the necessary parts and fix the wheelchair at the same appointment. However, because of the prior authorization requirements, New Motion must first contact the manufacturer to get an estimate, then contact the prescriber for the prescription, and finally the insurance provider for approval. This whole process can take up to 2 weeks, meaning the wheelchair user has now had broken equipment for a month or more and hasn't even had parts ordered. I don't understand this part of the process, why we need to have approval for a repair for equipment that has already been approved and already been purchased. We are asking for the removal of the prior authorization requirement for Medicaid users for the lifetime of the chair, which is just 5 years. Now, once New Motion orders and receives parts, they're ready to schedule the repair, but the response times are dismal. In the past year, I've had to wait 8 months for a seatbelt, 11 months for a joystick repair, and my so-called expedited repairs are taking 2 to 3 months. My suspension system failed 4 times in under 2 years, often leaving my wheelchair undrivable. When I didn't have a loaner chair, I was relegated to my bed, requiring a level of care that I do not have access to. Broken equipment puts me at risk of falls and other injuries. Right now, I have an outstanding repair to my foot plates, which is over 2.5 years old. And this has caused deformity in my left foot. And I also have 2 sores that have developed in the past 5 months. All of this requires medical attention. Because of my loss of independence, increase in stress, and decrease the quality of life. Besides this, my injuries are costing the state money. And this is not going to self-resolve. And we are asking for 4 days for the techs to complete assessment, 4 days for them to repair the wheelchair once the parts are received. The funds allocated to make sure these things happen will ensure we get the level of care that we need and decrease the risk of injury and save the state money. I enjoin you to read the Wheelchair Task Force report and to allocate the funds to bring our recommendations to fruition. Thank you for your time.
Thank you very much. Up next is Harvey Carson. Harvey?
Good afternoon. Senator Austin, co-chairs and members of the Appropriation Committee. I am Dr. Harvey Corson. I am the chair for the Education and Legislative Committee of the Connecticut Association of the Deaf. As I was advised, I am here to present my testimony on the budget adjustments regarding the proposed legislation of setting up a Bureau of Deaf, Deafblind, and Hard of Hearing Services under the Department of Aging and Disability Services, under the current consideration of the Human Services Committee. The State Advisory Board for persons who are deaf, hard of hearing, or deafblind set up a task force on Connecticut needs assessment for those who are deaf, deafblind, and hard of hearing. That was in April 14th of 2023. We were tasked with studying the results of the Connecticut statewide needs assessment report done by Innovi Strategies and the research report of state agencies serving people who are deaf or hard of hearing. And that was done by the Connecticut Connecticut General Assembly Office of Legislative Research. Secondly, we were to develop and recommend potential legislation. In summary, the findings indicated that the deaf, deafblind, and hard of hearing people are not satisfied with our current services in Connecticut. Also, there is not much accessible information and resources that are provided to them comparable to information and resources available to the general population during their everyday lives. And that was especially significant during the COVID pandemic. During the fiscal year 2021-2022, Governor Lamont recognized the difficulties experienced by thousands of people in this state during the pandemic. He remarked that, quote, "The deaf community was hit particularly hard during this pandemic, and the governor was recommending a revised $1 million in the American Rescue Plan Act for funding over 2 years to address deficiencies in support services for individuals in the general deaf community and at the American School for the Deaf. These investments will include operational supports for COVID-19 clear masks, vaccine informational videos, vaccine clinic supports, communication cards, and interpreter supports. We have also found that Connecticut is not listed in the updated list of the 38 states with the recent addition of Vermont and New York as having state agencies that primarily serve deaf or hard of hearing people. Of the 6 states in New England, 5 are included in that report as providing such an agency. And again, Connecticut is not one of those. In reviewing the information and data in this study, the task force wanted to present a forward-looking proposed legislation in a constructive manner in seeking realistic approach to help deaf, deafblind, and hard of hearing persons to reach a more accessible and thus meaningful, productive, and useful lives here in Connecticut. The task force presented its proposal to establish this legislation to the State Advisory Board, and it was endorsed. And also the Connecticut Association of the Deaf was involved, and the Connecticut Council of Organizations Serving the Deaf. So they were endorsed by all 3. It identified the 3 most important points in this proposed legislation. First, we have a definite need to have a cohesive state mechanism in place to provide information and resources. Secondly, the proposed legislation is to establish a bureau to improve communication access in Connecticut. And thirdly, this proposed legislation calls for the creation of one position, an executive director of this new bureau. And within this established framework and structure of the Aging and Disability Services, it is estimated that approximately $250,000 would be needed to create this bureau with a startup number of support staff members to work with the executive director. In closing, it has been an honor to serve and collaborate with the members of the task force as their chair, and to advocate that this proposed legislation for your consideration and support on behalf of the Connecticut deaf, deafblind, and hard of hearing community. Thank you.
Thank you. Mr. Carson, up next is Mary Ann Langton. Mary Ann Langton. pull one of those chairs out so that she can get, she can.
Hello, chairs.
You gotta push that button there, so it shows up red around the mic. See it?
Hello, chairs Olson and Walker and the Appropriations Committee. My name is Mary Ann Langdon, and Jill Bentavango, who is my assistant, will be reading my statement that I have written for today's meeting. Power wheelchairs are essential independent living adaptations that support people with disabilities to have independence and control over our lives. Along with the disability community, we are urging you to vote yes to a wheelchair repairs bill. This essential bill will come up later this session, but two kinds of expenditures with state funds are needed. Number one, costs associated with changes in Medicaid rules to allow for additional coverage of repair services like preventative maintenance and the elimination of prior authorization. And number two, resources for direct regulation of the wheelchair supply industry. Also, I am very opposed to the proposed Medicaid cuts, especially to Husky A and C. Does it make sense to massively cut Medicaid, specifically for low-income older adults and disabled people, by taking away the scheduled increase in income eligibility for Husky C to match and slightly exceed Husky D eligibility scheduled for 10/1/24 and reinstate the income eligibility discrimination against older adults and people with disabilities in our Medicaid program? No, I am on Husky C, and it is the only way that I can obtain my durable medical equipment. My power wheelchair costs $60,000, and power wheelchairs have a lifetime of 7 to 10 years. Please do not cut Husky A and C under the Medicaid program. Thank you.
Thank you. Up next is Rose Murphy. Rose Murphy here. New Haven Public Schools, remote. No. Up next is Anna. Doroghazi. How do you say it? This is like it sounds, like it's spelled.
Doroghazi.
Thank you.
You're welcome.
I'm just gonna let you say it, Anna.
No, that's all right.
floor
Thank
is
you,
yours. 3 minutes.
Senator Austin. Members of the committee, my name is Anna Doroghazi. I'm one of the policy directors at AARP Connecticut. Thanks for the opportunity to speak today on the governor's proposed FY25 budget adjustments. Our written testimony from AARP goes into a lot more detail about the 3 proposals I'm about to discuss. First, we join other voices from the aging and disability community in opposing the governor's proposal to lower the Husky C income limit from what was outlined in the enacted budget to, from what was outlined in the enacted budget. Husky C is critically important to older adults and people with disabilities, even if they also receive Medicare, because it gives them access to services that Medicare doesn't cover, including long-term care in nursing homes, community-based long-term care, transportation to medical appointments, and dental and vision care. The enacted budget put the income limits for Husky C more in line with what we see from other Medicaid programs, but the proposed adjustments would undo this progress and reduce the income limit by more than $500 a month. This would reinstate an old inequality and make it more difficult for some of our state's most medically needy residents to access the Medicaid support that they need to live. We oppose this change and hope the committee will allow the income eligibility for Husky C to move to 105% of the federal poverty limit after any authorized income disregards effective October 1st. Second, we strongly support the governor's proposal to provide an additional position and $90,000 to the Department of Aging and Disability Services to support the growth of the Community Ombudsman Program. Connecticut's been really successful in recent years in its Medicaid rebalancing efforts and now serves a majority of its long-term care Medicaid recipients in home and community settings, which is where most folks prefer to receive their care. Expanding the capacity of the new Community Ombudsman Program acknowledges this migration of care from institutions and into the community and helps the state prepare for a rapidly aging population. Finally, we support the governor's proposed investments in nursing homes and long-term care, which include $250,000 in ARPA funding to develop a Centers of Excellence model for nursing facilities and $500,000 in ARPA funding to create a nursing home dashboard to help individuals and their families access more information about nursing home quality and safety. These proposals would help the state develop incentives to encourage quality and innovative approaches to providing Connecticut nursing home residents with the high quality care that they deserve. Thank you for the chance to speak today. And as I mentioned, our written testimony contains more detail about our opposition to the Husky C changes and our support for the community ombudsman and nursing home funding in the proposed budget adjustments.
Thank you, Anna.
Right.
Up
Thanks.
next is Roger. Connecticut Working Families. Not online. Roger? Okay, if he comes back, let me know. Tamar Capehart, Tamar Capehart. 3 minutes.
Good afternoon, Senator Alston, Representative. Um, my name is Tamir Capehart, and I'm a personal care attendant in Norwich, and I'm also a community activist in Norwich. I am here today to ask you to fund and pass the PCA contract. As a single mother with a child on the spectrum, I need paid time off. When my child is sick or for an appointment, school or medical, some appointments are not always available on the weekends. We do not get overtime because the state won't allow. The state won't allow for it. So if I take a day off, I have to make a choice between buying meat or an activity for my child. As we know, children with this condition need added services like insurances and other things that Husky do not pay for as part of their coverage. 8 or 9 hours out of my paycheck is a choice between gas or a household necessity, lights, things like that. I'm sorry. I had to take 2 years off for work to get the proper services when he first was diagnosed, and I have to care for his well-being since I am his advocate. I went 6 months without a car, not able to get childcare for him as he is nonverbal. Another one of my demands or requests is sign language services, for which are few or none in the area. The Birth to 3 program is only available half a day at school. If at home, it is for 3 to 5 hours a day. He needed 5 days on this program due to the seriousness of his autism. That was not convenient for me financially. I needed to work at least a full day or make enough money to pay bills, rent, buy food, and keep lights on. I do not have a car at the time. I did not have a car at the time, so that was an added burden to get the bus, hitch a ride to carpool, and I needed to be close to my family. If we look at the pay PCAs receive, it's no wonder so many families have to go to social services for support, including myself. We won our new union contract last spring, and we won the first ever paid time off benefit, 5 days per year for full-time workers. However, it is hardly sufficient for someone with a serious illness or injury. PTO is essential to the health, mental health, and stability of my family needs. No working family should have to make those choices. We are the first choice for services, and we want to be the first choice when our personal business needs care as well. We are human beings. We deserve better. The new PCA contract would increase our PTO to a maximum of 50 hours. While that is not sufficient either, it is better than what we were offered before. Please fund and pass the PCA contract to ensure that home care workers get the pay and benefits that we need and deserve. Thank you.
Thank you. I would just tell you tomorrow that we don't have the contract yet. So you should tell your leadership that they need to file it so that we can get it to act on it. Because if it's not filed at the General Assembly, we cannot act on it. Okay?
Okay,
Thank you.
thank you.
Up next is Robert Russo. Robert Russo.
Good afternoon, Senator Austin and distinguished members of the committee. I'm Dr. Robert Russo. I'm the Chief Medical Officer of the State Medical Society. Our society represents the physicians and physicians in training in the state of Connecticut. There's more than 4,000 of us. I'm here today to talk about the Medicare problems that the physicians in the state of Connecticut are seeing. One of our biggest problems are the network systems that try to provide that care to this group of patients. If we use the work study group that was talking about distributions of physicians in Connecticut, you can see there's a significant shortage of primary care physicians, and our specialists are spread out unevenly across the state. So the biggest problem that we're having is when we then take this population, which would be the Medicaid population, and we lay it over the shortage that we see in the physician groups, we're having a significant problem providing the level of care that we need to do in the state. In particular, this group of Medicaid patients don't have access to computers, have very poor access to transportation, and we rely very heavily on the federally funded health clinics in the major cities to provide this primary care. But if you look at those health clinics, you'll see that they are predominantly primary care. To get specialist care, they need referrals. The system in Connecticut for Medicaid specialists is crippled. It's very hard to get specialists, especially in the major groups like cardiology, surgery, orthopedics, radiology, because they don't participate in the program. Now, we need to look at why they don't and what we can do to encourage them to get into it. One of the biggest ones is now, as you know, there's a shift towards private practice into the bigger groups. And as they shift for predominantly financial reasons. You can't keep up with today's world of inflation and computers and pre-authorization, all this stuff. So what happens now is those specialists, because they can't afford to practice large percentages of Medicaid patients, they limit the number. Therefore, the whole system begins to break down because the quality of care the doctors want to give, we can't give. We can't get to it. What can we do? We need to repair the fee schedules. I submitted in the written testimony all the things about what's wrong with the fee schedule. And of course, the biggest one is the problem we're having. We're based on 2007 Medicare for specialists at 57% of that number. So what happens, a quick story, tell you a group, there was a medical meeting and one radiologist stood up and said, it would be better for me to go into the waiting room, find out who's a Medicaid patient and give them $500 to go somewhere else. That's how crippling it is to a system that you can't afford to see enough of these patients. When we look at the network, if you look at the network of Medicaid physicians in Connecticut, what cripples it is there's hundreds of doctors outside Connecticut giving Medicaid services to Connecticut Medicaid patients. You see the problem. These people don't have transportation. They don't have computers. They can't do telemedicine. So they get bogged down into the system that won't provide the care for them. On top of all of this, if you look at Connecticut and again, in the work study group that went through the legislature, Connecticut ranks like 45th for a desirable place for a physician to come to practice. So now we have all of this and we can't provide the care. You need to do, actually even last year, there were promises that there would be more money to do this. 17 years, some specialists have waited to get a fee increase. You've got to give it to them because we can't recruit. So my testimony that I submitted is much longer, and it has statistics and stuff to back up kind of what I was talking about.
Thank you. Senator Lesser has a very, very quick question for you that you can give a very, very quick answer to. Because we have 266 people to testify.
Yes.
Understood. A couple hours ago, I asked Commissioner of DSS where the money is for the study. And I understood her to say that we were waiting until after phase 2 of the study would come in before we could start thinking about where to plug those holes. Is that going to work for the state medical society?
No, the problem, phase 1 was directed towards the physicians. Phase 2 is beyond that need. The problem we're having as if you were to increase Medicaid to take care of the migrant populations or whatever you do, the system can't hold it. We're going to break down. And when we break down like that, you find that those physicians that become overwhelmed get burnt out. And if they're not in the bigger corporate type groups and they're in private practice, they're going to quit. You just can't survive a small business with that sort of payment system behind it.
Thank you.
Thank you, sir.
Appreciate it.
You're all set. Thank you. Up next is Emily Morrison, who's online. Emily, 3 minutes.
Hello, thank you. Good afternoon, Senator Austin, Representative Walker, Senator Berthel, Representative Nuccio, and members of the Appropriations Committee. My name is Emily Morrison. I am a Putnam resident and Director of Development at United Services. United Services is a nonprofit certified community behavioral health clinic serving 21 towns in northeastern Connecticut. We operate more than 30 programs under our one administration. We are an enhanced care clinic and provide services regardless of an individual's ability to pay. More than 60% of our clients each year have Medicaid for their primary insurance. We contract with DCF to provide outpatient mental health services for children and families in our child guidance clinic, in-home parenting services, reunification and therapeutic family time, and a youth service bureau and juvenile review board. Thank you for the opportunity to testify on HB 5048, the governor's budget. I'm here to request that you increase funding for community nonprofits by 5% after providing $50 million to health and human services providers that did not receive the DDS-specific bonus funds in the FY24 budget. This is a total increase of $186 million. I deeply appreciate the increases the legislature has been able to provide over the last few years, but they have quite frankly not been enough to meet the needs of the people we serve. Our services are underfunded across the board, including Medicaid rates. In fact, United Services loses nearly $80 on each and every outpatient therapy appointment to an individual with Medicaid insurance. That's the difference between our cost and to deliver the service, that one service, and what Medicaid pays us. Last year, United Services lost more than $882,000 due to the Medicaid rate not covering our costs. After so many years of underfunding, United Services and many other nonprofits are not able to pay salaries that can compete in the labor market, which affects our ability to recruit and retain staff and continue to meet the tremendous need we are seeing in our communities. In terms of DCF funding, our Youth Service Bureau and Juvenile Review Board are critical prevention programs operating on the front lines of the children's mental health crisis. These programs have experienced a 155% increase in the last 3 years, and the acuity of the children we are seeing is significantly higher than it was before COVID. We are continuing to see tremendous depression and anxiety in children, leading to chronic absenteeism and fighting and using substances at school in many cases. For United Services, the urgent crisis centers are not accessible to residents we serve, as the closest is 90 minutes to an hour away from our coverage area, and there are no public or medical transportation options to get there. For us, we would rather see dollars invested in our prevention programs with the Youth Service Bureau and the Juvenile Review Board to catch children before or in the early stages of their crises. These programs are drastically underfunded, and United Services uses private grant and fundraising dollars to fill the gap between the limited state funding we receive and the surging community need. Please support increasing funding for community nonprofits by $186 million in FY25 so we can continue to deliver critical services to your constituents. Thank you for the opportunity to testify.
Thank you very much. Emily, up next is Joelle Fishman.
Good morning, Senator Austin and members of the Appropriations Committee. My name is Joelle Fishman. I live in New Haven. I'm testifying today regarding HB 5048 and the need to include Husky for immigrants. I'm testifying on behalf of the Connecticut Communist Party and as a member of Connecticut for All Coalition in support of funding an increase in eligibility for the Husky Medicaid program, asking that the Appropriations Committee fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. I had the opportunity to talk with some of the young people from Husky for Immigrants and hear their stories, their heart-wrenching stories of having to go without proper medical attention when needed and the impact on their families and community. Their message is very straightforward. What affects one community affects all communities. The COVID-19 pandemic revealed the need to strengthen our healthcare system overall and also expose long-term inequalities of race and economics in healthcare in all areas of life. The exclusion of immigrant communities from availability to healthcare is a matter of life and death for those left out, but also for the whole community. Eligibility for Husky, regardless of immigration status, has been established and increased over the last few years by the legislature, thank you, to include children up to age 15. In this budget, the request is to increase that to age 18. In 2021, it was estimated immigrant workers paid $1.8 billion in state and local taxes in Connecticut, of which $145 million were paid by immigrants without documents. So it's unjust that while these taxes contribute to funding the Husky program, immigrants have been excluded from coverage after a certain age. It's become common to say that healthcare is a human right, but the challenge is to make that a reality, including the entire immigrant community and healthcare programs, irregardless of status, will make our state a stronger and healthier place for all of us. So I hope that you take the next step and include Husky expansion to age 18 in this year's budget, and I thank you.
Thank you. Up next is Jonathan Sigworth, also online.
Yes, hi, good afternoon. My name is Jonathan Sigworth. I live in Stratford, Connecticut, and have been a wheelchair user for 18 years. I represent the nonprofit More Than Walking and am also a spokesperson for the Connecticut Wheelchair Reform Coalition. At least one bill is being written within the Human Services Committee to address the urgent issue of wheelchair repair delays in Connecticut, but minimal funding has not been included in the Human Services part of the governor's budget, specifically under Medicaid and DSS personnel line items. For years, Connecticut's roughly 5,000 wheelchair users like me have been putting up with service delays from the state's two dominant providers, New Motion and National Seating and Mobility, which are national and private equity owned and control 92% of the market and are insufficiently staffed. These are no longer mom and pop shops like they used to be here in Connecticut. Every wheelchair repair I've requested from my insurance-covered wheelchair service provider has taken over 2 months to be completed. Staffing levels are so low that instead of being trained to, say, replace a flat tire that may cost a few dollars, technicians are encouraged to replace an entire wheelchair wheel, which would cost, for a typical ultralight manual chair like mine, $700. Chronic understaffing, thus, while saving these companies money, is costing Connecticut and its disability community. So wheelchair users like me and several more who will testify later are fighting for minimal cost legislation aligned with the Connecticut Wheelchair Repair Task Force final report recommendations. I was on the task force as well, and these recommendations would accomplish the following. Assessment and repair deadlines. Service providers should conduct in-home repair assessments within 4 business days of the initial call, and likewise within 4 business days of insurance approval and receipt of parts. Service providers should conduct a visit to actually repair the wheelchair. There is precedent for this 4 business day requirement. Massachusetts, in their Senate Bill 2541, just passed it for in-home repair assessments. And if you think in-home services is a luxury, over 90% of us require in-home services because our wheelchairs are broken. We cannot get outside the home, let alone hundreds of miles, 2-hour round trip, not including traffic, to go to only 3 in-shop locations in the state. So this legislation is really important. The current wait times are unacceptable. It's 30 days for an in-home assessment, and then 30 days to get the wheelchair repaired. after parts and prior authorization has come in. And the second most important thing is elimination of prior authorization and extending the prescription validity for 5 years, the life of equipment. Over 90% of prior authorizations are ultimately approved across all insurance providers, and it adds 8 days to the timeline to get these repairs done. So there are many other recommendations that are included in this that have minimal cost, and the savings of the benefit for the disabled community as well as to the state, not having to hospitalize or put into nursing homes people in wheelchairs who suffer complications as a result of broken wheelchairs. It pays for itself. So please fund this bill when it comes out, and thank you so much.
Thank you, Jonathan. There's a phone number that we need identification for.
Yeah, so we have phone number 203-584-6828. I'm going to allow you to talk, and then if you could just let us know who you are so we can get you in the queue. 203-584-6828. All right.
Would the owner of 203-584
Oh, wait, they unmuted.
6828, they're not muted now. Can you please tell us who you are?
Yes, my name is Albert Mislow, and I'm representing the Curtis Home in Meriden. And my apologies, I thought I was presenting as number 111, but thank you for giving me this opportunity.
Well, you're gonna have to
I
come.
am the
We're just gonna, just so you know, we're gonna put your name down and we're gonna call you back to speak, okay? We just didn't know who you were.
Oh, okay, my apologies, okay.
Thank you. Just wait in
Thank
that
you so-
waiting room. We'll call you back in a little bit.
All right, thank you, ma'am.
Thank you. Roger, you're up.
Well,
You gotta speak loud, Roger.
sorry about that. Can you hear me?
Yep, kind of.
Senator Austin, members of the Appropriations Committee. My name is Roger Sanseric, and I'm a resident of East Haven and the Policy and Communications Director at Connecticut Working Families Power. My comments today will focus on the HASKI program. Everyone deserves a healthy, joyful life, no matter who they are or where they were born. No one should have to struggle with pain or sickness because they have the wrong passport. Healthcare should be open and accessible, especially for the most vulnerable among us. In recent years, Connecticut has acted upon these values by first opening, then expanding the eligibility of our HASKI health insurance program to immigrant children. Our state offers coverage to income-eligible minors until they turn 15. Lawmakers in this chamber have understood that this is the right thing to do, recognizing the importance of accessible healthcare for those unable to secure it independently. The same way that the health and sickness have little to do with the place of birth, healthcare needs remain past someone's 16th birthday. When you turn 16, you don't suddenly become healthy. You still need health insurance. So Connecticut has been steadily raising the eligibility age for immigrant children for HASKI. Working Families Power, we urge the Appropriations Committee to allocate the additional funding in this budget adjustment to expand HASKI eligibility to all residents up to age 18. We know this is the right thing to do, both because we have good research about this, and because we have the budget room to do this. There is plenty of studies. I quote a couple on the written testimony. The most recent one by Julia Rosenberg, that shows that children in the states that have, immigrant children in states that had HASKI expansions are first most likely to be uninsured, which makes sense, but also are much less likely to forego necessary medical care, to defer healthcare until later dates, meaning that they get, if they have a serious illness, it gets caught earlier. And they are much more likely to have preventive care and have routine visits to the doctor, which also helps with the healthcare in the long run. So we know this works, and we know that the state has the funds, that we have the resources to do this. We have a budget surplus. And we should use it to actually help those in need, especially doing something that is actually good both for the people receiving these and for the state for the long run. Something that it's going to reduce a lot of unattended medical care. It's going to make sure that these kids are healthier in the long run, and it will help the state bottom line down the road. I'll be happy to take any questions if you have, and thanks for your time.
Thank you, Roger. We're all set. Up next is Elza Montiero. Elza Montiero. She's not accepting the promotion. Elza, you need to accept the promotion if you would like to speak. You need to accept the promotion if you would like to speak. Up next is Elizabeth Wood Townsend. Three minutes.
Good afternoon, Senator Austin and members of the committee. My name is Elizabeth Wood Townsend, and I am a personal care attendant from Manchester. I've been in the healthcare field for 20 plus years, but I've been a PCA in this role for the last 3 years and 8 months. I help my niece with all her daily care needs because she was born with cerebral palsy and is unable to care for herself. She needs complete care and 24-hour supervision. I like that I'm able to help her and my sister have a better quality of life. A nursing home would be horrible for her at age 24. And having a familiar face to care for her brings joy to her, myself, and my family members. My sister would not have a moment to herself, let alone be able to have a job without my help. As a PCA, I have been able to grow to know what my client needs, even if she's not verbally communicating. I read body language, expressions, and emotions and have to be ready to respond instantly. It's not an easy job, but very rewarding. Caregivers provide the glue needed for families to overcome the hard realities of their lives. We help families survive. We are doing God's work, and that's what I love most. Being a PCA is challenging because the pay is not enough. We finally have a contract that will bump pay from $18.25 to $23 an hour in the next 2 years. Funding and passing our contract would mean less stress, which would allow me to give the best care. If I could be financially stable with one job, I could give all to that job and not have to prioritize. Right now, I have 2 full-time jobs and a couple part-time hustles. I barely see my children, which I regret, and I'm exhausted at the end of the day. My clients get my attention, but I know it'd be even better if I could afford an after-school program and not worried if my kids are doing as they're told, constantly having to check in and praying they remain safe. With the world we live in today, especially for Black families, we have to secure our children. If our family is safe, we can have our mind at ease and provide quality care. Being a wife and mother of 4, the long hours at work are very challenging. Thank God my husband and son are able to help with my small daughters, but this can be challenging as well because they both work too. Right now, we are focusing on making enough money to pay the mortgage and household expenses. We have no plan for retirement at this point. There's not enough money to pay all the bills, let alone save. Our priority is not being homeless and hungry. The sad reality is we are 2 paychecks away from poverty. We cannot even plan a vacation. Inflation, cost of food, gas, and energy, as well as housing, is drowning the average American in debt. Credit cards are the safety net, but that gets us further in debt. We need a real living wage and benefits like affordable health care and retirement. Our profession should be treated equally as every other public service profession, like police and firefighters. We deserve all the same benefits. Please hear me today. Help me gain back the power to care for my family, myself, and community by funding and passing the PCA contract. Thank you for your time.
Thank you. Up next is Eric Cruz. Eric Cruz, number 23. Just so everybody knows, we appreciate everybody's always rewarding someone who's just spoken, but we like it like this so that you can give the thanks and then we can continue right on with the things. Many people in the deaf community know it exactly what it means, but that's what we're trying to take a little bit of their community into us. Okay? Go ahead. 3 minutes.
Chairs and members of the Appropriations Committee, my name is Eric Cruz Lopez, Organizing Manager at Connecticut Students for a Dream and resident of Bridgeport, Connecticut. Thank you for the opportunity to testify regarding HB 5048 with respect to the budgets of the Human Services agencies, specifically the Department of Social Services, which administers Husky. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18. I have been an immigrant in Connecticut for over 20 years, arriving with my family when I was 7 years old. For the majority of those 20 years, my whole family has been uninsured, leading to various health problems across my family. Minor and major issues have plagued us, from hospital visits, eye care, glasses, car accidents, getting hit by a car, and things like that, all costing us money out of pocket. Connecticut must move to close the Husky health gap for all children in Connecticut, regardless of immigration status. Plenty of other states with smaller budgets and bigger immigrant populations have successfully opened up their projects up to 18 at a minimum, and several others above that. The piecemeal adjustments to Husky Health that Connecticut has made are not in line with the money that sits in our coffers. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. I also respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky A income eligibility requirements for parents and caregivers, and the reversal of fully raising the Husky C income eligibility limit. Thank you for your time.
Thank you very much. Up next is Elza Montiero. Elza. Elza, you have to unmute yourself. There you go. Speak loud, we can't hear you. I can barely hear you. Go ahead.
I am with Connecticut Workers Center in Bridgeport, and I worked in the healthcare as a surgical technician for 30 years, and now dealing with families. I see the need for the Husky for age up to 18. I'm also a coordinator to a food bank. So with that, I deal with many families struggling to make ends meet. And these immigrants are not finding jobs, and yet they are dealing with so much hardship. And then I get those that want help with health care, and I can't do anything about it. And it just breaks my heart that these people, they want to work. They don't want to be in the system if they don't have to. But some of them don't have a choice, and they can't get to a doctor. I have someone dealing with heart condition, and he can't make it to a cardiologist because he doesn't have the money. And it just breaks my heart with what's going on with that group of people that I have to deal with every single day. And with that, I support this campaign, because it's just heartbreaking what's happening out there. If you're not in the field, you don't really know what's happening. And I deal with that every single day. So I'm here with Connecticut Workers Center campaigning on this Husky for All. And I thank you for the opportunity for speaking on the platform.
Thank you very much, Elsa. Up next is Papa Kojo. Floor is yours, sir. 3 minutes.
All right. Thank you, Senator Austin and the members of the Appropriations Committee. My name is Papa Kojo Faney, and I'm an assistant administrator at Chelsea Place Care Center in Hartford, Connecticut. Chelsea Place, with over 200 employees and 216 licensed beds, has been a key provider of skilled nursing care to our community. Our home continues to provide rehab services and memory care services coupled with behavioral health programs. We also provide services to individuals who suffer from mental illnesses due to substance use disorder and are oftentimes hard to place. As part of the Eye Care Health Network, we are proud to embrace the mission of enriching the lives of every resident we serve. Although the public health emergency is over, the walk to our pre-pandemic life continues. Our nursing home residents we serve and our employees continue to be challenged like no other time in our history of providing services. However, we're determined as ever to get closer to a time when we can say the pandemic is truly behind us. Never before experienced inflation and the ongoing staffing crisis are the top issues that are not addressed in the budget recommendation. We're losing ground and unable to keep up with inflation. There's been an increase in the cost of raw food, medical supplies, oxygen lab, and radiology costs, to name a few. The proposed funding for nursing homes does not recognize what is happening with inflation, and we're asking you to recognize the real inflation that we're experiencing in the state budget, and to accommodate such to aid us take care of the residents we're entrusted to care for. The severe staffing shortage our nursing homes has faced during the pandemic are not letting up. Our staff can only pick up so many hours, and use the agency isn't really costly. It's costly, but it's not allow us to provide our residents the continuity of care they deserve. The lack of commitment from agency staff is noticed not only by the administrative staff, but by our residents as well. With the services we provide, we need dedicated nurses and aides to care for our residents to assure them that we're providing the best quality of care to enrich their lives. We have increased our staffing rates, refer friend bonus, sign-on bonus programs, and other incentives to encourage applicants. However, we aren't seeing the successful outcomes we hope to achieve. The current Medicaid rates don't reflect what the current cost price index is showing due to inflation. Our skilled nursing facility needs more resources to boost the pay of our extraordinary employees, but the proposed budget doesn't address this issue. The resources the state previously provided us to boost staff pay have made all the difference, but our employees are losing ground against inflation just as we are. On behalf of the employees and the residents of Chelsea Place Care Center, we're asking that more funding is needed in the budget to address the unbelievable inflation we're facing and to help us with our soaring labor costs. Thank you.
Thank you very much. Up next is Marietta Vasquez. Marietta Vasquez, the floor is yours, ma'am.
Yes, thank you. Dear Appropriations Committee, thank you for the opportunity. I'm a professor of pediatrics. I practiced general pediatrics for the past 30 years in our state of Connecticut and provide preventive care and tertiary care to children. And really, I'm here to give my strongest possible support to expand health insurance benefits, or HUSKY, to all immigrant children in the state of Connecticut. As a pediatrician, I face every day in my practice the devastating life and death consequences that stem from having uninsured children in our practice and in our communities. This is separating the haves from the have-nots. And this practice, when it comes to health, is shameful. It is really against our Hippocratic oath to know that the care that we provide immigrant children who are uninsured is limited, less or none compared to other children. And really, I think often, what is the future of a society that cannot take care of their own children? All children, regardless of immigration status, deserve access to essential healthcare services, and expanding these benefits ensures that immigrant children in the state of Connecticut have the same opportunities for good health and well-being as their peers. And I'm not just saying this because I'm a pediatrician and I'm an advocate. I'm saying this because it makes sense. Providing access to healthcare is essential for several reasons. From a public health perspective, ensuring that all children have access to preventive care will benefit not only those children, but it also contributes to public health outcomes. And we saw that with COVID. Providing timely healthcare can benefit and by preventing spread of contagious diseases. There is economic benefit. Healthy children are more likely to succeed in school and later in life. There are also the humanitarian considerations. Denying healthcare benefits to immigrant children will lead to unnecessary suffering and hardship. And obviously, none of us want that. Children should not bear the consequences of immigration policies that are really beyond their control. These are children. And we should provide them with access to healthcare, and it is a basic humanitarian principle. I'm a physician. I'm not an attorney. You're all the legal experts. There are legal and ethical obligations. Many countries have legal and ethical obligations to provide healthcare to children regardless of their immigration status. And I believe that upholding these obligations reinforces principles of justice and equality under the law. So really expanding health insurance benefits to immigrant children is not just the right thing to do, but morally, and it also makes practical sense for the health and well-being of our communities. Thank you so much.
Thank you. Up next is Yanamar Cortez. Yanamar Cortez.
Can y'all hear me? I'm sorry, I'm like in a car right now. Okay,
Yep, we can hear
perfect.
you. Go ahead.
Thank you. Good afternoon, chairs as members of the Appropriations Committee. My name is Mark Cortez. I am a resident of New Haven, Connecticut, and the New Haven organizer with Connecticut Students for a Dream. I am also undocumented myself and an immigrant. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025. With respect to the budgets of the Human Services Agency, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. I grew up without health insurance due to being undocumented, which made me ineligible for Husky healthcare. Living without health insurance, like many of y'all have heard, is very difficult. And for undocumented people, it means receiving the bare minimum medical care, home remedies, or none at all. For my family, it meant my parents having to work a bit more hours to afford simple physical exams or vaccinations. It also meant not having regular doctor's appointments and instead relying on free clinics, free dental buses, etc. My main concern now is my parents. They still don't have health insurance, and growing up, they put our health first and neglected their health because of the cost. As they gotten older, the consequences of doing this has shown up in the health issues they have that could have been avoided if they had preventive health care. The fear and anxiety of losing my parents one day due to the lack of health care is consuming and something that I carry every day. Currently, like I mentioned, I am the New Haven organizer with Connecticut Students for a Dream. My job is to organize our youth members to push this campaign forward, as well as to build their leadership skills. The greatest honor for me is to watch my members grow in their leadership and fight for what they deserve. Many of my members recently arrived to this country not too long ago. Some are undocumented and impacted directly, some are not, but have loved ones that are. Every year, members ask me to help them with different kinds of things like affordable and safe housing, affordable higher education, or college application help for undocumented students, information about food banks, access to affordable health care for themselves or their loved ones, and so much more. I always see every year how these concerns affect them mentally and give them anxiety. And let's be clear, it should not be normal for anyone to have these concerns like this. Young people shouldn't have these concerns. Obviously, one of the biggest concerns for them is healthcare and on having access to it due to affordability. This summer, actually, my members and young people, all from ages 40 to 25, canvassed and talked to about 200 people in New Haven to tell them that undocumented children 0 to 12 and prenatal and postnatal care are not eligible to apply for Husky health insurance, and that children 13 to 15 will be eligible to apply in 2024. They were excited and so happy to do this because they care and they want to keep winning, even though many of them are still not eligible for Husky health insurance because they were left out last year. This year, I am hoping that Connecticut keeps moving forward by expanding Husky health insurance so my members are eligible to apply. My members in the undocumented community deserve to have access to health care and deserve to not live in fear of getting hurt or not affording to seek help. I know my members are organizing to win and know that we won't stop till we get it because it's a matter of life and death for us. I asked the Appropriations Committee to fund Husky eligibility for all income CT, regardless of immigration status, up to the age of 18 this year, and for the future to create a long-term plan. Thank you for your time.
Thank you very much. Up next is Brandy Doubleday. Brandy Doubleday, who will be followed by Kathy Ludlam. Brandy Doubleday? Yes, no? All right. Kathy Ludlam? Is Kathy Ludlam here? Oh, Kathy Ludlam? Okay. Kathy Ludlam. You need to unmute yourself.
Microphone off. Hello, can you hear me?
We can hear you. Go ahead.
Great, thank you. Okay. Um, Senator Austin and members of the Appropriations Committee. My name is Kathy Ludlam. I'm a consultant and an advocate. I'm also a wheelchair user. I encourage you to read my entire testimony. In 2021, my power wheelchair stopped. It continued to stop every day at a different time. If someone was here to turn it off and turn it on again, I was okay. But otherwise, I was just stuck wherever I landed. So I got in the habit of staying close to my computer and my phone in one place. I use National Seating and Mobility, and between a technician who couldn't fix it, a technician who had ordered new motors for it, shipping delays, and incomplete parts, it was 7 months before my wheelchair was fixed. And by then, I'd been not driving for so long that I could no longer operate my wheelchair safely. So I am here, along with many others, to request better service that would make Connecticut a leader in this area. I'm requesting reasonable deadlines, 4 days from the first call to evaluation, 4 business days, that is, and 4 business days between getting the parts to making the repair. Savings from fines and averted medical cost would more than make up for any cost to the state in helping this happen. Again, elimination of prior authorization, because it makes no sense to require this on a device that has already been approved and paid for. Of course, you have to fix it when it breaks. And then maintenance and repairs for primary and backup wheelchairs. Because sometimes equipment breaks down. And if you don't have a way of getting around, then you're stuck in bed with all the adverse health effects and life damage that causes. So investing in preventative maintenance and repairs will save the state money in the end by reducing healthcare costs and bringing in revenue from fines. Even this minimal funding for these reasonable changes is not right now included in the human services part of the governor's budget, but it should be. Wheelchair users have been putting up with bad service from the 2 main companies, of which we don't have any other choice but using one of these, for many years. Please help us. Please help Connecticut's wheelchair users to be able to live our lives and not endure broken wheelchairs for years and terrible service. Connecticut deserves better than this. Thank you so much.
Thank you very much, Kathy. Up next is Natasha Karenko. Natasha.
Hello.
Minutes.
Can you click it?
Good afternoon, members of the Appropriations Committee. My name is Natasha. I'm a lifelong resident of Connecticut and a staff member of Connecticut Citizen Action Group, or CCAG. On behalf of CCAG's thousands of members, alongside my loved ones and all other persons living with disabilities who would face great hardship from the proposed budget cuts, I urge you to reconsider the sharp income limit reductions to Husky C Medicaid programs. I'd like to begin with a story about my long-term partner, whose name will remain anonymous. He's lived with severe Crohn's and colitis for nearly 20 years. These are progressive intestinal diseases that require extensive monitoring, cause many disruptions to everyday life, and have resulted in multiple long-term hospitalizations after he experienced life-threatening flare-ups. When his union benefits expired last year, we scrambled to find an affordable option that wouldn't neglect his medical needs. Budgetary restraints complicated this process, the rising cost of housing, gas, utilities, car insurance, and so on, plus the $600 or more a month he spends on ostomy supplies. With great relief, we discovered he was eligible for Husky C and was quickly approved. To me, my partner is one in a million, but in this case, he is one of countless other Connecticut residents living with a disability whose lives would be detrimentally altered by this budget cut. There are many overlooked factors in Husky's income limits, which are already incredibly low compared to other state programs, including the elevated cost of living in this beautiful state. The median rental cost in Connecticut is $1,800. Affordable housing for Medicaid recipients is few and far between, frequently requiring relocation away from friends and family, which can be terribly burdensome for those living with a disability. Disability comes with additional unavoidable costs. Households including an adult with a disability require 28% more income to achieve the same standard of living as non-disabled households. Yet the income limit for Husky C is only 6% higher than that of Husky D currently. This undeniable inequity will be further intensified by reducing the Husky C income limit. These already sordidly low limits leave many Medicaid recipients at a dead end, wanting to earn a livable salary, knowing full well their health care will be unaffordable after passing a certain threshold. The little chance of economic mobility low-income residents have will become nearly impossible by the proposed budget cuts, especially for those unable to temporarily forgo health insurance. I grew up witnessing the American dream become increasingly precarious. These budget cuts are another step toward making it disappear. We need to work toward making healthcare accessible for all who need it, regardless of immigration status, and not reducing access for our most vulnerable populations. Thank you for your consideration.
Thank you very much. Up next is Fanny Ferraria.
Good afternoon, members of the Appropriation Committee. My name is Fanny Ferreira, and I'm the Program Director at Building One Community, a nonprofit organization located in Stanford. Building One Community's Executive Director, Anka Baturina, has submitted a written testimony but couldn't be here with us today. So on behalf of her, I will be reading this testimony. Building One Community was founded in 2011. B1C's mission is to advance the successful integration of immigrants and their families into our society. We achieve this through programs that educate, employ, and empower immigrant families and individuals while engaging the entire community. B1C supports an act adjusting the state budget ending June 30, 2025. With respect to the budgets of human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. I'm here to speak in support of funding and increase in eligibility of Husky Medicaid program and to ask to the Appropriation Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. We applaud this committee and General Assembly for the advances in recent years in Husky coverage for Connecticut children who may be undocumented, but whose important first step protecting all children through age 21 and certain children to age 18 have not gone far enough. Many of people at B1C that we serve, we cope with illness and injuries without insurance. I'm going to mention Camila from Guatemala, has a 13-year-old daughter. She was injured in a sexually assault because she was not eligible for Husky and her mother could not afford to bring her to a specialist. A necessary surgery was delayed for almost a year. She suffered with a great deal of pain during this time. Both the mother and daughter needed psychological support for what had occurred. But without insurance, the services are difficult to pay. Camila, to this day, has multiple unpaid bills for her daughter continued care. We also saw people that had benefit from Husky, which is already on the testimonial letter. We know from research relied by the State Department of Social Services that expanding public health benefits for young people increases college enrollment and postpones the age at which young women have their first child. Also, that the young adults who have benefited from expanded healthcare access pay more in taxes and require less public assistance in later life. And individuals with expanded healthcare access when young have fewer hospitalizations as adults. All these benefits from expanded Husky are critical for those we serve here at B1C. In its 12 years of existence, we have served over 14,300 immigrants from 117 countries. These people have formed a backbone in our economy, and their education, health, and welfare are vital for our future.
Danny, can you
We
wrap
thank
up,
you.
please?
We thank you very much for this opportunity.
Thank you. Appreciate it.
Thank you.
Up next is Fali Sidivar, number 30. Fali. Oh, Fali, if you can hear me, you need to accept a promotion in order to come on. And so if you would accept that promotion, we could move along.
Thank you. I just did. Are you able to hear me?
Yes, we are. The floor is
Thank you
yours,
so
3
much for
minutes.
allowing me to join. Thank you, Senator Austin, for holding this hearing. I'm joining to speak for providers who provide care to children with autism in the state of Connecticut. These are children who receive services under the auspices of Husky program, Connecticut Medicaid program. I'm the CEO of Helping Hands Family. Helping Hands Family is an organization that provides care to children with autism in 5 states, Connecticut being one of them. And we provide ABA therapy, applied behavior analysis therapy, to children with autism in all 5 of these states. We do this through about 30 clinic settings, one of which is in Trumbull, now Shelton, Connecticut. We just moved. Our goal is to help parents navigate the path. They get a diagnosis. It's a really difficult time for all of them. They're trying to find care, therapists who could provide autism services, ABA therapy. They struggle to find that care today. And then it's even more difficult for them if they have Medicaid coverage, because the rate that the state of Connecticut pays for ABA therapy are so low that hardly any provider in the state of Connecticut is able to provide these services under those rates. So these Connecticut Medicaid reimbursement rates are the lowest in all of the surrounding states. They're lower than any of the states that we are working in, and they significantly lag any other, for example, commercial plan that an individual might have. This is an untenable outcome for the state, because the state, I know, has taken pride in serving the underprivileged, especially underprivileged children with autism. And so I would support increasing the ABA rates. We've got certain codes, 97153, H0046, H0031. We'd love to add caregiver training and be reimbursed for it. So the caregiver for the child is the parent of the child. And what we understand is that the child cannot make progress if the only therapy they receive is through us in our clinic setting or in the home setting. We also need to be able to have training sessions with parents where we coach them on how to carry forward the therapy. We don't have an opportunity to be reimbursed for those services, which are significant. are significantly onerous, quite expensive for us, and they're not reimbursed today. We would encourage the state of Connecticut to reimburse those services as well. And then we'd love to see the Medicaid Husky program cover ABA, Husky B cover ABA as well. So for parent transitions from Husky to Husky B, they could lose their services today, which is untenable for the child. And what we've realized, and I've had personal interventions with parents who have called our clinic looking for care for their child, and these parents report a tragic outcome. Ours is maybe the 15th clinic that they have called, the 15th organization that they have called looking for services. Every organization has said to them, we either don't take Medicaid because we can't afford the rates, or we don't have staff, or one of both, which is we have staff, but we can't keep them because the rates we get paid. And so we're just not providing services to Connecticut Medicaid, kids under Connecticut Medicaid. Helping Hands Family provides services, but because of the rates just being unsustainable, we're only able to do it to a small percentage of the kids. And so I'm here to encourage the state of Connecticut, Senator Austin, to look again at the Medicaid ABA rate and to provide an increase that makes the services sustainable, allowing kids to get intervention early in their life, saving the state and the children a lot, and the parents a lot of money and angst in the remainder of their life. Thank you for allowing us to present this.
Thank you very much. Appreciate it. Up next is Tamika Smythe. Tamika.
Hello. Dear presidents and members of the Appropriations Committee of Connecticut, I am from Jamaica and I've lived in Connecticut for over 8 years. My family has been here for like 4 years, and my kids attend Bridgeport Public Schools. They're doing good. My husband does a little construction here and there, and I spend most of my time with my kids. However, accessing healthcare is very, very difficult. My 2 youngest have health insurance, but my 16-year-old does not. And we adults, we don't have it either. However, my 16-year-old has been diagnosed with a blood condition, and she also has migraine, which requires many healthcare trips and also heavy prescription costs. Sometimes it's hard to get an appointment to do her tests because I just can't afford it. And if I get a referral, sometimes it's hard because I have to go to a private facility and it's very expensive. She also has, she does well in school, and she has been referred to see a hematologist and a neurologist. However, whenever she sees the dentist, we have to pay out of pocket, and this is also a burden. Sometimes she sighs and she said that she wished she had health insurance like her siblings because she wouldn't have to wait until we get a paycheck to get her medicine, because she's diagnosed and she has to have a prescription. She has to take daily meds for both conditions. We also believe that, we've been paying taxes and we're productive members of the society, and being a child, it's hard for us to explain to her that she's not able to, get the care that she needs. For us, last year, I had to do some dental work that I could not afford, and it took months. I was referred to get a root canal, which was very expensive. It was so painful that I cried because I couldn't afford it. Oftentimes, my husband and I, we'll try home remedies on ourselves because we're older. And sometimes it works, but sometimes it doesn't. And if we had access to health insurance coverage, then at least it would be one less thing to stress about, and we would all be living healthier lives. Today, I asked the Appropriations Committee to help us to get covered for all income eligible adults or children, even up to 18 years this year. Thank you so much for your time.
Thank you. Up next is Grace Xiong, number 32.
All right, chairs and members of the Appropriations Committee, my name is Grace Xiong, and I'm a resident of Trumbull, Connecticut, and a supporter of the Husky for Immigrants Coalition. Thank you so much for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025. I'm here to speak in support of funding an increase in the eligibility of the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents regardless of immigration status up to age 18. In the last 3 years, we successfully expanded Husky coverage to undocumented children ages 0 to 15 and to undocumented pregnant people. And these policy changes are already having a positive impact on our state. Health equity is something that we must continue to strive for. The Universal Declaration of Human Rights recognizes medical care as a fundamental right, but this is far from the reality in the United States and even in Connecticut. Undocumented people face countless barriers in accessing healthcare, compounded by the inaccessibility of Husky Medicaid. And beyond the age of 15, people who are undocumented are not currently eligible for Husky, which only worsens the existing healthcare inequalities that we're seeing. So furthermore, childhood and adolescence are critical stages of growth, development, and change, and it's crucial at all these ages, especially, that all children have access to healthcare. It is much more effective to bolster access to primary healthcare and increase preventative measures. When people are unable to afford routine checkups and primary care appointments, we are allowing them to fall through the cracks of our healthcare system, exacerbating chronic conditions like diabetes, hypertension, and heart disease until they become emergencies that require hospitalization. These conditions are often manageable with early detection, intervention, monitoring, and education. And health coverage ultimately means access to preventative care, leading to a healthier state, a lower uncompensated care costs for hospitals, as well as lower healthcare costs overall for our state. Through volunteering in EMS and in free health clinics, I've seen what happens when people can't afford medical care, or what it looks like when a chronic health condition exacerbates into a health emergency. People are left in pain and uncertainty, and sometimes with their life on the line. The healthcare system is broken if so many people cannot take care of their health because of financial barriers. I respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky income eligibility requirements for parents and caregivers, and the reversal of fully raising the Husky C income eligibility limit. Ultimately, expanding Husky to all income eligible immigrants, regardless of status or age, is a key policy to advance equity as well as public health care in our state. Thank you for your time.
Thank you very much. Up next is Michael Louise. Michael, number 33. Thank you. I don't know if I said your last name right.
You did. All right. Good afternoon, Appropriations Committee, Senator Austin. My name is Mike Louise. I am the Director of EMS for the town of Stratford. I'm also the Secretary and Legislative Chair of the Connecticut EMS Advisory Board and the Connecticut EMS Advocacy Coordinator for the National Association of EMTs. And I am here today to speak about restoring the $5 million in funding, Medicaid funding for ambulance services in Connecticut. Connecticut and states across the country continue to experience critical challenges in the provision of EMS. Three key areas that are challenging us today are staffing, increased call volume, and increased costs for providing service with decreased reimbursements. Connecticut is no different, as many EMS providers have decided to leave EMS for other positions. In Stratford, we have seen about a 5 to 10% attrition rate, specifically coming out of COVID. There's a considerable expense related to replacing these human resources, and this also has an impact on service provision and places undue pressure on those who choose to remain and provide service. Nevertheless, our frontline first responders continue to show up and provide critical, important services to Connecticut residents. In Stratford, our volume has increased about 3% year over year, between 3 and 6%. With the decrease in reimbursements, EMS is less capable of supporting staff the way they need to be supported. Reduced staff ultimately means reduced capability of meeting call volume demands, which inevitably leads to patient care and customer service issues for patients in Connecticut. Additionally, EMS regularly must respond to calls that we are not compensated for. These would be calls where somebody calls 911, we respond out there and they refuse service, or it's a canceled call. There's an expense associated with that, and we won't be reimbursed for those services. After the cuts to Medicaid in 2010, with no meaningful resolution since, the costs of providing ambulance service have only increased, especially post-COVID. We have seen a significant rise in costs due to inflation, Stratford, in Stratford, 16.9% of our population is served by Medicare, and therefore about 22.8% of our call volume is reimbursed or should be reimbursed by Medicare. Ultimately, this places EMS agencies in a huge financial disadvantage if this funding is ultimately removed. In many cases, in municipalities throughout the state, the difference between the cost to provide service and the reimbursements ends up falling on the taxpayer as a, to fill that gap. So we urge you to please restore the $5 million in Medicaid funding to ambulance providers so that we can continue to support our workforce and ensure the stability of EMS for the residents of Connecticut. Thank you very much.
Thank you very much for coming today. Appreciate it. Up next is Ken Barella. Ken Barella, number 34.
Yes, can you hear me?
We can.
Chair and members of the Appropriations Committee, my name is Kenneth Barella. I'm a resident of Hartford and the CEO of the Hispanic Health Council, the largest Hispanic research, advocacy, and service delivery system in the state. We are also a member of the Husky for Immigrants Coalition. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human service agencies, specifically for the Department of Social Services, which administers Husky. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18. Any expansion to our state Medicaid program has a positive impact on communities, and the cost of this program expansion is minimal compared to the long-term health economic impacts of this policy. One, without healthcare coverage, many individuals delay seeking care until their condition requires emergency department visits or hospitalizations. Early treatment reduces the amount an individual will pay for healthcare in the long term by preventing health issues from developing further and worsening. Two, lack of access to healthcare means that easily managed or treated chronic health issues such as heart disease and diabetes, which is prevalent among the Latino population, can develop into more serious conditions that require more medical interventions and become more expensive in the long run. Three, without coverage, countless families and individuals risk economic insecurity and debt simply for visiting a doctor and receiving costly treatment. Four, lack of access prevents immigrant residents from early treatment, increasing the chances of their health condition developing and worsening. Five, if Connecticut expands Husky to all, regardless of immigration status, the uninsured rate in the undocumented community will drop from 58% to 39%, allowing roughly 21,400 currently uninsured people to gain coverage. This huge benefits cost would only represent approximately 3% of the state's annual Medicaid budget. In the last 3 years, we successfully expanded Husky coverage to undocumented children ages 0 to 15 and to undocumented pregnant people, prenatal and postpartum. These policy changes are already having a positive impact on our state, to include lower uncompensated care costs for hospitals and lower healthcare costs overall for our state. More importantly, members of our community, regardless of their documentation status, who also happen to be children and pregnant women, have access to proper health care. Given the positive outcome, it only stands to reason that we ensure that more individuals have access to the Husky program. I respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky A income eligibility requirements for parents, caregivers, and the reversal of fully raising the Husky C income eligibility limit. The fight for health justice is not siloed, and we recognize that Husky coverage is essential to achieving health equity. The thought of my pregnant wife not having access to quality health care because of a lack of health coverage, or my children not having access to care while growing up, is a horrifying thought. Significant gains have been made to the Husky program over the last few years to cover more people, and those gains should be protected, not diminished. It is imperative that we not only maintain the status quo, but expand eligibility for economic, health equity, and more importantly, humanitarian reasons. Thank you for your time.
Thank you very much. Up next is Francisco Lopez. Francisco Lopez. Up
Me-
next is,
Oh, I'm here.
go ahead. The floor is
Oh,
yours.
thank you so much. Well, thank you for allowing me to be here. My name is Francisco Lopez. I'm from Bridgeport, Connecticut. I will read selectively part of my presentations, so to short the time. I'm here to speak in support of funding an increase in eligibility for Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to all ages. After my story, I will keep brief. I will attempt to explain briefly in a non-technical way why this may not be as costly as it may seem without analysis. Husky saved my life, literally. I used to live in Miami Beach, Florida, a state with a different ideological stance related to human services issues. Swing or sink. There, if you don't have enough wealth, you will receive the attention and the benefits of an undocumented person received here in Connecticut. For years, I did not see a doctor, and the cost was too high for what I could afford then. My health deteriorated, and after not being able to work, became homeless. Category 5 Hurricane Andrew changed my life for the worse, and I lost everything. I can write a book about the things I saw while survivors and the hopeless in the street, people from all walks of life, veterans, families, undocumented immigrants, mental cases, and marginal characters. Severe weather, even hurricanes, will be in the sun. It's a predatory environment where one lives in misery, exposed to the elements of the police, who are ordered to keep the place clean or ugly, undesirable, and bad people in the midst of luxury and wealth. That was my vision. Occasional generous hand from time to time lessens the misery and helps keep the faith in humanity. I took everything as an adventure to keep my sanity. My family, which I never thought about my situation, somehow learned about and ordered me to go to a brother that living in Bridgeport. I reluctantly accepted and my plane ticket was paid. That's how I ended up here and how I discovered that I was diabetic for years without treatment and in a serious condition. I got snapped, husky, and I saved my legs, eyes, kidneys, and had several surgeries and a stroke that almost killed me. I went to the other side for 2.5 minutes, and after my brain was shutting down, I saw everything that was there. Very peaceful, surrounded by incredible beautiful music. I didn't want to come back, but someone pulled my legs, and I landed back in my ICU bed. Was flatline, and my body was about to be harvested. I am an organ donor, but back to life, to bring my back. Terminator. Later, the judge declared me disabled. I will not be here enough for the great medical attention and rehabilitation services I received via Husky. Now is the time to use my second chance in life to pay back to society. I volunteer in this effort using my knowledge of economics, finance, banking, and investment, also engaged in a sacred hobby I have, composing classical music. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of the immigration status and age. Politically, you may need to an incremental approach up to 80 years of age, and in the future to create a long-term plan toward opening access to all immigrants regardless of their age. Healthcare need to not end at age 15 or 18. Although initially I may
Can you wrap it up, sir? I'm sorry, can you wrap it up?
yes, the things may not be as expensive, but there's a multiplying effect when you enter money in the economy. You may have already have that money, but putting people back to work, but in health, so they can be able to work and produce rent for the state, can be better than have them in the subterranean economy. Well, that's all. Thank you so much for your time.
Thank you very much. Appreciate it. Nice story. Up next is Evilise Correa. And I'm turning it over to my colleague and co-chair, Representative Walker.
Evilise? Okay. Brianna Yambe? Okay. Minerva Antigua? No. Okay. Kyla Goulet? Yes? Hey, hi Kyla. Bye. Take it easy. Go right ahead. You have 3 minutes, ma'am.
Okay, thank you. Hi, my name is Kayla Goulet. I'm a charge nurse at Davis Place in Danielson. I've worked there for 13 years. I enjoy helping others. I started as a CNA, providing direct patient care, and then I went on to become a nurse. Working in healthcare, I find a sense of purpose in what I do. As a charge nurse, it's my responsibility to administer medications, provide wound care, patient education, obtain vital signs, complete patient assessments and observations, monitor for changes in condition, and report and collaborate with providers regarding patient care. I also rely on my coworkers, as we are all part of the same team, providing various aspects of care and services that affect patients and residents at the facility. It is hard work, but it is rewarding. I am here today to ask you to fund nursing homes so that we may attract and maintain staff to be able to increase staffing levels and provide the quality of care that all of our patients and residents deserve. Right now in nursing homes, we are seeing higher acuity patients and patients with more complex diagnoses. We see patients who are not stable enough and are not ready for discharge from the hospital, but are still being placed in nursing homes. We see patients with more mental health and drug and alcohol addiction problems. These type of patients require more staff and to ensure that patients and residents and staff are safe. Instead of being able to attract and retain staff because we're compensating them fairly, money is spent on pool staff or agency staff who are not familiar with the patients or the facility and do not have an attachment to them. I often work 16-hour shifts due to poor staffing, which means that on those days, I don't get to see my family. I've had to put off school so that I can work an additional job to barely make ends meet, as my primary employer pays below other facilities in the area. Current staffing ratios are beyond ridiculous. They do not take into account patient acuity or behaviors. However, they allow to be taken into account staff who are just in the building and not providing direct care for the patients. A nurse sitting in an office away from patient care areas should not be taken into consideration when looking at staffing ratios, as they do not provide any direct care. Having these ratios only allows the employer to get away with poor staffing ratios and puts both the residents and patients at risk. More funding would be able to help ensure that there's a higher rate of pay to attract and maintain qualified employees. If we're able to maintain more staff, we're able to, if we're able to maintain more staff, we would be able to obtain more appropriate staffing ratios and more manageable workload for each individual, and continuity of care from employees that are happier, healthier, and less stressed. With more staff, we'd be able to provide the highest level possible of care and would be more likely to have a higher employee retention rate of employees at the facility. Not to mention, we'd be able to care for ourselves and our families better. Please do the right thing and increase the funding to nursing homes so that we can hire more staff and increase staffing levels to be able to provide a more effective and safer level of care. Thank you for your time.
Thank you, and thank you for your testimony. Brianna Yambe? Minerva Antigua? Okay. Waleska Martinez? Good afternoon.
Good afternoon, everyone. My name is Waleska Martinez. I live in New Britain, and I've worked as a CNA at Amberwoods in Farmington for 9 years. I've come before you today to support an increasing funding to nursing homes so we can staff appropriately and make sure our residents are receiving the care they deserve. CNAs are responsible for feeding residents, helping them with hygiene, and ensuring they are safe. This itself is time-consuming, difficult work, but oftentimes CNAs up helping with tasks that aren't in our job description because they need to get done. We return carts to the kitchen due to dishes to get done. We don't have enough dietary aids. This takes up 45 minutes of our time every meal. Despite the challenges of this work, I love what I do. My residents are my main focus, and I've grown to love them like my family. They are very considerate, and we and know we are short-staffed. They see us trying our best, and many residents are patient with us, but that is not fair to them. On days we are short-staffed, we are hustling from 7 a.m. to 2 after our shift ends at 3. We've had 2 CNAs for 30 residents at a time, and I've ended up staying late to ensure they all get their showers. On days like that, we don't take breaks. It's hard and as a professional caregiver to work in this environment. We are angry, frustrated, depressed, and leave every day drained. When I get home, I shut down. I never have the energy to spend time with my own family. How is that fair to me or my coworkers? Our love for our residents and our compassion is exploited and used against us. Our residents deserve better, and so do we. When we are staffed properly, we are able to do our job. Residents are well groomed, showered, and we can actually slow down to talk to them and make them happy. When we are short, we have to rush from one resident to the next and no time to talk with them. It fills my heart to be able to socialize with my patients because I know many of them aren't visited by friends or family. We are their friends and family. Funding would help to address issues of short staffing by raising the fund levels in nursing homes. The state can send a message that you care for residents and the people who care for them. Please do the right thing and fund our nursing homes. Thank you.
Thank you, and thank you for your testimony. Richard Famiglietti? Richard? No. Okay, Richard, you must accept the promotion in order to do the testimony. Richard? Okay, so we're gonna come back and try him. Javier? I see you right there. Javier? Javier Villatoro?
Javier Villatoro.
Hello, yes, I am here. I was just having some technology issues, but I'm here. I'm ready to go now. Can you hear me? Okay. Good evening, chairs and members of the Appropriations Committee. My name is Javier Villatoro. I am an immigrant from New Haven and a member of the Semilla Collective of New Haven. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30, 25. With respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible city residents, regardless of immigration status, up to age 18. I am a worker owner of a cooperative tortilleria. We work with dignity and love for food sovereignty in our communities. I care about the Husky for Immigrants campaign because me and my loved ones are undocumented and have been through the medical industrial complex, which fails to tend the health needs of even US citizens, being even more alienating and challenging when you lack documentation and cannot access health insurance. 2 years ago, when I injured my lower back and specifically the sciatic nerve, I went to a sliding scale clinic. The doctors there suggested I took more rest and even Advil. No recommendation was made to seek a specialist that would work with the injured tendon or the therapy I needed to heal my hurt back and leg. I assume this was because I have no health insurance and the cost of any special treatment would be outside of my capacity to pay. Last year, we asked you to raise the age of the bill to 27, understanding that a healthy adult workforce is the backbone of this country. and the people do not stop needing healthcare when they stop being children. I am 28 now. My brother is 24. We would both benefit from access to healthcare because the health of the workers relates directly to the health of this state. Do not wait for the emergency rooms visits when treatment is long overdue. Invest in life and care. It is the healthiest path forward, not just for us immigrants, but for the state of Connecticut. I ask the Appropriations Committee to fund Husky eligibility for all income eligible city residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you for your time.
Thank you for your testimony. Have a good day.
You too.
Next, Anna Livipuma.
Madam Chair, before we go to Anna, I'm gonna allow Richard to speak. Richard, number 41.
Aha.
Richard, could you?
Good evening. My apologies for missing the promotion the first time.
Well, I'll promote you now and we'll get you in the queue, okay?
Thank you.
Thank you.
Okay. Go ahead, Tom. Okay, Richard, go right ahead. You have 3 minutes. Richard? Okay.
Good afternoon. Can everybody hear me?
Go right ahead.
Thank you. Good afternoon. My name is Richard Funiglietti. I'm here to testify today as a working person with a disability on the Husky C MedConnect program. I have a quadriplegic resulting from a spinal cord injury, and I work a 40-hour week. I have discovered that there is a discrimination towards people with disabilities, income and asset limits for the same entitlement programs as able-bodied people. There are lower income limits and extremely low asset limits for the disabled, where able-bodied people do not have asset limits at all. I'm speaking in regards to Husky C. I would like to thank our legislators who heard us and ended the discrimination by increasing Husky C income limits to 105% of the poverty level after allowable disregards. Thank you very much. Now our governor is proposing to cut and take away those Husky C income increases that you, our legislators, had passed. The governor is trying to reinstate the previous discrimination. I ask that our legislators stay strong and not let our governor bully you into discrimination again. Further, I'd like to ask our heroic legislators to remove the asset limits from Husky C as well, because there are no asset limits for able-bodied people and other Husky programs. Even MedConnect has an asset limit where Husky D does not. Why do the disabled have lower income and asset limits than those who are not disabled? The governor is now cutting other Husky programs, and to my understanding, these cuts may result in people losing health care entirely, and the ones who can go to the exchange will not receive the same services. It will cost more to those people. Don't let the governor bully you into discrimination and remove Husky asset limits. Protect our Husky C increase that has passed and stop the cuts to all Husky programs. As you have heard, there are angry wheelchair users, and rightfully so. There are only 2 wheelchair companies in Connecticut, and they are forcing us to go to the shop for repairs. And for people who can't go to the shop, repairs are taking 6 months and longer. Please pass legislation to reduce those wait times. We're asking for less than 4 days for assessments and less than 4 days for repairs after parts are received. Thank you.
Thank you. Thank you, sir. Thank you. Thank you for your testimony.
Madam Chair, before we move on, we have a phone number in the queue again, area code 203-565-5269. I'm going to allow you to speak. Please unmute yourself and let us know who you are. Again, area code 203-565-2969. We have to know who you are.
Hola.
Please.
No.
Ten- Tenemos un número de teléfono en la fila 203-565-2969. Necesitamos saber quién es, por favor, identifíquese.
Thank you, Margot.
You're gonna have to disconnect. Okay. Moving right along. Number 43, Ana Livipuma.
Hola, buenas tardes. Mi nombre es Ana Puma. Soy madre soltera de un joven que actualmente tiene 15 años, 10 meses. Nosotros residimos en la ciudad de Stamford, del estado de Connecticut. Somos inmigrantes. Llegamos hace 2 años, 2 meses. Mi hijo tiene actualmente
Ana,
15,
Ana.
43 years.
Tony, let me. Margot, are you?
Yeah,
Yes, I'm here. I will be interpreting her. Yes, I am.
Margot, excuse me. Hold on.
Sure.
You are interpreting for Anna. So you're not using our in-house interpreters for Anna. You will be doing the interpretation?
Right, I will be doing that.
Great. Thank you, Margot.
You're very welcome. Ana,
Hola.
adelante.
Mi nombre es Ana Puma, soy madre soltera de un joven que actualmente tiene 15 años, 10 meses. Nosotros residimos en la ciudad de Stamford, en el estado de Connecticut. Somos inmigrantes. Llegamos hace 2 años, 2 meses. Mi hijo estudia en el High School West Hill, está en el grado 10. Todos los días se esfuerza por ser un buen estudiante y estar en los programas académicos, en los deportes, por ser parte activa para la sociedad. Hemos estado buscando ayuda por un seguro médico desde que llegamos, pero lamentablemente en Husky nos dijeron que eran elegibles únicamente los niños hasta 12 años, 11 meses. En ese entonces, mi hijo tenía 13 años, 10 meses, por el cual se nos murieron las esperanzas, pero nos dieron una pequeñita esperanza que en lo posterior iban a extender la edad. Y con la bendición de Dios, actualmente se extendió la edad, pero lamentablemente entra en vigencia en julio, cuando mi hijo ya tiene 16 años, 3 meses, y se nos trunca nuevamente las esperanzas, por la cual yo digo, hay muchos jóvenes que están pasando por la situación de mi hijo, y sé que un seguro médico le hace muy bien para el futuro de ellos. Recientemente a veces yo digo, qué difícil y qué doloroso es vivir con realidades que nos toca atravesar de un momento a otro. Recientemente mi hijo sufrió un accidente en un programa en la cual él se requiere tratamiento especializado y la verdad, se rompió la clavícula que queda entre el hombro y el cuello. Y entonces no tener seguro médico se convierte en una preocupación más grave, sin saber ahora cuánto tendré que pagar y que tal vez no pueda con esos gastos, quizás resulten inalcanzables a pagar. Ruego la ayuda a todo el comité de asignaciones y le pido al comité de asignaciones que financie la elegibilidad para que pueda asimismo Husky cubrir a todos los residentes de Connecticut con ingresos elegibles, independientemente también digo del estatus migratorio, hasta los 18 años que sea este año y que estudie tal vez poder extender a futuro, a largo plazo, un plan que pueda abrir para los inmigrantes independientemente de su edad, porque las necesidades de una atención médica no terminan a los 15 años ni a los 18 años, por lo que se pudiera ampliar la edad para que muchos jóvenes tengan ese beneficio de corazón, de corazón. Dios los bendiga.
My name is
Thank you.
Ana
Thank
Gibi Puma. My name is Ana Gibi Puma, and I am a single mother of young 15 years old and 10 months. We reside in the city of Tanford, Connecticut. We are immigrants. We arrived in the country 2 years and 2 months ago. My son studies at West Hill High School and is in grade 10. Every day he strives in his studies and in the student academic programs and sports to be an active part of society. We have sought help since we arrived, since medical insurance was required for school checkups and for student programs. But at Husky at that time, they informed us that due to his age, he would not be able to count on help, since only children up to 12 years, 11 months were eligible at that time, and he was 13 years and 10 months. There have been so many struggles and hopes, and now the law was extended until the age of 15. But by the time it goes into effect, my son will not be eligible because he will already be 16. Young people do not have the help of Husky that would really help us a lot in their future. How difficult and painful it is to live with realities that we have to go through from one moment to the next. Recently, my son suffered a serious accident in school that required specialist treatment since he broke his collarbone. And not having medical insurance becomes the most serious concern, not knowing now how much I will have to pay, and that perhaps you cannot help because perhaps it's unattainable, the expenses that will happen. I beg the help of the entire Appropriations Committee, and I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, through age 18 this year, and to create a long-term plan to open access in the future to all immigrants, regardless of their age. Healthcare needs do not end at 15 or 18 years old, so that if they could extend the age so that many young people have the benefit of heart, God bless you. From the bottom of my heart, I beg you and I thank you for everything that you can do for us.
Thank you. Thank you, Anna, and thank you, Margot. Have a good evening. Thank you. Next, Christina Emery.
Gracias, Hannah. Que tengas buenas tardes.
Thank you.
Thank you so much. Thank you so much.
Go right ahead. You have 3 minutes.
Good afternoon, Representative Walker and distinguished members of the Appropriations Committee. I'm Christina Emery, Executive Director of Brooker Memorial, a nonprofit agency in Torrington dedicated to the health and wellness of children. Thank you for allowing testimony on HB 5048. Brooker Memorial understands that children affected by tooth decay are at risk for pain, nutrition problems, tooth loss, difficulty with speech, poor long-term oral health, and other chronic diseases. As a designated safety net pediatric clinic, we have been serving low-income children throughout Northwest Connecticut since 1994 and are committed to equitable access to oral health services for all. Last year, we provided more than 8,700 visits in our dental center and at 10 public schools throughout Litchfield County. 85% of our patients are either receiving Husky insurance or are uninsured, making us the largest provider of dental care to low-income children in Northwest Connecticut. Unlike other safety net providers that are federally qualified health centers, hospital-based, or dental hygiene schools, Brooker Memorial receives no additional supplemental payments for caring for a predominantly Medicaid population. For the 22-23 fiscal year, our dental program filed 3,900 Husky claims for an average reimbursement rate of $125 per claim, compared with 149 PPS rate paid to the local FQHC. Both of these rates are well below private insurance reimbursements for the same services. The Brooker Memorial Pediatric Dental Clinic had a net loss over $208,000 last fiscal year due to low Husky reimbursement rates, charity care for the uninsured, and increasing expenses. This current financial outlook is threatening our ability to provide care for at-risk populations in the future. I urge you to consider increasing the pediatric dental rate for community safety net providers to ensure all children, especially those most at risk for poor oral health, have equitable access to critical services. Thank you for your consideration.
Thank you, and thank you for your testimony. Next, Alicia. Good afternoon.
Good afternoon, Representative Walker, Senator Austin, and members of the Appropriations Committee. I'm Alicia Gajudi. I'm the President and CEO of Edelbrook Behavioral and Developmental Services. Edelbrook is a multi-service agency specializing in autism spectrum disorders, developmental services, and behavioral health treatment. We contract with DCF, DDS, school districts, and we receive Medicaid funding. We support 350 amazing young people with highly complex behavioral and developmental needs and their families through the expertise of more than 650 caring employees in 27 locations throughout Connecticut. And we do this work not only to fulfill our mission, but also in partnership with and on behalf of the state of Connecticut. Many of the children and young adults we serve have extensive trauma histories. They've experienced multiple hospitalizations, and they've been in other treatment programs, often out of state. We work to understand and address behaviors, help individuals develop and improve communication skills, maximize their unique talents, remain safe and out of the hospital, and ultimately help them find hope and happiness. But our success is dependent on our talented, committed, and compassionate staff. They are the ones building relationships, establishing trust, and providing care. So I'm speaking to you today in support of our amazing staff, asking that you increase funding for community nonprofits by 5% in fiscal 25, and that you, most importantly, index future increases to inflation. We truly appreciate the increases the legislature has fought to include over the past few years, but growing costs have far outpaced those increases. We must be able to recruit and retain high-quality staff to meet the growing demands for services, but we need your help to do that. Although the proposed DCF budget infuses resources for crisis-level services, without a well-supported system of care at all levels, those children and families may not be able to access the services they need beyond the crisis. So we must stabilize our current system and plan strategically to address gaps so that kids are able to move quickly and easily along a continuum of care. It is just not reasonable to expect us to continue to provide services, meet complex regulatory requirements, and address growing demands at reimbursement rates that don't come close to meeting our costs. Costs for salaries, health insurance, utilities, and rent have increased steadily, but our state reimbursement levels have not come close to keeping pace. Nonprofits have been losing staff to telehealth companies and school districts, hospitals, even the state, and private practices, and there is a severe shortage of staff to serve children and families. So this is the time for government to invest in the nonprofit human service system so that we can continue to be part of the solution for children, families, individuals, and for our government. Our employees deserve to be paid at levels that reflect their expertise and their dedication, and to know that they will get consistent funding increases. The children we serve deserve to have consistent staffing with limited impact of turnover. This is the time to support vital human services and our most vulnerable children, adults, and families. Thank you so much for your time and attention.
Thank you, Alicia. Good to see you again.
Good to see you, Representative Walker.
You're welcome. Excuse me, young man. Young man over there. Over there. Yes, you. Excuse me. There are people that are testifying in here, so they would like quiet when they testify. Sir. Over here. Over here. Thank you. All right, next, Rosa Velasquez. Good afternoon.
Good afternoon. Thank you for pronouncing my name properly.
Oh, wow. I mess up everybody else's, so you're lucky.
Noted, noted. Thank you. Honorable members and chairs of the Appropriations Committee of the Connecticut General Assembly, thank you for the opportunity to speak today. My name is Rosa Velasquez, and I'm the Executive Director of Connecticut Students for a Dream. I'm here to speak on HB 5048. C4D is a statewide youth-led network that advocates for the rights of undocumented immigrant youth and their families. We do this through community organizing, leadership development, and advocacy. With the many important priorities being funded by the governor's budget for human service agencies, I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program. And I ask the Appropriations Committee to fund Husky eligibility for all eligible Connecticut residents, regardless of immigration status, up to age 18. Connecticut Students for a Dream and our members believe that all young people need access to healthcare to lead healthy lives. The majority of our members are between 15 and 26, and many do not have access to healthcare because of their immigration status. Adding funds needed to expand Husky up to the age of 18 today to all, regardless of status, would make a tremendous impact in the lives of our members. I want to emphasize that many of our members are between the ages of 18 and 26. Most are transitioning out of high school, beginning the rest of their lives as young adults. They are the future of Connecticut, and we should unequivocally provide the best care for our youth to ensure that they lead healthy lives. Expanding Husky up to the age 18 would provide health care and preventative care to a wide variety of persons, young parents, workers, and students. If Connecticut wants to work towards a thriving and growing workforce that is ready to meet the needs of our future, Connecticut must ensure that these individuals have access to health coverage. Expanding care to young immigrants up to the age of 18 would advance health equity in our state while also being fiscally prudent. Hospitals would save money on uncompensated care, and the state would also save money on reduced emergency Medicaid spending. The policies this honorable body passed in 2021 and 22 are working. Over 2,000 undocumented children ages 0 to 12 have already enrolled in Husky since January 1st of 2023. And last year, over 1,600 undocumented pregnant people accessed critical prenatal services. We can and should continue this progress by expanding to age 18. As we look into Connecticut's future, we cannot afford to sit and do nothing about the lack of access to affordable health care. Today, this committee can send a bold message that our state and our legislators believe in equitable healthcare for Connecticut residents, regardless of immigration status, and that you are committed to seeing Connecticut residents healthy and thriving. We at Connecticut Students for a Dream respectfully ask you to please include funding to provide Husky coverage for undocumented individuals up to age 18 today. Thank you.
Thank you, Rose, and watch me butcher the next name, okay? Chenye Leslie? Chenye? No, okay. Hannah? I'm not trying the last one. No. Okay. Lucella Fuentes? Lucella Fuentes? Cynthia Johnson? Wow. Yay. Good afternoon, Cynthia.
Good afternoon.
Want to do me a favor and pull the microphone close to you so we can hear you? There we go. Go right ahead, ma'am.
Good afternoon, Senator Austin, Representative Walker, Senator Bethel, Representative Nushi, and members of the Appropriations Committee. My name is Cynthia Johnson. I live in New Haven, and I worked for the last 5 years caring for my daughter, Anissa Johnson, as her personal care attendant, PCA. I come before you today to ask that you give PCAs like myself the funding we need for livable wages and benefits by funding and passing the PCA contract. I love my daughter and have cared for her entire life. However, a series of events that began in 2015 led me to become her PCA. My daughter Anissa lives with a rare case of epilepsy. It's a syndrome which causes her to have different types of seizures. The last type was called drop seizures. In 2015, she had a series of drop seizures, which caused her to fall, hit her face, break her jaw in 3 places, and her teeth just left her mouth. They didn't break, but they left her gums. With that fall, my daughter experienced not only the healing of her jaw, but she was left with PTSD from the traumatic experience of it all. She went from 156 pounds to 93 pounds, and it took 92 years for her to recoup, and she still has nightmares from it. And the treatment of it all is a lot of love and care. I was at that time writing my 3rd book. I was in school for relationship therapy, and I had to end that and take care of my daughter. Of course, I've been with her all her life, but that was a trauma for her. And it changed over and over and over again. This work, PCA work, is love and care. We as PCAs, we take care of our consumers with all the love and all the care that we can give them. Her recuperation was me staying at home with her, taking care of her. However, as a PCA working in Connecticut, I'm saddened because as a PCA, I'm not being taken care of. PCAs are professionals, and we work every day to take care of others. And for some reason, we are not being taken care of, and our work is not being taken seriously. And I just want the appropriations to understand that we have a good contract that's up, and we really need our contract for the legislators to understand that that contract really needs to get passed, because it really will help. It's a step towards the right direction for all PCAs in Connecticut. It's over 11,000 of us, and we really work hard each and every day. You know, it's too many of us that are out here living in our cars, going to food lines, and we work every day. We are essential workers, and we work hard each and every day.
Thank you, Cynthia. Thank you for your testimony.
Thank you.
Thank you for your testimony, and I think we are going to hear your contract sometime soon, I hope.
Thank you.
Okay.
Thank you.
Thank you. Chenier?
Hi, thank you for coming back around.
Go right ahead.
All right. Chairs and members of the Appropriations Committee, my name is Chinya Jelly, and I am a 4th-year medical student at Yale living in New Haven. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget from the biennium ending June 30th, 2025, with respect to the budgets of the human service agencies, specifically the Department of Social Services, which administers Husky, that includes Medicaid and CHIP. You have already heard Connecticut residents explain how access to Medicaid would improve their lives. Over the years, you may have heard arguments for why undocumented families deserve access to health care. They pay taxes, they contribute to the economy, and they need the care. You have heard countless people express their beliefs that healthcare is a human right. While I definitely agree, I don't think I can make these points in a more poignant, relevant, or heartrending way than anyone that has spoken before me. So as a researcher and a healthcare provider, I will focus your attention on a peer-reviewed study. A Yale professor and a couple of federal government officials did a study, and it showed that giving children Medicaid coverage had a profound effect on their lives as adults. They were less likely to die young and more likely to attend college, and on average, they earned more income as adults. They collected fewer tax credits and paid more in income taxes. By the time the children turned 28, the government had already recouped 58 cents on every dollar spent on Medicaid for them. If things continue at that rate, the government will make more than it initially spent on them. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and to ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18. Doing so is in the best interest of our communities and in the best interest of the government's pockets. As a healthcare provider and former Medicaid beneficiary, I asked the Appropriations Committee to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs not end at age 15 or age 18. Our commitment to Husky for all residents, regardless of status, is rooted in our belief that immigrant parents, disabled immigrants, and working immigrants all need access to healthcare to create healthy communities and families. We also believe that the health of children cannot exist without the health of their parents and caretakers. Thank you so much.
Thank you, and thank you for your testimony. Hannah? Okay. Lucila Fuentes? Lucila Fuentes? Okay. Crystal Crespo? Crystal Crespo? Okay. Stefani, Connecticut Students for a Dream, Stefani. Okay. Joseph Short, I saw Joseph. I think I saw Joseph. Yes, I saw Joseph. Joseph? Joseph? Joseph. Okay. Move on to the next. Kim I'm sorry.
Mr. Short, number 52, would you please unmute yourself and testify? It's your turn. We're going to pass you by. Going once. Going twice.
Come on down, Kim.
Good afternoon.
Good afternoon.
know
Go
it's
right
been
ahead.
Long day, and thank you so much for your time.
Oh, it's
Representative
quite
Walker.
a long time ago.
I
Don't worry
know.
about it.
I feel for you.
Go right ahead.
I just want to say thank you for your time so much. My name is Kim Arrow. I am the president of Aetna Ambulance and Ambulance Service of Manchester. Both companies are regional providers, large regional providers in the Hartford and Tolland County area. We respond to over 50,000 emergencies a year, and they've been in business, both of them, for over 75 years. I'm here to testify on behalf of all the providers, EMS providers. I think many of them were in the room earlier this morning, for the need to restore the $5 million for the Medicaid increase. I know many legislators have been very good at reaching out to all of us and meeting us these last few months, and it's been wonderful to get to know them. They've been listening to us and hearing our plea, and we certainly appreciate and hope that you can advocate for that to be restored for us for the fiscal year 25. I'm sure many of you have read and heard many of the stories of how we are all struggling. I'm here today to point out what has changed so significantly in the past few years. I've been working for the two companies for the past 20 years, 8 being as president. And this most significant change that has occurred is our entire state is in a major upheaval. Most of it is because of the majority of the state is covered by volunteer services. And let's face it, after COVID, volunteerism has been very challenging. And they're struggling horrifically. So they're being forced now to either pay for their staff or hire a staffing agent. See, I think there's been numerous conversations or articles and papers right now that are saying that towns are now, or the agencies themselves, the volunteer agencies, are absorbing over $600,000 annually to pay for the staff. You have to think about that. That didn't exist a couple of years ago. That is significant for a small little town to all of a sudden be hit with a $600,000 bill. There's not enough call volume for that. And a lot of those towns are predominantly Medicaid towns. Some of the larger towns as well, Bridgeport, New Haven, City of New Britain, major components of the payer mix is 40 to 50% Medicaid. They're struggling. We haven't had an increase in Medicaid for 3 years, yet all those expense lines, payroll, insurance, the cost of vehicles, the cost of the equipment has all gone up 30%. That doesn't add up. It's not, we're on like a precipice right now. More than any medical provider, I have to stress that. Our world has changed upside down and it affects everyone in the state. We're not going to be able to survive if we don't have an increase. We can't wait for another year for a study. It has to happen now. I ask you all, plead with you all to please restore this. It's a small ask, but I think you understand that the federal match is much more significant. It's, I think, north of 15 million. So we need that in order to survive, or else there's going to be severe consequences of staffing. Lastly, I just want to point out a couple things that we cannot bill for. A lot of people don't understand our billing structure, but we're not like a lot of providers. We can't bill for medical supplies. When we respond to a cardiac arrest, we spend over $500 on just medical supplies alone. The Medicaid reimbursement for that transport is only $350. So we're in the hole already, $200 just for the medical supplies. That's not covering our staff, our fuel, our insurance at all. Secondly, we respond to numerous calls in the last few years that require multiple ambulances or other supervisor trucks because there's risk of danger of combative patients, patients with behavioral health issues, bariatric patients. They require 2 ambulances all the time. And we can only bill for 1 transport. I know I've probably gone over, and I'll end now, but I just appreciate your time and look forward to answering any questions you have in the future. My background is accounting, so I understand the finances of all this. Happy to answer any questions in the coming weeks. Thank you.
Thank you, and thank you for your testimony. Farah Garland. Farah Garland. Joe Goldsmith. Good afternoon. Go right ahead, sir.
Good afternoon, Representative Walker and members of the committee. Thank you for allowing me to testify today. For the record, my name is Joe Goldsmith. I serve as Regional Network Director of Strategic Partnerships for Youth Villages. I'm here today to thank the committee for funding the Youth Transition Success Programs, known as Transitional Support for Emerging Adults, or simply TSEA, in provider settings and in this testimony. My organization, Youth Villages, created the TSEA program to serve 17 to 22-year-olds who are leaving the foster care system by giving them the support needed to transition to adulthood. Findings from a rigorous random assignment evaluation of the model showed that young adults who participated in the program fared better in several outcome domains compared to those in a control group. Those outcomes include reduced instances of intimate partner violence, homelessness, and economic hardships, and improved mental health, employment, and earnings. Since the program's inception in 1999, TSEA has helped over 25,000 young adults across the country. It is currently offered in 22 states and Washington, D.C., either through direct service delivery by Youth Villages or through licensing and training high-quality local nonprofits to implement the program in their own community, which is how this program is implemented in Connecticut through a partnership with DCF and 2 local agencies. DCF brought TSEA to Connecticut to fill a need for more robust services for this population. Community Health Resources in Wheeler Clinic began implementing TSEA in 2019, serving roughly 2/3 of the state. With the support and funding of this committee, the program is still going strong and has been able to maintain the same level of service for 4.5 years. Since 2019, 280 young adults have been served in the program, and upon exiting, 84% of them were living independently or with positive supports. 93% had avoided arrest, and 95% had obtained at minimum their high school education, were employed, or a combination of the two. We have found that these outcomes in Connecticut are consistent across race and ethnicity as well as gender identity. Of young adults served 1 year after exiting the program, 95% had avoided arrest and 100% had housing and employment and or educational stability. I've spoken a lot about positive outcomes and statistics, and these are great. It means the program is working as intended. Just as important, though, if not more, is how do young adults who participate in the program experience that? I'm excited that we have 3 participants here today to talk just about that in just a few minutes, their experience in this program. I applaud them for sharing their stories and advocating for young adults like them who will benefit from this program in the future. Their words are far more impactful than anything I can say, and they are proof that money invested in this program is an investment in ensuring young adults have the skills they need to be successful. I want to close by again thanking the committee for supporting the program. The TSEA program looks forward to continue helping young adults into the future. Thank you.
Thank you. Thank you, and thank you for your testimony. Have a good day. I see that Stefania, number 51. Stefania,
Yes.
go right ahead.
Necesitas un traductor. Voy a necesitar un traductor para decir
I'm
esto.
here. Estoy aquí, Stephanie, para ti.
Ok, mucho gusto. Mi nombre es Stephanie Naupari Venturo. Soy estudiante de Denbury y miembro de City Studying for Dream. Gracias por la oportunidad de testificar sobre HB 5048, una ley que ajusta el presupuesto estatal que termina el 30 de junio de 2025 con respecto a los presupuestos de la Agencia de Servicios Humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicinal, Medicaid y CHIP. Hay importantes prioridades que financian en el presupuesto del gobernador. Por agencias de servicios humanos, estoy aquí para hablar en apoyo de la financiación de un aumento en la elegibilidad para el programa Husky Medical y pedirle al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut elegibles por ingreso independientemente de su estatus migratorio hasta los 18 años. Soy Estefanía. Esto es importante para mí porque es una necesidad básica que todo ser humano debería tener. La cobertura sanitaria es algo que todo el mundo debería tener en este momento. Hace poco me caí y me golpeé el coxis y me duele mucho hacer cosas básicas como sentarme, caminar, subir escaleras y otras actividades. Lamentablemente no puedo ir al médico por el alto costo, entonces tuve que aguantar el dolor hasta encontrar un lugar que pueda ayudarme. Por el motivo de que soy inmigrante y no puedo tener cobertura médica. Nos ayudaría mucho que los accidentes que pueden ocurrir, no importa si es grave o no tan grave, porque el seguro médico es para todos. Les pido al Comité de Asignación que financie la elegibilidad de Husky para todos los residentes de Connecticut, elegible por ingresos independientemente de su estatus migratorio hasta los 18 años. Este año y que en el futuro cree un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad. La necesidad de atención médica no termina a los 15 ni a los 18. Muchas gracias por su tiempo. Mi nombre es Estepanea Naupari Venturo.
Thank you. Thank you for your testimony. Go ahead, Margot.
My name is Estebanea Naupari Venturo. I am a student from Danbury and member of Connecticut Students for a Dream. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding and increasing eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18. I am Estebanea. This is important to me because for me, it is a basic need for every human being. Health coverage is something that everyone should have. I recently fell and hit my coccyx, and it hurts a lot to do basic things like sitting, walking, climbing stairs, and other activities. Unfortunately, I can't go to the doctor because of the high cost. So I have to put up with the pain until I find a place that can help me. For the reason that I am an immigrant and cannot have health coverage. It would help us a lot with accidents that can happen. It doesn't matter if it is serious or not so serious because health insurance is for everyone. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 nor age 18. Thank you for your time.
Thank you and have a good day. Thank you. Next, Joseph Short. Joseph Short. Go right ahead, sir.
Good afternoon, Representative Walker and all members of the Appropriations Committee. My name is Joseph Short, and I'm here to testify on behalf of the Centers for Independent Living. First, thank you for your ongoing support and for last year's funding increase. But the Centers for Independent Living are still far behind inflation and cannot continue to serve the entire state with their current budget. Therefore, I'm requesting that you increase funding for the Centers for Independent Living by $1 million annually so they can meet the increased demand for services and continue serving individuals with disabilities throughout Connecticut. I've been a quadriplegic for over 20 years and have a master's degree of social work. Centers for Independent Living are unique because they are primarily run by qualified individuals with disabilities such as myself. The term Center for Independent Living means a consumer-controlled, community-based, cross-disability, non-residential, private nonprofit agency that is designed and operated by individuals with disabilities and provides an array of independent living services to consumers at no cost. On a daily basis, I'm taking calls from people in dire circumstances, seeking hope that there's someone that can help. We want to continue to be there for those who need us the most, but we have been severely underfunded for many years and simply cannot continue serving everyone throughout the state with the funding the Centers for Independent Living are currently receiving, or with the proposed minor increase in House Bill 5048 of $25,000 divided between the 5 centers. Centers for Independent Living currently provide a range of critical services, including independent living skills training, peer counseling, advocacy, information and referrals, benefits advisement, assistance with housing, transitioning from or avoiding unnecessary institutionalizations, youth transition services, and more. The size and the scope of these services are ultimately decided upon by available funding. People call and want an appointment as soon as possible because they're losing housing, being discharged from the hospital with a new disability, need help navigating the system, or getting accommodations for their child, or someone wants to change their life situation and try working while keeping a support system of benefits. Because of our personal and professional experience, the Centers for Independent Living staff are experts at helping people navigate the vast systems that could shape their futures, connecting them to services to deliver results for people that needed help yesterday. I want to be able to continue helping those individuals immediately and not have to put them on waiting lists or turn them away because of funding constraints. That's why we need your support of a $1 million increase to their funding, which is long overdue and essential to sustaining independent living services throughout Connecticut. Thank you very much for your time, your consideration, and for allowing me to testify.
Thank you, and thank you for your testimony. Next, we have Farah Garland. Number 54, Farah Garland.
Madam Chair, after Ms. Garland, could we please go back to number 38?
Hi, good afternoon. Thank you for circling back. I appreciate it. I've been here since about 2. I don't know why I was not able to join as a panelist, but I appreciate you coming back to me. My name is Farah Garland. I am a disability rights activist and an advocate and a wheelchair user. When I'm here today, there's so many great things to talk about, but I'm here to talk about wheelchairs. When I first got my chair, which took years to get approved in the first place, there were months of delays just for it to arrive in the National Seating and Mobility shop. Then last second, a supposed additional delay of just 1 day cropped up, which allowed my insurance on file to change conveniently. The insurance, which they had already run, and when the order was first placed, and then they had run again when the order was processed, this caused what was once supposed to be my fully covered, extremely necessary medical device to suddenly cost me over $18,000 with no insurance coverage. That is twice my annual disability income. And that is abysmal and frankly treacherous. And now that I finally have my chair, while my world has gotten much bigger, I have also found myself avoiding travel, especially by air. The idea of my precious mobility, my independence, being taken away by having my chair damaged and having to go through the exhausting, dehumanizing, and immobilizing experience of dealing with vital repairs is frankly terrifying. For me, lengthy delay times would likely just be painful, isolating, and reduce my ability to work and connect with others in the world around me. But for, say, Ingresia Figueroa, a disability rights activist and complex wheelchair user from California, it was lethal. We deserve to be able to live freely and fully without fear of being neglected, abused, and forgotten about by the industries that are supposed to care for us. And that, by the way, profit off of us quite a lot. For years, Connecticut's roughly 5,000 wheelchair users have been tolerating absolutely abhorrent service delays from the state's 2 leading providers, New Motion and National Seating and Mobility. Ta-da! Both are national and private equity owned, and they control over 90% of the market, and yet they are somehow insufficiently staffed. Current wait times are unacceptable, nearly 30 days just for an assessment, and another 30 days, if you're lucky, for repairs. The SA 23-22 Wheelchair Task Force's final report recommendations are changes that we at the Connecticut
Sarah,
Wheelchair.
could I get you to sum up because you're over 3 minutes now.
Oh, yeah, my last sentence, or 2 sentences, I promise. The Wheelchair Reform Coalition and its disabled people broadly are fighting for because they are vital to our equality in our state. As many others have pointed out, so I won't. These recommendations can and should be used to fund state agency like DSS, to ensure that repair deadlines and care deadlines, as laid out in the task force's recommendations, are met.
Thank you. Thank you, and have a good day. Thank you.
You too. Thank you very much.
Number 38, Minerva Antigua.
Yes, I am.
Good afternoon.
Hi,
Go right ahead
buenas,
with your testimony.
okay. Buenas tardes, presidentes y miembros del Comité de Apropiaciones. Mi nombre es Minerva Antigua. Llevo 4 años viviendo en la comunidad de Bridgeport y soy miembro líder de Se Hace Camino Connecticut. Gracias por la oportunidad de testificar con respeto al Bill 5048, ley que ajusta el presupuesto estatal para el bienio que termina el 30 de junio del 2025. Con respecto a los presupuestos de la Agencia de Servicios Humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Estoy aquí para hablar en apoyo de la financiación de un aumento de la elegibilidad para el programa de Medicaid Husky y pedir al Comité de Apropiaciones para financiar la elegibilidad de Husky para todos los residentes de Connecticut que cualifican basado en sus ingresos independientemente de su estatus migratorio hasta los 18 años. Nuestro hijo tiene seguro médico, Husky, pero mi esposo y yo no tenemos. Y es importante tener seguro médico, porque si mi hijo se enferma, ¿quién lo va a cuidar? Es muy difícil cuando tiene un problema de salud y los médicos te mandan de arriba para abajo sin ninguna solución, simplemente porque no tiene un seguro médico que cubra el costo o visita o especialista para ver dependiendo de la enfermedad que tiene. He vivido momentos muy difíciles en mi persona, tanto como yo y mi familia. Créanme que no es nada agradable. Mi rodilla derecha y mi brazo derecho no me dejan dormir y mis únicos aliados son ibuprofeno y Tylenol por unas cuantas horas. Hemos luchado mucho en nuestra comunidad para que todos los residentes puedan tener un seguro médico que cubra sus necesidades sin importar su estatus migratorio. En nombre de la comunidad latina inmigrante de Connecticut, quiero decirle que uno no se enferma desde los 8 años hasta los 18, sino desde que nace hasta que muere. Pido al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut que cualifican basados en sus ingresos, independientemente de su estatus migratorio, hasta los 18 años. Este año y en el futuro, crear un plan a largo plazo para abrir el acceso a todos los inmigrantes, independientemente de su edad. La necesidad de salud no terminan a los 15, sino por mucho más años. Gracias por su tiempo. Mi nombre es Minerva Antigua Gutiérrez. Buenas tardes.
Thank you. Margot?
Good afternoon to the chair and members of the Appropriations Committee. My name is Minerva Antigua, and I have been living in Bridgeport for 4 years, and I'm a mother and leader for Make the Road, Connecticut. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. I am here because my son has medical insurance, but not my husband or me. We don't have any type of health insurance. And it's really hard when you have health issues and the doctors have to send you, up and down without any solution simply because you don't have health insurance that covers the cost of visits or specialists to see depending on what illness you have. I have lived many hard and difficult moments, and my family has too. And believe me, it is not something nice. My right knee and my right arm don't let me sleep at night, and my only allies are ibuprofen and Tylenol for a few hours. We have fought a lot in our community so that all the residents can have medical insurance that will cover the needs without care of what their immigration status might be. In the name of my immigrant Latino community of Connecticut, I want to tell you that one does not get sick between the ages of 8 and 18. One gets sick from birth till death. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future, to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 nor at age 18. Thank you for your time. My name is Minerva Antigua.
Thank you, Margot. Number 56, Tanya Barrett. Tanya Barrett. Okay, number 56.
Hello, can you hear me?
Yep.
Great, thank you. So, good afternoon, committee and Representative Walker. My name is Tanya Barrett, and I am the Senior Vice President of 211 Health and Human Services. I want to thank you for the opportunity to provide testimony in support of the Connecticut United Way's request to serve more of our neighbors who rely on the 211 information and referral service for connections to needed resources by increasing funding to meet the demand of callers. 211 information and referral is a free, confidential, 24/7, 365 days per year phone and web service that provides Connecticut residents from every corner of the state, inclusive of all races, incomes, languages, and family compositions, with connections to essential services. These are callers who are seeking help to pay utility bills, find summer camps for their kids, childcare, find tax prep resources, or a hot meal. Of the more than 1.7 million inquiries we received last year, 30% were related to housing and shelter, 12% were for food, another 12% were for mental health and addiction services, 7% were for help with employment and income. 211 call volume has increased 20% and 20-fold at 211ct.org in just 5 years. We are very grateful for the support that our State Department of Social Services provides, but it no longer can support the demand for our services. Flat funding since FY 2010 means that our frontline staff who answer residents' calls has decreased from 32 down to 16 during this time period. So that means that there are people who are not accessing the existing resources already available for which they likely qualify. The additional funding would support 13 resource navigators, resulting in an increase in the number of callers, up to 1,700 additional callers served per week, and better service in that callers for information and referral would wait 5 minutes or less. When 211 has the resources to meet demand, we are a top performer. 211 is the crisis and suicide lifeline, which you might know as 988 for Connecticut. And we are one of the top performers in the US for our speed to answer these urgent calls. We answer 95% of the 988 calls in under 10 seconds. So it's about resources, and your continued funding is essential to not only maintain, but also improve this critical infrastructure to ensure a thriving future for everyone in our state. Thank you.
Thank you, and thank you for your testimony. Next, Sarah Giovanello.
Hi, can you hear me?
Yep.
Hi, good evening, Representative Walker, chairs and members of the Appropriations Committee. My name is Sarah Giovanello. I'm a resident from New Haven, a member of Local 34, and chapter vice president of the Blake Street Tenants Union. And thank you for the opportunity to testify regarding HB 5048. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and to ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up until age 18. I'm a proud union member, and I have seen firsthand how good, consistent healthcare has positively affected my community. In the past, I've helped organize several non-union hotels, casinos, and restaurants. And when I'm talking to people about their jobs and their lives, lack of good healthcare and unexpected medical bills frequently come up as a destabilizing event in people's lives. One medical bill can lead to homelessness for a struggling family, especially right now, as well as the housing crisis in the state is becoming a big problem. And, one of the first questions I always ask people is, have you ever not gone to the doctor because of the cost? And the answer is almost always yes. And then when people join my union, suddenly their healthcare is affordable or free. And they often talk about the peace of mind that this brings them and how it allows them to accumulate generational wealth that they wouldn't otherwise have been able to. I think about one person in particular who had a massive heart attack, and was airlifted to Hartford Hospital, and it cost him like $100. You know, so that kind of thing can be an amazing relief for people. Undocumented immigrants are an important part of the state's workforce, just like everybody else, and they deserve the same things so that their families can thrive the way that previous generations of immigrants have been able to, like my family. And so I'm asking the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs certainly do not end at age 15 or 18. Thank you.
Thank you. Thank you. Good to see you. Thank you for your advocacy. Next, Beatrice Mancado. Beatrice Mancado.
Beatriz Montacada.
No. Okay. Next, Matt Barrett.
Hi, good evening, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Matt Barrett. I'm President and CEO of the Connecticut Association of Healthcare Facilities and the Connecticut Center for Assisted Living, and I'm grateful for this opportunity to testify. As the committee carefully evaluates the needs of all of our state's constituencies and communities in the developing midterm budget adjustment, we once more ask you to consider the needs of Connecticut's skilled nursing facilities in your deliberations. Unfortunately, the midterm budget recommendation continues the policy of eliminating skilled nursing facility statutory inflationary Medicaid rate increases adopted in last session's biennial budget. For state fiscal year 2025, the state's share of this reduction is $96.4 million. When adding the loss of associated federal revenue at the 50% federal match rate, the overall reduction is $192.8 million. Providing these inflationary increases at this time is critically important to Connecticut skilled nursing facilities, given the extraordinary inflation, escalating staffing-related costs, and dramatically rising temporary nurse staffing agency fees that providers continue to experience. Several skilled nursing facilities are providing testimony at today's hearing, and dozens more are submitting testimony in writing to underscore that existing Medicaid rates are clearly falling considerably behind these escalating costs. Connecticut skilled nursing facilities are working collaboratively with state policymakers on a range of oversight and rate reform set in motion since the public health emergency, such as a new case mix-based payment associated with the acuity of the resident population, new transparency provisions and ownership disclosure requirements adopted last session, the development of a value-based payment system, and we have been stakeholders in the ongoing work of the Department of Social Services Excess Bed Capacity Work Group. However, the foundational issue of an underlying inflationary adjustment in the Connecticut state budget remains unaddressed. Thank you once more for your consideration, and I'd be happy to answer any questions you may have.
Thank you, Matt. Thank you for your testimony. Have a good evening.
Thank you.
Next, Mercedes Castro. Mercedes Castro. Okay, next, Rena Hernandez. Rena Hernandez. Huh? I'm sorry? Okay, next is Edgar, wait a minute, wait. Oh, okay. Edgar Arcina? Nope, okay. Okay, he was, okay. Next, Caprice Taylor. Caprice Taylor. Okay. Next, Mauricio Valari. Mauricio.
Villarreal. Mauricio Villarreal.
Is Mauricio here? No. Okay. Carmen Bautista. Carmen Bautista. Carmen? No. No. Okay. Okay. Chris Lacey.
I am here.
Chris Lacey. Go right ahead, sir.
Thank you. That sped up quickly. Good evening, Madam Chair and members of the committee. My name is Chris Lacey. I'm the CEO of the Waterford Country School in Quaker Hill, Connecticut. We are a 102-year-old nonprofit special education school and social service agency working with hundreds of kids and families in different programs throughout Eastern Connecticut. We have several contracts with the state of Connecticut, specifically DCF. We've had a foster care program since the early 80s, a Star Shelter program since the 1990s, and currently also operate a visitation program for children and parents. Thank you for the opportunity to testify on House Bill 5048, the governor's budget. I'm here to request that you increase funding for community nonprofits by at least 5% over last year's budgeted amounts. I understand that the governor has proposed another 0% increase to nonprofit contracts in this budget. I am here to let you know that that is in stark contrast to the 20% increase our health insurance carrier wants, the 30% increase our liability carrier has already passed along, or the increases our private sector vendors have long been charging us. Flat funding also does not allow us to give the cost of living increases we need to our employees, who are the key to any good work we do. The Child Advocate released a child fatality report this week for a young baby who died from fentanyl. Of particular concern to me as a provider is that the performance of the community substance abuse provider involved in that case was noted to have been negatively affected by staff turnover and inadequate supervision. That should be concerning to you too, because as you've heard over and over today, that is the state of nonprofit social services in Connecticut right now. We are all experiencing high staff turnover, loss of supervisors, and loss of experience that are negatively affecting service delivery. Funding has a direct impact on our workforce, and our workforce has a direct impact on the clients we serve. Last year, my agency closed our more than 50-year-old DCF residential program because we simply couldn't operate it well within the funding available. Now, Connecticut kids and Connecticut tax dollars are waiting months and years to be sent out of state to receive the same treatment services. Without regular, predictable, dependable cost of living increases to state contracted nonprofit providers, our workforce will crumble, fewer clients will be served well, and more programs will close. Please support increasing funding for community nonprofits in fiscal year 25 so that we can do our jobs for the children and families of Connecticut. Thank you for the opportunity to testify. I appreciate it.
Thank you, Chris, and have a good evening. Next, Evelyn Alvarado. Evelyn? Is that Evelyn? Yay! Good evening. No, good afternoon, still. Go right ahead.
My name is Evelyn Alvarado. I live in Hartford, and I'm a part of the Hartford Deportation Defense. Thank you for the opportunity to testify regarding to HB 5048. I'm here to speak in support of founding the expansion of the Husky Medicaid program to include all Connecticut residents who qualify based on income. regardless of immigration status of up to 18. I care for the Husky for immigrants because it is important for people like me to be able to go to the doctor and check on how our health is. My father was sick and almost passed out in the middle of the street, and they rushed him to the hospital, and because he didn't have insurance, it was harder for him to get help. Having access to health insurance would help me because every time I get sick, my parents wouldn't have to get so worried about where they could take me or how they could help me get better. It would help my community by giving them an opportunity to know how their health is. I asked the Appropriation Committee to fund Husky for all the income eligible Connecticut residents regardless to immigration status up to 18 this year and in the future to create as long-term to plan tours opening access to all immigration regardless of age. Healthcare needs to not end at age 15 or 18 because so many people need like to know how their health is and to just like not worry so much about it because it just like doesn't help them like mentally or physically. It just like worries them too much and it could cause so many like mental problems, not only like for like young people but like for old people. And yeah.
You did a fantastic job. No clapping. No, 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 no. We got to do happy hands, happy hands. But you did a fantastic job, even for us old people, okay? Yes. No, 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 we're not doing questions. No, no questions. Huh? No, 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 no. We have another 200 people that have to testify. Nope, no,
Yeah.
no.
Yes, I just want to say thank you very much for coming. I think it is very, very important to see young people get involved and have some concern.
Thank
Thank
you.
you very much.
Thank you.
Thank you. I didn't know that. I didn't want that. Thank you.
You're welcome.
Yeah.
And thank Representative Gonzalez, because she's going to stay all evening now with everybody else. Luis Luna? Luis?
Representative Walker, good evening. Representative Terziak, Representative Gonzalez, and whoever else is on Zoom. My name is Luis Luna. I am honored to serve as the coalition manager for Husky for Immigrants. Today, I stand before you representing a coalition of over 40 organizations dedicated to ensuring equitable access of healthcare to all Connecticut residents, irrespective of their background or immigration status. We firmly believe that healthcare is a fundamental right. Today, you will hear, and you have been hearing testimony from community members, healthcare providers, faith leaders, and immigrant justice advocates, all underscoring the importance of expanding healthcare access. We urge your support for raising the age eligibility for Husky Health Program to include income-eligible individuals up to the age 18, regardless of immigration status. Additionally, we respectfully oppose the governor's proposed budget adjustments that would reduce Husky A income eligibility requirements for parents and caregivers, as well as the reversal of fully raising the Husky C income eligibility limit. The stories shared today highlight the profound impact of healthcare access on individuals and communities. As we celebrate the strides made since 2021, where the General Assembly expanded healthcare coverage for undocumented immigrant children up to age 15 and provided medical coverage for pregnant and postpartum undocumented individuals, we recognize the ongoing need to break down barriers to healthcare access to more of our communities. Our collective efforts have already yielded significant progress. With over 10,000 children enrolled in coverage since implementation began in 2023, this achievement not only improves public health outcomes, but also it strengthens our healthcare infrastructure and promotes fiscal responsibility through preventative care. This is good policy. And we should rejoice to know that some children who didn't have access before now have it. But we are leaving other children behind, and we must do and can do better. We extend our gratitude to the Governor and the Department of Social Services for their dedication to implementing the expansion of the Medicaid program, and also want to transmit our gratitude to this esteemed committee for their invaluable collaboration in securing the necessary funds to sustain this program. However, our work is far from complete. Too many immigrant communities still face barriers in accessing healthcare, highlighting the urgency of our continued advocacy and struggle. As we commemorate the 5th year of our fight to expand access, we acknowledge the hundreds of individuals who have contributed to these shared victories. Together, we reaffirm our commitment to the principle that healthcare is indeed a human right, regardless of immigration status. Let us remain steadfast in our pursuit of equitable healthcare access to all immigrant communities in Connecticut. Thank you for your time.
Thank you, Luis. Good to see you again.
Thank
for
you.
your
Thank you so much.
Thank you. Next, we have 63, Caprice Taylor.
Good evening.
Good evening.
Thank you, Appropriations Committee members.
Go right ahead.
And
You have 3 minutes, Caprice. Go right ahead.
great. I am the president at Universal Healthcare Foundation. As we measure ways to save money, it behooves the state of Connecticut to remember the extensive research that says spending dollars early on the onset of one's health journey, preventive dollars, early intervention dollars, actually saves a lot more money down the road. And this is why ACA became ACA. This is why the state had supported sustenance in the past. But we are still leaving out too many human beings in the state of Connecticut, even after a global pandemic. It behooves us to consider hours lost in wages, hours taxes that are not collected, ways in which health and the lack of access to health insurance harms our ability to support the collective community. We need to have adults who are healthy, who are thriving, who can pay taxes, larger amounts of taxes. I've worked 8 years in the healthcare industry, supporting immigrants from all sorts of countries, and have witnessed people losing limbs because of not having diagnosed diabetes and not having the preventive care that they needed, the early intervention care. How much difficult is it to be fully employable and pay greater amount of taxes when you have a limb that you've lost? These are the kinds of questions the Appropriations Committee needs to consider, where increasing access to Husky is the right thing to do. Recent research shows investing now in integrating immigrants into our society, that is the question of allowing for Husky to cover those that need coverage. And our Social Security needs more citizens, more people invested, being able to work in our society, being healthy, because our population is aging and immigrants will sustain the very fabric of the well-being of all. We will depend on them. Will we have a healthy population workforce, or will they be incapacitated? Thank you for your time.
Thank you.
And I appreciate the opportunity to speak today.
Thank you for testifying. Next we have Carmen Batista. Seth Freeman. Meg Morelli. I think I saw her. There's Meg. Go right ahead, ma'am. You have 3 minutes.
Thank you, Representative Walker, members of the Appropriations Committee. My name is Mag Morelli, and I'm the president of Leading Age Connecticut, a statewide membership association representing not-for-profit provider organizations serving older adults across the continuum of aging services. I'm here today to testify in support of the governor's recommended investments in quality nursing homes, residential care homes, and community-based services that are currently contained in the biennial budget, and to encourage continued planning and investment in our entire system of aging services. It's vital that we address this sector of our healthcare system as our population continues to age and their need for long-term services and supports continues to grow. We must work together to plan and invest in a system of aging services and supports that is fair, balanced, and sustainable. And Leading Age Connecticut is ready to partner with the state in this planning effort. There are many factors influencing the future of aging services. The current workforce crisis is having a profound impact on aging services and is significantly affecting the funding needs throughout the continuum. Our aging infrastructure is something we must address as we work to strike the correct balance between facility-based and community-based care. And technology holds the potential of transforming the aging services sector in new and dramatic ways. These are just a few of the influences we see impacting our sector, and we hope to address them together with the state in an effort to build a strong and high-quality system of aging services. Regarding nursing home funding, the state's currently addressing a long-standing inequity in the nursing home rate system by phasing in both an acuity-based rate methodology and a rebased nursing home rate system. We are extremely grateful for this investment into a modernized rate structure. The rebased rates will be fully implemented in July of 2024, and we are hopeful that once completely phased in, this new rate system will bring some level of financial stability to the sector. We thank you for your patience and support during this transition period. Regarding the residential care homes, we're extremely supportive of the residential care home model, as many of our members offer this level of service within their continuum. We are hopeful that the investment plan that was put into the current budget will in fact encourage the growth and sustainability of the residential care home model. And then regarding home and community-based services, our members provide the full continuum of long-term services and supports, including a wide range of home and community-based services. We're grateful for the funding provided to those services in the current budget, and we urge continued support of this sector. We know that more needs to be done, and we eagerly await the second phase of the provider rate study that will include the sector of the continuum, something we have advocated for and continue to support. A strong network of home and community-based providers is what is needed to achieve a successful rebalanced system of aging services, and we support these strategic efforts to build and fund a sustainable network. I want to thank you for this opportunity to testify tonight, and to also, we have submitted some additional written testimony for your information. So thank you very much.
Thank you, Meg. Thank you for your testimony. Have a good evening.
Thank you.
Next, Jennifer Nadeau. Jennifer.
Good evening, members of the Appropriations Committee. My name is Jennifer Nadeau, and I'm a licensed clinical social worker and the Senior Vice President of Child and Family Services at Community Health Resources. CHR is an essential healthcare provider that meets the behavioral healthcare needs of children, families, and adults from throughout the state. We provide a full range of services from 24/7 crisis care to outpatient and school-based therapy, as well as intensive community-based services, residential treatment programs, and more. We rely on state funding to continue to respond to the growing demand for services with effective, evidence-based, and individualized services. Thank you for the opportunity to testify on the governor's proposed budget for fiscal year 25. I'm here to request that you increase funding for community nonprofits. No increases to mental health and substance use grant funding is unacceptable at a time when the state has ample resources to invest in vital services while maintaining its financial strength. It's not an either-or situation. I deeply appreciate the increases the legislature has been able to provide over the last few years. but they have not been enough to meet the needs of the people we serve. We continue to be hit by crippling increases in our costs that far outpace the rate of increases the legislature has provided. Since 2007, factoring in the increases, we're still 32% behind. Children, adolescents, and their families need services more than ever. The acuity of the symptoms we're seeing and the volume of referrals to our programs has never been this high. Just last week, the Connecticut Insider reported that hundreds of children were stuck in emergency rooms across the state because they don't have access to needed behavioral health services in the community. Despite several years of focus from the legislature, we continue to hear the same old story. Nonprofits are continually being asked to serve children with increasingly high needs, and waitlists for programs continue to grow. Last week, a study of some of the state's Medicaid rates was released by the executive branch. We've been making the case for years that the state is underfunding behavioral health services. This study backs up what we've been saying and provides proof that Connecticut is spending less than half of what comparable states are spending for outpatient behavioral health services. Meanwhile, we can't afford the market rate for clinical staff. Each clinician that we cannot hire means that more children and families are not able to receive the services that they need. Many of our programs operate with large deficits. We're continually faced with the dilemma around whether we can continue to operate programs that are losing money, knowing that if we close them, it means even less access for families. In light of the ongoing mental health emergency for children, the devastating opioid use epidemic, and record homelessness, this is a time to invest in the state's mental health safety net. We need increased funding for services so that more people can access community-based services that they need. I appreciate the opportunity to provide my perspective on the budget. Please support increasing funding for community nonprofits. Thank you for all that you do to stand up for nonprofits like CHR in the budget process. Have a nice evening.
Thank you, and thank you for your testimony. Have a good evening. Lacey Jarrow? Lacey?
Hi, thank you. Good evening, Madam Chair and committee members. My name is Lacey Giroux, and I'm the Director of Government Relations at the National Diaper Bank Network. The National Diaper Bank Network is a national membership network of more than 300 basic need banks in all 50 states, but we are proud to be founded and still headquartered in Connecticut. Today, I'm here to express our wholehearted endorsement and support for increasing the Diaper Bank of Connecticut's allocation of state funding. This increased funding is crucial to allow the Diaper Bank of Connecticut to continue their work to address diaper need in the state and continue their existing programming that works to ensure that Connecticut families have the basic necessities they need to thrive. Now more than ever, continued and expanded government investment in diaper banks is necessary. In spring of 2023, the National Diaper Bank Network concluded a nationally representative study that found that nearly 1 in 2, or 47% of U.S. families are experiencing diaper need. This is a sharp increase from the first diaper need investigation in 2010 and in several subsequent studies that found that nearly 1 in 3 U.S. families reported diaper need. Diaper need is a pervasive issue affecting families from all walks of life. It is not merely a matter of convenience, but a fundamental aspect of infant and toddler health and well-being. The lack of access to an adequate supply of diapers can lead to serious consequences, including diaper rash, infections, and heightened stress for parents. Not to mention, without enough diapers, children cannot go to daycare, forcing parents to miss work. With the increase in need, there is an increase in demand, making expanded funding necessary to address the need and allow for diaper banks to continue and expand its current programming, like the Diaper Connections program. The National Diaper Bank Network commends the state of Connecticut for its commitment to recognizing and proactively addressing diaper need throughout the state through previous appropriations, and we urge you to lend your support to increasing the appropriation. Thank you for your attention to this important matter, and we look forward to witnessing the positive impact of continued and expanded funding for diaper distribution on the lives of families throughout Connecticut. Thank you.
Thank you.
Good evening, Representative Walker, Senator Lesser, Senator Austin, and all the members of the Appropriations Committee. My name is Janet Stolfi Alfano, and I'm the Chief Executive Officer of the Diaper Bank of Connecticut. You just had the pleasure of hearing from my colleague at the national level. I'm going to talk to you a little bit about how that issue impacts Connecticut. Since 2004, the Diaper Bank of Connecticut has been helping families meet this basic need. We provided over 40 million diapers to Connecticut children since we started 20 years ago. I've had the pleasure of being part of this great organization since 2007 and honored to lead it since 2011. And while we are an established diaper bank and one of the largest in the country, we are only meeting a fraction of the true need in our state, serving about 6,100 infants and toddlers each month, but the need is somewhere closer to around 80,000 infants and toddlers based on Connecticut's DSS data portal. We know that diaper need impacts the health and well-being of infants and toddlers and the entire family. Diaper need has been documented to be the #1 predictor of postpartum depressive symptoms, above and beyond food insecurity in a sample of low-income mothers in New Haven, Connecticut. Extended periods in a soiled diaper or even reuse of a previously soiled diaper can increase the risk of urinary tract infections, hepatitis, eczema, and severe diaper rash. In 2018, the Yukon Connecticut Center for Economic Analysis released a report highlighting some of the specific issues that families faced. It showed that providing diapers is helping to reduce incidence of diaper rash, which in turn reduced medical expenses for families. And providing diapers and a supply of diapers that is needed for childcare helped families get to work. More than half of the parents using childcare to go to work have missed work because of an inadequate supply of diapers. And on average, parents were unable to access childcare, lost about between 4 and 5 days of work a month. And if you are working a minimum wage job, that works out to about $6,000 every year. We're working to provide this basic need that's essential for the health and development of infants and toddlers. It reduces the incidence of diaper rash and associated health risks in babies and decreases stress in mothers. Emergency COVID funding created an opportunity for us to increase our distribution throughout the state, including a first of its kind in the country, Diaper Connections, which is a partnership between the Diaper Bank, the Hospital Association, and acute care hospitals. That funding is ending, but the need is not. We know that nationally, diaper need has increased from 1 in 3 families to 1 in every 2. Increasing our line item will allow us to maintain support for those 2,200 babies being served by Diaper Connections today and expand it even further. Our network is made up of home visiting programs, community action agencies, childcare centers, family resource centers, faith-based organizations, and other community-based organizations providing critical services to families in our state. The simple fact is diapers are a basic health need for the optimal health and well-being of children and families. And thank you to Connecticut for being such a leader in this space.
Thank you, and thank you for your testimony. Have a good evening. Next, we have Seth. I saw Seth. No, sorry. Seth Freeman? Is Seth Freeman here? No. Okay. Huron Rodriguez, and I cannot, Garrett Dubbin and Charlize Price. Okay. You have 3 minutes, guys. First, you got to turn the microphone on. It is? Oh, good. Okay. Everybody's microphone's on. Make sure you say your name and then go ahead.
Hello, my name is Karan Rodriguez. I'm from East Hartford and I'm part of the TSEA program. And I think it's been very helpful for me because they help me go to like my meetings for school and like help set that up for me. And then like a really big thing is they help with transportation. Like they help me get to my job interviews and any important appointments that I may need to go when I can't get there myself or I can't get there on time due to public transportation. So I really like that about the program and all the other resources.
Yes.
Hi, my name is Garrett Dolan. I'm 18 and I live in Southington in a foster home. I've been with this program, TSEA, since September of 2023. My worker, when we first met, she was really nice. We got to talking about personal interests and she asked me what I wanted to get done. I had a list, license/driving school, college preparation, getting a bank account, and getting a credit card. Even though it's only been a couple months, she said she could. She said she could help with that. Even though it's only been a couple months, we've gotten a lot of stuff off the agenda. I have a bank account. I have a credit card. I've got college acceptance letters. Yesterday, actually, I just got my permit, and I'm starting driving school soon. So I just want to say this is a really good program.
Thank you. Okay.
Hi, my name is Charlize. I'm from Norwich and I am a part of the TSEA program. And I've been in this program for about a year and a half. And I am working on getting my own apartment and going to college. And my TCSEA worker helped me with driving school. Yeah, they helped me.
Thank you for your testimony. TSEA should be very proud of you, and thank you for testifying today. So thank you and have a great evening. Thank you, guys. Thank you.
Thank you.
Next, Gage Smith.
Good afternoon, Senator Lesser, Representative Walker, and members of the committee. My name is Gage Smith. I'm a PCA from Brooklyn, Connecticut. As a PCA, I help my consumer get moving for the day, do physical therapy, walk, get out of the house. He suffered a leg wound and it robbed him of his mobility and caused him to gain a serious, significant amount of weight. But since I started working with him, he's lost over 100 pounds. And now even small things like standing up to do the dishes, he's able to do. Before his injury, he would led a very active lifestyle. And now he can see that he can work towards repairing or regaining the things that bring him joy and make his life worth living. He now makes healthy food choices to maintain good health. And I partner with him because I enjoy working with him in his journey and achieving his goals. I help him with housekeeping because his wife needs a double knee replacement and they have 3 young children and they can't do it by themselves. So I assisted them in that day-to-day aspect of their lives, and I genuinely enjoy my job because I get to serve the community and help my consumer reach his milestones. I think sometimes I'm more excited about his accomplishments than he is. There's really no better feeling than helping someone regain their sense of self. Finally, we have a PCA contract that will raise wages from $18.25 to $23 an hour in the next 2 years. Higher wages would help me not only have to not worry so much about meeting my needs like groceries, paying the mortgage, and having gas to get to work, but it would afford me more mental and emotional energy to put into the work that I do. When people who care for others get their needs met, they can do a lot more for the people they care for. I also think about retirement in my future. I know working in this field that not a lot of people have that option. I know PCAs personally that are of retirement age and are still working because they can't afford to retire because they'll lose their homes. And that's heartbreaking. Please fund and pass our PCA contract because it will start to get us where we need to be as healthcare workers and caregivers. Investing in healthcare workers is an investment in vulnerable populations we serve and the communities in which we all live.
Thank you. Iva, would you like to say something and introduce yourself, please?
My name is Iva Johnson. I am the organizer for 1199. And I'd like to let everyone know about 10 years ago, I was here. And I was nervous. And I didn't read anything from my paper. And Representative Walker was here and we stayed till about 2 o'clock in the morning.
Okay.
And it's so important to make sure that your voices are heard everyone that is in this field or everyone that has a struggle, the lawmakers need to know that. They need to know about the struggle because they're here to do the moral right for the state. And in order for us to make sure that they remember and understand what their huge job is, we have to share our stories. Thank you very much.
Did you state your full name?
Iva Johnson.
Iva Johnson, thank you. Thank you very much. Have a good evening.
Thank you.
Thank you. Michaela Bosm? Michaela?
Hello.
Oh, good. Okay, sorry. Go right ahead.
Good evening, Madam Chair and members of the committee. My name is Michaela Bozum, and I am the director of the Urgent Crisis Center at Child and Family Agency located in New London. I am here today to strongly support the need of additional grant funding for the urgent crisis centers across the state of Connecticut. Over the last 8.5 years, I have been in the field of child and adolescent mental health in different capacities. I have worked alongside police departments, home-based settings, school settings, outpatient settings, and now the Urgent Crisis Center. As a licensed professional counselor, I have supported children and their families who have been negatively impacted by many different traumatic events, specifically that of intimate partner violence. I have worked alongside DCF in an attempt to help aid the families who struggle. I have seen firsthand the decline in mental health within our youth. I have seen the level of crisis continue to rise. Now my work continues as I have the opportunity to support youth and their families through the Urgent Crisis Center as long as funding supports. We are responding to the national state of emergency of children's mental health. In Connecticut, there has been a 24% increase in children aged 5 to 11 years old visiting the emergency departments for mental health related concerns. There has been a 31% increase in children aged 12 to 17 years old visiting the EDs regarding a mental health crisis. The American Academy of Pediatrics reported that youth suicide is a serious public health problem, responsible for more deaths among youth ages 10 to 24 years old than any single major medical illness. Furthermore, national surveillance data suggests that roughly 7 to 8% of adolescents attempt suicide each year, and roughly 17% report serious suicidal ideation. The urgent crisis centers can support these youth and their families with a comprehensive mental health evaluation, safety planning, discharge planning support, and follow-up contact to allow these youth and their families to regain hope. The urgent crisis centers are new to the state of Connecticut with data that is less than a year old. What I can say with confidence is that each month we are open, the utilization continues to rise. We predict the utilization will continue to grow as we remain focused on collaboration with area EDs, schools, and community partners. Since August, our utilization has increased by 800% to date. The Urgent Crisis Center has allowed for 90% of those children to be diverted from the ED. To date, Child and Family Agency alone has supported 166 youth. In summary, the Urgent Crisis Centers need continued support with funding to be able to help the youth within the state of Connecticut. With blended funding from grant, Medicaid, and commercial insurance, we can be able to continue to improve this important level of crisis intervention and support families in getting connected to ongoing clinical support and foster a positive turn in our youth's and families' overall mental health. Thank you.
Thank you. Number 66, 61, I'm sorry, number 61, Rena Hernandez. Rena Hernandez.
She'll need the interpreter, Madam Chair.
She'll need the interpreter? Okay. Yes, please. Yeah. Rena.
Rina, yo soy Ana, voy a ser tu intérprete. So puedes comenzar en cuando puedas. Hello.
Sí, buenas tardes.
Ok, buenas
Bueno.
tardes. Vas a hablar y cada 2 oraciones para yo poder traducir, ¿ok?
Sí, perfecto.
Ok.
Sí, buenas tardes. Mi nombre es Reina Hernández.
Good afternoon, my name is Rina Hernandez.
Y soy una PCA.
I am a worker of public health.
Sí, yo trabajo para una muchacha, una joven con autismo.
I work for a girl that has autism.
Sí, mi pregunta es,
Dale.
sí, mi pregunta es, que quisiéramos el sueldo un poco más, porque la verdad, todo está muy caro.
I am
Todo ha
asking
subido.
for higher
Ay,
salaries since life is getting too expensive.
sí, todo es demasiado caro, la luz, la renta, y con 18.25 lo que estoy ganando, eso no es suficiente.
Everything's higher, the rent, the utilities, and getting a salary of $18 an hour is not enough to cover everything.
Sí,
Sigue.
para yo poder hacer un trabajo para una paciente, pues también yo necesito pues un salario más,
Más alto. In order
más
for me to
alto,
keep
sí.
doing this job, I need a higher salary. Dale.
Sí, pues eso es todo. Yo pienso que por ahora eso es todo.
This is all I want to share with the community.
Muchas gracias y muy amables.
Thank you very much.
Thank you. Thank you, Rena.
Okay.
Muchas gracias, Rina.
Next, Rose Murphy. And I will turn it over to our Representative Datham at this time. Thank you. Have a good evening.
Thank you very much. My name is Rose Murphy, and I'm a proud New Haven Public Schools high school teacher and member of the New Haven Federation of Teachers. Thank you for the opportunity to testify regarding HB 5048, specifically for the Department of Social Services, which administers Husky. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and to ask for the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut kids, regardless of their immigration status, up to age 18. As a high school teacher, I have already seen the positive impact of Connecticut's successfully expanded Husky coverage to undocumented children up to age 15. These children are now getting preventative care, some of them for the first time. Now we need to ensure that all of Connecticut's children have access to the Husky program. Like all of us here, I have heard many comments about this bill over the last few weeks. Many of these comments go beyond callousness or a lack of understanding. They're vicious. And as a high school teacher who is honored to teach Connecticut teenagers each day, these comments have really shocked and saddened me. They also prompted me to reflect and wonder whether those advocating for withholding eligibility for healthcare coverage from children truly understand the realities of who they're impacting. So I teach high school sophomores, juniors, and seniors. And if you're an adult here today, I'd like you to please think back to your sophomore year of high school. Remember what you were worried about and what was on your mind and what you valued at the time. The children we're here advocating for today are those Connecticut students, sophomores, juniors, and seniors in high school. They are anxious about the SATs. They're trying to get their math homework done before their boisterous younger siblings get home. Some of them are just beginning to learn to drive, and I hear them discussing whether they'll ever be able to parallel park. They're balancing friendships that have become more complicated seemingly overnight, and they're beginning to wonder how they'll face the new challenges of independence that await them after graduation. I don't bring up these images of our collective adolescent years to trivialize what my students are going through, because many of them, as you can imagine, are living with challenges that are far outweighing academics or sibling rivalries. Instead, I'm going to ask you to conjure this image of a high school kid to establish that when we talk about this issue of ensuring healthcare access, we are talking about kids, not about conceptual ideals or hypotheticals, but children in our public schools. Our state is one of the wealthiest and the wealthiest country on earth, and we absolutely have the means to ensure that these children can access medical care. So this decision, whether to grant them care, is not really a financial one. The choice we're making is a moral one. Are our undocumented high schoolers deserving or undeserving of access to healthcare? I'd like to share the story of one such high schooler, one of my former students. She had just turned 16. Her friend had just been hired at Dunkin' Donuts, and the student eagerly asked me if I could help her write her first resume so that she also could apply for her first job. As we reviewed the application, she realized she didn't know her social security number. Most 10th graders don't. She called her mother to ask what to write, and that was the moment she found out that she was undocumented. Neither of us will ever forget that afternoon, although this is a relatively common situation. Many high school kids find out this information when they're applying for a job or applying to college. And in that instant, so many things about my student's life suddenly made sense to her. Why she was 16 and hadn't been to the dentist since she was 11. Why her mother prayed over her with desperation at every childhood illness. Why she couldn't get a sports physical, which was $400 without insurance, to join the school soccer team. This student has since graduated. She will not be helped by the decisions made here today. She will always be someone who went through her childhood and entered adulthood without adequate health care. And that does not have to be a reality for kids today. For all Connecticut residents to have the opportunity to thrive, our policies must prioritize care for people who need it the most. Husky expansion to all income-eligible immigrants, regardless of status or age, is a key policy to advance equity and public health in our state. Thank you.
Thank you for your testimony and thank you for your patience. Next, we have Seth Freeman, number 69. You have 3 minutes, sir.
Thank you very much. Chair, then members of the Appropriations Committee, my name is Seth Freeman, and as President of Congress of Connecticut Community Colleges, 4Cs, representing faculty and staff across all 12 community college campuses in Connecticut, along with part-time faculty at Charter Oak State College and the University of Hartford, I'm privileged to lend my voice in support of the Husky for Immigrant Coalition and the Connecticut for All Coalition. The current gap in Husky eligibility, which terminates at age, leaves many of Connecticut's immigrants exceedingly vulnerable, exacerbating existing disparities in healthcare access. This gap puts countless families and individuals at risk of economic insecurity and debt simply for seeking medical attention and receiving necessary yet costly treatment. Furthermore, without coverage, many individuals postpone seeking care until their conditions necessitate emergency department visits or hospitalizations. Early treatment is crucial in mitigating healthcare costs in the long run by preventing health issues from escalating. Drawing from my 2 decades of experience as a faculty member at Capital Community College in Hartford, I've witnessed firsthand how lack of healthcare coverage for themselves or a family member affects our students in our community colleges. The burden of medical expenses can derail their educational pursuits, forcing students to take much longer to obtain their associate's degree, or even forcing students to drop out. Ensuring healthcare coverage for every student in Connecticut will eliminate this barrier and ensure more equal opportunities for all students pursuing higher education. Expanding Husky eligibility to all income-eligible Connecticut residents, regardless of immigration status, up to age 18, is a critical step in addressing these disparities. Over the past 3 years, we've made strides by extending Husky coverage to undocumented children and to undocumented pregnant individuals. These policy changes have already demonstrated positive impacts on our state, promoting healthier communities and reducing uncompensated care costs for hospitals. Therefore, I urge the Appropriations Committee to allocate funding for extending Husky eligibility to all income-eligible Connecticut residents, regardless of immigration status, up to age 18 this year. Additionally, I call for the development of a long-term plan to extend coverage to all immigrants, regardless of age. Connecticut's current budget surplus affords us the opportunity to prioritize strengthening the safety net for those most in need. By expanding Husky to all income-eligible immigrants, irrespective of status or age, we can advance equity and public health in our state. Thank you very much.
Thank you, Mr. Freeman, for your testimony this evening. Next, we have Eduardo Pila. Is number 74 Eduardo in the room? He's due to be remote, but I don't see him.
I don't see him in the room either, Madam Chair.
Okay. Next, we will move on to number 79, Andrew Wildman. He looks like he is on the Zoom ready to go. Mr. Wildman, you have 3 minutes. Wildman, excuse me, you have 3 minutes.
All right. Thank you. Members of the Appropriation Committee, my name is Andrew Wildman. I serve as the administrator at Wilton Meadows Nursing and Rehabilitation Center in Wilton, Connecticut. With 36 years of dedicated service to our community, Wilton Meadows has been a cornerstone of the nursing home care in our region. As a 448-bed facility with 180 committed employees, we are proud members of the Connecticut Association of Healthcare Facilities. Even as the official declaration of the COVID-19 public health emergency has concluded, our nursing home, its residents, and our staff continue to face unparalleled challenges. While we remain resolute to our commitments to serve our community, the journey to recovery remains arduous. Inflation compounded by severe staffing shortages represents two critical challenges that remain unaddressed in the current budget recommendation. Inflation, the relentless surge in expenses exemplified by soaring costs in food, electricity, medical supplies, equipment, and contracted vendor rates is eroding our financial stability. The proposed funding for nursing home fails to acknowledge the true extent of the inflammatory pressures, necessitating the recalibration of budget allocations to reflect the realities we face. The staffing crisis, the persistent shortage of qualified staff, exacerbated by the pandemic, continues to strain our operations. Despite our efforts, including the engagement of agency staff, increased wages to attract new hires, and investments in training programs, the allure of higher agency rates has led to the attrition within the unsustainability reliance on agency staff, coupled with the escalating labor cost, presents a dire predicament that demands immediate attention. While past allocations have provided some relief, the proposed budget overlooks the pressing need to bolster staff remuneration in light of inflationary pressures. In conclusion, I urge the committee to recognize the urgent need for increased funding to address the dual challenges of inflation and staffing shortages confronting skilled nursing facilities in Connecticut. The resilience of our nursing home, its residents, and our dedicated staff hinges upon our commitment to allocating resources that commemorate with the scale of the challenges we face. Thank you for your attention to this critical matter. I stand ready to provide any further information or address any inquiries you may have. Thank you.
Thank you, Mr. Wildman. We appreciate your testimony this evening. We are wanting to hear from the public this evening, so this is why our panel that is here on Zoom or in person doesn't have any specific questions for you, but we appreciate you spending time and submitting your testimony this evening. Thank you.
Thank you.
Next, we have on our list Heather Gates from Community Health Resources. I think you are in person, Heather. Oh, I see you coming to the desk. I think you know the drill. 3 minutes. Thank you.
Good evening, members of the Appropriation Committee. I'm Heather Gates, and I'm the President and CEO of Community Health Resources. We provide mental health and substance use treatment services to residents from throughout Connecticut. Over 25,000 children, families, and adults receive our services every year. And when we are fully employed, we have about 1,000 staff. That full employment is what we are here to talk about tonight, and some of the things that you might be able to do to help us with that. I want to testify on both the DCF and DSS budgets. We're requesting that you increase the grant funding that we receive along with other providers by 5%. That's a total of about 186 million. We were not included in the money that DDS providers received last fiscal year, which was about 50 million. We deeply appreciate the increases that you have been allocating over the last several years. They really helped to basically pull us back from the cliff. And it is not enough to offset the cost of inflation and the dramatic salary increases that have been happening as a result of the pandemic are are so far beyond any of the increases we've received the last several years. Clinician salaries just during the last 2 years have increased by 50%. And we still can't hire folks with the increases we've received. Our vacancies mean we are not serving people, and that's what we're here to do. You heard from several young people tonight who receive services in one of our programs. That's why I come here every single year asking you to please get funding to us so we can do what we do best, which is provide services. We support the DCF budget and the inclusion of funding for both the UCCs and the subacute crisis centers, but so much more needs to be done for the mental health services for children of Connecticut, and it needs to happen now. That cannot get delayed. And our current funding levels just don't support what needs to happen. I also want to comment on the DSS budget and the recently released rate study. The study affirms what we have been saying for years. And I have to say, when I read that study, I thought, finally, there is on paper what we know to be the case. We are losing $1.1 million right now just in our organization on outpatient services that is directly related to the Medicaid rates, which are 50% lower than any of our comparison states. One of those states is Massachusetts. We frequently used to recruit clinicians from Massachusetts. We cannot do that anymore because that state pays adequate Medicaid rates. So we need you to please look at that study carefully and implement phase 1 of that study, which is at least bring Connecticut up to the other states that are in that comparison. Thank you.
Thank you so much for your testimony this evening, Heather. Next, we have on our list number 81, Caitlin Benacourt. Looks like you're online this evening.
Hi, chairs and members of the Appropriations Committee. My name is Caitlin Betancourt. I am a student from Stanford. I am 9 years old and my parents are immigrants. I support health insurance for immigrants and I will tell you why. I care about this because I think people should still be able to get health insurance even if they don't have their papers. Also, I think that health insurance is more important than needing to have your papers. And the experience that I have affected my life, family, or community were when my dad didn't have his papers and he wouldn't go to the doctor. I think all kids should be able to go to the doctor because if they are really sick, they could die. Also, they might miss school and not learn what kids in school are learning. Lastly, kids should not have to pass on sickness to other kids because they can't see a doctor. Thank you for listening to my testimony. I hope the committee supports health coverage for all immigrants.
Thank you, Caitlin. What a brave girl you are to be reporting in front of the Appropriations Committee this evening. Thank you so much for your time.
You're welcome.
Have a good evening. Next, we have number 82, Emily Rook. Looks like you're all ready to go. You have 3 minutes, madam.
Good evening, chairs and members of the Appropriations Committee. My name is Emily Rueg, and I am a physician assistant in the school-based health clinics and Hartford Public Schools. And I'm a supporter of the Husky for Immigrants Coalition and part of the Connecticut for All Coalition. The Hartford Public School-based health centers serve all children and teens living in Hartford who are students, either attending a Hartford Public School or live in the city. And our clinics provide preventative care such as yearly physicals and immunizations, mental health screenings, as well as sick visits throughout the school year. And we see all of our students regardless of their insurance status. Thank you for the opportunity to testify regarding HB 5048 with respect to the budgets of the human service agencies, specifically for the Department of Social Services, which administers Husky. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18. Working in the clinics in the Hartford Public Schools, I've seen firsthand how not having access to health insurance affects our students' long-term health, their school attendance, and the overall health of our community. It's heartbreaking for me as a provider to witness families in such need of primary care and specialty care beyond what I can provide for them and to have nowhere to send them due to their lack of insurance. When long-term health conditions go untreated, such as the ones I see in my clinic every day, such as asthma, thyroid disease, blood disorders, it leads to unnecessary ER visits, hospitalizations, and adverse long-term health outcomes for these students. Recently, I've had difficulty finding tuberculosis screening for my uninsured students. When a student moves to our district from a country that is designated as a high-burden TB country, they are required to have a screening before entering school. This not only allows us to address any latent or active infection in that particular student, but it also helps us keep the student body and that student's overall community safe as well by preventing any possible spread of the disease. This is something, TB screening is an easy screening process to administer, and that has such a big impact on keeping our community safe. However, without access to insurance, I have nowhere to send my students to get the screening done. Raising the age of Husky eligibility to 18 would allow all of our students to have access to this important screening and would in turn help keep our community healthier. I asked the Appropriations Committee to fund Husky eligibility for all income-eligible CT residents, regardless of immigration status, up to age 18, and in future create a long-term plan towards opening access to all immigrants, regardless of age. Thank you so much.
Thank you, Emily, for your testimony this evening. Next, we have number 83, Sharon Heddle. I see you online, ready to go. You have 3 minutes, madam.
Thank you. Good evening, members of the Appropriations Committee. My name is Sharon Heddle, and I'm the Executive Director of Disabilities Network of Eastern Connecticut. We're one of the state's 5 independent living centers. I'm here to ask you to increase the funding to the independent living centers by $1 million. The independent living centers provide vital services and supports to individuals with disabilities in our communities. The services we provide give them the opportunity to live in their community as independently as they choose. In the last few years, our independent living centers have seen an increased need for suitable housing options. This additional funding would allow us to have a designated staff person to work with people to find housing, to navigate the application process, advocate for them with landlords and housing complexes. Increased funding to the independent living centers would allow each center to hire additional advocates to address the unique needs of individuals with disabilities in our state. Our advocates provide support to individuals in accessing healthcare, transportation, and employment opportunities. We work to raise awareness about the challenges faced by individuals with disabilities and advocate for policy change at the local and state levels. We do outreach to inform people with disabilities about the independent living centers. With additional funding, we could hire staff to fill the gaps and expand into the more rural areas of Connecticut, areas we currently do not have enough staff to reach. We're the place our consumers call when their SNAP card doesn't work, when the taxi doesn't pick them up for an appointment, when they cannot understand what the doctor is talking about, when they can't balance their bank account, when their tablet isn't working, and so many other things. We cannot tell these people we will put them on a list and call next week. In summary, the $1 million increase in funding that we're requesting, this is $200,000 for each of the 5 independent living centers, is crucial to the continued success and impact of the independent living centers. The ability to keep up with the current demand, the establishment of a housing coordinator position, and additional advocates would allow us to better serve the individuals with disabilities in our community and address the pressing needs they face. We hope that you will consider our request and allocate the necessary funding to support the independent living centers. Thank you for your time.
Thank you, Sharon, for your time this evening. We appreciate you coming out to testify.
Thank you.
Jenny Canapia, you are on Zoom. I see you ready to go. We have 3 minutes for you, madam.
Good evening, chairs and members of the Appropriations Committee. My name is Jenny Canepa, and I'm a resident of Stamford from United Parents for Student Success. We support the Husky for Immigrants Coalition. Thank you for the opportunity to testify regarding HB 5048 and act and adjusting the state budget for the biennium ending June 30, 2025, concerning the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. Important priorities are being founded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee of fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18. Any expansions to our state Medicaid program has a positive impact on our communities. On the cost of this program expansion is minimal compared to the long-term health and economic impacts of this policy. You might ask why this is important to me and why I'm here. That is because as a United Parents for Student Success founder, a group of almost 400 parents, these past years, I have been experienced many parents looking for a doctor who can help their kids. Not always is easy to find a doctor who can help, who can take care of them. It takes time. In the meantime, the child has to suffer the pain until they can find a professional who can help them. And most of them are expensive. Sometimes they need to take the kids to the hospital or emergency room, and after that, they receive costly bills, which negatively impact their little economy. This can be different if they can have access to health care. I know many kids and families in our community can benefit from the Husky program. Please, I ask and implore to you to help and support Husky. I don't want to see more kids crying in pain, and because a doctor cannot attend to them. I don't want to see more parents desperate and looking for help or where they can take their children for assistance. Please, very please, we are human beings and we need to take care of all our community. In the last few years, we talk a lot about equity and inclusivity, and this is part of it. I respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky A income eligibility requirements for parents, caregivers, and the reversal of fully raising the Husky C income eligibility limit. I recognize that Husky coverage is essential to achieving health equity. Significant gains have been made to the Husky program over the last few years to cover more people, and those gains should be protected, not diminished. Last, with all respect, I just want to remind you, Connecticut is one of the wealthiest states in the wealthiest country in the world and has the resources. Connecticut can do better. This is in your hands, and this is a part of your responsibility to our community. Thank you for your time and attention. Have a good night.
Thank you, Ms. Jenny, for your testimony this evening. We really appreciate your time. Next, we have Sarah Bernal Garcia, but I don't see her on the Zoom right now, so I'm going to move on to Sarah Pincaneda. She doesn't look like she's online either. So I do see Amanda Skinner online, ready to go. Madam, you have 3 minutes, please.
Thank you. Senator Ostin, Representative Dathan, and Representative Walker, and honorable members of the Appropriations Committee. My name is Amanda Skinner, and I'm President and Chief Executive Officer at Planned Parenthood of Southern New England, testifying regarding the Human Services budget of House Bill 5048. As the state's largest family planning and sexual and reproductive health care provider to over 45,000 patients last year at 14 health centers across the state, Planned Parenthood believes all people should have access to quality, affordable health care as a basic human right, regardless of who they are, where they live, their income, whether they have insurance, or their immigration status. We are compelled to speak out about the importance of the Medicaid program to our patients, nearly half of whom are enrolled in the Husky Health program, and the importance of investing in reproductive health care providers at family planning clinics in Connecticut. As a healthcare provider, we do thank Governor Lamont for prioritizing strategic investments in women's health care and family planning, which included an increase in the Medicaid reimbursement rate for family planning provider services in the FY23 budget adjustments, which brought us to 90% of the OBGYN fee schedule, yet there is still a gap, and abortion services were not included in that rate adjustment. Family planning clinic Medicaid rates for abortion services are unchanged since 2008, yet labor costs have nearly doubled since then, increasing by $8.5 million. The cost of providing care at PPS&E has risen substantially in just the last 3 years. Labor costs have increased by $1.6 million in just 3 years. Health insurance costs for our employees have increased 80% or $938,000 in just those 3 years, and cybersecurity costs are skyrocketing and have increased just in our premiums 400% in that same time period. Increasing family planning clinic Medicaid rates for abortion services will strengthen patients' access to essential health care. Based on volumes across the state for previous years, we estimate a rate increase for abortion services at family planning clinics would require an investment of approximately $3 million. Connecticut needs to raise reimbursement rates in order to support the infrastructure, which includes staffing, to provide equitable access to abortion care services. An investment of this amount would underscore Connecticut's position among other states who are firmly committed to ensuring that reproductive health care remains safe, legal, and accessible for all who need it. PPS&E is focused on health equity. We serve all who need our services, regardless of their insurance type and regardless of their ability to pay. PPS&E serves a disproportionate share of Medicaid patients or patients who do not have insurance at all, requiring substantial fundraising efforts, and we write off more than $3 million a year in unreimbursed care since 2017 in order to make services available for so many who have no other source of care. Unlike private practices, PPS&E has little ability, in fact, almost no ability to offset low Medicaid rates with higher private insurance rates because of our service mix, which is 85% of preventive services without high margins to offset those losses. I want to take a moment to comment that over the past 3 legislative sessions, the legislature did take important action, also expanding Husky Health for undocumented immigrant children ages 0 to 15 years old. And we would like to urge the committee to expand Husky up to age 18 for those who are income eligible, regardless of immigration status. In closing, I would like to say that increasing Medicaid reimbursement rates for abortion services will strengthen long-term access to time-saving essential reproductive health care. And we ask the administration and this committee to continue your commitment to strengthening and improving reproductive health. Thank you for your time.
Next, we have Dr., and apologies if I mispronounce your name, Gurman.
Thank you. Thank you, Senator Austin, Representative Walker, Representative Dathan, and distinguished members of the Appropriations Committee. Thank you for the opportunity today to address you. My name is Horam Guman, and I am a private practice family physician in East Granby, a rural part of our state where access to quality healthcare is crucial. I'm the president-elect for Connecticut State Medical Society, and I'm here to advocate for much-needed Medicaid rate increases that are essential for maintaining the integrity of our healthcare system and ensuring equitable care access to all of our residents, especially those in underserved communities like mine. As a family physician, I serve a diverse patient population with a significant portion of my pediatric and adult patients are covered by Medicaid. While I'm committed to providing care to all individuals, regardless of their insurance status, the current Medicaid reimbursement rates pose significant challenges to sustaining my practice and meeting the needs of my patients. Over the years, primary care providers like myself, we have seen minimal and inconsistent rate increases that fail to keep pace with the rising cost of providing good quality care. These rate increases are neither uniform, predictable, nor understandable in their calculation, making it difficult for physicians to plan and budget effectively. As a result, many primary care physicians, such as myself, are forced to make difficult decisions about limiting their patient panels or even discontinuing Medicaid participation altogether, jeopardizing access to care for some of our most vulnerable community members. It is important to understand that when patients are unable to access primary care, they often end up seeking care in more costly areas like urgent care centers, walk-in centers, and emergency rooms, leading to increased cost to the healthcare system, and the entire system pays for it. Moreover, primary care plays a critical role in early detection and treatment of chronic conditions, preventing costly complications, and improving overall health outcomes. I want to emphasize my desire to remain independent and continue serving my community is unwavering. However, the current reimbursement landscape in Connecticut, coupled with the challenges of remaining independent in an increasingly complex healthcare environment, it's making it very, very difficult to sustain my current independent primary care practice. Increasing Medicaid reimbursement rate is essential for enhancing access to care for Medicaid beneficiaries, and studies have shown that closing the gap in payments between Medicaid and private insurers significantly reduces disparities in access to care and leads to improved health outcomes. As the recent State Commission study has shown, Connecticut Medicaid physician payment rates currently lag behind those of other states and Medicare benchmarks, making it difficult to attract and retain physicians in our state. The finding of the study underscores the urgent need for action to address these disparities and ensure equitable care access to our members, Connecticut residents. I urge the Appropriations Committee to allocate funding in the state budget to increase Medicaid physician payment rates at least equal to Medicare payment rate for those services provided by a primary care family physician. By doing so, we can strengthen our healthcare system, improve access to care, and promote the health and well-being of our Connecticut residents. I want to thank you for your time and attention to this critical issue. I look forward to working together with you and your team to ensure that all individuals in our state have access to timely and quality healthcare. Thank you.
I do hope you will tune in tomorrow. The Appropriations and the Human Services Committee are having a joint hearing on the Medicare rate. So I do hope you'll tune in for that. But thank you for your testimony.
Thank you.
Next, we have number 89, Tracy Wodach. I believe you are in person.
Yes, I am.
Oh, wonderful. Madam, you know the drill. 3 minutes, please.
Yeah, thank you. Senator Lesser, Representative Dathan, and distinguished members of the Appropriations Committee, Human Services Subcommittee. My name is Tracy Wodach, President and CEO of the Connecticut Association for Healthcare at Home. I am also an RN with 40+ years experience. Our members at the association include home health, hospice, and non-medical home care. Together, we provide services that foster cost-effective home care for Connecticut's Medicaid population in the setting that they prefer most, their own homes. Each year, I testify urging this committee to invest in our home and community-based providers, both home health and non-medical home care. This year, our message is even more dire. We are now at 16 years of flat funding, compounded by the 2016 15% MedAdmin rate cut, the 2017 removal of an add-on rate for high-risk cases, and multiple unfunded mandates, most notably and recently the electronic visit verification, or EVV. Many small agencies have now closed or have been acquired by larger entities, and several more are likely to close due to the most recent EVV impact on home health. Couple this underfunding and unfunded mandates with our newest high-priority challenge, that of ensuring the safety and welfare of our visit staff. This is not a new priority. Rather, recent tragedies have drawn more attention to it. Our visit staff have the expertise to recognize risks and put a safe plan of care in place based on information obtained. But they don't always receive accurate, thorough information, and they don't have funding to pay for added staff or technology to mitigate the risks. Please help us ensure the safety of home and community-based service providers. Specifically, we're seeking a greater transparency of complete referral information for all home and community-based services. This includes information from healthcare institutions as well as state agencies such as Department of Corrections and the State Board Review Board. Restore the add-on rate cut in 2017 for both medical and non-medical home care services in certain high-risk situations. In addition, the chronic underfunding resulting in critical workforce shortages is now impacting access to care issues in the home. We are also asking the committee to implement consistent annual provider Medicaid home health and non-medical home care rate increases indexed to the federal CPI. Restore the MedAdmin rate to the 2016 level, develop a home health social work Medicaid rate to address and support social determinants of health and invest in the healthcare workforce for tomorrow. This underfunding Medicaid home care services must stop, or there will be no one to care for the tens of thousands of people who want to receive care in their homes, care that is a vital cost savings vehicle for the state. Thank you very much.
Thank you, Tracy Lodge, for your testimony this evening. Next, we have a panel. In person, Sean Deb and Frick Poland, or excuse me, Sean Frick, Deb Poland, excuse me, that was my bad. I understand that you have 5 minutes because you are a panel, so your time goes ahead and starts now. Thank you very much.
Thank you, Representative Dathan. Good evening to you, Senator Lesser, Representative Terziak, and the members of the Appropriation Committee. My name is Deb Poland. I'm the Chief Strategy Officer for the Community Health Center Association of Connecticut, or CHCACT. We are the statewide association that works with the 17 community health centers in Connecticut, also known as federally qualified health centers. I'm here this evening with Sean Frick, who is our new CEO. Some of you have already met Sean. He has worked in the community health center movement for his whole career in several states and also with our national organization. So he comes to Connecticut with an interesting perspective, including how health centers can partner with the state to provide health care to our neediest residents. We have submitted written testimony, and you'll also hear from several health center leaders about these issues. For now, I'm going to turn this over to Sean.
Good evening, and thank you, Deb. All community health centers are nonprofit organizations, and while we are known for healthcare, we're equally about community development. We build community assets across Connecticut and need the state to support us. In 2022, Connecticut Health Centers provided primary medical, dental, and behavioral care to constituents in all of your districts, totaling over 420,000 patients. About 250,000 of those patients are on the Husky program. That's 60% of our patients. How health centers are reimbursed by Medicaid has a huge impact on our finances and operations, ultimately impacting their ability to provide health care to your constituents. Although tonight is an opportunity for us to respond to the governor's budget, we actually want to talk to you about what's not in the budget. That is Medicaid rate increases for health centers. While we commend the state of Connecticut for its commitment to Medicaid eligibility, we need to make one thing perfectly clear. Eligibility does not mean access. Providers equal access. So we have 2 suggestions around Medicaid rates that you will see in your written testimony. First, increase Medicaid rates. While we are not asking you to wait for phase 2 of the rate study and increase healthcare rates this year. We need rate increases this year to be able to hire providers and see more patients. Again, providers equal access. We feel comfortable making this request because we have already hired a national expert to complete the FQHC portion of the study. Here's what we found, and you can see it in the written testimony. On average, Connecticut's health centers lose more than $84 for each Medicaid medical visit and more than $121 for each Medicaid dental visit. As a result, in aggregate, health centers lost over $75 million in 2022 from these 2 services. We agree with the Commissioner's comments earlier this morning that comparing our Medicaid rates to other states is important. We have completed that work as well. It turns out that Connecticut's average rate of $163.37, that's for Medicaid medical visits, is one of the lowest in the country, including being the lowest in New England, the lowest in the Northeast, lower than Nebraska, lower than Arizona, and lower than Louisiana. As a reminder, health centers, by federal law, cannot turn away patients and cannot cap the number of Medicaid patients. We cannot shift costs to other payers and cannot use our federal grants to supplement Connecticut's Medicaid program. To summarize, low rates make it hard for us to keep our doors open, hard for us to hire and retain providers, and hard for us to see patients. To illustrate this point, right now, one Connecticut Community Health Center has a waiting list of 1,192 people for a dental appointment. Earlier today, we checked with our health centers. They currently have 590 open jobs, of which 58 were for doctors. Again, providers equal access. Increasing rates will reduce these wait lists, and health centers will serve more patients. If you're wondering how much this would cost, we need about $30 million in state funds to close the $75 million gap I referenced earlier. $30 million is about one-tenth of 1% of our state budget.
We also have another recommendation in our written testimony, and it relates to the implementation date of the Medicare Economic Index. The Federal Medicare Economic Index, or MEI, serves as a sort of cost of living adjustment for health centers across the country. The MEI is announced by the federal government each September for the upcoming calendar year. Most states implement this increase in January, and some states implement the increase in July. Connecticut is one of the only states that implements the increase 10 months into the calendar year in October. This keeps health center rates lower than necessary for longer than necessary and leaves millions of federal dollars in Washington each year instead of bringing them back to our communities. Changing the implementation date to January would have a one-time cost of about $10 million total, or a state cost of about $4 to $5 million. We urge you to support a vital part of the healthcare system and your communities. And we thank you for your consideration of these requests and happy to answer your questions and work with you throughout the session.
Thank you, Deb. Appreciate that. We are listening to the public this evening, so we may reach out separately with additional questions as they come up, but we appreciate you taking the time to testify for us this evening. Next, looks like we have 94, Rhonda Evans in person. Is she in the audience?
She's walking up, Madam Chair.
Oh, wonderful. Thank you so much. Rhonda, you get yourself settled. You can turn on the microphone, introduce yourself, and you have 3 minutes, please.
Good evening, distinguished members of the Appropriations Committee. My name is Rhonda Evans, and I'm the Interim Executive Director of the Connecticut Association for Community Action, or CAFCA. Thank you for holding this public hearing about the governor's midterm budget proposals. The Connecticut Association for Community Action is the state association that works with the 9 community action agencies that provide a wide array of services to nearly 200,000 low and moderate income folks from each of the 169 cities and towns across the state. I'm here to share some thoughts on the creation of opportunity centers as proposed by Governor Lamont. The governor's proposal creates a coordinated service delivery model for various state agencies by co-locating staff at these opportunity centers in addition to some community partners to deliver various social services to leverage state and local community partnerships to help residents attain self-sufficiency. It also allocates $1 million in bond funding to refurbish a space in Hartford to pilot this program. Connecticut's community action agencies are actually already using a very similar model of service delivery here in Connecticut and can provide invaluable support in this effort. For over 50 years, the Connecticut Community Action Agencies, who are the largest statewide safety net service provider, have been connecting neighbors in need with resources that stabilize and improve their lives and communities. By providing holistic, comprehensive, multi-generational approach to service delivery, much like the Opportunity Centers model outlined in the governor's proposal. It's called the Human Service Infrastructure, or HSI. The CAAs work with people in need to plan, achieve, and maintain a realistic path to short and long-term economic self-sufficiency and success. This no wrong door approach helps to ensure that anyone who comes into a community action agency for any reason gets access for all programs, services, and resources that they may be eligible for, both internally and through community partnerships or collaborations with various state agencies and other community partners. The Connecticut's Community Actions Network has a long history of partnership and collaboration with state agencies, such as the Department of Labor, the Department of Social Services, and others in the provision of service delivery. In some instances, the CAAs are already co-located or in close proximity to state agency, and this allows for a more seamless provision of services. Our long-standing holistic model of self-delivery which was developed in partnership with the Connecticut Department of Social Services, relies on collaboration and partnerships that make us well-suited to continuing partnering with the state of Connecticut as current and future initiatives emerge. We'd love the opportunity to talk more about how we can extend our statewide reach in partnership with state agencies. And thank you for your consideration.
You're muted, Madam Chair.
Oh gosh, I've been going on for about 30 seconds now. Anyway, thank you so much, Rhonda, for your testimony this evening. We appreciate you coming out this evening. Next, we have Doris Yambe. I see you online, ready to go. You have 3 minutes, madam.
Hi, chair members and the portion committee. My name is Doris Yambe and I'm a resident of Danbury, Connecticut. Thank you for the opportunity to give me to testify regarding the HB 50488, an act adjusting the state budget for biennium ending June 30th, 2025. With respect to the budget of the Human Services Agency, specifically for the Department of Social Service, with administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for Husky Medicaid programs and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut students, residents, regardless of immigration status up to age 18. I'm a resident in the United States who, although is an legal immigrant with healthcare, understands the struggle. Husky for immigrants matters to me because not only is it a basic human right, but many people suffer due to this. Parts of my family were undocumented. Many of them wouldn't go to doctors simply because of the high healthcare cost. This stemmed from the fact that healthcare itself is very expensive, that they wouldn't be able to afford, especially living in this economy. I personally have seen how my family has suffered with the pain simply because they couldn't afford to go to the doctors. I am lucky to receive healthcare, and I believe this has become a privilege rather than a human right. This benefits my community because it provides a higher quality of life for those who come to this country with the dream of bettering themselves. It helps those who suffer from pains, aches, yet still work to support their families. Being an immigrant isn't easy with the new language, culture, and having to adapt. However, having one less thing to worry about can change lives and uplift individuals. I asked the Appropriation Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 or 18. Thank you.
Thank you so much for your testimony this evening. It's very appreciated. Next, we have Gregory Alter. I see you on, ready to go, sir. You have 3 minutes.
Thank you, Representative Dathan, and good evening, distinguished members of the Appropriations Human Services Subcommittee. My name is Greg Allard, and I'm the president of the Association of Connecticut Ambulance Providers. I did provide written testimony, so I'm just going to provide a brief summary. First, I'd like to thank all of the EMS providers that were from around Connecticut today. There at the Legislative Office Building earlier today to show support of this initiative of ours, trying to restore the $5 million in funding, a Medicaid increase for all Connecticut ambulance services in the fiscal year 2025. I'd also like to thank Senator Austin for her kind words about EMS and when she was talking with or asking questions of the DSS Commissioner earlier today as well. And I want to point out that this is not the only ask or the only initiative that EMS is pursuing this year. I mean, this is going to be a significant help for us all, but we are trying to do other things within our purview to face, to overcome the challenges that we are facing. Points of interest within my testimony are talking about the Medicaid rates themselves. Our rates are 77 to 90% lower than the rates set for us by the state of Connecticut Department of Public Health, Office of Emergency Medical Services. EMS in Connecticut is a controlled utility in that our rates are established for us. In comparison, our rates to surrounding states, our rates are much lower, and this is due in part to the scrutiny that our rates undergo annually that other states don't go through. As Connecticut EMS organizations understand, we'll never see Medicaid rates equivalent to what our state rates are. However, we would like to see them match the Medicare allowable rates at some point in time. And in comparison, our Medicaid rates are 72% lower than our Medicare allowable rates at this current point. Our mileage rates remained the same for 20 years before seeing a small increase in 2021. Our paramedic intercept rates were experienced at the same time frame, 20 years before seeing a small increase. Our ALS non-emergent transport rate dropped in 2013 and has only seen a $1.62 increase since 2007. Our BLS non-emergent rate dropped in 2013 and again in 2015. We've not seen an increase that equates to those two drops. And our current rate is $10.25 more than our established rate in 2005. These reimbursement rates clearly need attention, and that it's for these regions that we urge you to restore the $5 million in Medicaid for ambulance organizations so that we can continue to support our workforce and ensure the stability of the Connecticut EMS system. Thank you for your time. I appreciate it.
Thank you, Mr. Allard, and sorry for mispronouncing your name this evening. Next, we have Eileen Haley. I see you on. I don't know if you are able to unmute yourself and give your 3 minutes of testimony.
I will. Good evening, Representative Dathan and Appropriations Committee members. My name is Eileen Healy. I'm the Executive Director of Independence Northwest, one of Connecticut's 5 independent living centers, otherwise known as ILCs. We serve the northwestern corner of Connecticut. I am also representing the Connecticut Association of Centers for Independent Living. Our chairperson could not attend this hearing. I'm here to thank you for your past support of the ILCs and ask that you increase funding by $1 million or more annually to restore and support the expansion of vital independent living services to people with disabilities in every town and city in Connecticut. Independent living centers are frequently confused with assisted living. ILCs are disability resource and advocacy centers where non-residential serve people with all types of disabilities and of all ages. Our only eligibility criteria is having a disability. We assist people to navigate the multitude of services and benefits that exist as silos in Connecticut. We employ qualified people with disabilities who share our experiences and our paths to independence, offering practical guidance because we have lived it. The ILCs are the only place where people can go when they can't afford or are found ineligible for other programs or their needs aren't addressed holistically. Despite some increases over the last several years, previous budget cuts have never been fully restored. We are working at more than capacity and have been forced to cut back on the towns we serve and created waiting lists. As the attached map in my written testimony demonstrates, the largest numbers of people served are in Connecticut's urban cities. Those in rural areas do not have the same access to IL services due to a lack of adequate funding. There's also a huge need for housing coordinators and additional advocates throughout Connecticut. Without additional funding for the ILCs, people with disabilities will be at risk of costly nursing facility placement, and many won't achieve equity in employment, education, and healthcare, among other areas. I urge you to increase the funding for the independent living centers by $1 million or more. I also want to draw your attention to my written testimony opposing the proposed cuts to Husky A and C. And on behalf of the many wheelchair users we work with, I ask for your support by adding funding to the budget to implement the Connecticut Wheelchair Repair Task Force's final recommendations. Thank you for your time and consideration.
Thank you, Ms. Healy, for your testimony this evening. Your testimony is online, so members of the committee are able to access it later. So thank you so much.
Thank you.
We did have Beatrice Moncada join us this evening. Madam, we're going to go back to you. You have 3 minutes.
So when
noches. Estimados,
Beatrice, could you please bear with me for a second while I get one of the interpreters?
I'm here for her.
Wonderful. Thank you, Margot.
Margot, yeah, thank you.
Please proceed, Beatrice.
Hola, buenas tardes. Soy Willy, va a ser su intérprete de hoy. Usted va a hablar por frase y va a
Willy,
parar.
yo voy a estar interpretándola a ella. Perdona.
Just for a minute, we do have Beatrice is online here this evening. Margot, could you assist her? I think there was somebody else in the committee room. Beatrice, please proceed.
Ok, buenas noches. Mi nombre es Beatriz Adela Moncada Cortés. Estimados representantes y miembros del comité de aprobación, soy casada y tengo 5 hijos vivos en la ciudad de Norwalk. Vivo en la ciudad de Norwalk. Soy miembro de la organización Comunidades Sin Fronteras en Connecticut para todos. Gracias por la oportunidad de testificar con respecto a HB 5.4 con respecto a los presupuestos de las agencias del servicio humano, especialmente especialmente para el Departamento de Servicios Sociales, que administra Husky, Medicaid y CHIP. Hay prioridades importantes que se financian en el presupuesto del gobernador para las agencias de servicios humanos. Esto aquí hablamos en apoyo de la financiación de un aumento de la elegibilidad para el programa de Medicaid, Husky, y pedir al comité de aprobación para financiar la elegibilidad Husky para todos los residentes CT que cualifican basados en su ingreso, independientemente de su estatus migratorio hasta los 18 años. Tengo mucho con una hernia. Me duele mucho. Tomo pastillas para el dolor por mucho tiempo.
Representative Dathan.
Yes, I was just hoping that Margot could translate. I don't know.
I don't think she's not going to be able to translate that much data all at the same time, but
I will. Don't worry about it.
Is this the woman who called last night about housing, Margot?
I'm sorry?
Is this the woman who called last night about housing, saying she was going to get evicted?
I have no idea. ¿Usted fue la persona que llamó porque la van a desalojar de su hogar?
No, estaba dando un testimonio que le dije yo que era en otra sala que tenía que estar, entonces yo lo di ayer. Específicamente lo tuve que dar ayer, pero el que estoy dando ahorita es respecto al Husky.
She gave a testimony yesterday, but right now she's doing her Husky testimony.
Margot, if you could please summarize Beatrice's testimony since we are beyond the 3-minute mark of her speaking.
Okay, so I will give it. Beatriz, se pasaron tus 3 minutos, así que voy a dar el resumen de lo que tú dijiste ahora en inglés, okay? My name is Beatriz Moncada. I am from Norwalk. I am married and I have 5 children, and I belong to Comunidades Sin Fronteras in Connecticut. Thank you for the opportunity to let me testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. I have a hernia, which hurts a lot. I have been on pain medications for a long time, and not having health care has not made my situation easier. And that's as far as she could go within her 3 minutes.
Okay, thank you for your testimony this evening. Next, we will hear from Coco Selman.
Gracias por tu testimonio, Beatriz. Buenas tardes.
Okay, buenas tardes.
Okay, did you say Coco Selman? I couldn't hear you very well. Sorry.
Yes, yes.
Okay, great, great. Senator Austin, Representative Walker, Senator Lesser, Representative Gilchrist. Thank you very much for having me. And just distinguished members of the Appropriations Committee and Human Services Subcommittee. My name is Coco Selman, co-owner of All Point Home Care, a licensed and accredited home health agency specializing in around-the-clock care of medically fragile children and adults. Also, my 22-year-old stepdaughter, Amelia, is a recipient of complex care nursing in our home. I am testifying before you today to ask for the following. First, fund CPI-indexed annual rate increases for home health services. Second, restore medication administration rates that were cut by 15% in 2016. 3, fund the safety of home care workers. Imagine this happening to you. You are a first-time parent, and your baby is born 12 weeks early. She is less than 1 pound, has underdeveloped lungs, and a heart whose 4 chambers haven't completely set. Imagine she sustains a brain injury from a stroke when she is only 5 days old. She needs 4 heart surgeries. Imagine your baby girl living in the hospital for over 100 days before you can finally bring her home. This is how Amelia came into the world. It is also how most of our patients come to our agency. Despite recent rate increases to fuel complex care nursing, the rates are still not competitive. We still cannot fill many of our shifts because we cannot pay nurses what facilities are able to pay, up to $10 an hour more. This makes bringing new patients home from the hospital a continued impossibility. Without in-home complex care nursing, our patients would not be able to live at home. They instead live in a facility at a cost to the state of $3,000 to $5,000 per day versus less than $1,000 per day at home. Our bordering states all have higher rates for complex care nursing. My agency also specializes in pediatric diabetic in-home care, a life-saving specialty which depends on medication administration rate, which was cut by 15% in 2016. Please restore the med admin rate. Lastly, the tragedy of home health nurse Joyce Grayson's death has left us all desperate to protect our teams while never wanting to compromise patient access to care. As a provider, we are taking every necessary step to ensure safety of our teams, but funding is needed. I urge you to invest in home health and invest in this much needed cost-effective solution to caring for our state's most vulnerable. Thank you.
Thank you for your testimony. Next up, we're going to hear from Dr. Leonela Villegas. Please go ahead.
Good evening, everyone, chairs and members of the Appropriations Committee. So my name is Dr. Leonela Villegas. I am a pediatric nephrologist, so someone who specializes in kidney care, and I am a supporter of the Husky for Immigrants Coalition. I serve the Hartford area, and I provide in-hospital and clinic services without regard to one's ability to pay for the care that they receive. Thank you for the opportunity to testify regarding Husky expansion for undocumented patients to the age of 18. Really, any expansion to our state Medicaid program has a positive impact on the disadvantaged communities, and the cost of this program expansion is minimal compared to the long-term health and economic impacts of this policy. And the policies passed in the last 3 years, we know are working. We have over 8,000 undocumented children and pregnant individuals aged 0 to 15 that have already enrolled. And we continue this process by expanding to age 18. As healthcare providers, we recognize a responsibility to care for all patients, regardless of race, income, or immigrant status. Unfortunately, our state laws don't reflect the same commitment just yet. And given that I take care of a very chronic pediatric population that goes anywhere from having mild stages of kidney disease to the highest care that you can imagine, which would be dialysis and transplant, I've witnessed firsthand the disparities that the undocumented and uninsured patients and families face. It's already a hard and difficult experience telling a child that their life is going to change medically, need for medications, more hospital visits, being hospitalized, and changing school and home supports, but let alone placing another really big burden on them, which is whether or not they can afford their care, those medicines, transportation, and everything that goes along with that. Our goal really as a pediatrician and physician is to be able to support a patient and prevent as opposed to react to situations. And our system is not built for that yet, but this can be the start. Let's allow all of our children, regardless of immigration status, to be able to set up to be successful adults without the mental or financial burden from their healthcare. Let's set up this next generation for success, because ultimately we can help avoid those complications and the high use of our emergency rooms and hospital visits that we know are already burdened by everything that's been going on from COVID and moving forward. And a quick story, I did have a 15-year-old patient who was uninsured, requiring dialysis and transplant due to not receiving the appropriate preventative care and the checkups. And this led to the family actually having to relocate to another state to get what he needed with his appropriate insurance status. Not only did we fail the patient, but his whole family, who had to make further sacrifices, as you can imagine, to get him what he needed. And I don't want to see that occur again. This also goes for other chronic illnesses. It's not just kidney disease, diabetes, inflammatory bowel disease, cardiac conditions, and the list goes on. So as a healthcare physician, I want what's best for our patients and hope that you are able to continue to expand Husky. And thank you for your time and appreciate any questions if anyone has any.
Thank you for your testimony. Next, we're going to have Dr. Mahesh Baya.
Good evening. Can you hear me, Senator?
Yes, we can.
Excellent. Good evening, Honorable Co-Chair Senator Austin, Senator Lesser, Representative Walker, and members of the Appropriation Committee. My name is Mahesh Baya. I'm here speaking on behalf of 800 physicians and physicians in training in the medical specialties of dermatology, ophthalmology, otolaryngology, and urology. As a practicing otolaryngologist in Waterbury for more than 20 years, I have seen firsthand the challenges that healthcare providers face in delivering quality care to those in need. Despite our best efforts, too many of our patients struggle to access the care they require due to a lack of resources and support. This is particularly true for those who rely on Medicaid for their healthcare needs. Physician reimbursement rates for Medicaid are often woefully inadequate. As recently noted in this phase 1 Medicaid study, physicians receive an average of 56% of Medicare reimbursement for most commonly billed surgical procedures and 65% for outpatient services provided to patients on Medicaid. For many common codes, the reimbursement is even lower. Tonsillectomy, one of the commonest procedures performed on children in the United States, reimburses 50 or 53% of Medicare rates. The cost of delivering care exceeds the amount that Medicaid reimburses. In a time of pressure on medical practices and high inflation, such a reimbursement scheme is not sustainable and is a strong disincentive for physicians participating in this program. Providers like myself who do accept Medicaid are overburdened. To put things in perspective, the last increase in Medicaid rates was 2007, considering an average annual inflation rate of 2.35% over the last 17 years. $1 today only buys 67% of what it could buy back then. Compounding this is a shortage of physicians, and the ever-increasing presence of private equity models that focus on profit over patient care. This most vulnerable Medicaid population is at highest risk for delayed and fragmented care. The situation is dire and puts further strain on emergency departments, healthcare systems, and community health centers. Increasing Medicaid reimbursement for physician services would incentivize more providers to participate in the program and provide timely care for patients, which will help reduce expenses to the healthcare system. I understand that the healthcare funding problem is complex and multifaceted, but I implore you to consider the critical need for increased reimbursement for physician services. Our patients deserve access to quality, affordable care, and it is our responsibility to ensure that they receive it. Your leadership will have a lasting impact on the health and well-being of our citizens. Thank you for your time and consideration.
Thank you, Doctor. Next up, we have Joanne Borduas, followed by Catherine Vieira.
Good evening, members of the Appropriation Committee. Thank you so much for your time this evening and allowing me to testify this evening on these important issues. My name is Joanne Borduas. I am the CEO of Community Health and Wellness Center, an FQHC, with locations in the northwest corner of our state in Torrington, Winstead, and North Canaan. These are areas that are lacking resources. The issues that I come before you with today are those that you've already heard from many of my colleagues and providers who are able to take care of our Medicaid populations. Two important critical steps need to be taken in order to sustain the financial solvency and viability of community health centers, who are the largest network of primary care providers as well as safety net providers within our communities. We serve uninsured patients, underinsured patients, and we serve a large community-based immigrant population who unfortunately will not be able to take the benefit of insurance. Without us in the community and without other Medicaid providers who are willing to see these patients, there will be an untoward effect from not increasing our Medicaid rates to be able to at least cover our costs. That is a critical step so that we can continue to take care of these patients. You've heard from some of my colleagues this evening about the losses that we sustained. $75 million was the figure that you heard. Community Health and Wellness Center is one of the smaller community health centers in the state. And this past year, we will have experienced a $1.7 million gap and a loss in care when you look at the rates that we are reimbursed for our patients that we provide medical services, dental services, and mental health services for. In total, across those three service lines, that gap in payment is $1.7 million. You also heard from my colleagues this evening about the comparative rates in Connecticut versus even our bordering states, and that difference is significant. We can no longer be expected to absorb costs and be able to continue to provide the high level of quality care that we do provide our community patients and those underserved and marginalized communities that we take care of. If we continue to do that, we will have to be forced to scale back services. Much of that may include needs that will cause, again, what the state is working very hard on doing, which is to lower primary care costs. So not being able to take care of patients will lead to things like overutilization of ED services, inappropriate readmissions, patients utilizing urgent care centers to receive continuity of care, and then uncompensated care in acute care hospitals in those beds. So we urge this committee this evening to please consider what you've heard from my colleagues, the rate increases that are needed to sustain us, and the MEI issue, which becomes something that we could very easily help solve problems with a small step, and being able to provide us that increase in January versus a 9-month lag. I thank you for your time and your consideration.
Thank you for your testimony. Next up, we have Catherine Vieira, followed by Thomas Burke.
Good evening. Senator Austin, Representative Walker, Senator Lesser, Representative Gilchrist, and the esteemed members of the Appropriations Committee and Human Services Subcommittee. Thank you for the opportunity to testify regarding HB 5048 on behalf of Health Equity Solutions. We're a nonprofit organization with a statewide focus on advancing health equity through anti-racist policies and practices. Our vision is for every Connecticut resident to attain optimal health regardless of race, ethnicity, or socioeconomic status. Lack of health insurance is one of the most significant barriers to health. And while health insurance alone does not ensure optimal health or quality care, it is a crucial component of access. Therefore, we respectfully urge the Appropriations Committee to oppose the proposed budget items to reduce Husky 8 income eligibility requirements for parents and caregivers from 160 FPL to 138 FPL, and oppose the reversal of fully raising the Husky C income eligibility limit. Due to cuts implemented in 2015, more than 11,000 parents and caregivers lost their Husky health coverage in 2016. And though the budget proposes moving people from Husky A to covered Connecticut, this will impact their covered benefits and provider networks. This proposal negatively impacts the immediate and long-term challenges to accessing healthcare. For example, people earning between 100 and 199 FPL have the highest rate of uninsurance at 11.9%. And this is largely due to the high cost of coverage, as this population includes most adults who have exceeded Medicaid and covered CT income limits. Steps should continue to be taken to improve cover options, not to eliminate them. Additionally, we acknowledge the state's efforts to broaden coverage options in recent years, and we respectfully urge the Appropriations Committee to support funding for the state-funded Husky program to increase eligibility for all income-eligible Connecticut residents regardless of their immigration status up to the age of 18. 12 states and the District of Columbia have expanded coverage to income-eligible adults and children regardless of their immigration status in recent years. And most states in New England now cover all children regardless of immigration status through their Medicaid programs, except for New Hampshire and Connecticut for children between the ages of 16 and 18 years old. Based on country of origin estimates, it is reasonable to assume that most immigrants without documents living in Connecticut are people of color. As a result, ensuring access to healthcare for all immigrants living in Connecticut is a crucial part of advancing health equity in our state. Husky programs play a vital role in mitigating racial health disparities and promoting health equity in our state, prioritizing and protecting the current Husky A standards, the anticipated income increase for Husky C, and expanding coverage for all children regardless of their immigration status ensures access to healthcare services for individuals who might otherwise face significant barriers due to systematic injustices. So with that being said, thank you for your time and for the opportunity to testify.
Thank you for your testimony. Perfect timing. Next up, we have Thomas Burke, followed by Constanza Segovia.
Yes, good evening, Senator Lesser, Senator Austin, Representative Walker, and Representative Dathan, and members of the Appropriations Committee. My name is Thomas Burr. I am the Public Policy Manager of the Connecticut chapter of the National Alliance on Mental Illness, otherwise known as NAMI Connecticut. I am testifying today in regard to HB 5048. NAMI is dedicated to building better lives for those with lived experiences with mental health conditions and their families. NAMI Connecticut and its 9 local affiliates provide support groups and education programs for people with mental health conditions and their loved ones, and advocates for policies to improve the lives of people affected by mental health conditions. As the country's largest grassroots mental health organization, we know that getting access to treatment in a timely fashion is key to recovery from a mental health condition. However, some of the items in the governor's proposed budget will negatively impact access to care, which are delineated in my written testimony. But briefly, last year, Governor Lamont signed a bill raising the income limit for Husky C, the Medicaid program only for elderly and disabled people, which effectively raised the income limit for an individual under Husky C to about $1,789 per month, with the current $1,211 per month for one person. This increase both ended the unfair treatment of people with disabilities and older adults in terms of Medicaid income eligibility and corrected the violation of our state constitution, which prohibits discrimination based on physical or mental disability. However, the governor's proposed budget now takes away almost all of the increase passed into law to raise the income limit to only about $1,276 per month, beginning in October this year. He also proposes to end Medicaid for caretaker relative adults on Husky A between 138% and 160% of FPL, including those over 65 or disabled, which he then claims that these adults can instead get coverage on the exchange with extra subsidies under Covered Connecticut, and thus have the quote unquote same coverage. This coverage is not the same, and people over 65 and disabled people on Medicare cannot qualify for any subsidies on the exchange. So there is no affordable alternative coverage. Cutting the essential Medicaid program will exacerbate health disparities. The governor's proposed cuts will terminate many people from coverage at income levels disproportionately represented by minorities. It will also increase medical debt, which the governor cares about because of the impact on minorities and is seeking to reduce by making many more people encourage large medical debt, up to $511 per month more, to qualify for Medicaid under Husky C, or as a result of newly paying on credit for things like dental services because they have lost their Husky A coverage with no substitute. As many people who have chronic mental health conditions rely on Husky for their health care, these proposed cuts will definitely have a negative impact on the people we represent and care about, some of the most vulnerable citizens living here in Connecticut. Instead of these cuts, the legislature should lift the very low asset limit in Husky C, and also which discriminates based on disability or being over 65, because no other Medicaid groups have any asset limits. Therefore, in summary, please do the right thing, end this discrimination and these disparities, and please address these harmful changes in the budget. Thank you for your time and attention tonight.
Thank you for your testimony. I would just ask all folks to try to keep within the 3 minutes. We have over 100 more people, actually 160 more people signed up to testify tonight. Next up, we have Constanza Segovia. Is Constanza here? Is William Nash here? I see William is on. I see William online. Oh, William, you've got to accept the promotion, or we can't. Is William there? Okay. Do we have Lisa Otto?
Yes, thank you so much. Good evening, Madam Chair and members of the committee. Thank you for allowing me the opportunity to speak this evening. My name is Lisa Otto, and I serve as the CEO of Child and Family Agency of Southeastern Connecticut. Child and Family provides behavioral health, medical, and supportive services to over 10,000 children, families, and adults in New London, Middlesex, and Windham County each year. I deeply appreciate the increases the legislature has been able to provide over the last few years, but they have not been enough to meet the needs of the people we serve. We continue to be hit by crippling increases in our costs that far outpace the rate of increases the legislature has provided. As an example, Child and Family Agency's outpatient psychiatric clinics for children in Groton, New London, Pawcatuck, and Westbrook have seen a staggering 56% increase in expenses since FY14. These increases, primarily driven by rising salaries, fringe benefits, and health insurance costs, have far outpaced the 11% increase in grant and fee revenue we have seen during the same period. Our clinics are enhanced care clinics, which serve as a crucial safety net to Medicaid-insured children. We receive an enhanced reimbursement rate in exchange for a guarantee of immediate access to care for youth in crisis, but also experience the financial bind that this status creates. Although the funding is increasingly inadequate, we cannot reduce staffing or capacity without violating our ECC status. As a result, we are facing an anticipated deficit of $875,526 for these 4 clinics for this year alone. To mitigate this shortfall, we've been forced to consider drastic measures, including selling off assets or closing this program, which served 1,195 children last year. Moreover, financial constraints have compelled us to scale back on the services we offer. For instance, we were forced to close the final intensive in-home child and adolescent psychiatric services program in New London County in January of 2023 due to ongoing budget deficits. 36 families were waiting for ICAPS when we closed this program. The closure has eliminated a crucial component of the behavioral health service array in southeastern Connecticut. Without ICAPS, no services exist in New London County to provide intensive in-home support for youth aged 6 to 11 or to offer in-home support for youth transitioning back home after psychiatric hospitalization. The closure of ICAPS has led to an influx of referrals to our other intensive in-home programs, functional family therapy and multidimensional family therapy. These programs are suffering from staffing shortages, primarily due to workforce shortages and our inability to offer competitive salaries. As a result of increased referrals and reduced staffing, FFT currently has a 6-month wait list, and MDFT, which cannot maintain a wait list, was unable to accept 120 referrals to serve youth with substance abuse disorders last year. Please support increased funding for community nonprofits by $186 million in FY25 to enable us to maintain access to children's outpatient care and to expand access to intensive in-home behavioral health services for our most vulnerable children. Thank you so much for the opportunity to testify.
Thank you, Lisa. Next, we're going to try to go back to William Nash. Mr. Nash, is it working now?
Can you hear me?
Yes, we can.
Okay, great. My name is Dr. William Nash. I'm a dentist from Fairfield, Connecticut. Been practicing longer than I care to admit. I'm here today talking to you as the co-chair of the Connecticut Foundation for Dental Outreach. This is a separate organization from the State Dental Association, which I have testified for in the past. The CFDO is the organization that puts on the annual Connecticut Mission of Mercies, which is a free dental clinic. Was put on last October in New Haven, where we provided about a little over $1 million worth of free dentistry, with the cost of that clinic being around $500,000. We've been doing this for around 15 years, and the numbers you'll see in the written testimony from our executive director, Lisa Swain, who is down the list somewhere. So you will get to that. But the work that has been done is consistently been a big game changer for a lot of people, for a lot of patients. Not only that, but the fact that so many people come to the clinic in pain. They come to the clinic with broken teeth, missing teeth, and a lot of these people would otherwise be going to the emergency room. Well, when you go to the emergency room for the dental problem, they say, okay, we'll give you some antibiotics and we'll give you maybe some painkillers, and they send you on your way. They never address the problem. That's one of the things that the mission does. We take care of these problems. Matter of fact, other states which have other missions of mercy have recorded a significant dip in ER dental emergencies in the past following any of their clinics. So, I could talk about, and every time that you pay an ER visit, you're saving the state considerable amount of money. The average, national average is around $550 per visit. And I think Connecticut's a little higher. Connecticut gets about a little over 20,000 of these dental ER visits per year. So you can see that if you do the math, it works out pretty favorable to have a clinic like this taking care of a lot of these things. But more than the numbers, it's the way lives are changed. Dental problems can be debilitating, not only with pain and the relation to general health, which is well documented. We're talking about the relationship with heart disease, for instance, diabetes, but also just the way that it will affect a person's outlook on life. You can't imagine you have to see it for yourself. When a person gets a problem fixed, when the person gets a fractured tooth that is disfiguring, physically disfiguring, fixed, you get a person who has it's a partial denture to replace the missing teeth. Their whole outlook changes. They can smile. They are more willing to go out, and I would suspect in many cases that results in them getting jobs that they would not have gotten otherwise.
Thank you, Doctor.
Okay. Thank you.
Thank you for your testimony. All right. Next up, do we have Brian Uyagwari? Do we have Enmi De Leon? We do? Okay. Enmi, are you there?
Sí, necesito un traductor.
Aquí estoy en mí.
Mi nombre es Enmi de León, soy estudiante de Denbury. Gracias por la oportunidad de testificar sobre HB 5048, una ley que ajusta el Estado presupuesto para el bienio que termina el 30 de junio de 2025. Respecto de los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Hay importantes prioridades que se financian en el presupuesto del gobernador para servicios humanos, agencias. Estoy aquí para hablar a favor de financiar un aumento en la elegibilidad para Husky, programa de Medicaid, y solicitar al Comité de Asignaciones que financie la elegibilidad de Husky para todos residentes de Connecticut elegibles por ingresos independientemente de su estatus migratorio hasta los 18 años. Soy Emi de León, un estudiante inmigrante, y esto me importa ya que la salud es importante para todos y creo que todo el mundo debe tener acceso a este derecho. La edad debería ser definitivamente extendida, ya que si un familiar se queja de haber enfermado o se siente mal, ejemplo, mi padre, un hombre trabajador, pero con miedo de ir al hospital por el constante miedo a no poder pagar el monto requerido. Los costos en los hospitales en el día de hoy son muy altos y están incrementando en los últimos años. Mi padre siempre nos ha dicho que este es un problema muy serio para nosotros como inmigrantes. Tener acceso a un seguro de salud es crucial, ya que brinda seguridad financiera y asegura atención médica oportuna. Personalmente, aliviaría la carga de costos médicos elevados para mi familia, permitiéndonos priorizar nuestra salud sin preocuparnos por posibles tensiones financieras. En un contexto más amplio, para la comunidad, el acceso mejorado al seguro de salud promueve el bienestar general, la atención preventiva y reduce la presión sobre los recursos de atención médica pública. Le pido al Comité de Asignaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut elegibles por sus ingresos, independientemente de su estatus migratorio, hasta los 18 años, y en el futuro para crear un contrato a largo plazo para abrir este acceso a todos los inmigrantes independientemente de su edad. Las necesidades sanitarias no terminan a los 15 o 18 años. Gracias por tu atención. Enmi de León.
Chairman and members of the Appropriations Committee, my name is Enmi de Leon. I am a Danbury student. Thank you for the opportunity of allowing me to testify on HB 5048, a law that adjusts the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the Human Service Agency, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities funded in the governor's budget for human services agencies. I am here to speak in favor of funding and increasing eligibility for Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. I'm Emi de Leon, an immigrant student, and this matters to me because health is important for everyone, and I believe that everyone should have access to this right. age should definitely be extended since a family member has complained of having taken ill. An example would be my father, a working man, but scared of going to the hospital because of the constant fear of not being able to pay the required amounts. The costs of hospitals today are extremely high, and this has increased in recent years. My father has always told us that this is a very serious problem for us and the rest of the immigrant community. Having access to health insurance is crucial as it provides financial security and ensures timely medical attention. Personally, it would alleviate the burden of high medical costs for my family, allowing us to prioritize our health without worrying about possible financial tensions. In a broader context for the community, improved access to health insurance would promote general well-being, preventive care, and reduce the pressure on the public health care resources. I asked the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future, to create a long-term contract to open access to all immigrants, regardless of their age. Health needs do not end at 15 or 18 years of age. Thank you for your time. I'm Enmi de Leon.
Thank you for your testimony tonight. Next, we will hear from Dolly Virginia Robinson. Okay, Marcia Blake Henry. Albert Mislow Sr.
Yes. Yes, good evening. Can you hear me?
Yes, we can.
Yes. I'm the executive director of all the Curtis Home buildings, but today I speak to you concerning our 34-bed residential care center located at 380 Crown Street in Meriden. In 1896, Samuel Curtis, a philanthropist, began his vision to provide care to the most needy in our area, no matter what their pay or source. Myself and our board of our not-for-profit organization continue to support that dream, but we are concerned that shortly that vision will end. Currently, our census is 27, which is below the 90% required occupancy threshold. Because of that, we are penalized in a manner in which we are reimbursed. I'm not an accountant, but I've asked Art to explain the calculation, and that results in a $23.24 a day loss per day per resident. Yes, we want to maintain 100% occupancy every day to care for the most needy, but we cannot. We cannot provide the needed oversight, structure, professional guidance, and medical care that our population requires. Almost all of our residents have a diagnosis of mental health and alcohol and drug addiction in the past. We provide a full-time nurse, which is not a reimbursable expense and not even required by the public health code. But without their oversight, the residents could not manage their daily living. We accept residents that many other homes would not admit, but Mr. Curtis' vision would not be met. However, we need the funds to care for our current residents and the services to maintain a healthy and safe environment for all, including the staff. The recent increase we received was 86 cents in our daily rate, which equates to $8,470 for the entire year. As you are well aware, our utilities, health insurance, food supplies, and the list goes on, have increased dramatically. Add that to the daily shortfall of $23.24. I don't know how much longer we can sustain that. The question continues, does the state of Connecticut want to fund and support residential care homes as a housing option for Connecticut residents? And I thank you for listening and have a good evening.
Thank you, sir, for your testimony. Next, we are going to hear from John Roach.
Thank you. I would say good afternoon, but I believe good evening is more appropriate.
Good evening.
Good evening. So to the distinguished members of the Appropriation Committee, I'm Fire Chief John Roach, representing the town of Summers and the Summers Fire and EMS Department. I'm here today to testify in regards to House Bill 5048, Act adjusting the state budget as the needed to restore the funding for Medicaid increases towards ambulance reimbursement rates. The emergency medical service providers in this state are approaching a crisis point. Costs for medications, equipment, and especially staffing have gone up significantly in recent years. However, our recent reimbursement rates from Medicaid to provide these services have remained stagnant. After much effort and the generous support of this legislature, we thought there might finally be some relief in sight with the original proposal to provide $5 million for Medicaid increases for EMS services. While this was still not where we hoped funding to be long-term, we saw it as an incremental step in the right direction. All of us in the public safety arena were shocked and saddened to hear the governor's latest proposal, which is to cut this funding needed to support our first responders. Let me be clear, this is not simply an issue for the urban EMS services or our rural ones. This is an issue that impacts every EMS agency in the state. Even in a community such as ours in Summers, almost 30% of our patients are on Medicaid. In most instances, our services are losing money responding to these types of calls. While we acknowledge that 911 services are never going to make a profit, municipal leaders, especially in my town, are pressuring us to curtail these losses. That is resulting in cuts in services across the board. This effect also is now visible in the overall lack of EMS resources available for 911 calls across the state. Last year, the town of Summers was required to respond to over 500 mutual aid calls to our neighboring communities. For a town of our size, this is a little bit unreasonable and unsustainable. Our town did not sign up for these calls. However, our community has a little bit of fortune that we can take firefighters off of our fire trucks and staff an additional ambulance because there was nobody else in neighboring towns to answering those calls. Unfortunately, this is seen as a direct result of the current EMS reimbursement rates. It is simply not cost effective for our neighboring communities, whether municipal or commercial, to put on the appropriate number of crews to answer the calls in their own towns. I do understand that the state is in the process of studying Medicaid reimbursements rate, but this is further delaying any type of relief that our agencies desperately need to operate now. We urge you to restore the $5 million in Medicaid for ambulance reimbursement currently and to support our first responders today. Thank you very much.
Thank you very much, Chief, for your testimony. Next, we will have Mario D'Aquila.
Yes, thank you. Can you hear me okay? Thank you. Hello, distinguished members of the Appropriations Committee. My name is Mario D'Aquila, and I'm the Chief Operating Officer and co-owner of Assisted Living Services, Inc. I serve as the chairman of the DSS Medicaid Committee for the HCAOA Connecticut, as well as serve on the board of directors for the Connecticut Association for Healthcare at Home. When my great-grandfather was diagnosed with Alzheimer's disease and living at home alone was not possible, my mother stepped in to provide the necessary home care needed for him to age in place. And from that personal experience, our company was established in 1996. Since then, we've employed and provided quality non-medical home care services to thousands of Connecticut residents. Our company now has offices in Cheshire, Westport, and Putnam, Connecticut. I am here today to support increased Medicaid reimbursement for home care providers. We provide services to many seniors throughout the state, but our main client base are clients who are funded by the Medicaid waiver programs, such as the Connecticut Home Care Program for Elders. These programs are an integral component in keeping our beloved seniors aging in place safely and happily at home. Not only do these programs support a higher quality of living for seniors, but they also save the state a tremendous amount of funds annually. We are supportive of increasing our valuable employees' wages, as well as employment benefits such as health insurance, supplemental insurance, retirement benefits, and more, but would be faced with a challenging feat of continuing to provide services to clients funded by the Medicaid waiver programs if there's not an increase in rates for providers. On January 1st of 2024, Connecticut's minimum wage was increased from $15 an hour to $15.69 per hour. That's a 4.6% increase in wages. With the 4.6% increase in wages, providers have not received any increase in reimbursement rates in order to match the cost of minimum wage increase. Also, in 2025, minimum wage is scheduled to be increased again in order to match the percentage change in the Federal Employment Cost Index. My request is that starting this June of 2024, providers get a reasonable 4.6% increase in reimbursement rates. Then in subsequent years, get respective increases to keep up with the ever-increasing minimum wage. We would also request that this increase be applied retroactively back to January 1st of 2024, so that providers will be able to recoup losses incurred during that time. Please note these rate increases will just allow us to break even with the increase in wage costs so that we can continue to provide services to clients participating in these waiver programs. Thank you for your time.
Thank you for your testimony. Next up, we have Dr. Dante Britis. Is Dr. Britis on? No. Okay, Janella Gonzaga. Janella, you have to accept the promotion. Go ahead, Janella.
Adelante, Yanela.
Buenas noches. Aló.
Continúa, corazón, te estoy escuchando. Voy a ser tu intérprete.
Ok. Buenas noches, mi nombre es Yanela Gonzaga. Soy estudiante de Danbury y miembro de Students for a Dream. Gracias por la oportunidad de testificar sobre HB 5048, una ley que ajusta el presupuesto estatal para el bienio termina el 30 de junio de 2025. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Hay importantes prioridades que se financian en el presupuesto del gobernador para agencias de servicios humanos. Estoy aquí para hablar en apoyo de la financiación de un aumento en la elegibilidad para el programa Husky Medicaid y pedirle al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut elegibles por ingresos, independientemente de su estatus migratorio, hasta los 18 años. Soy Yanela y me importa porque creo que todos deberíamos tener derecho a tener Husky porque es importante que todos tengamos un seguro médico. Un día mi padre estaba mal de salud y le dije que fuera al hospital y no quería ir porque tenía miedo de que al cabo de unas semanas le llegara una factura con mucho dinero por haber ido al médico. Hace unas semanas estuve enferma y no podía ir al médico porque tenía miedo de pagar mucho dinero. El miedo es tanto que uno no quiere ir al hospital así se encuentre mal de salud solo porque al cabo de las semanas le puede llegar un bill con un monto de tanto dinero. Y creo que todo el mundo debería tener un seguro médico porque a veces nos enfermamos y necesitamos ir al médico sin miedo a recibir una factura con una cantidad de dinero muy elevada. Le pido al Comité de Asignaciones que financie la elegibilidad para Husky para todos los residentes de Connecticut elegibles por ingresos, independientemente de su estatus migratorio, hasta los 18 años este año, y que en el futuro cree un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad. Las necesidades de atención médica no terminan a los 15 ni a los 18 años. Gracias por su tiempo. Buenas noches.
Good night, chairs and members of the Appropriations Committee. My name is Dianela Gonzaga. I am a student from Danbury and a member of Connecticut Students for a Dream. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th of 2025. With respect to the budgets of the Human Services Agency, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents regardless of immigration status up to age 18. I am Gianella and I care about it because I believe that everyone should have the right to Husky because it is very important for everyone to have health insurance. One day, my father was in bad health, and I told him to go to the hospital, and he didn't want to go because he was afraid that after a few weeks he would receive a bill with a lot of money for having gone to the doctor. A few weeks ago, I was sick, and I couldn't go to the doctor because I was also afraid of having to pay a lot of money. I believe that everyone should have health insurance because sometimes we get sick and we need to go to the doctor without the fear of getting a bill with a very high amount of money. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you so much for your time.
Thank you for your testimony. Next up, we have Carolina Bueno, followed by Tanisha Joyner. Is Carolina on? No. I don't think she's on. So is Tanisha Joyner? I do see Tanisha Joyner online. She needs to accept the promotion. Tanisha, if you could accept the promotion. You should be good to go.
Okay, can you hear me now? I'm so sorry. I'm having an issue with my phone.
Now we can hear you. Please proceed.
Okay, this is Tanisha Joyner. Hi, how are you?
We're great. Please go ahead.
Hi, so my name is Tanisha Joyner, and I live in Stanford. I'm one of the 11,600 personal care attendants paid by the state and federal Medicaid dollars. And we, care for people. I care for my grandmother who have physical and intellectual disabilities, and help them live with dignity at home. 80% of us are women, and nearly 70% of us are people of color. The vast majority of us make $18.25, yet we do not have access to any paid time, sick time off. Many of us have no health insurance. None of us have any retirement, and we have a new PCA agreement that will raise wages from $18.25 up to $23 an hour over the next 2 years. So I'm here today asking to fund and pass the PCA contract because it matters to PCAs like me. I've cared for my grandmother for 15 years. When I saw my grandmother needed more help, despite working 2 jobs, I decided it was time for me to step up and help her. I quit my other jobs to care for her full time. Caring for my grandmother means so much to me, and I have a lot of dreams for the future. As a PCA, I make an average of the 825. I'm newly engaged, and my fiance and I are dreaming of a wedding, a house, and kids someday. I simply do not make enough to fund my future, don't have any security for this future and the dream that I dream of. My wages are not keeping up with the rental prices. My fiance and I can't afford monthly rent, let alone first and last months in deposits. We deserve the same security we bring to our consumers, and we're calling on you to set aside the funding that is needed for us to earn up to $25 an hour and to have access to health insurance, retirement, and paid time off. We're just looking for basics, but we need your support to get there. Please, and thank you for your time.
Thank you, Tanisha. Thank you for being with us tonight. Next, we have Holly Hackett, followed by Ruth Valera Herrera.
Good evening, distinguished members of the Appropriations Committee. Can you hear me okay?
You're a little muffled.
Okay. I had this problem last night too. There's a problem with my speakers. My apologies. My name is Holly Hackett. I'm a resident of Brantford and the co-chair of Mothers and Others for Justice's Health or Helping Everyone Achieve Lifelong Trusted Healthcare Committee. The main reason for my testimony today is to oppose the proposed cuts to Husky A and C. I also urge you to raise the age eligibility for the Husky Health Program to include individuals up to 18, regardless of immigration status. I will have more comments in my written testimony of other things that I support. Last session, a step in the right direction was taken to end the discrimination against those of us with disabilities or who are elderly. Now, the governor proposes to take away almost all of the increases passed into law to raise the income limit in October. It is yet another example of how the most vulnerable of us are consistently being treated as second-class citizens and being discriminated against. Do not let the governor disobey the law by violating our state constitution, which prohibits discrimination based on physical or mental disability. It seems like those of us with disabilities are always the ones who get our necessary services cut from the budget. Speaking for myself, currently I have $2,168.66 on my care credit card, which is specifically for medical expenses. I was supposed to be on MedConnect, which is a Medicaid for employees with disabilities. I worked for approximately 3 years and was never put on this program. If I were, then I probably wouldn't have incurred this very large medical debt. And again, I do not understand why, if one of the priorities of the administration is to remove medical debt, but yet they cut Husky C, and which will cause us to incur more medical debt. I think it's wonderful that others' medical debt were paid off. It's great for so many. But since I am no longer working, I do not qualify for MedConnect, and I am no longer sure that I will not incur even more medical debt. And my credit cards will put me even more over the edge. So instead, why not tackle the root causes of medical debt and address those? To me, it just doesn't make fiscal sense. I think there is a lot of misinformation being put out to the public and perhaps even among the administration and some legislators regarding the cuts to Husky. For Husky A, for a caretaker relative over 65, if adults over 138 of the federal poverty level are terminated from all Medicaid coverage, they will not get the same coverage under the covered Connecticut plan on the exchange with extra subsidies, because people over the age of 65 and disabled on Medicare cannot qualify for any subsidies on the exchange, so there is no affordable alternative coverage. So these cuts to essential Medicaid programs will worsen health disparities, terminate many people from coverage at income levels that are disproportionately represented by Black and brown people, and increase medical debt for so many. Please do not let the fiscal guardrails hurt some of the most vulnerable of our Connecticut residents. We have a large surplus and enough revenue to cover the full increased cost of Husky C and of maintaining Husky A eligibility
your time
guidelines.
has expired.
Are we good? Thank you again for your time. And you've heard this before, but I'm going to say it again. Please pass a moral budget instead of a budget that will not only hurt so many, but is also discriminatory.
Thank you for your testimony. Next, we have Ruth Valera Herrera, followed by Delfina Arango.
Sí. Buenas noches, miembros del Comité de Apropiaciones. Me llamo Ruth Valera Herrera, soy de Perú, tengo 55 años y vivo en New Britain, Pueblo. Soy miembro de Hartford Deportation Defense. Gracias por la oportunidad de testificar con respecto al HB 5048, una ley que ajusta el presupuesto del Estado para el bienio que termina el 30 de junio del 2025. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales, el que administra Husky. Soy madre soltera con 2 hijos, uno de 23 y el otro de 25 años, que están en edad de hacer carrera. En sus trabajos les descuentan el seguro médico, pero ellos no reciben, no pueden acceder a este seguro médico porque no cumplen los requisitos, porque no nacieron aquí. También tengo una madre de 86 años y ambas dependemos de mi salario. Trabajo cuidando personas mayores, ancianos, y me descuentan el seguro médico de cada sueldo, pero tampoco puedo acceder y no puedo recibir esa ayuda médica por ser inmigrante. A veces me he lesionado la espalda y la mano derecha levantando y aseando a personas mayores. No he ido a fisioterapia porque cuesta más de $100 la visita y me piden más de 2 visitas a la semana. Pido por esto al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut, que reúnan los requisitos de ingreso independientemente de su estatus migratorio hasta los 18 años este año y que en el futuro cree un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad y de su estatus. Las necesidades sanitarias no terminan a los 15 o a los 18 años. Ahora he estado enferma también, he tenido que dejar de trabajar y por eso estoy aquí a través del Zoom. Gracias por su tiempo.
Good night, chairs and members of the Appropriations Committee. My name is Ruth Valera Herrera. I'm from Peru. I'm 55 years old and I live in New Britain. I'm a member of the Hartford Deportation Defense. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th of 2025 with respect to the budget of the Human Services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. I'm a single mother with 2 sons who are 23 and 25 years old and are on age to build a career. Health insurance is deducted at their jobs, but they don't qualify because they weren't born here. I also have an 86-year-old mother and we both depend on my salary. I work taking care of senior citizens and they deduct health insurance from every paycheck, but I also cannot receive that benefit because I am an immigrant. Sometimes I have injured my back and right hand lifting, cleaning senior citizens. I have not gone to physical therapy because it costs more than $100 per consultation and is at least twice a week. I've been sick and I haven't been able to go back to work. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you so much for your time.
Thank you for your testimony.
Thank you.
Next, we have Delfina Arango. Is Delfina on? No. Do we have Caitlin Ogilvy?
Yes, I'm here.
Okay, great.
Good evening, members of the Appropriations Committee. My name is Caitlin Ogilvy, and I'm a licensed clinical social worker serving the children and families of Connecticut for over 16 years. I'm a service director serving the children and families of Connecticut at the Community Health Resources, overseeing child outpatient, school-based therapy, and several community-based programs. CHR is an essential healthcare provider that meets the behavioral health care needs of children, families, and adults throughout the eastern portion of the state. We rely on state funding to continue to respond to the growing needs and demands of the communities we serve with effective, evidence-based, and person-centered services. I want to thank you for the opportunity to testify on HB 5048 and oppose the proposed budget that does not provide an increase to nonprofits and their DCF-funded programs. I'm here to request that you increase the grant funding for community nonprofits by 5% during the time of ample state resources and investment is vital. We appreciate the increases the legislature has been able to provide over the last few years, and they have not been enough to meet the needs of the people we are serving. We continue to be hit by debilitating increases in our costs that far outpace the rate of increases the legislature has provided. The demand for children's behavioral health services is higher than ever. The acuity of the children initiating services is significantly higher than pre-pandemic times. Children and their families are seeking services for the top 3 reasons: traumatic experiences, depression, and anxiety. Children are presenting with suicidal ideation, self-injurious behaviors, homicidal ideation, substance use, and school avoidance. We continue to see reports of children being stuck in emergency rooms across the state. Based on early and promising data and the need for a safe place during crisis, the budget needs to include the urgent crisis centers and subacute centers. Additionally, a budget increase would support outpatient and community-based programming needs for preventative care while ensuring that children discharging from these acute services have clinically appropriate follow-up care, implemented the right frequency and intensity. Dosage is critical. Meeting client needs is becoming increasingly difficult as waitlists for services continue to grow due to a loss of seasoned staff and difficulty hiring. Last week, a study of some of the state's Medicaid rates was released by the executive branch. The study provides devastating proof that Connecticut is spending less than half of what comparable states are spending for behavioral health services, which results in increased health disparities in our state. The study reinforces what we know. We operate at large deficits and can't afford the market rate for clinical staff. This directly impacts the number of children and families we can serve. In the next year's budget, increasing funding for our services, we would be able to start addressing some of these concerns through filling vacancies and retaining staff. I appreciate the ability to provide testimony today and for your support of agencies like CHR. Please support increased funding for community nonprofits by 5% in fiscal year 25. Thank you.
Thank you. Okay, next we have, is Bella Lopez Silva with us? Yes. Bella, I think you have to accept promotion.
Bella, tienes que aceptar la promoción para ser panelista para poder hablar.
Bella, please go ahead.
Adelante. Te tienes que quitar el silencio, Bella, y proceder adelante.
Okay, sorry about that. Right. Good evening, chairs and members of the Appropriations Committee. My name is Bella Lopez Silva, and I am the Development Manager for Connecticut Students for a Dream and an immigrant living in Bridgeport. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky. There are important priorities being funded in the governor's budget for human services agencies. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask for the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to the age of 18. I am an undocumented immigrant, and I care about this because my younger sister and I grew up without access to healthcare. We didn't know what getting regular healthcare checkups was like until we reached adulthood and were able to pay out of pocket for these services. I did not get my first pair of glasses until I was in 7th grade through a free program that was offered at my middle school. I needed glasses long before that, but because I did not attend regular eye checkups or any other regular medical support, I didn't realize that my sight was slowly getting worse. Having access to healthcare would impact my community so that they don't have to go through what I did with my eyesight. As an immigrant who has grown up without insurance and whose parents also didn't have it, I now that I'm older, I now see the value of learning healthy habits of attending regular checkups from a young age, because I now at 27 years old, I have difficulty, getting into that habit of scheduling and attending regular medical visits. I respectfully ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you for your time.
Thank you for your testimony. Next up, Carmen Lanche, followed by Robin Davis.
Buenas noches, estimados presidentes y miembros del Comité de Apropiaciones. Mi nombre es Carmen Lanche, soy casada, tengo 2 hijos y vivo en la ciudad de Norwalk y soy la directora ejecutiva de la organización Comunidades Sin Fronteras. También somos miembros de la coalición Husky para Inmigrantes y Connecticut para Todos. Gracias por la oportunidad de testificar con respecto a la HB 5048. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales, que administra Husky, Medicaid y CHIP. Sin cobertura de atención médica, muchas personas retrasan la búsqueda de atención hasta que su condición requiere visitas al departamento de urgencias y sus hospitalizaciones y el tratamiento temprano reduce la cantidad de una persona para que pagara más por la atención médica a largo plazo, al evitar que los problemas de salud se desarrollen y empeoren. Connecticut tiene un programa de Medicaid y emergencias que cubre atención de emergencia para personas que califican según sus ingresos. Independientemente de su estado migratorio, los costos de este programa, aproximadamente 15 millones en el 2021, se reducirían sustancialmente por la disminución de la falta de seguro entre los inmigrantes recientemente indocumentados y legalmente presentes. Los inmigrantes indocumentados apoyan la economía de Connecticut, pagando 338.3 millones de impuestos federales y 187.5 millones en impuestos estatales y locales en el 2019, para un total de más de 500 millones de dólares en ese mismo año. Nuestro compromiso con Husky para todos los residentes, independientemente de su estatus, se basa en que nuestra creencia de que todos los padres inmigrantes, los inmigrantes discapacitados y los inmigrantes trabajadores necesitan acceso a la atención médica para crear comunidades y familias saludables. También creemos que la salud de los niños no puede existir sin la salud de sus padres y cuidadores. Pido al Comité de Apropiaciones que financie la elegibilidad de Husky para que todos los residentes de Connecticut que califiquen basado en sus ingresos, independientemente de su estatus migratorio, hasta los 18 años este año y en el futuro crear un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad. Las necesidades de salud no terminan a los 15 ni a los 18. Así que espero que se toquen el corazón y aprueben por lo menos este año hasta los 18 años de edad. Gracias y buenas noches.
Good evening, chairs and members of the Appropriations Committee. My name is Carmen Lanche. I am from Norwalk. I'm married with 2 children, and I am the Executive Director of Comunidades Sin Fronteras and member of the Husky for All Coalition in Connecticut. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025. With respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding and increasing eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. Without health insurance, people wait until it's too late to reach the emergency department, and then the health costs are higher and their treatment is not the appropriate one. We, undocumented immigrants, pay a lot of taxes. We pay over $330 million in federal taxes and over $150 million in state tax. That's over $500 million in taxes that should cover healthcare for us. It would definitely cover the $50 million that it's supposed to be cost to cover that. All immigrants, families, and disabled folks deserve the right to health care. Children's health cannot prosper if their parents' health is not well. We need health plans for all. I beg the help of the entire Appropriations Committee, and I ask the Appropriations Committee to find it in their hearts to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, through age 18 this year, and to create a long-term plan to open access in the future to all immigrants, regardless of their age. Healthcare needs do not end at 15 or 18, and I reiterate, parents need to be healthy to care for their children. So that there should be a long-term plan to extend the age so that everyone can benefit from this. God bless you. I ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to 8/18 this year, and for everyone in the future. Thank you for your time.
Thank you for your testimony. Is Robin David on? Robin, you need to accept the promotion. Great, Robin, please go ahead. Okay, we're gonna come back to Robin. Sarah Lockery.
Good evening. Good evening, Madam Chair and members of the Appropriations Committee. I'm Sarah Lockery, a Bramford resident. I work at the Children's Center of Hamden as the Chief Operating Officer, where we provide a continuum of behavioral health services and a clinical day school. I'm also the co-chair of the Statewide Advisory Council for the Department of Children and Families. In the most turbulent days of COVID-19 pandemic, I recall feeling comforted and grateful that I lived in Connecticut, a state where elected officials sought advisement from medical experts. My goal in testifying today is to plead that this same wisdom be applied to behavioral health. Our children's mental health system is collapsing. Please hear the warnings from providers and parents. On paper, Connecticut's behavioral health system looks quite robust. It includes services ranging from in-home to outpatient and day treatment to 24-hour care. Our state's response to the tragedy in Newtown contributed to the growth in services. Our state's response to the mental health needs of children in the aftermath of COVID is lacking. Waitlists are growing, all while programs have openings. Why? Because we don't have enough staff. Nonprofits are critical to restoring access to services. When adequately funded, we could provide a living wage and attract and retain employees. I truly fear, that those employees who remain, many who see our work as their mission or calling, will also have to leave. Rents have increased by 30%, groceries and utility costs are rising. It's completely understandable that a person prioritizes the financial needs of his or her family. My plan about 5 years ago was to retire this year. To leave now, when our mental health system is collapsing, seems incredibly irresponsible to me. I just can't do it. In my 30-plus year career, I've had the privilege of working with compassionate and competent people, both providers and parents. Connecticut is rich in resources. Our children need us. Our children need you. Please fund nonprofits with the additional $186 million as requested by others. We are the solution to this crisis. Thank you all for your time and service to our state and for the opportunity to testify today.
Thank you for your testimony tonight. Let's try Robin again. Robin, are you there?
Yes, hi. Can you hear me?
Yes, we can.
Okay. Good evening, Senator Austin, Representative Walker, and the members of the Appropriations Committee. My name is Robin David, and I have been a personal care attendant for over 20 years. I currently stay in Naugatuck, but have been basically homeless for the past 14 months. I split nights between staying with my friends and working an overnight shift with my consumer in New Haven. I like working with people, and I've learned so much from my consumers over the years. Caring for individuals with autism, Alzheimer's disease has taught me so much more than I could ever learn from a book. Over my 2 decades as a caregiver, I've cared for total care patients with quadriplegia, dementia patients, experienced sundowners, and I've even cared for a Holocaust survivor. However, there are a lot of challenges to being a home care provider. Our wages are too low, and we still don't have access to use the paid sick days we won in 2022. I have severe osteoarthritis, which periodically debilitates me to the point that I have to take dozens of days off unpaid unpaid over the past couple years. I've worked many more days and pain because I couldn't get coverage. There have been times I've gone to work when I could barely walk or stand. I'm also starting to have tremor syndromes, which makes it very difficult to work at all. Allied is finally being replaced, but Allied's late payments were one of the reasons I fell behind in my rent and got evicted last year. I also lost my car. Now I'm piecing together bus fare, train fare, and taxi rides to keep my job. Last spring, I was so overwhelmed by the stress that I took myself to the mobile crisis unit. Finally, we have a new PCA agreement that will raise wages from $18.25 up to $23 an hour over the next 2 years. I recently lost my food stamps, so this raise is badly needed to make sure I can afford groceries, rent, and the basics to stay afloat. Please hear us and vote yes on the PCA agreement to put us on a path towards the wages and benefits we desperately need and deserve.
Thank you so much, Robin, and I'm glad you were able to testify. And I know you're taking care of others, but it sounds like you need help yourself, and wishing you the very best.
Thank you.
We're going to go back to number 104, Constanza Segovia, and after her, we're going to go return to the list.
Thank you, Senator Lesser. Chairs and members of the Appropriations Committee, my name is Constanza Segovia. I'm a lead organizer with Hartford Deportation Defense. Our organization represents 300 plus immigrant families in the Hartford area, and we work with our neighbors to fight for a just and dignified life in our state, where everybody has a chance to thrive, no matter their race, gender, immigration status, or zip code. We're also part of the Connecticut for All Coalition. Thank you for the opportunity to testify regarding HB 5048. I am here to speak in support of funding the expansion of Husky to include all Connecticut residents who are income eligible, regardless of status, of immigration status, up to age 18. In our members' testimonies, many of them have testified today. You will hear people always talking about the health of their children first. You will hear them set aside their own health in order to make sure their children get the support that they need. We know that parents are willing to do anything for their children. However, that sentiment should not include suffering every day, worrying every day simply because our government prevents them from accessing the healthcare that they deserve because collectively they pay more than $187.5 million per year in state and local taxes. Parents deserve quality care. Single adults deserve quality care. Children deserve quality care. Everyone in our state deserves quality care. Connecticut is one of the wealthiest places in the country and currently bragging about how much money we have left over in surplus funds. How is it that we're here again begging for the state to fund something as basic as healthcare access for our residents who need it the most? Even worse, we are hearing about cuts to the Husky program by shifting funding to Covered Connecticut, which is a way to funnel federal funds to private health insurance corporations' pockets. What is worth is that this automatically disqualifies undocumented adults from being able to access healthcare in that income bracket when we finally win one day Husky for all undocumented people, no matter their age. Cover CT was supposed to cover a gap for folks who made a little too much to be on Husky, and that was a positive thing. It was not meant to be a version of Husky that continues to drive inequities in our state. We are in this fight because this truly is a life or death issue. People die because they cannot afford the care that they need and because they are denied care due to lack of insurance. You have the opportunity in this committee. You have the opportunity in this committee. Yes. That's my daughter, sorry. You have the opportunity to change this reality in part by funding Husky expansion for minors up to the age 18. And the Human Services Committee made that recommendation last session. We would love to be able to say at the end of this session that all children living in poverty in our state can have access to health insurance, period, without discrimination based on immigration status. Thank you.
Thank you, Constanza. Next, we have Kimberly Smith, followed by Rodrigo Nino.
Good evening, members of the Appropriations Committee. My name is Kimberly Smith, and I am the Program Director of Disabilities Network of Eastern Connecticut, one of 5 independent living centers in the state. I am here today to provide testimony on the importance of increasing the funding for the independent living centers by an additional $1 million. Independent living centers like ours are lifelines for individuals with disabilities, providing a crucial support that enables them to live independently and actively participate in their communities. The demand for our services continues to grow, underscoring the vital role we play in improving the lives of those we serve. One area where increased funding is urgently needed is in staffing. Our dedicated team is working tirelessly to meet the needs of our consumers. But with the rise in service requests, we are facing significant challenges. Hiring additional staff members, particularly a community advocate and a housing coordinator, is essential to ensure we can effectively support individuals in securing housing, advocating for their rights, and accessing community resources. Over the past several years, we have witnessed a considerable increase in requests for a community advocate and housing coordinator. The barriers faced by individuals with disabilities in finding suitable housing and overcoming discrimination are staggering. Our current staff is swamped with requests, and the need for additional personnel is evident to ensure that we can provide timely and comprehensive support to all of those in need. Increasing funding for independent living centers like ours is not just about meeting current demands, but also about expanding our reach and serving our larger segment of our community. By allocating the necessary resources and support, we can empower individuals with disabilities to lead independent lives, stand up for their rights, and actively engage in their communities. In conclusion, I urge the Appropriations Committee to seriously consider our funding request of $1 million. This additional funding will allow us to enhance our services, hire critical staff members, and continue to make a substantial impact in the lives of individuals with disabilities. Your support will help us fulfill our mission of creating a more inclusive and supportive community for all. Thank you for your time and consideration.
Thank you for your testimony tonight. Rodrigo Nino.
Estimados presidentes y miembros del Comité de Apropiaciones, mi nombre es Rodrigo Nino. Soy casado y tengo 2 niños. Vivo en la ciudad de Norwalk y soy miembro de la organización Comunidades Sin Fronteras y CETE para Todos. Gracias por la oportunidad de testificar con respecto al HB 5048, con respecto a los presupuestos de la Agencia de Servicios Humanos, especialmente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Desde el 2019 mi vida cambió drásticamente. Me dio la bacteria Helicobacter pylori. Esta bacteria se originó úlcera y gastritis crónica. Es muy difícil llevar el dolor que tengo en el 2020. Tenía una fecha de operación, pero cuando comenzó la pandemia las operaciones se detuvieron por completo. Tengo esperando 4 años. Siempre me preguntan por mi seguro médico y respondo que no tengo. ¿Acaso mi vida no importa? Tomo medicina diariamente y estoy desesperado. Un total del 94% de todos los residentes de Connecticut tienen seguro médico. Es por eso que US y News y Gold Report clasifican a Connecticut en el segundo lugar del país por la calidad y accesibilidad de la atención médica. Pero lamentablemente, eso no se extiende a nuestra población indocumentada. El 58% de los aproximadamente 113,000 inmigrantes indocumentados en Connecticut no tienen ningún tipo de cobertura de seguro médico. La salud es un derecho humano, no un privilegio. Pido al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut que cualifican basado en los ingresos independientemente de su estatus migratorio hasta los 18 años este año y en el futuro crear un plan a largo plazo para abrir el acceso a los inmigrantes independientemente de su edad. La necesidad de salud no termina a los 15 o a los 18 años. Gracias por escuchar a la comunidad inmigrante.
Chairs and members of the Appropriations Committee, my name is Rodrigo Nino. I am married and have 2 kids. I live in the city of Norwalk, and I am a member of Comunidades Sin Fronteras, Husky for Immigrants, and Connecticut for All. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. Since 2019, my life changed drastically. I got the Helicobacter pylori bacteria. This bacteria caused ulcers and chronic gastritis. It is very difficult to bear the pain that I have. In 2020, I had a date for surgery, but when the pandemic started, surgeries were stopped completely. I had been waiting for 4 years. They always ask me about my health insurance, and I answer that I don't have any. Maybe my life doesn't matter. I take medicine daily. I'm desperate. A total of 94% of all Connecticut residents have health insurance. This is why U.S. News and World Report ranks Connecticut second in the nation for the quality and accessibility of healthcare. But unfortunately, that does not extend to our undocumented population. 58% of the roughly 113,000 undocumented immigrants in Connecticut do not have any form of health insurance coverage. I only ask you to make having medical insurance a reality for all the families that suffer for our health. Health is a human right, not a privilege. I ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you for listening to the immigrant community. I'm Rodrigo Nino.
Thank you for your testimony tonight. Next up, we have Mariam Hakim Zargar, Dr. Mariam Hakim Zargar.
Hi, good evening. Can you hear me?
Yes, we can.
Perfect. Good evening, Senator Alston, Senator Lesser, and esteemed members of the Appropriations Committee. Thank you for allowing me the opportunity to speak tonight. My name is Mariam Hakim Zargar. I'm an independent solo private practice orthopedic surgeon in Torrington, where I've been in practice for the past 14 years since I finished my training here in Connecticut. I'm speaking on behalf of the Connecticut State Medical Society, where I'm the current vice president. I'm here to speak to you about the critical need to allocate funding to the Department of Social Services to increase Medicaid rates for physicians. We're dealing with complex, multifactorial societal issues here. So today I want to share a story that I think vividly illustrates the pressing challenges we face in our healthcare system and in society. Meet Anne. She's a 26-year-old single mother of two, works 3 part-time jobs. None of them provide her with any health insurance benefits. She has Medicaid. One evening, she slips and falls in her kitchen, hurts her ankle. It swells up. It's painful, but she can't leave her kids alone to go to the emergency room, and she can't afford a babysitter on short notice. She's hoping it'll just get better on its own by tomorrow. She barely sleeps that night due to the pain. And in the morning, the ankle's twice as swollen. She can't walk on it. She calls in sick to work, gets her kids on the bus, and then starts calling around to get an appointment to be seen. But either they don't take her insurance or the next available appointment is 2 or more weeks out. So she heads over to the urgent care center where she's evaluated and diagnosed with an ankle sprain. She's splinted and told to follow up with the orthopedic surgeon. She calls around. No one takes Medicaid. No one has an appointment. She calls the number on the back of her card, and they give her the name and number of a doctor who's 40 miles away and can see her today on the same day. So she doesn't have a reliable car. She can't afford gas. She calls a medical cab, and by the time she arrives at her destination, she's 15 minutes late, and the appointment has already been canceled. They schedule her for 2 days later. She will now miss 3 days of work just to be seen for a simple ankle sprain. Because she's missing 3 days of work, she won't have enough money for food or groceries this month for herself or her kids. Anne's cab driver, in the meantime, has already gotten paid 4 times what the doctor would have gotten paid if he had seen her in her community. The current Medicaid reimbursement rates don't cover the cost of a time slot in my practice. I'm not aware of any state employee or state contractor who's doing the state's work at a net loss. I don't turn patients away. I see all the Medicaid patients who are referred to my practice, but with the current inflation and cost of running a small business in Connecticut, it's unaffordable for physicians to accept the current HESP rates. If the physicians in Anne's community were paid a fair market price, she would have been able to get timely appointment in her own community and would not have incurred the cost of an urgent care center, the cab ride, and she would not have missed 3 days of work wages and all the financial woes that creates for someone who's in her situation. Anne's story is just one of many illustrating urgent need for systemic reform. By investing in fair reimbursement rates and prioritizing community-based healthcare, we can ensure that individuals like Anne receive the timely access to healthcare they deserve. Thank you so much for this opportunity, and I'm happy to take questions if you're taking any.
Thank you, Doctor, for your testimony tonight. Next, we'll hear from Judith Nodwell.
Good evening, Senator Lesser, Madam Chair, and members of the committee. My name is Judy, and I'm a proud nurse coordinator of the Child and Family Agency of Southeastern Connecticut's Urgent Crisis Center in New London. I want to begin with a deeply heartfelt thank you to every person present today and to all who have made the UCCs of Connecticut possible. It is an honor to care for our at-risk youth and a privilege to be a part of this initiative that is truly changing the way mental health care is being delivered to our youth and their families. For the past 13 years, I've been caring for children and adolescents at the inpatient level of care. I found myself processing with my patients the trauma of their ED stay for quite some time before we could even get to the question, what brought you to the ED? While the inpatient level of care is so necessary for some, I found myself seeing how damaging the exposure of an inpatient unit was for other children. A depressed and lonely 13-year-old is admitted to the psychiatric inpatient unit. leaves with an eating disorder, a new way to hide their cutting, or perhaps having been groomed for human trafficking. I have seen all of these situations. Children who become known as frequent flyers, where an inpatient stay has become routine, largely in part because they never connected to or completed their aftercare referrals. A well-intended system full of well-intended professionals doing the best they can and not getting the desired outcomes. There was a clear systems issue, and the urgent crisis centers is the brilliant solution. To those who conceptualize this, you have my sincerest admiration. I wish I could say I thought of it. At the UCC, we're providing a level of care that utilizes evidence-based risk assessment in an environment where our clients are treated as the priority. The UCC promises to aid in preventing some children's mental health from progressing and avoiding a psychiatric inpatient stay altogether. As a new facility, I explained to our families that we exist because the mental health crisis for children is real and they're not alone. It's beautiful to watch the shame and embarrassment leave them, knowing them they're not the only ones struggling. The UCCs are helping to eradicate stigmas often associated with seeking mental health. This in itself is healing to these families. In these 13 years as a psych nurse, I've lost 14 children to death by suicide and high-risk behaviors, 14 preventable deaths of children who sought professional help. These are the ones I know of. 14 children, 14 families, 14 communities have suffered tragic losses. My coworkers and I have grieved too many lives lost. The trauma and losses have made me question my choice to become a nurse many times. We try to remind ourselves that we're part of the solution and not part of the problem. And for the first time in my career, I feel that to be true. I am so proud to be part of the solution. Following an inpatient stay, we would discharge our children with referrals and hope that they connected to care. At the UCC, we discharge our children with referrals and follow up with them every day until the families are connected with care. We are ensuring that our stressed and tired caregivers have the support they need to prevent recidivism in a setting conducive to children. Most recently, a young child on the autism spectrum with his delayed speech so beautifully exclaimed, "This is a cool hospital. It's comfy here." I am pleading with the state to commit to adequate ongoing grant funding, $12.5 million for the 3 community-based UCCs, so that the UCCs can continue to be a part of the solution to the children's mental health crisis, to continue serving our at-risk youth in a safe environment, and so that I never have to know the number 15. Thank you for your time and consideration.
Thank you for your testimony tonight. Next, we'll hear is Alaneth Ventura on? Don't think so. Is Bruce Baxter on? Is David Weinrep on? Yes, David is on.
Yes, I am here.
Please go ahead.
Thank you. Good evening. My name is Dave Weinreb. I'm a bilingual educator, community organizer, and LGBTQ advocate from New Haven. I'm also the co-chair of the Ward 14 Democratic Town Committee. I'm a documented insured patient of my local federally qualified health center, Fairhaven Community Health Care. I stand in strong support of HB 5048. If this bill is passed, we have the opportunity to invest in the success of our newcomer families, which I want to speak to, increase access to gender-affirming care for undocumented LGBTQ youth, which is sorely needed, and strengthen the overall health and wellness of our neighborhoods, not just our undocumented population. I've been working as an educator, working with new immigrant students since 2010. While working at the Fairhaven School, which is just 5 blocks from my current home, here in the Latinx majority community of New Haven, I was privileged to teach 5th and 6th grade Spanish-speaking newcomers, many of whom were undocumented children from Guatemala, Mexico, Ecuador, and the Dominican Republic. They're brilliant young people with incredible life experiences and families who care deeply about their children's education, health, and well-being. They and their families also have tremendous unmet needs, neglected and exacerbated by the inability to access healthcare. Many have experienced significant trauma in their journeys, and if their mental health challenges are not addressed, they distract and derail students and their families from academic success. Many also suffer from a variety of untreated chronic medical conditions, and the symptoms and pain of which impact students' attention, attendance, and of course their health. I've worked with parents who are trying to access healthcare, but their provider options and the services and medications are limited or prohibitively expensive, appointments are sparsely available, concern regarding documentation discrimination pervades. The consequence is that families of our children, some of the strongest, most persistent people I've ever met, struggle to succeed. I'm also the founder and lead organizer for the City of New Haven LGBTQ Youth Task Force. Through this work, we've learned the many challenges faced by LGBTQ identifying teenagers as well as their families in schools and outside, including their ability to identify welcoming providers and access gender affirming care. Building LGBTQ affirming schools is not enough. Until undocumented LGBTQ teens and their families are able to access Husky, many will struggle mightily to survive and cannot access the variety of services and supports they need to thrive in their schools, in their homes, and in their communities. We can work to fix this. We can pass HB 5048. We can help teenagers and their families access the mental health services as well as the regular, consistent medical care that they need. We can pass this bill. We can help undocumented LGBTQ youth access the resources and advocacy they need to lead healthy, open, safe, and meaningful lives. I support the passage of this bill, and I ask the committee to support and pass this legislation. Thank you for your time.
Thank you for your testimony tonight. Next is Olivia Rinks on? Yes.
Yes. Hi. Yes. Thank you. Thank you and good evening to the Appropriations Committee for the opportunity to testify. My name is Olivia Rinkus. I'm a resident and taxpayer of North Stonington, Connecticut. I'm also a student at the University of Connecticut. I would like to testify tonight in regards to HB 5048 and actually adjusting the state budget for the biennium ending June 30th, 2025. With respect to the human services agencies, specifically the Department of Social Services, which administers Husky, Medicaid, and CHIP, I would like to speak in support of funding an increase in the eligibility for the Husky Medicaid program, and also to request funding for Husky eligibility for all income eligible Connecticut residents, regardless of their immigration status, up to age 18. With the assurance that these should include dental and mental health care services in addition to physical health care. Healthcare is a human right and crucial to the health and success of Connecticut's residents and communities. Healthcare needs do not end because of age and immigration status, and legislators need to prioritize ensuring a future pathway to extending Husky eligibility to all income eligible Connecticut residents, even those over 18. Also, in regards to the human services budgets, I would like to voice my support for the repurposing of the money saved from the closure of Connecticut carceral facilities into the budgets of for human services, specifically for the use of reentry services to those who have experienced incarceration, into reintegrating upon their release, as well as into other non-carceral and non-police public services essential to community health, with a priority for those serving communities that have been impacted by over-policing and mass incarceration. As a taxpayer, I want to see my tax dollars going to the care and support of my fellow Connecticut residents and communities. Thank you so much for the opportunity to testify.
Thank you for your testimony. Is Milagros Lostanaudo on? No.
Milagros Lostaunado.
So, Mr. Chair, we have an iPhone that we just promoted, and perhaps that is.
¿Me escuchan? ¿Me escuchan?
Sí.
Can you hear her? Yes.
Okay. Presidentes y miembros del
Adelante.
comité. Okay. Presidentes y miembros del Comité de Apropiaciones, muy buenas noches. Mi nombre es Milagros Lostaunado, soy residente de Hartford e inmigrante y miembro de Hartford Deportation Defense. Gracias por darme la oportunidad de poder testificar con respecto a la ley de ajuste de presupuesto del estadio para el bienio que se realiza. Con respecto a los presupuestos de agencias de servicios humanos, específicamente para el Departamento de los Servicios Sociales, como es Husky y Medicaid y SHIT, hay prioridades importantes que se financian en el presupuesto del gobernador para las agencias de servicios humanos. Estoy aquí para hablar en apoyo de la financiación de un aumento de la elegibilidad para el programa de Medicaid Husky y pedir al comité para financiar la elegibilidad Husky para todos los residentes de Connecticut que cualifican basado en sus ingresos, independientemente de su estatus migratorio hasta los 18 años. Puesto que cuando yo estaba embarazada di positivo a tuberculosis. En realidad todavía estoy esperando para el tratamiento, ya que aún no he recibido, he llamado y todo, pero no he recibido respuestas a eso. E incluso los médicos me han sacado prueba de sangre para volver a, para que pueda saber si sale, por si acaso, si sale negativo, pero aún así sigue saliendo positivo y la verdad que es muy difícil ir a estas citas porque te sale mucho, bueno, sale demasiado caro y yo no tengo tanto dinero para poder pagar y temo también que mi salud corra en peligro, más aún que yo tengo un bebé de 1 año y 2 meses. Tengo facturas muy elevadas de los servicios ambulatorios de salud para mujer del hospital de Hartford. Si tuviera seguro médico me sentiría un poco mejor, ya que todos sabemos que la tuberculosis es muy peligrosa y si no puedo recibir el tratamiento adecuado, me puede pasar algo y es muy lamentable porque tengo un bebé al cual tengo que cuidar y alimentar. También no he podido ir al dentista, en realidad eso está desde que llegué acá, no pude ir al dentista porque también es un poco costoso para mí. Y el acceso a la atención sanitaria es una cuestión de salud pública. Si nuestros hijos en el instituto no tienen seguro, sus compañeros tampoco están sanos, así que no estamos sanos con nuestros vecinos. Por lo cual pido al Comité de Apropiaciones que financie la expansión de Husky para todos los residentes de Connecticut que califican basado en sus ingresos, sin importar su estado migratorio hasta los 18 años, y que se cree un plan de largo plazo para cubrir el acceso de todos los inmigrantes, independientemente de su edad. La necesidad de salud no termina a los 15 o a los 18. Gracias por su tiempo.
Chairs and members of the Appropriations Committee, my name is Milagros Lostanaudo, and I am a resident of Hartford. I am an immigrant and I'm a member of Hartford Deportation Defense. Thank you for the opportunity to testify regarding HB 1548, an act adjusting the state budget for the biennium ending June 30, 2025. I am here to speak in support of funding the expansion of the Husky Medicaid program to include all Connecticut residents who qualify based on income, regardless of immigration status, up to age 18. When I was pregnant, I tested positive for tuberculosis. I still have to continue the treatment for it. The doctors keep testing me and want to take my blood test, but it's very hard to get follow-up appointments because I cannot afford the bills, and I'm afraid that my health is in danger. I have a 1-year-old and I cannot leave him behind. I have been calling and it's very hard to reach them. I don't have the money, and I still need to check if I'm positive for tuberculosis. It's very dangerous, and I still haven't even been to the dentist yet. If I had health insurance, I would be better. It's hard to have tuberculosis and not have access to medical care and not know if I can get the right treatment. If I had health insurance, I could take better care of myself, go to the dentist. I haven't been able to. Healthcare access is a matter of public health. If our kids in high school don't have health insurance, their classmates aren't healthy either. We're only as healthy as our neighbors. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future, to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you so much for your time.
Thank you for your testimony. Is Emma Vilcamiche on? No. Is Michael Taylor on? Michael? Michael, can you hear us? Okay, Sandra Trigueros. Carla Valentina Diaz Estrada. I still see Michael on. If Michael is there, he can go, but no. All right. Carla? Carla, you have to accept the promotion. This will go much faster. We've got 100 and some people waiting to testify, so it'll all go much faster if people accept their promotions. Okay, is Tanisha Signora?
I'm here.
Okay. Please go ahead.
Okay, thank you, members of the committee. My name's Tanisha Signor. I'm the policy director for She Leads Justice, formerly known as QUELF. We are members of the Husky for Immigrants Coalition. Thank you for the opportunity to testify regarding HB 5048 today with respects to the budgets of human services agencies, specifically Department of Social Services, which administers Husky. First, we would like to voice our support of a funding increase in eligibility for Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents up to age 18, regardless of immigration status. Policies which expand Connecticut's Medicaid programs have a positive impact on communities, and costs are minimal compared to the positive long-term health and economic impacts. In the last 3 years, Connecticut has expanded Husky coverage to undocumented children ages 0 to 15 and to undocumented pregnant people, prenatal and postpartum. These policy changes are already having a positive impact on our state. Health coverage means access to preventative care, leading to a healthier state, lower uncompensated care costs for hospitals, and lower healthcare costs overall for our state, thus demonstrating that these expansions are not only good policy practice, but also economically sound. She Leads Justice's legal education program serves over 1,000 clients per year, the majority of which are low-income women of color with one dependent. Some of the clients we serve are undocumented and come to us with questions about housing, workplace issues, their immigration status, and more. Since many of them are parents, some of our clients who are undocumented will be faced with the challenges of having their children grow out of the program and become uninsured again once they hit the age of 15. Others will have to deal with the reality of having only some of their children insured through the Husky program and others uninsured due to their age. We stand in support of funding Husky eligibility for residents up to 18, regardless of immigration status. However, our long-term commitment is to continue fighting to ensure that all immigrants, including parents and adults, have access to the health care they need. This is because we know healthy kids need healthy families. Investing in Connecticut families serves as an investment in the future of Connecticut and will substantially reduce healthcare costs for all members of our state. Second, we respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky A income eligibility requirements for parents and caregivers, and the reversal of fully raising the Husky C income eligibility limit. The fight for health justice is not siloed, and we recognize that Husky coverage is essential to achieving health equity. Significant gains have been made to the Husky program over the last few years to cover more people, and those gains should be protected, not diminished. Connecticut is one of the wealthiest states in the wealthiest country in the world, with a budget that is currently running a surplus. Our state's policies should prioritize strengthening the safety net for people who need it the most. Thank you for your time.
Thank you, Ms. Signor, for being here today.
Thank you.
Thank you. Next, we're going to go back to 139, Carla Valentina.
Hello, good evening everyone. My name is Valentina Diaz and I'm a student at Gateway Community College and a member of Connecticut Students for a Dream, an organization that fights for the rights of undocumented youth and their families. Thank you for the opportunity to testify regarding the HB 504A, an act adjusting the state budget for the biennium ending June 30, 2025. With respect to the budgets of the human services agencies, especially for the Department of Social Services, which administer HUSC, Medicaid, and CHIP, there are important priorities being funded in the governor's budget for human services agencies. I'm here to speak in support of funding an increase in eligibility for the HUSC Medicaid program, and ask the Appropriations Committee to fund HUSC eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18. A little about me. I'm from Colombia and I came to the United States alone in May 2021 due to the wars and drug trafficking that I was experiencing there. I came to the United States in search of a better opportunities and a decent life with no fear. When I arrived to the US and felt the security of being able to walk without having the anguish of thinking that you are gonna get kidnapped or harmed, I felt free. But not having health insurance affects both my mental and physical health. For 3 years, I have found myself having to resort to non-safe methods such as self-medication, trying to avoid to go to the hospital for fear of not being able to pay the bill. Unfortunately, I am not the only one who is in the same situation. Many immigrants in this country and Connecticut do not have access to medical care simply because they do not have a social security number. This is very unfair because access to good health is an undeniable right for all human beings, regardless of where you come from or where you were born from. I asked to the Appropriations Committee to fund HUSC eligibility for all income eligible in Connecticut residents, regardless of immigration status, up to age 18 this year, and into the future create a long-term plan towards opening access to all immigrants regardless of age. Healthcare needs do not end at age 15 or age 18. Thank you for your time.
Thank you, Ms. Diaz Estrada, for your testimony and your time. We're going to go back to Michael Taylor. Are you with us?
Yes, I am. Can you hear me?
Yes, go right ahead.
Oh, wonderful. Thank you so much. My name is Michael Taylor, and I am the Chief Executive Officer of the Cornell Scott Hill Health Center. Thank you so much to the members of the committee for the opportunity to comment regarding the human services provisions in our state budget. On behalf of Cornell Scott Hill Health Center, I want to thank the committee also for its dedication to listening to Connecticut residents regarding these important matters. Founded in 1968, the New Haven-based Cornell Scott Hill Health Center is Connecticut's oldest community health center and is now the state's second largest, serving more than 55,400 greater New Haven residents annually. One distinguishing characteristic of the Cornell Scott Hill Health Center is that we are as significant a provider of mental health and addiction services to all ages, as we are a leading provider of primary medical specialty, and dental services. With that, we have amassed internal capacity and expertise that allows us to provide whole person, patient-centered, integrated care. What's more, approximately 61% of our patients are covered by HUSC. And with that, in 2023, we served more than 34,000 HUSC patients from across Connecticut. Cornell Scott Hill Health Center is deeply committed to providing access to high-quality care for all, including HUSC patients. To achieve that, however, we respectfully recommend that the committee consider the following. First, increasing Medicaid rates. Cornell Scott Hill Health Center recognizes the legislature has ordered a Medicaid rate study, and that health centers are included in phase 2 of that study. However, having conducted research on the gaps between rates and allowable costs, as well as the rates paid by comparable states, we believe the FQHC portion of the rate study is already complete. Rates must be raised immediately to preserve and protect patient access to care now and in the future. As shown in the attachment to my presentation, which was previously submitted, Connecticut health centers have a large gap between the rates and allowable cost. That allowable cost as determined by the Department of Social Services. On average, health centers lose $84.57 for each medical visit and $121.76 for each dental visit we provide to Husky recipients. As a result, in aggregate, health centers lost over $75 million in 2022 for these two services alone. In 2023, our health center experienced a gap of $54.22 every time we provide a medical visit, and $90.23 each time we provide a dental visit to a Husky patient. Although comparable Medicaid rates across the states is imperfect, or comparing rates across the state is imperfect, CT's average Husky rate of $163.37 per medical visit is one of the lowest in the country and the lowest of all New England states. Because such a large percentage of our patients are on Husky, these low rates have a direct line impact on access to care, as they negatively impact our ability to hire and retain providers and other staff who are essential to maintaining patient access. As some of you might know, the workforce shortage among healthcare workers has only increased over the past 3 years of the COVID-19 pandemic. The shorter supply of workers has dramatically increased competition for staff, and with that, the cost of recruiting and retaining them. This is particularly true for primary care providers and nurses. And the public's need and actually demand for behavioral health providers has never been higher, and that too has increased competition and compensation quite dramatically for these professionals. Succinctly stated, we simply cannot maintain and certainly can increase patient access unless we are paid rates that are sufficient for us to pay competitively. I urge the committee not to wait another year for another study, and instead to raise rates immediately for a total of $75 million that will cost the state about $30 million. We would be pleased to engage in discussion around a phase-in of higher rates if necessary. However, immediate action is necessary for health centers to maintain fiscal solvency that enable patient access.
Thank you, Mr. Taylor. We do need you to wrap up.
Okay. The second request is to change implementation date of the Medicare Economic Index, which is a quasi cost of living increase, but far below the actual inflation rate. With that, we encourage the committee to consider, or the legislature to consider implementing that earlier in January.
Great.
Thank you very much for your consideration, and we greatly appreciate the opportunity to testify.
Thank you so much for your testimony and your time tonight.
Thank you.
Next, we'll go to Sandra Trigueros. Are you with us? Sandra, if you are with us, you're on mute. Sandra Trigueros? There you go.
Yes, I'm here. Thank you.
You're welcome.
I'm a little bit nervous. All right. Well, thank you for, I'm gonna be talking in Spanish. I don't know if there's any traduction people there that...
Yep. Margot, are you with us?
Sí, estoy aquí.
Ok, gracias. Muy buenas noches, presidentes y miembros del Comité de Apropiaciones. Mi nombre es Sandra Trigueros, soy de West Haven. Quiero dar las gracias por la oportunidad de testificar con respecto a la ley HB 5048. Adjusting the state budget for being ending June 30th, 2025. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky. ¿Me puede decir si continúo leyendo o...?
Puedes continuar, corazón.
Ok, gracias. Como sabemos, ¿verdad? Hay prioridades más importantes como la que estamos viviendo en este momento, que es el no tener un seguro médico, podamos tener seguro médico todos. Y me preocupa mucho saber que quieren cortar ya lo que se ha logrado hasta este momento. Yo como inmigrante que no tengo seguro médico, con muchas condiciones médicas, me estresa mucho saber que hay mucha gente como yo que no puede tener acceso a un seguro y todavía sabiendo que quieren cortar lo que se ha logrado hasta el momento. Es muy difícil. Yo desde hace 15 años fui diagnosticada con una enfermedad crónica y mi vida no es fácil. Desde todos esos tiempos cada vez se complican, más por el hecho de no poder atenderme, ¿verdad? Creo que todos tenemos derechos a recibir tratamientos dignos para poder llevar, ¿verdad?, nuestra enfermedad dignamente. Y pido al comité y Appropriations que financie la expansión del programa Husky para todos los residentes de Connecticut, que califiquen por sus ingresos independientemente de su estatus migratorio hasta los 18 años este año. Y en el futuro poder crear un plan a largo plazo para expandir a todas las edades. Creo que la salud no se terminan a los 15 o a los 18 años. Muchas gracias por su tiempo.
Good evening, chairs and members of the Appropriations Committee. My name is Sandra Trigueros. I am from West Haven and part of Semilla Collective. It worries me as an immigrant with a lot of health issues that a lot of people are going through the same thing as me. It's very hard knowing that they want to limit the help we can get. So thank you so much for the opportunity to testify regarding HB 5048 and act adjusting the state budget for the biennium ending June 30th, 2025. With respect to the budgets of the Human Services Agency, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. I am a Guatemalan immigrant without health care with many health conditions due to the fact that I don't have access to medical insurance. I was diagnosed with a chronic disease 15 years ago and my life fell apart because I couldn't get the care I needed. And now, after so many years, my condition has gotten worse and I undergo new complications daily. I know that like me, there are many, many more. It will help me so much to have access to decent treatments to carry my illness with dignity. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future to create a long-term plan towards opening access to all immigrants regardless of age. Healthcare does not end at age 15 or age 18. Thank you so much for your time.
Can you please tell her thank you so much for being here and for sharing your experience?
Muchísimas gracias por estar aquí y compartir su historia.
Gracias a ustedes por permitirme hablar.
Thank you guys for allowing me.
Next, we'll hear from, or is Marlene Ciccarella with us? Marlene Ciccarella? All right. How about Litzy Chacon? Is Litzy Chacon with us? There you
Hello.
are. Hi.
Chairs and members of the Appropriation Committees, my name is Litzy Chacon and I am from an immigrant family from Danbury. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th on 2025. With respect to the budgets of the Human Service Agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human service agencies. I am here to speak in support of funding an increase in the eligibility for the Husky Medicaid program and ask the appropriation committees to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to the age of 18. I, Leticia Cohn, a proud daughter to immigrant parents, I care about this because everyone deserves to have access to health insurance no matter their status. Recently, I had to go through a life struggle where my parents went through horrible hospital debt while my father had to struggle with his health and had to go through a surgery so he can improve his health. The thought of losing a parent is a nightmare that no kid should be worrying about at a young age. As I go through everyday life, I see the same struggle within my community, not having access to health insurance. Children at a young age get sick but can't get the proper attention just because of their status. They come to this country alongside their parents for a better future, which includes better health care, but it isn't being given to them. So why take privileges away from innocent people? Your hearts aren't feeling anything. Children's lives are at stake. Within this new economy, it became more of a struggle with medical bills skyrocketing for a small family who make just minimum wage. Many people dare to say, well, you should make more money, but yet they don't realize that status plays a big role in what I like to consider a game. Danbury has a vast number of immigrants, over half of whom live without health insurance. We the people should have many rights, but just because we come from an outside place, we don't. All we ask is to get coverage for all. Having access to healthcare in my community will enable children and teenagers to live healthy lives. Many immigrant children suffer on their own, so they won't make their parents go through more. But why have this happen to young children who have a whole life ahead of them, where they can strive and look back one day and realize that they got the future they came for? A life where they can run endlessly, knowing that if anything happens, they can get medical attention. The worry is not only lifted off their parents' shoulders, but also their small bodies. A small mind can understand more than we think. So why make them understand that they are so-called, in quoted, unfit for insurance? Health insurance and care shouldn't end at a certain age. It should be lifelong. I ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare does not need to end at age 15 or age 18. Thank you for your time.
Thank you, Ms. Chacon, for your testimony and your time tonight. Next, we'll hear from Sabrina Trokici. Are you with us? Sabrina?
Yes.
Great. Go right ahead.
Great. Good evening, chairs and distinguished members of the Appropriation Committee. I thank you for the opportunity to speak this evening. My name is Sabrina Troki, and I am the President CEO of Wheeler Clinic. Wheeler is a community behavioral health provider and a federally qualified health center. As a community behavioral health provider, we contract with every state agency in Connecticut that provides health and human services. We offer child welfare, foster care, mobile crisis, intensive community-based and in-home behavioral health services, early childhood, community justice, special education, and prevention and wellness programs. These programs on an annual basis serve over 40,000 children, families, and adults across Connecticut. As a community health center, Wheeler offers comprehensive integrated primary care, mental health, substance abuse, and many other services through our health centers in Hartford, New Britain, Bristol, Waterbury, and Plainville. These centers serve over 20,000 children and adults, some of the most vulnerable, medically underserved populations in our state. Approximately 80% of all of our patients are on Husky, our state Medicaid program. Wheeler is so deeply committed to providing equitable access to high quality care for all of our patients, including our Medicaid patients. But this is increasingly becoming difficult for us to do. Our Connecticut Medicaid rates, our state grant program, which currently in fiscal year 25 is projected to get a 0 cost of living increase, makes this very difficult for us to continue. I've provided written testimony that has a lot more details, but I do want to touch on a few areas that I respectfully recommend the committee consider. One, increase Medicaid rates. Several of my colleagues have talked about the the Medicaid rate study and how health centers are included in the second phase of the study. However, health centers have already done, we've conducted research and we've looked at the gaps between rates and allowable cost. And as part of this, we compared our rates to our peer, a number of peer states. What you will find from the data, and I did attach the data from that to my testimony, that comes to no surprise to us as providers, but our Medicaid health center rates are the lowest in the country, including being the lowest in New England and the rest of the Northeast. This comes to absolutely no surprise to us. Our rates today are based on 1999 cost reports and were established in 2001. That's 23 years ago. No surprise at all to us. Our low rates are unsustainable and are negatively impacting patient care. I urge the committee not to wait for the study and to raise the rates. My second request was related to our community nonprofits. We cannot proceed with a 0% cost of living increase for fiscal year 25. We're asking for a 5% increase. I thank you for your time and for your consideration.
Thank you, Ms. Trokey. Thank you for staying and being there. Next up is Garrett Dolan. Is Garrett with us?
He went already, Madam Chair. With the
Oh,
panel.
thank you. Next, Rosanna Ferraro. Is Rosanna Ferraro with us?
I am in person tonight. Thank you.
Great.
Hello, everyone. Senator Lesser, Representative Gilchrist, and the other lone legislator joining us tonight. I appreciate the opportunity to speak tonight on HB 5048, especially since it's already been a long day. I know that there have been a lot of really important issues elevated that we agree with. But first, I am Rosanna Garcia Ferraro, Program Lead for Health Justice Policy Advocacy at Universal Healthcare Foundation of Connecticut. Our mission is to accelerate the movement for health justice for everybody because health is a human right and core to social justice and equity. The president of Universal, Caprice Taylor Mendez, testified earlier today in support of expanding Husky through age 18, regardless of status, this year. This work was started when the Human Services Committee JF'd a bill to do just this last year, and we urge the committee to finish that job this year. I've been watching this hearing since 2 p.m. So many people are asking for help to keep their health insurance or to get insurance. The narrative in this building is that we simply don't have the funding. There is only a little wiggle room under the spending cap. I think I've just come here to say there is money. We say this outside the building, and I think we need to say it inside. There's money to cover all people who are income eligible for Husky, regardless of immigration status, rather than leaving thousands in our community without access to care. There's money to keep the Husky A income eligibility for parents and caregivers at 160% of FPL, rather than decreasing it to 138 FPL. There is money to keep the promise made in the 2023 budget, to raise income eligibility for Husky C to $17.89 a month rather than only $12.76. There is money to raise or fully eliminate the asset limit in Husky C rather than continue to impose it, which no other Husky program has. There is money. Don't ask us where the funding will come from, because we have answers, solutions, analyses, proposals. Ask Connecticut Voices for Children. Ask Connecticut for All. There is money. Thank you for your time tonight.
Thank you, Ms. Ferraro. Next, we'll hear from Terrell Williams.
Hello, can you hear me?
Yep, go right ahead.
Hi, hello, ladies and gentlemen of the Appropriations Committee. My name is Terrell Williams. I'm a home care worker out of New Haven. I've been working in this field for the past 13 years, and I found that I have a passion for it. I actually love caring for people. It's one of the jobs where I make the joke that I never have the Monday blues. So one of the issues that I have is that I always have to work multiple consumers and traditionally work more than 40 hours a week, but still it's hard for me to make ends meet with the current rates that we have and wages, inflation, all of that. Also, I have pre-existing health conditions. I'm diabetic, and about a year ago, when I was working, I got a letter from the insurance people, DSS, whatever, saying that I made too much money to qualify for that insurance. And so I went a few months without my insulin, and I actually lost my sight. Eventually got to the point where my consumer said that I had to go to the emergency room because if I wasn't caring for myself, I couldn't care for them. They gave me an emergency insulin supply, and after about 6 weeks, I did regain my sight. So we have the opportunity right now to alleviate that type of stress from all of my fellow workers, as well as myself and the people who we care for. There's a huge piece in this contract concerning a stipend, as well as the increase in wages that will literally increase our quality of life. So I urge you humbly to fund the home care bill contract. Thank you.
Thank you, Mr. Williams. I'm glad your site came back and that you've found your passion in this work. Thank you for being here. Is Amy Martinez with us? Yep, there you go.
Hi. Good evening. My name is Amy Martinez. I'm a resident of New Britain. I'm submitting written testimony regarding HB 5048, especially with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. In a single year, individuals with access to medical insurance visit all types of healthcare professionals, from a general doctor, dentist, therapist, or specialist, to maintain good physical or mental health or care for a serious illness. To many, it's hard to imagine a place where you couldn't seek medical attention because you lacked healthcare, and a single visit to a doctor would result in a financial burden. However, I'm a daughter of immigrant parents who, for the first 20 years in this country, lived without access to healthcare. My parents constantly sought for programs and services offered to the immigrant community, which were scarce. As time went by, they got used to ignoring their health and were forced to learn how to live in constant pain and illness. Today, both my parents are fortunate to have adjusted their immigration status and are now permanent residents, which made them eligible for health insurance. In addition, currently Husky is only accessible to undocumented children up to the age of 15. My sister is 16 years old, and had she not been born in the United States, she would have aged out of eligibility. This age limit restriction leaves many undocumented children and people without access to health insurance. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to the age of 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs not to end at age 15 or age 18. Thank you.
Thank you so much, Ms. Martinez. Next, we'll go to Scott McCall. Scott, are you with us? All right. Sheldon Tubman, go right ahead.
Good evening, Representative Gilchrist, chairs, and other members of the Appropriations Committee. I am Sheldon Tubman. I'm a litigation attorney at Disability Rights Connecticut. That's the protection and advocacy system for Connecticut, serving individuals with a full range of disabilities. I'm here to testify about the impact of certain of the provisions in or not in the governor's proposed budget on people with disabilities. First, the governor's budget proposes two large cuts to the essential Medicaid program, which will have major negative impacts on people with disabilities throughout the state. In order to make the budget work under the arbitrary fiscal guardrails he insists on following, the governor in his proposed budget is relegated to proposing to slash basic health care for thousands of low-income disabled people and older adults. The primary cut is to Husky C, the Medicaid program only for disabled and older adults. It currently has an income limit of $12.11 a month, far below any other of the Medicaid Husky programs. Last year, however, because of awareness of the discrimination against disabled and older adults in our Medicaid program, the legislature ended the discrimination against them in terms of income eligibility. Effective October 1st, 24, the income limit for Husky C under the law signed by the governor will be raised to about $17.89 a month. But before the benefit of this essential change is even implemented, the governor proposes to take it away, arguing the amount he budgeted for the change is not enough to cover the cost of the increase signed into law. And rather than fix the math to correct his budget office's error, he proposes to change the law to match the bad math, allowing only a tiny increase in the income limit in October and reinstating the discrimination. What are the consequences of this? I urge you to take a look at the testimony by Brenda Moore from New Haven, a client of mine, explains in detail what she will lose. 51 hours of PCA services will disappear if the governor is successful here. The governor also proposes to severely cut the Husky A program by terminating for Medicaid coverage all adults with incomes over 138% of the poverty level. This cut will particularly harm older and disabled adults losing healthcare coverage. I know the governor's budget director and the DSS commissioner have both said, oh, they would not lose coverage, and they basically get the same coverage on the exchange and covered Connecticut. That is just not true. There are many services not covered under the exchange plans with or without covered Connecticut relative to Medicaid, such as the critical Community First Choice program that provides PCA services needed to avoid institutionalization. There are broad federal rules protecting access to the extent of services that don't apply outside of Medicaid. And the health plans on the exchange are run by insurance companies, which apply much more extensive prior authorization. So as a practical matter, coverage is substantially harder to access if you need any kind of expensive care, even from a willing provider on the exchange. More to the point, as noted by others, for somebody on Husky A who was also over 65 or disabled and on Medicare, there are no federal subsidies. There is no covered Connecticut. They will lose all access to all Medicaid services not covered under Medicare. Also, the government proposes not to address the continuing discrimination against elderly and disabled people under Husky C in terms of the asset limits. None of the other Husky programs, as you heard, have any asset limits at all. The asset limit at Husky C is extremely harsh. The governor's budget also fails to address the abysmally low Medicaid payment rates for certain providers. Of course, there's the interim study that came out, but the governor proposes to do nothing meaningful until the second report comes out, which of course will be too late for the season. It's the second year the study was used. The idea of a study was used to delay any action, any meaningful action. It's sort of like Lucy and the football here. Lastly, the governor's proposed budget makes no allowance for the small additional costs needed to adjust the Medicaid coverage rules to allow for more expeditious repairs of custom wheelchairs for the 5,000 or so Medicaid enrollees who use such devices, or to ensure that there's a state agency, possibly DSS, empowered to enforce the proposed new deadlines for assessment and repair of wheelchairs as recommended by the groundbreaking Wheelchair Repair Task Force in its February 1st report. And I did want to thank you, Representative Gilchrist and Senator Lesser, for making that task force possible. Thank you for the opportunity to speak with you so late this evening. Appreciate it.
Thank you, Sheldon. Good to see you. Next up, Leslie Blateau.
Good evening. Greetings, chairs and members of the Appropriations Committee. My name is Leslie Blateau. I'm a teacher and parent in New Haven Public Schools, and I'm the president of the New Haven Federation of Teachers and Pre-K-12 Divisional Vice President of AFT Connecticut. I'm also a member of Connecticut for All. I live in New Haven, and I'm here today to testify regarding HB 5048. First, I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18. Any expansion to our state Medicaid program has a positive impact on communities, and the cost of this program expansion is minimal compared to the long-term health and economic impacts of this policy. The issue is important to me as an educator and a parent for many reasons. First and foremost, healthcare is a human right. In my international issues class, we discuss Article 25 of the Universal Declaration of Human Rights, and we acknowledge the fact that we fall short as a state and nation on providing medical care to our residents. As educators, we know that access to health care is a key factor in improving student attendance and promoting positive growth for our students at school. We should be working together to remove barriers to care to ensure our students and their families have what they need to live healthy lives, attend school, engage in learning, and thrive in our communities. We know that access to preventative health care saves lives. Lack of access prevents immigrant residents from early treatment, increasing the chances of their health conditions developing and worsening. The current gap in Husky eligibility, which cuts off at age 15, makes too many of Connecticut's immigrants much too vulnerable, further exacerbating existing disparities in healthcare access. And let's talk more about that gap. The policy decision that prevents our immigrant students 16 years and older from accessing Husky. I represent hardworking educators in New Haven who see the impact of this decision that prevents our students from accessing healthcare. This lack of access shows up in a range of ways that interferes with our students' ability to attend and fully engage in school and live the lives that children should be able to live. In addition, New Haven is a proud sanctuary city. Our public schools welcome students and families from around the world and seek to provide them with the necessary support to help them belong, learn, and thrive. We rely on our partnerships with medical care providers and your legislative body to ensure that we meet the needs of the whole child. This means we must fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18. In addition, I respectfully urge the Appropriations Committee to oppose the governor's proposed budget items to reduce Husky A income eligibility requirements for parents and caregivers, and the reversal of fully raising the Husky C income eligibility limit. My written testimony says more on that, and I'll close here. Connecticut is one of the wealthiest states in the wealthiest country in the world with a budget that is currently running a surplus. Our policy should prioritize strengthening the safety net for people who need it so our state can become more equitable and all CT residents have the opportunity to thrive. Thank you for the opportunity to testify tonight. I appreciate the work that you're all doing and wish you well.
Thank you, Ms. Plateau. So good to see you.
You as well.
Next up, Lorena Martinez.
Chairs and members of the Appropriation Committee, my name is Lorena Martinez. I am from Norwalk, Connecticut, a daughter of immigrants, a proud supporter of Connecticut's immigrant community, and a master's in social work student from the University of Connecticut. Thank you for the opportunity to testify regarding House Bill 5048. I'm here to speak in support of increasing eligibility for the Husky Medicaid program for all income eligible residents, regardless of immigration status, up to age 18. As previously stated, I am a daughter of immigrants and stand for my community, consisting of families and friends who are immigrants or children of immigrants. Throughout my life, I have worked closely with immigrants through volunteer or community-based work. My experiences have given me insight into how vital access to healthcare is for undocumented immigrants. I have volunteered as an interpreter at a healthcare clinic in Connecticut that offers free primary healthcare and, where possible, free secondary and tertiary care. This clinic has saved lives, supported the well-being of families and individuals, and reduced emergency room visits and the costs incurred at local hospitals. However, I know this access to healthcare is only available for some in the state. I have seen all too often parents who have become ill without the ability to go to the doctor, people living with chronic pain, unable to access care to manage the pain, and people who have to endure terminal illnesses without any support, all because they are not eligible for health insurance, which in theory is a human right that in reality we do not abide by. Undocumented immigrants, who I do not believe should be labeled as such, are an essential part of our state's community. They are our friends, neighbors, those who care for our children, and those who provide the vital services we depend on. These members of our community are law-abiding and pay the very taxes that fund Husky. Access to healthcare is a fundamental human right and should not be denied due to someone's legal status. As the World Health Organization declared, every human being has a right to the highest attainable standard of physical and mental health. Countries have a legal obligation to develop and implement legislation and policies that guarantee universal access to quality health services and address the root causes of health disparities, including poverty, stigma, and discrimination. According to the American Medical Association, providing access to health care to all individuals, including those who do not have legal status, is economically savvy and keeps society healthy. It diminishes the burden of illness and prevents higher costs to the community. Providing health insurance would control infectious and communicable diseases and keep individuals healthy to continue contributing to our society. In sum, providing Husky would be a win-win for all. We would have a healthier and more active society that would prevent and address diseases, leading to healthier outcomes and positive economic benefits. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future, to create a long-term plan towards opening access to all immigrants irrespective of age. Thank you for your time and consideration of this critical issue.
Well done, Ms. Martinez. Always great to see a fellow MSW. Next up is Tina Yeats. Is Tina with us?
I am. How are you?
Good. Oh, you're coming up. There you are.
Yes, here I am. Good evening, members of the committee. Thank you for your time tonight. My name is Tina Yitz, and I'm the administrator at the Eliza Huntington Memorial Home located in Norwich, and I'm also the president of the Connecticut Association of Residential Care Homes. I'm here today to support the governor's added funding for residential care homes while urging the legislature to ensure all homes receive an increase in their rates. Specifically, I want to urge you to provide funding to residential care homes for inflationary increases. Despite the efforts to invest in residential care homes by allocating $5.2 million to the industry, many homes like mine did not receive any rate increase for the current fiscal year. This is because DSS opted to use the funds to support a rate rebasing using the 2022 cost year. This is a cost-based reimbursement system that caps inflationary costs in many categories, such as food. So while my facility spent about $20,000 more in food year over year, DSS caps that at 7%. So they only acknowledge that 7%, and it's as if the other 25% didn't happen. So that gets disallowed and doesn't count towards the rate rebasing. As an industry, we were thrilled to see that there were finally monies allocated in the governor's budget, and we thank this committee deeply for hearing from us year after year. That being said, unfortunately, the way the funds were allocated, only a fraction of the industry saw these benefits, which I don't believe was the intention when it was allocated. It is our understanding that only about $3.7 million was used for the rebasing, but the remaining funds did not get put into the industry. They were put back into the general fund. For 10 years, there has been a rate freeze for residential care homes, meaning that we had to operate within our means. It has been extremely challenging, but we have had to make do. Unfortunately, paying employees the necessary wages to attract new people to our industry is almost impossible, resulting again in higher turnover. Now with the minimum wage changes, it is harder and harder to get good people and keep good people. Our industry strives to employ people in long-term careers so they can establish and maintain relationships with our residents. We know that this leads to better long-term health outcomes, stability in their homes, and savings for our state. The inconsistent funding also challenges our operations. We are constantly having to make repairs that are subject to state inspections and yet have virtually no margins to do so. For this reason, we strongly support efforts to inject additional capital into residential care homes. We provide critical services for our state and care for some of the most vulnerable people in it. And we do this for a very low cost. My home and other residential care homes throughout the state have had to get by with rates failing to keep up with costs, and yet we serve as a safety net for the frail and the elderly. So I thank you for your time. Have a great evening.
Thank you, Ms. Yitz, for being there and for your testimony tonight. Next up, Lorenza Perez Aguilar. Are you with us? Lorenza?
Not on, Madam Chair.
Nope. Okay. Moving on to Xochitl Guillen.
Doesn't appear to be in the room or online.
Okay. Thank you. Eva Oseguera. All right. Okay. Sean McCuster. All right, then Liz Gustafson, you're up.
Hi, good evening, chairs and members of the Appropriations Committee. My name is Liz Gustafson, and I am the Connecticut State Director of Reproductive Equity Now. Reproductive Equity Now works in Connecticut and across New England to make equitable access to the full spectrum of reproductive health care a reality for all people. It is imperative that we continue building on progress made towards health equity and respectfully ask the committee to fund Husky eligibility for all income eligible residents, regardless of immigration status up to age 18. The ability to care for ourselves and provide a better life for our family should not be dependent on immigration status. We are grateful for the ongoing leadership of the Connecticut General Assembly to expand Husky access for young people, as well as pregnant and postpartum adults, as our policies have already had a positive impact, covering approximately 8,000 children and pregnant people. At the same time, in order to achieve true reproductive equity, we must also break down barriers that prevent our communities from accessing all types of healthcare. One of the key tenets of reproductive justice is ensuring that we are able to raise families in a safe and dignified environment. That means ensuring all of our children are able to access the healthcare they want and need. That means ensuring all parents are able to access the healthcare they want and need. And that means ensuring Husky for all people, regardless of immigration status. Ultimately, we want to work towards a future of health coverage that treats abortion and sexual and reproductive health care no differently than it does any other preventative, critical, and life-affirming care. As legislators with the responsibility of weighing and balancing the state's many budgetary priorities, we urge you to acknowledge the long-term cost savings of early treatment and access to preventative care. Investing in accessible health care is not only beneficial to the overall health and well-being of our neighbors and communities, it is also an investment in the financial future of Connecticut. Also, as state and local taxpayers who fund the state health programs, Connecticut's immigrant communities deserve an equal and fair opportunity to access the very programs that they pay for. Additionally, despite the fractured landscape of abortion access across the country and decades of unmitigated targeted restrictions of family planning clinics, providers continue to show up for their patients, and our state must show up for them. We also urge the committee to recognize the importance of ensuring family planning providers are wholly compensated for the many ways that they care for patients, and respectfully ask that the committee increase family planning Medicaid reimbursement rates for abortion services, which have not been adjusted since 2008. Reproductive Equity Now urges the committee to fund Husky eligibility for all income eligible residents, regardless of immigration status, up to age 18, and in the future create a long-term plan towards expanding access to all immigrants, regardless of age and documentation status. Thank you so much for your time and for your consideration.
Thank you so much, Ms. Gustafson. So good to see you.
You too. Take care.
Next up, Deirdre Merck.
Hi, good evening. Thank you all for hanging in there. I'm Deidre Murch. I'm one of the vice presidents and the home care director at 1199, and I lead the home care division of our union. So we are representing about almost now 12,000 home care providers, PCAs, who are employed through home and community-based Medicaid waiver programs. Part of what makes this program so special is that not only does it allow consumers who have intellectual or physical disabilities to live at home and receive care, but many of these caregivers care for someone they love. So it's really a special program. And, this program has also doubled in the last decade. When we first began organizing caregivers, there were about 5,000, and now we are almost at 12,000. We anticipate the workforce will double again in the next decade. But there's some real challenges here. This is a workforce that is still almost 90% women. It's a workforce that is majority caregivers who are people of color, and the majority earn $18.25 an hour. In our last survey of our membership, 1 in 5 are still uninsured. And unfortunately, we're going to see that number grow as wages thankfully increase. That also means less people will have access to Husky. And even though we won an agreement for paid time off, no one can access the paid time off that we won 2 years ago until Allied is finally out the door and the new payroll company is in next month. And not only that, but no PCAs have access to retirement savings. So I think it's fair to say that PCAs don't just work paycheck to paycheck, but really work a paycheck or two behind. Now, the good news is that we've reached a new agreement with the Governor's Workforce Council that will do some really important things. One is that it will raise the minimum pay rate from $18.25 up to $23 an hour over the next 2 years. So that's several steps closer to what we believe is a true living wage. It's going to improve the current health insurance stipend that's available to those who no longer qualify for Husky or don't have access to health insurance through another job or a spouse, so that folks have more resources to purchase their own health insurance. And it's going to finally make the paid time off secured 2 years ago available and actually increase the accrual rate a little bit. But just to give you a sense of how far we still have to go, once this new agreement is in effect, caregivers will have access to a little over 6 paid days off a year. And I think we all know that sickness and need for time off and rest does not neatly confine to 6 days a year. So there's many more improvements that are needed for this vital workforce that are not yet in our tentative agreement. We're closely monitoring this transition to the new payroll company. And we might need additional legislative protections if they're not categorically better than Allied. And we're also urging lawmakers to support the workforce violence bill to make sure the most vulnerable providers that work one-on-one in people's homes have additional protections. And we still have a really pressing need for a provider directory that helps caregivers and patients connect. But in the meantime, this new agreement is an important stepping stone toward that future that caregivers and consumers really need and deserve. So we urge you to support and champion approval of this new agreement that will, be another important step in stabilizing this workforce. And we believe it will improve the lives of caregivers, consumers, and the families who rely on those services.
Great. Thank you so much, Ms. Murch. Thank you for being here in your testimony.
Thank you.
Next, we'll hear from Juan Gavidia. Juan, are you with us? If you are, you just need to unmute. There you go.
Buenas noches a todos los representantes, hablaré en español. Mi nombre es Juan Gavidia, soy líder del Comité de Lucha de la organización Hace Camino Connecticut y residente de Bridgeport. Doy gracias a la audiencia por la oportunidad que me dan para testificar en favor del presupuesto para las agencias de servicios humanos HB 5048 de la ley que ajusta el presupuesto estatal para el bienio terminal del 30 de junio del 2025. Yo soy inmigrante procedente de Venezuela, residenciado, como ya dije, en Bridgeport. Yo he tenido dificultades extremas para acceder a la atención médica debido a las barreras financieras, ideológicas y por las políticas sociales injustas, inspiradas, implantadas, donde no podemos calificar los inmigrantes o los más necesitados por no tener un estatus de residente, porque para eso se nos cierran las puertas por no ser residente. Yo desde que llegué a este país solo he podido ver un doctor en las ferias de salud que se hacen y en los programas de apoyo universitario, como en la Clínica Hispana de la Universidad de Yale, que se está liderando por estudiantes y supervisados por médicos ya. Yo quiero expresarle a ustedes que el sistema de salud en Bridgeport, que es donde yo vivo, es de difícil acceso porque exigen una serie de requisitos para ser atendidos en un centro comunitario. Además, el tiempo de espera para uno tener acceso a esta atención es de 3 meses. Primero, para ver una trabajadora social que decida si uno califica o no. Y luego, para ver al especialista. Lamentablemente, la espera es para escuchar siempre. Usted no califica, le faltan documentos, los cuales a veces uno no puede obtener por su estatus migratorio. Ninguno de nosotros tenemos un contrato de trabajo, ninguno de nosotros podemos implantar eso. A veces cuando llevamos una carta notariada, a veces no son aceptadas. Yo en una visita médica que tuve en mayo del año pasado, fui diagnosticado con cáncer de próstata. Desde esa fecha, que fue en el 2023, y hasta ahora, yo por falta de seguro médico no he podido obtener o iniciar un tratamiento necesario para parar esta enfermedad, lo cual tengo que esperar lo peor, porque no puedo atacar ese mal. Destaco que esta situación ha deteriorado significativamente mi salud, porque la ansiedad, el estrés y la impotencia de no poder hacer nada me lleva a pensar que puedo tener un final trágico, un desenlace, que es lo más seguro, mientras espero que ustedes den paso a un seguro para todos, sin límites de edad. Solo deseo que averigüen con los médicos cuántas personas quedan con un diagnóstico terminal dando vuelta por las calles sin tener tratamiento por falta de acceso equitativo a la atención médica. Y pueden ver las muertes que se han podido evitar. Mi único esfuerzo para combatir este mal es tomar calmantes para los síntomas de dolor y adormecimiento de las partes de mi cuerpo, porque no tengo otro remedio que automedicarme o buscar remedios caseros. Esta acción es para no ir a emergencia porque no podré costear el monto de la factura de los medicamentos o del servicio que me puedan prestar en la emergencia. Llamo la atención de los congresistas y de los comités encargados para el presupuesto de la salud, porque si tuviéramos un seguro médico universal, como el estado de California, como Nueva York, se transformaría mi vida y todos a mi alrededor, porque podría tener un doctor primario y los cuidados necesarios para prevenir la muerte, que es lo único que me puede esperar ante esta sintomatología que estoy presentando. Por eso apoyo y estoy a favor del presupuesto de la HB 5048 y le pido al Comité Apropiaciones que financie la elegibilidad del HOSKI para todos los miembros de Conérico que califican basado en sus ingresos, independientemente de su estatus migratorio, hasta los 18 años este año, y en el futuro crear un plan a largo plazo para abrir el acceso a todos los inmigrantes, independientemente de su edad. Las necesidades de salud no son planificadas, sino que llegan inesperadas y todos las requerimos. Yo quiero que por favor tomen en consideración esta situación del diagnóstico que estoy presentando. Quizás yo no pueda disfrutar lo que pueda hacerse con el HOSKI a futuro, pero pienso que crearía las bases para que tomaran conciencia de lo que estamos viviendo algunas personas que estamos sin seguro médico. Muchas gracias y feliz noche.
Dear President and members of the Appropriations Committee, hello, my name is Juan Gavidia. I am the leader of the Fight Committee of the Make the Road Connecticut organization, a resident of Bridgeport, Connecticut. Thank you for the opportunity to testify on behalf of Human Services Agency budgets HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025. I am an immigrant from Venezuela, a resident of Bridgeport. I have extreme difficulties in accessing medical care due to financial and ideological barriers and the unfair social policies implemented, where we cannot qualify those most in need because they do not have the status of resident. Since I arrived, I have only been able to see one doctor at health fairs and in university support programs such as the Yale Hispanic Clinic led by students. The health system in Bridgeport is difficult to access because it requires a series of requirements to be treated in a community center. In addition, the wait time is very long, for 3 months. First to see a social worker and then for a specialist. Unfortunately, the wait is to hear you do not qualify or you are missing documents, which I cannot obtain due to my immigration status. I have been diagnosed with prostate cancer since May 2023, and due to the lack of medical insurance, I have not been able to obtain or start the necessary treatment to attack the disease. I emphasize that this situation has significantly deteriorated my health because the anxiety, stress, and helplessness of not being able to do anything leads me to think that I could have a tragic end, which is the safest, while I wait for you to make way for insurance for everyone. I just wish that we'll find out from the doctors how many people are left with a terminal diagnosis walking around the streets without treatment due to the lack of equitable access to medical care, and they can see the death that could have been avoided. My only effort is to combat this evil is to take painkillers for the symptoms of pain and numbness in the parts of my body because I have no other option but to self-medicate or look for home remedies. This action is to avoid going to the emergency because I will not be able to afford it, the amount of bills or medications. I draw the attention of the congressman. After all, if we had universal health insurance like the state of California and New York, my life and everything around me will be transformed because I could have a primary doctor and the care necessary to prevent death. That's why I support and I'm in favor of the House Bill 5048 asking the Appropriations Committee to fund Husky. Thank you for your time.
Thank you, Mr. Gavidia. Thank you for being here.
Muchísimas gracias por estar aquí.
Next up, Lawrence Levy.
Thank you, Representative Gilchrist. I appreciate the time. To the members, the chairs, the vice chairs, and the members of the Appropriations Committee, especially Senator Lesser, my state senator. I see him perking up. I'm here representing, I'm a general dentist in Middletown, but I'm here representing the Connecticut Foundation for Dental Outreach. I'm also the chair, the co-chair of the Connecticut Mission of Mercy Free Dental Clinic. We're the clinic that's been around for 16 years that's been providing all the free care in the state. As I look through the members of the Appropriations Committee, I know there's a lot of you that have visited our clinic. For 16 years, we were able to fundraise on our own, but now we're asking the state of Connecticut to help us with providing, if we could, $500,000 a year on an annual basis. And just so you know, this isn't something new. I guess it is something new for Connecticut, but other states have provided. In Florida, they got $500,000 this year, $250,000 last year. Arizona and Tennessee both provide to their missions and mercies. And I know there's a number of other states right now that people like me are trying to appeal to the state to get funding. For 16 years, we've run these clinics. The first one was in Tolland in 2008. We did New Haven in 2009, Middletown 2010. And if you continue on to where we are now, we've treated over 23,000 patients. And we provided $14.5 million worth of free care. And it was all fundraising, basically what we could do on our own as best as we could. Up until when we first started, it would cost about $200,000 to do these clinics. And we did okay. And then as time went on, it went to $250,000 and then to $300,000. It costs us about $500,000 right now to keep these clinics going. That's why we're asking for $500,000 a year. Somewhere around COVID, everything kind of went haywire and our costs just went way up. At the same time, our fundraising capabilities sort of went down. So we're doing the best we can. In 2022, we ran a clinic in not New Haven, why can't I talk? I'm sorry. in Hartford at the UConn School of Dental Medicine. And that year we ran a deficit of 165,000. Now the university was wonderful and gave us a ton, but we just couldn't fundraise. Last year we were in New Haven. It worked out. We were basically broke even. We're trying to plan a clinic now in Waterbury. We don't know if we can pay for it. We're doing the best we can. We have a lot of grants that we're waiting to hear, but we'd like to get to a point, I know my time's running out, we'd like to get to a point where we can plan ahead and have the money to pay for it. So I know there's two other people that have already, one other's already spoken, and we have one more at number 232. Lisa, our executive director, will continue on. But thank you for the time, and if you have any questions, I'd be glad to answer.
Thank you, Mr. Levy, for the work you do and for being here.
Thank you.
Next, we'll hear from Emmanuel Hart. Emmanuel, are you with us?
I don't believe so, Madam Chair.
All right. How about Stephen Gorelli? There you are.
Hi, I'm here. Good evening, Representative Gilchrist and members of the committee. My name is Stephen Girelli, and I'm the president and CEO of Klingberg Family Centers. We are a multi-service agency based in New Britain whose mission is to help build healing relationships that empower children and families to reach their full potential. We pursue that mission through the provision of over 20 programs and services that last year helped 5,000 children and their families from 118 towns and cities across Connecticut. I am here to support the request that you increase funding for community nonprofits by 5% and provide the $50 million to Health and Human Services organizations that did not receive the DDS-specific bonus funds in the FY24 budget. Klingberg, like all of the other nonprofit human services agencies in Connecticut, is at a crisis point. We have struggled for nearly 2 decades with increasingly inadequate funding. That inadequacy has compounded year over year. As a result of the pandemic, among other factors, demand for children's behavioral health services is at an all-time high. As one of your colleagues articulated in this morning's hearing, we face a children's behavioral health crisis. DCF's funding of nonprofit service providers is grossly inadequate to address that crisis. Moreover, the inadequacy of DCF funding is compounded by the inadequacy of Medicaid reimbursement rates. The state's own study demonstrated that Connecticut is spending less than half of what it should on behavioral health services. Plain and simple, we are not adequately funded, and that underfunding has had myriad implications. Among them, and most importantly, consistent with the DCF Chief Financial Officer's testimony this morning, we have a staffing crisis. At Klingberg, 30 of our 320 positions are currently vacant, some for many months. And when we finally succeed in filling a position, it is often again vacated in a matter of months or even weeks, resulting in a turnover rate of roughly 35%. To put the impact of staffing shortages and turnover into human terms, we are currently serving 25% fewer families in our outpatient clinic. Our trauma specialty service has a 2-month waiting list. Our after-school clinical program is operating at 65% of its normal capacity. 2 recent inquiries for one of our group homes were declined. We have 4 youth who have been awaiting adoption, and the effectiveness of our advocacy services for child abuse victims has been significantly compromised. My colleagues in the industry report similar gaps in their services. At the very time when the mental health needs of Connecticut's children and families are at their peak, we and the other nonprofit providers are least able to meet them. Put bluntly, unless there are funding increases, and soon, this downward spiral will continue as needs increase and services disappear. Thank you for your time.
Thank you, Mr. Gorelli. Thank you for being here. Next, we will hear from Robert Moreau.
Good evening, Representative Gilchrist and members of the Appropriations Committee. My name is Dr. Robert Moreau. I am the president and CEO of the Connecticut Council of Family Service Agencies. We are a network of 13 nonprofit organizations throughout the state that provide services to children and families such as behavioral health, basic needs, crime victim supports, prevention and screening, and many other services. Collectively, we employ 2,600 staff and serve roughly 150,000 individuals each year. The people we serve are friends and neighbors in your communities. The teenager going through a depressive episode, the 28-year-old who recently relapsed on opioids, the first-time parents who are worried sick that their 4-year-old child is not meeting developmental milestones and might have a diagnosis they don't want to hear, and the family whose primary breadwinner just lost their job 2 months ago and now can't pay rent. We are grateful for the increases the legislature was able to provide during the pandemic. However, costs these days are far exceeding our capacity to keep up. Since 2007, factoring in these increases, we're still roughly 32% behind. Healthcare insurance costs increase each year, sometimes by double digits. Utilities, technology upgrades, occupancy have also increased. Nonprofits struggle to provide a livable wage for their staff, often losing them to higher paying jobs with the state. And the consequences are staggering. Staff turnover rates are running at roughly 33%, and vacancy rates up to 20%. Behavioral health clinics at some of our agencies are now serving 25% fewer clients. Wait lists are running 60 to 90 days or longer just to begin services. One agency that runs the DCF-funded in-home clinical program lost 5 out of 8 clinicians over a 3-month period this past fall. Now it has to hire and invest significant monies retraining new staff. This is a predicament that cannot be addressed with further belt tightening, additional fundraising, or grants from philanthropic
I just put it back on.
foundations. Frankly, the current structure is unsustainable. There are ways the legislature can solve this issue at a time when the state surplus continues to grow. We respectfully request that you increase grant funding for community nonprofits by 5% in this current budget. And we also respectfully ask that you raise Medicaid reimbursement rates. These efforts would make a significant impact on nonprofits' ability to sustain services to families and neighbors in our communities. I thank you for your time and your dedication in working to solve these difficult issues.
Thank you, Dr. Muro. Thank you for your work, and thank you for being here tonight. Next, we'll hear from Amir Klahar.
Hi, hello.
Hello, go right ahead.
Hi, good evening, members of the committee. My name is Amir Klahar, and I'm a personal care attendant. I'm here today to ask you to fund and pass our PCA contract. As a PCA, I provide my client with total care. I take care of all his needs. I clean up after them, I cook for them, and I cut and arrange their food into pieces they can manage. And when he needs to go to the bathroom, I'm the one to go to the bathroom with them, put them on the toilet and get them situated, and then come and clean them up when they're done. I love that I have a job that is able to help someone who really needs my help. I don't feel like an unnecessary cog in a machine that makes someone else money. I'm doing work that benefits them, society, and saves this state thousands of dollars every time I clock in. Funding and passing our PCA contract would allow me not to have a second job. I wouldn't have to say, no, I can't come in today because I need to work my second job. I will be able to survive on taking care of my client alone. And as a healthcare professional, I should be able to take care of my client and make ends meet. Getting paid at the same amount as a person working retail or fast food is insulting for the work we do. It's insane that I can make more money on the grill at Chili's than taking total care of another human being. As a PCA, we don't have retirement benefits or affordable health care. If I had retirement benefits at this age, I'll be able to have the peace of mind that comes with knowing my future is set. Right now, I have to worry about my present and my future. And at this moment in time, I have to eat ramen noodles and eggs every night for dinner just to make sure I can make rent this month. Having retirement and healthcare will relieve my stress and make my mental health healthy. Luckily, we finally have a contract that starts to respect the work we do. We have a contract that raises the wages from $18.25 to $23 an hour over the next 2 years. Our contract also increases benefits for us and provides the first ever longevity bonuses for workers, so we are able to hopefully lower the rate of turnover in this field. It's not everything that I deserve currently, but it is a start to getting workers like me some respect and dignity on the job. Please hear us and support funding and passage of our PCA contract. Thank you for your time.
Thank you, Mr. Clayhar. Thank you for being here and for your testimony. Next, we'll hear from Dana Hillman Sabato. Is Dana with us?
I'm here in person.
Great, thank you.
Thank you. Good evening. My name is Dana Hillman Sabato, and I am a clinician and now currently support the implementation of Child First throughout the state of Connecticut. I thank you for this opportunity to share more information about Child First and on behalf of our community-based organization serving young children and families across the state. With over 200 children on our waiting list across the state of Connecticut, 74 families in just one of our sites, we are grateful to the committee for the ongoing investment and continued support to maintain the current $1.9 million of funding under the Office of Early Childhood and $5.2 million under the Department of Children and Families. Child First is an intensive early childhood mental health home visiting program that helps struggling families build strong and nurturing relationships that heal and protect them from the devastating impacts of trauma, adversity, and chronic stress. We were established in Connecticut, where we've been operating for over 20 years. Our model uses a multi-generational approach with team members that includes a mental health professional and care coordinator that engage with children and caregivers in their home 1 to 2 times per week for 6 to 12 months on average. Our trauma-informed model provides psychotherapy to parents and their children, and our care coordinators connect families with needed services to help reduce stress and support healthy child development. Child First is unique in that we are a clinical service that really supports and fills the gap in the service for families of very young children with very acute needs. We're an outcome data-driven organization, and so we have completed a randomized control trial in 2011, which indicated that program participants experienced a 64% decrease in maternal depression, a 42% decrease in child aggression and behaviors, a 40% reduction in child welfare involvement, a 68% decrease in child language problems. And we continue to evidence outcomes that reflect that original RCT finding. Building off of our current funding levels, Child First is seeking a total of $10.2 million in the funding per fiscal year and the Connecticut state budget. This ask represents a $3.1 million increase above the proposed executive budget and provides Child First program providers with funding in line with the fiscal year 2021, which was prior to a supplemental grant through ARPA funding. We are inevitably grateful for the support of DCF over the years and are committed to being a strong partner in leveraging future federal pass-through funding in order to build a sustainable braided funding strategy that maximizes the opportunities for Connecticut families with very young children who have acute needs. Thank you for your time.
Thank you so much for being here. Next, we'll hear from Kathy Ludlum.
She previously testified, Madam Chair.
Okay, thank you. Lisa Dupuis. Did I mess that up?
No.
Go right ahead.
All distinguished members of the Appropriations Human Service Committee, my name is Lisa Dupuis. I'm the Executive Director at All About You Home Care Services. I have over 20 years in the home health and hospice industry. All About You is located in the towns of Naugatuck, Torrington, and East Haven. We are a licensed home health agency and non-medical care provider. About 50% of our patients at All About You are part of the State of Connecticut Medication Administration Program. As a provider of services for the behavioral health population funded by Medicaid, we have witnessed the benefits of this program in keeping residents of Connecticut in home-based settings. We have also witnessed what happens when these very vulnerable patients don't take their medications and end up hospitalized or in a crisis. With minimal institutional resources for this population, it is essential that this medication administration program continue to serve this population safely, not to mention the increased cost to the state if these individuals needed to be put in a facility. We cannot continue to provide this care at the current rates due to staff shortages as well as inflation rates. We are unable to attract staff to work in the home-based care due to the low reimbursement rates as well as the anticipated safety issues. Staff are also leaving home-based care to go into settings that pay higher rates. At All About You, we take employee safety very seriously. We work with our referral sources, staff, and patients to make sure the care plan is the most thorough and safe for all involved. Each referral we receive, we review the clinical information and last psychosocial note to determine the best safe arrangement. We pre-screen the patients with our introductory calls. At times, getting the necessary clinical information is challenging, and we do come across some barriers. Easier access and cooperation on behalf of the referral source would increase the safety and ability to put the best care plan together. I am testifying before you today to ask for the additional funding in the state budget to focus on safety for home healthcare workers and for funding to allow agencies to continue this much needed service. I ask that we work on transparency in the referral process to allow home healthcare to plan for the best and safest services to the patients we serve. We must all work together to deliver the best healthcare to the residents of Connecticut. Thank you.
Thank you, Ms. Dupuis. Good to see you. Have a good evening.
You too.
Next up is Michelle James. Michelle, are you with us?
She's in person. She's coming.
Great, thanks.
Good evening. Okay, great. Good evening. Senator Austin, Representative Walker, and distinguished members of the Appropriation Committee. My name is Michelle James, and I am the Executive Director of the Community Action Agency of Western Connecticut. I am also the Vice Chair of the Community Action Association for Community Action, or CAFCA, the State Association for Connecticut's 9 community action agencies, or CAAs. I am here to share my overall support of the governor's proposed midterm budget and some thoughts on the creation of the Social Service Opportunity Centers. As the largest statewide safety net service provider, Connecticut's Community Action Network provides services to limited income individuals, children, and families in all 169 cities and towns in Connecticut. The CAA served almost 200,000 individuals last year with essential and basic needs services such as food, shelter, heating assistance, housing, childcare, and other services. By utilizing a comprehensive customer-focused integrated service delivery system called the Human Services Infrastructure, or HSI, every customer that comes through our doors is connected to the tools, resources, programs, and services they need to move towards short and long-term economic stability. One of the core components of the HSI service delivery model is partnership and collaboration with various state agencies and other community partners. In fact, HSI has, through a strong partnership between the CAAs and the Connecticut Department of Social Services. Through the HSI model, the CAAs also work collaboratively with other state agencies such as DSS, DOL, DOH, and others. These collaborations help to ensure that all appropriate connections are made that will assist participants in their efforts towards economic self-sufficiency and success. The governor's proposal creates a coordinated service delivery model for various state agencies by co-locating staff along with community partners at opportunity centers to deliver social services to help residents attain self-sufficiency. It also allocates $1 million in bond funding to refurbish a state space in Hartford to pilot the program. Co-location and outposting of staff is a service delivery model that has been in use by CAAs for some time and is deeply integrated into the holistic provision of services in the HSI model. Due to this long-standing holistic and outcome-oriented model of service delivery, the community action agencies are well suited to continue to assist the state in helping residents on the road to economic independence. We encourage you and the administration to consider ways that the community action system and its existing model of service coordination and integration can support efforts to increase the economic well-being of residents across Connecticut. We have a system in place that works. We welcome the opportunity to discuss additional ways that the Community Action Network can support these efforts, and we look forward to working with you and the administration to continue serving our state's neediest residents. Thank you for this opportunity to testify.
Thank you, Ms. James. Thank you for your testimony and your time. All right, next we'll hear from Jim Maffoyd. Jim, I see you on. You just have to unmute. There you go.
All righty. Hi, good evening. Thank you, members of the committee. I'm Jim Maffoyd. I'm the CEO of the Children's Center of Hamden. We are a 190-year-old agency that has met the unique behavioral health and educational and emotional needs of children and families throughout the state throughout all those years. We provide an array of services from psychiatric residential treatment to outpatient behavioral health and substance use services, extended day services. We have a K through 12 special ed clinical day program and a home for 4 women with developmental disabilities. I thank you for the opportunity to testify on HB 5048. And I'm here to request that you increase funding to the community nonprofits by 5%, which is a total increase of $186 million. Throughout today, you've heard numerous providers and individuals express their concerns about the state's behavioral health system and the devastating impact inadequate funding has had on providers and patients alike. Due to the lack of annual contract COLAs, Medicaid rates that don't cover the cost of services each year, my agency, just like my other agencies you've heard from today, we have a difficult challenge trying to continue to provide services. This past year, we had a 25% increase on our medical insurance cost alone. That's $700,000 of increase. Our broker told us expect on average a minimum of 10% each year, year over year. So the challenges continue to be upon us. But many of our staff, some have been with us 10 to 15 years, have decided to start leaving our service area, the nonprofit arena, to go find a way to make increased wages, living wages, so they can take care of their families. Fitting with our mission, we've chosen to be part of this system, and it's a system that's designed to provide access to care for the most needy in our state, but it's funded through state contracts and Medicaid reimbursement. And while my colleagues and I, over the last 30 years, have talked about the challenges in our system, the fact is even though we're running businesses, we're not really operating in a free market system like other businesses. We're dependent on state fees and state rates. We don't get to set our own rates as in a normal free market. And the rates are significantly below what we need to sustain services. So at this point, I just feel like we're in a system that has been continually challenged. We've said someday we're going to get to the point that the ship might sink. And I fear that we're in that place right now. So I ask that you support the nonprofits, the $186 million increase. These are real deficits impacting real people with real emotional problems and behavioral challenges. So I hope it's time for the state to take real action to help those in need. I thank you for your time.
Thank you, Mr. Maffoyd, for your time and for your testimony. Is Yokari Montero with us?
Hola, buenas noches.
Hello.
Yo el día de hoy voy a necesitar un traductor.
Ya estoy aquí.
Ok, muchas gracias. Presidentes y miembros del Comité de Asignaciones, mi nombre es Yokairi Montero y soy un estudiante de Denbury. Gracias por la oportunidad de testificar sobre HB 5048, una ley que ajusta el presupuesto estatal por el bienio que termina el 30 de junio de 2025. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Hay importantes prioridades que se financian en el presupuesto del gobernador para agencias de servicios humanos. Estoy aquí para hablar en apoyo de la financiación de aumento en la elegibilidad para el programa Husky Medicaid y pedirle al Comité de Apropiación que financie la elegibilidad de Husky para todos los residentes de Connecticut elegibles por dependiente de los 18. Y soy miembro líder de Connecticut.
Ms. Montero, you're going in and out. Maybe turn off your camera and we'd be able to hear you better.
También tenemos derechos.
Miss Montero.
Somos personas como ustedes, así que no entiendo cómo nos critican. Y soy miembro líder de Connecticut Estudiantes por un Sueño. Y para mí es importante que aumenten la edad de Husky porque los inmigrantes indocumentados también tenemos derechos. Somos personas como ustedes, así que no entiendo por qué nos quitan nuestro derecho humano a la atención médica. Creo que estamos demasiado avanzados en nuestra generación para seguir discriminando a cualquier tipo de persona. Mi pregunta es, ¿cómo tienen la conciencia tranquila sabiendo que nuestra gente muere por no tener acceso a Husky? ¿Cómo es posible que tengamos que estar luchando por algo que nos corresponde como humanos que somos? Es decir, nos exigen que paguemos nuestros impuestos porque eso es lo que tenemos que hacer si vivimos aquí en Estados Unidos. Pero si les pedimos que beneficios a cambio, miran para otro lado y ponen 1,000,000 de excusas. Esto es totalmente injusto. Mi pregunta es, ¿por qué dicen que no tienen el suficiente dinero cuando literalmente les estamos dando el dinero para cubrirlo? Es obvio que tienen el dinero. Entonces, ¿qué hacen con ese dinero? Por favor, es solo razón humana para saber que esto es injusto. Y me siento impotente cuando simplemente dicen que no. ¿Cómo les perjudica esto? Necesitamos apoyo para seguir con vida. Mi madre tuvo un accidente hace años en su país natal, pero cuando llegó aquí no pudo continuar con su tratamiento para los costos de dicho tratamiento. Ahora mi mamá tiene que vivir su vida con una cantidad limitada de tiempo en el que puede ponerse de pie y no puede completar tareas simples como pasar tiempo al aire libre jugando con sus hijas, y eso significa correr o caminar mucho. Esto ayudaría a mi madre a vivir una vida mejor. Mi comunidad no tendría tantos problemas económicos si la gente no tuviera miedo a ir al hospital. Le pido al Comité de Asignaciones que financie la elegibilidad para Husky para todos los residentes de Connecticut elegibles por ingresos, independientemente de su estatus migratorio, hasta los 18 años este año. Y que en el futuro cree un plan a largo plazo para abrir el acceso a todos los inmigrantes independientemente de su edad. Las necesidades de atención médica no terminan a los 15 ni a los 18 años. Gracias por su tiempo. Yokairi Montero.
Chairman and members of the Appropriations Committee, my name is Yokairi Montero. I am a student from Danbury. Thank you for the opportunity to testify on HB 5048 and act adjusting the state budget for the plenum ending June 30th, 2025, with respect to the budgets of human services agencies, specifically for the Department of Social Services with Ministers Husky. There are important priorities funded in the governor's budget for human service agencies. I am here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to 18 years. My name is Yokairi Montero. I am leading member of Connecticut Students for a Dream, and for me it is very important that they increase the Husky age because undocumented immigrants also have rights. We are people like you, so I do not understand why they take away our human right to medical care. I think we are too advanced in our generation to continue discriminating against any type of person. My question is, how do you have a clear conscience knowing that many people die from not having access to medical care? How is it possible that we have to be fighting for something that belongs to us as human beings? That is to say, the government required us to pay for our taxes because that is what we have to do if we live here in the United States. But if we ask them for benefits in exchange, they look the other way and make a million excuses. This is totally unfair. My question is, why do you say you don't have enough money when we are literally giving you the money to cover it? So what do you do with that money? Please, it's only human reason to know that this is unfair, and I feel helpless when they just say no to increasing the age limit and budget. How does this harm you? We need support to stay alive. My mother had an accident years ago in her home country, but when she arrived in the United States, she was unable to continue her treatment due to the cost of said treatment. Now my mom has to live her life with a limited amount of time. She can stand and can't complete simple tasks like spending time outside playing with her daughters, if it means running or walking a lot. This will help my mother live a better life. My community will not have so many economic problems if people were not afraid to go to the hospital. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, through age 18 this year, and to create a long-term plan to open access in the future to all immigrants regardless of their age. Healthcare needs do not end at 15 or 18 years old. Thank you for your time.
Thank you so much, Ms. Montero. Thank you for being here tonight and for your testimony.
Muchísimas gracias, Ms. Montero, por estar aquí, por tu testimonio hoy.
Next, we'll hear from Brenda Gonzalez. Is Brenda with us?
No, ma'am.
Okay, then Monica Doshi.
Hi, good evening.
Hello.
Dear chairs and members of the Appropriations Committee, my name is Monica Doshi. I'm a resident of West Hartford, an academic, a public health professional, and a member of the Hartford Deportation Defense. Thank you for the opportunity to testify regarding HB 5048. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of their immigration status, up to age 18. In the last 3 years, we successfully expanded Husky coverage to undocumented children ages 0 through 15 and to undocumented pregnant people. As a result, approximately 8,000 children and pregnant people have been insured. These policy changes are already having a positive impact on our state. Despite these recent gains, the human right to health continues to be differentially realized, with undocumented immigrants disproportionately affected. Currently, more than half, that is approximately 58% of an estimated 113,000 undocumented immigrants in Connecticut, do not have any form of health insurance coverage, a key determinant in healthcare access, utilization, and retention. In the absence of healthcare coverage and the presence of many other barriers, undocumented immigrants experience differential access to healthcare services, contributing to delays in needed care, signaling potentially high levels of unmet health needs, and leading to downstream disparities in morbidity and mortality. The adverse consequences of unmet health needs, specifically mental health needs, are of particular concern among adolescents, with uninsured, undocumented adolescents further burdened given the barriers they face in accessing care. Rapid biological changes coupled with changes in the social environment can render adolescence a period of vulnerability to mental illness. Many mental illnesses, including those that are treatable, first appear during adolescence and persist throughout adult life, leading to long-term morbidity. Depression, for example, is estimated to become the world's leading cause of disability-adjusted life years by 2030. The gravity of increased vulnerability to mental illness during adolescence has recently been compounded by the deleterious effects of the COVID-19 pandemic on adolescent mental health, with more symptoms of depression, anxiety, and loneliness reported among adolescents independent of gender. These findings underscore the critical importance of early detection and treatment. Without access to consistent mental health care, uninsured, undocumented adolescents in our state potentially remain undiagnosed and untreated. Moreover, uninsured, undocumented adolescents with chronic physical health conditions continue to struggle with unmet health needs. Expanding Husky coverage to all income eligible Connecticut residents, regardless of immigration status, up to age 18, will promote prevention and early intervention, public health strategies that have proven not only to reduce morbidity and mortality, but also to reduce costs. The World Health Organization's constitution states, Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We understand that the right to health is an unalienable human right. We must translate this understanding into action. I ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18. I also ask that the respective committees of the Connecticut General Assembly continue their work to ensure that all immigrants in this state have access to healthcare regardless of their age. Thank you for your time.
Thank you, Ms. Doshi. Thank you for your testimony and your time. Is Estela Jimenez with us?
No, Madam Chair.
Okay. Marissa Jones.
Good evening, members of the Appropriations Committee. My name is Marisa Jones, and I'm the Executive Director at Parkway Pavilion Health and Rehab Center in Enfield, Connecticut. First of all, I want to thank you guys for taking the time to listen to our testimony. I know it's been a long day for you, and I appreciate you guys hanging in. The public health emergency may be over, but Connecticut nursing homes are still recovering and continue to be challenged like no other time before. With that said, I can also say that our nursing home here in Enfield is determined as ever to continue serving quality care and regaining the stability that we had prior to the pandemic. Ravaging inflation, severe staffing shortages, and increasing labor costs continue to slow our ability to recover. And unfortunately, these things are not adequately addressed in the current budget recommendations. With the current rate of inflation, we're losing ground despite exhaustive efforts to manage our expenses. The cost of utilities has skyrocketed, not to mention the cost to feed our residents and provide the necessary medical supplies that they need. In addition to the costs mentioned above or mentioned with inflation, we also continue to have extreme labor-related costs, primarily as a direct result of having no choice but to use the staffing agencies. This financial consequence has been enormous, but one that we are obviously willing to incur because the quality of care for our residents is our top priority. In addition to the costs of staffing agencies, we're also incurring costs of having to pay overtime and bonuses for our own staff as a priority rather than using these agencies. We are seeking additional resources so that we can pay our extraordinary employees what they deserve and what we feel that they deserve. Before closing, I'd like to express our appreciation to the state legislator for the tremendous support we have received. The resources previously provided to us to help boost staff pay have made all the difference, but unfortunately, we're losing ground. More funding is needed in the budget to address the extreme inflation and exorbitant labor costs we are facing. Please help us deliver the high quality care we're committed to by supporting additional funding to our nursing homes. Thank you for your time and consideration.
Thank you, Ms. Jones, for your testimony and your time tonight. Is Margaret Walker with us?
No, Madam Chair.
All right. Darius Mastagimi. Did I do it?
Hello.
Hello.
Good evening, Representative Gilchrist and members of the Appropriations Committee. My name is Darius Mastagimi. I'm a fourth-year Yale medical student, a clinical advisor at Haven Free Clinic, and resident of Madison. I appreciate the opportunity to comment on the adjustments to the governor's budget in this Appropriations Committee, specifically with regards to Husky eligibility requirements. I asked the committee fund Husky eligibility for all CT residents up to age 18, regardless of immigration status. Expanding Husky is important to me because I believe that a thriving society requires an equitable healthcare system that prevents children and those without the means from dying of simple, preventable, or easily treatable causes. As a medical student, I started rotating at federally qualified health centers for primary care and pediatrics like Cornell Scott Hill Health in New Haven, and volunteered at the student-run free clinic called Haven, where all our patients receive care because they are without insurance. Many had not seen a doctor in several years and had undiagnosed or unmanaged health conditions. A good number of these patients had a history of going to the emergency rooms because of complications of heart disease, asthma, chronic pains, depression, suicide. I won't linger on the profound short and long-term financial and clinical benefits of healthcare access and preventative care, I want to touch a little on the crushing nature of mental health disease, which Monica Doshi just spoke a little about, and intimate partner violence that is unseen but prevalent in the undocumented immigrant community. In my limited experience, I've already seen ubiquitous cases of depression and anxiety, preventing patients from being present with their families and participating in the jobs and society to the fullest of their desire and ability. These patients are heavily motivated, but under the collective weight of medical debt, low pay, health issues, among a myriad of other stresses. Physicians are trained to screen and treat these conditions. At Haven Free Clinic, I've seen countless patients come in debilitated, and with simple counseling, connection with our behavioral health volunteers, referrals to proper therapy and proper medication prescription make a tremendous improvement. At Haven, we wish we could see every patient who needed us, but we can't, and honestly, we shouldn't, because we are just students. I've also seen an uncomfortable amount of patients that have experienced intimate partner violence come to these clinics. Women coming in for their medical visit would sometimes mention physical or sexual abuse at the home, and sometimes children are involved. At Haven, we connect patients to the necessary medical, legal, and mental health resources. But if children are involved, of course, we ensure the proper authorities are involved to ensure the child's safety. However, so many abused adults and kids are living in the shadows without proper recourse because they do not have a trusted medical provider to give them a hand. The connection between a physician and a patient is sacred and brings these patients out of the shadows, even for things that are not obviously medical. Expansion of Husky invites a hardworking community that lives within our society into our society, enjoying the same basic benefits that the rest of us take for granted and that they deserve. Therefore, I beseech the committee to fund Husky eligibility for all income eligible CT residents, regardless of immigration status, up to age 18 this year, and with a commitment to open access to all immigrants, regardless of age in the future. It was a privilege speaking with you all tonight.
Thank you, Mr. Mostagimi. So good to hear you tonight. Thanks for your testimony.
Thank you.
Is Peaches Quinn with us? All right. How about Oralis Guzman? Oh, what?
Peaches is in the queue.
Oh, that's right. I see her. Peaches, if you're with us, you just have to unmute.
All right, all set?
Yep, go right
Okay.
ahead.
Oh, thank you ever so much. Good to be with you this evening, Representative Gilchrist. Thank you for the opportunity. Thank you for hanging in, and thank you for, again, the opportunity to address appropriations. My name is Peaches Quinn, and I am president of the Connecticut Coalition on Aging, a statewide volunteer organization that delivers education and advocacy on issues of importance to Connecticut's older citizens. I should also mention I am a longtime resident of New Haven's 93rd District, Representative Tony Walker. I am well over the age of 70 and a full-time caregiver to my husband. I have my own understanding of the day in, day out determination of so many older adults to make ends meet, deal with inevitable physical disability, and struggle to avoid institutional care down the line. The news from the last session was near joyous. Finally, the eligibility income limits were raised for the Husky Seed program. Excuse me, the full benefit Medicaid program for disabled persons and older adults, among whom I should particularly mention a disproportionate number are persons of color. Section 302 of Public Act 23204 was righting a terrible wrong, glaring long-time discrimination. Since its inception, Husky C has had the lowest income eligibility limits of any Medicaid program, 97% of the federal poverty level, as compared to Husky D, the Medicaid program for non-disabled, non-elderly, and an income eligibility limit of 138% of the federal poverty level. What the governor signed last year meant more seniors and persons with disabilities could, as of October 1st, get essential at-home services not available through Medicare. Many people think the services are available through Medicare, and they are not. These are services which would keep its recipients out of institutions and less exposed to medical debt, and institutionalization costs more money than the coverage. You heard from Sheldon Taubman about our fellow advocate Brenda, who lives in New Haven. She is facing possible institutionalization. Well, I guess she pretty strongly feels she'll have no recourse if, in fact, the governor is enabled to change and reverse Husky C income limits. We ask why he would want to. Why would representatives and senators support such a move? Why are older adults and persons with disabilities treated so poorly? It's not a money issue. The money is there. We guard, or the focus is on the guardrails, but isn't it important to ask ourselves who's getting thrown over the guardrails? Equity is just a word if the governing body is not willing to put dollars behind it. Please reject proposed changes to HB in HB 5048 that would cut Husky C income eligibility limits. I thank you for your time.
Thank you, Ms. Quinn, for your testimony and your time.
Absolutely.
Is Oralis Guzman with us?
Oralis Guzman.
No. Okay. Sarah Leon.
No.
No. All right. Jeff Shaw.
Good evening, Representative Gilchrist and members of the committee. My name is Jeff Shaw. I'm the Senior Policy Advisor at the Connecticut Community Nonprofit Alliance. The Alliance is the statewide association of community nonprofits. Thank you for the opportunity to testify on the governor's budget proposal. The Alliance respectfully requests that you increase funding for community nonprofits by 5% after providing $50 million to health and human service providers that did not receive the DDS-specific bonus funds in the fiscal 24 budget, a total increase of $186 million. The increases that you fought to provide in the past few years were deeply appreciated by those who depend on the vital services that nonprofits provide in every city and town in Connecticut. However, as you heard earlier, those increases were just the start of a long-term effort to compensate for historically inadequate funding. Since 2007, factoring in the increases, nonprofit providers are still 32% behind the growth of inflation. As an example, while last year's providers received a 2.5% increase on state contracts, just last month the minimum wage rose by 4.5%. Even with this increase, nonprofits have lost ground. Further, according to an Alliance survey, 85% of nonprofits reported that their expenses rose by at least 10 to 20% in the last 5 years, with 22.5% nonprofits reported that their expenses rose by 30 to 40%. An ongoing workforce shortage paired with skyrocketing demands for services means that the crisis is worsening. That same survey found 73% of nonprofits identified being unable to offer competitive salaries as the biggest barrier to recruiting staff. In that same survey, 88% of nonprofits report demand for services increased over the past 3 years. The result led to almost 60% of nonprofits having wait lists for essential services, such as intensive in-home services for children. As you heard earlier, demand for children's behavioral health services is higher than ever. Just last week, the Connecticut Insider reported that hundreds of kids were stuck in the emergency room, and there's a wait list of more than 500 children waiting for the ICAP services, twice as much where it stood before the pandemic. We do appreciate the governor's budget proposal seeks to create a permanent funding structure outside of ARPA funds for urgent crisis centers and substitute crisis centers. As you also heard earlier, last week, a study of some of the state's Medicaid rates were released, which shows that proves the case we've been making for years that the state is underfunding services. So the study clearly illustrates what nonprofits have been saying and facing. Many operate at big deficits and can't afford the market rate to keep and retain clinical staff. For each clinician that can't be hired means that people are receiving less services. The state budget is healthier than ever. Connecticut is projecting a big budget surplus of more than $100 million this year, next year, and every year in the future. Please support increasing funding for community nonprofits by $186 million in fiscal 25. Thank you.
Thank you, Mr. Shaw, for your testimony and your time. Thanks for being there. Is Diane Manning with us? All right. How about Rick Sebastian? Okay. How about Lucas Nascimento?
No, Madam Chair.
Okay.
Queue is
Mark, oh,
Martha
sorry.
Flores.
Okay. Martha Flores, go right ahead.
Marta Flores, presidentes y miembros del Comité de Apreciaciones. Mi nombre es Marta Flores, soy de New Britain, tengo 3 hijos nacidos acá, que son el futuro del mañana. Gracias por la oportunidad de testificar con respecto a HB 548. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky. Estamos aquí pidiendo seguro médico porque no podemos ir a un doctor aunque tengamos un dolor muy fuerte o tengamos condiciones médicas porque los biles son demasiado caros, demasiado costosos, afectan mucho a mi familia porque si no hay salud, no hay tranquilidad. Me ayudaría mucho para que mis hijos estén tranquilos y no estén preocupados que me voy a enfermar y no voy a poder ir a un doctor por no tener un seguro médico. Pido al Comité de Apreciaciones que financie la expansión de Husky para todos los residentes de Connecticut que califican por sus ingresos, independientemente de su estatus migratorio hasta los 18 años este año y el futuro, crear un plan de largo plazo para expandir a todas las edades. Las necesidades de salud no terminan a los 15 o a los 18 años. Gracias por su tiempo. Mi nombre es Marta Flores.
Chairs and members of the Appropriations Committee. My name is Marta Flores. I am from New Britain and a part of Manos Unidas. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak to support of funding and increasing eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18. My name is Marta Flores, and we are asking for health insurance because we cannot go to a doctor, even if we are in a lot of pain, because the bills from the hospital are very costly. This affects my family greatly because if there is no health, there's no peace, there's no life. This would help me a lot because my children will feel calm and wouldn't worry about me getting sick and not being able to see a doctor because I don't have medical insurance. I ask the Appropriations Committee to fund Husky eligibility for all income-eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 nor age 18. Thank you for your time. My name is Marta Flores.
Thank you, Ms. Flores. Thank you for your testimony and your time. At this point, I'm going to turn it over to Rep. Johnson.
Gracias, señora Flores, por su testimonio y su tiempo.
Gracias a ustedes.
Thanks to you all.
Very good. Okay. So, thank you, Marco Flores. We're looking for Marco Vincino Lamachimba. Okay. No, not here. Okay. Next one is Jordan D'Angelo.
Good evening, members of the Appropriations Committee. My name is Jordan D'Angelo, and I am a personal care attendant, PCA, living and working in Winston, Connecticut, and I care for my mother. Caring for others has always been a part of my life. As a teenager, I cared for my grandmother, so when it became clear that my mother would benefit from a PCA, I stepped in. I enjoy caring for her. It makes me happy to know that I'm able to help her, allowing her to continue living in her home and doing so comfortably. That said, the fact that I'm caring for my mother doesn't make it any easier. As a PCA, I am a professional caregiver and deserve to be able to care for myself without it being a large setback for myself and my mother. It saddens me deeply that we work so hard to provide a dignified life for our consumers, yet we are treated with utter disregard by the society we live in. When I was 23, I suffered a heart attack and was taken to the hospital in an ambulance. The ambulance ride was $1,000, and I'm still paying it off to this day, including other medical debt I've incurred in that time. Additionally, the doctor in the hospital at the time urged me to see a cardiologist, but I didn't because I could not afford the cost and the work time I would have lost. Even routine preventative measures are out of the question for me, and it has been so long since I've had a routine cleaning, I don't even remember when the last time it was that I've had one. In addition to not having health insurance, we also don't have paid sick days. We were fortunately able to win paid time off in our last contract, though it is barely enough to cover for minor injuries or illnesses like the common cold and flu, let alone more serious injuries or illness like a heart attack. Our new contract, if it should get ratified, will increase our paid time off up to a maximum of 50 hours. While this still isn't adequate, it is a step in the right direction. High turnover among PCAs due to the lack of benefits also means disruption of care for our clients. They are left to find new PCAs, train them, and build trust and rapport. This is especially difficult with clients who have dementia or similar conditions since they need consistency. PCAs are like family to are like families to us. I apologize. In cases like mine, we are literally family. Both PCAs and the consumers we care for deserve respect. We have been promised so much by the state and have been let down time and time again. Please fund and pass the PCA contract when it comes before you. We deserve to finally live healthy and dignified lives too. Thank you for your time.
Thank you so much for your testimony and waiting so long to testify. Thank you so much. The next person is Jenny Cole.
Thank you, and good evening, Representative Johnson, Senator Walker, Senator Austin, and Representative Walker, and all of the members of the Appropriations Committee. My name is Jenny Cole, and I'm the Advocacy and Outreach Coordinator at the Diaper Bank of Connecticut. Thank you for the opportunity to testify this evening. I'm here to urge you to support increasing the Diaper Bank of Connecticut's allocation of state funding. A diaper is truly not just a diaper, it's a basic need, and the inability to afford an adequate supply of diapers impacts the family's health and well-being of not just the baby, but the entire family. There's health outcomes. Extended periods in a used or reused diaper can increase the risk of urinary tract infections, hepatitis, eczema, and severe diaper rash. Diaper need also has been documented to be the #1 predictor for postpartum depressive symptoms above housing and food insecurity. There's economic outcomes. Families who are unable to afford diapers miss on average 4 to 5 days of work per month, which is about $6,000 a year based on Connecticut's minimum wage. And there's educational outcomes. Children of families who are unable to afford diapers miss out on early childhood education programs, affecting their school readiness and overall development. We are proud of the work that we're able to do here in Connecticut to support families. But with that being said, we are not meeting the entire need in the state. Despite being one of the largest diaper banks in the country, the Diaper Bank of Connecticut currently only serves about 7% of the need. The Diaper Bank's current state funding is $737,000 annually through DSS, which supports our work to serve about 8,000 babies throughout the state. The need, however, is much greater. According to the National Diaper Bank's diaper check of 2023, 1 in 2 families struggle to afford diapers. In Connecticut, over 100,000 children under the age of 4 are enrolled in Medicaid, the majority of whom would directly benefit from our services. We're asking for our line item to be increased to $2 million as our COVID-related emergency funding comes to the end. This increase is imperative to meeting the current distribution levels, addressing the growing need of the growing need in our state, and continue to fund our diaper connection program. This is a program that is first in the nation. It's a partnership between us, the Connecticut Hospital Association, and all of Connecticut's acute care hospitals, in which families are screened for diaper need and connected with resources at birth, with the goals of improving health outcomes for babies and reducing related medical department expenses. A child's health, safety, and security is a worthy investment here in our state. I thank you for your time and all you do for the state.
Thank you so much, and thank you for waiting, and thank you for your testimony and your work. Much appreciated. Next person we have here is Giselle Nino. Oh, no, I'm sorry, Judith Paz. Are they Judith Paz? And neither is Giselle Nino? Okay. Gary Stick? Okay, very good.
I'll take your blessings.
Good evening.
Good evening. My name is Gary Steck. I'm the CEO of Wellmore Behavioral Health. We provide comprehensive services under contract to the state, including outpatient, intensive, in-home, mobile, group home, and operate the state's first urgent crisis center for youth, serving approximately 9,000 residents of Western Connecticut, the majority of which are on Medicaid, living in poverty. I'm here to request that you increase funding for community providers in the coming year by at least 5% for all of our contracts, after providing $50 million to health and human service providers that did not receive DDS-specific bonus funds in FY24, as well as the associated Medicaid rates, and allocate full funding for the urgent crisis centers of $12.5 million to DCF. We hope that you will index future contracts increases to the inflation rate. As I speak, we have about 30 vacant positions, dramatically diminishing our capacity. As an example, our regional ICAPS program has a wait list of 70, which is at half capacity, and little has changed since I testified here last March on this matter. Statewide, the ICAPS wait list, which is the key intensive outpatients. Okay. ICAPS wait list has the statewide ICAPS wait list is over 500. Were we fully staffed, we would serve another 1,000 to 2,000 clients. The good news is, as I mentioned, that we opened Connecticut's first urgent crisis centers for youth, and now we're open 24/7, 365, and the results have been quite promising so far. The vast majority of clients that we've cared for have been deterred from emergency rooms or inpatient stay, and we look forward to presenting more data to the legislature on this key new investment. The UCC is a dramatic change, a new level of care. Typically, 3 years of full funding are provided under a new RFP of this magnitude. We need stable, committed funding, yet again this year, the funding is in limbo. At least $12.5 million in grant funding is needed to sustain the 3 sites. To be clear, same as for our outpatient services, it is our belief this model will never sustain without grant funding. I know that there has been talk, and even in the governor's budget, he mentions that this will be dramatically funded by Medicaid. That has not been our experience, and we currently do not have a Medicaid rate for the service. We're hopeful that there will be greater Medicaid billing and income from third-party sources in the coming years, but these are not in place at this point, and we really do need committed funding. How can you run 24-hour crisis service without committed funding? Thank you very much for your time and for your work and for sticking it out with me here tonight.
Thank you so much for sticking it out tonight and your work. Thank you. Much appreciated. The next person on the list is Carlos Torres. And are you online? There you are, Carlos. Please.
Yes, hello.
Thank you so much.
Hello, Chairperson. My name is Carlos Torres, and I'm a student at Yale University. I'm here on behalf of one of our student organizations, MECHA, and we are supporting the Husky for Immigrants Coalition. Um, Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the human services agencies, specifically the Department of Social Services, which administers Husky, Medicaid, and CHIP. These are really important priorities, which are being funded in the governor's budget for human services agencies. First, I'm here to speak in support of funding an increase in eligibility for all the Husky Medicaid program, for the program, and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to the age of 18 years old. Any expansion to our state Medicaid program has a positive impact on communities, and the cost of this program expansion is minimal compared to the long-term health and economic impacts of the policy. In the last 3 years, we successfully expanded Husky coverage to undocumented children between the ages of 0 to 15, and to undocumented pregnant people, prenatal and postpartum. These policy changes are already having a positive impact on our state. Health coverage means access to preventative care, leading to a healthier state, lower uncompensated care costs for hospitals, and lower healthcare costs overall for the state. Now, we must ensure that more individuals have access to the Husky program. As a child of immigrants myself, who is now going to college in the state of Connecticut, I understand that immigrants come from a variety of ages, careers, backgrounds, and face significant barriers to healthcare. Immigrants are a vital part of the city, state, and nation, and they have been since it was created. As legislators, you must acknowledge that Black, Brown, Indigenous, and immigrant communities have been exploited for their time and labor by state and private actors throughout the history of this state. And in that time, legal precedents have been set that we, as individuals, have responsibility to change, because the state has a responsibility to care for all of the people who live, work, and form the heart of it, regardless of any of their characteristics, whether that be immigration status, race, age, gender, or disability. Because we and our children are the future of this nation, and we deserve to live healthy and productive lives. So I'm really excited to see what we can do here together, and thank you so much for your time.
Thank you so much for your time and effort and being here this evening and waiting to testify. Much appreciated. Next person is Susanna Dos Santos. Oh, okay, moving on to Lori Pasqualini. Pasqualini.
Good evening,
Good evening.
Senator Austin and Representative Walker and the entire Appropriations Committee. My name's Lori Pasqualini. I'm the Chief Financial Officer of Ability Beyond with headquarters in Bethel. We provide services on the western part of the state from the Connecticut River through New York to many departments within the state, Department of Aging and Disability Services, Developmental Services, Department of Mental Health and Addiction Services, Social Services, and many others. I'm here to testify on House Bill 5048 for the budget. We're here to testify to increase the rates for the community nonprofits by 5% to match what was funded for the Department of Developmental Services, total increase of $186 million. We deeply appreciate the rate increases we've gotten over the last couple of years, but recognize that that's not enough. I've got some information on increases that our organization has incurred over the last 4 years. For example, our property liability and vehicle insurance has increased 80% over the 4-year period. Our maintenance costs have increased 56%. Our utility costs have increased 66%. Food costs have increased 69%. And the cost to purchase handicapped vehicles has doubled. And the Department of Social Services has not raised the funding for vehicles, particularly any vehicles, but particularly accessible vehicles. I believe the cap right now is $58,000, and we're paying about $115,000 for accessible vehicles that have all of the requirements to accommodate wheelchairs. The disparity and lack of funding is causing us to pay different wage levels to staff doing the same duties, depending on which funding source they're working in with or funded by within our organization. It's about $2,600 difference in starting wage annually for a full-time person. And it's just not fair to the people working with the people we serve. And even the rates that we're getting are not enough for our staff to live, to provide a living wage without working 60 to 80 hours a week, which many are doing now. Our direct care vacancy rate is the highest currently in our history of 70 years. Prior to the pandemic, we thought we had bad overtime vacancy rates at 9%. Today, it's over 15%, again, with the increased funding that we've gotten over the last few years. We do have specific locations where our vacancy rate is 30%. You've heard other people talk about the issue with caregivers coming in and out. We provide 24-hour care in about 100 settings throughout the state. And when a different person's coming in every shift that they don't know from time to time, it makes it very difficult for the person doing the services as well as the person receiving the services. Our overtime costs have increased 36% over where we were in 2019, and we've had to add shift differentials as the pandemic came about. And this past year, we spent about $610,000 on those. The cost of inflation and wage, pardon?
Kindly summarize, please. We're in 3-minute intervals here.
I'm sorry.
You're
I'll
great.
send you my things. The other piece of the wage disparity is that we do help people get jobs with disabilities, and the rates that we're able to pay that staff is making it difficult for them to get job, which is hurting the Connecticut economy as well. Just to summarize, I just want to say that we really need the funding and cost of living increases built in annually to all of the rates that we get, not just certain ones each year. Thank you for your time, and I appreciate your service.
Thank you. I appreciate your service. Great work. Thank you so much for your testimony.
Thank you.
Moving on to David Santos. Thank you so much for being here, and I'll refresh everyone's recollection about the 3 minutes.
Good evening. I'm Dr. David Santos, and I'm the Executive Director of Covenant to Care for Children. And I'm here this evening to ask you to support the funding proposal for our organization at the level proposed by the governor. Covenant to Care for Children provides a safety net for abused, neglected, or impoverished children in Connecticut by providing essential support in moments that are critical for a child's ability to thrive and a family's ability to stay together. Now in its 37th year, Covenant to Care for Children has provided basic essential goods to over 858,000 children throughout Connecticut. And this evening, let me just share two brief success stories from our work. Covenant to Care for Children recently delivered 2 twin bed sets along with linen to a father in Middlesex County. Bob had gone through a rough divorce, and along with alimony, child support, and mortgage payments, it was difficult for him to purchase beds for his son and daughter when they were staying with him. Bob expressed his appreciation that Covenant to Care for Children existed to provide aid to people struggling through hard times. And then we received this from a social worker. Good morning. I wanted to share a little bit about the 2 families that your program recently assisted. The first, a mother of 4 children, works part-time at a daycare and struggles to meet the family's financial needs. The children did not have beds. Covenant to Care for Children provided new bunk beds along with pillows and linen. It is amazing to see how excited the children were when they received a new bed and the bedding to go along with it. It was also greatly appreciated by the family. The second family were grandparents who recently became their 1-year-old's grandson's foster parents. The house was not baby-proofed, nor did they have the furniture and supplies needed for their grandson. We were able to provide a new car seat and stroller. We also connected the family with a church that graciously donated new baby gates and a gift certificate to purchase new toys. It's been overwhelming, the social worker says, to see the support that this family has received to make the transition of a 1-year-old into his grandparents' home go as smoothly as possible. And again, from the social worker, much thanks and gratitude. Covenant to Care for Children strives to allow kids to be kids in all the positive ways that make for a promising life. Our goods and services are provided to kids that are more likely not to graduate from high school, more likely to face chronic unemployment or underemployment, kids that have a high likelihood of being homeless at some point in their lives without our intervention. And so again, I ask for your support this budget season. Thank you so much for the opportunity.
Thank you so much for your work and staying here to tell us about all the good things that you're doing. Next person on the list is Myra Facunda. Nope. I'm moving along to Sonia Hernandez.
Yes.
No, Sonia Hernandez.
Yes, I'm here.
Oh, hi, Sonia.
Hi, good evening, everybody. Thank you. So dear presidents and members of the Appropriation Committee, thank you for this opportunity. My name is Sonia Hernandez. I live in Bridgeport, Connecticut. I am a mother. I am a fight-back organizer at Make the Rock, Connecticut, where we empower and develop leadership in our immigrant community, Black, Brown, and working class community. Also, I am part of the Husky for Immigrant Coalition. Thank you for the opportunity to testify in favor of the HB 5048, an act adjusting to the state budget for the biennium ending on June 30, 2025 for the Department of Social Service, with administrate the Husky Medicaid and CHIP. As an immigrant mother from Honduras with 3 children who have health insurance, I am related to know that my children can go to the doctor even I have to pay co-payments. But as a parent with temporary status to work legally in this country, I am lucky that I can obtain health insurance through my job and benefit my family. This benefit saved the life of my husband, who contracted COVID-19 and was hospitalized for 3 months. This affects his nervous system and left him paralyzed with lifelong consequences. We have to pay a bill of $2,000 co-payment to stay in the hospital and the ambulance, which the insurance did not cover. Just thinking that I could have lost my husband and my children lost their father make me sad when I remember and I think I have not have insurance. Through my job, he will not be here, and also he will not have access to the care that he needs after he is discharged from the hospital, like therapies, follow medical appointments to specialists, a prescription that he has to buy for the rest of the life, and we have to pay monthly. I work with immigrant and mixed status families daily. I listen to the women talking about their struggling with reproductive and preventive care. I listen to parents, their concerns about their children, their medical debt, that they cannot go to the primary doctor appointments, the prescriptions that they cannot pay, when they're giving referrals to specialties who cannot provide follow-up because they cannot pay. Who sometimes they has a broken tooth. They has a lot of pain that they cannot go to the dentist because they don't have access to care. I hear some seniors that they have has health insurance due to the pandemic, but now they don't have it because they cannot renew it because they don't have a status. There are so many stories, so many people, residents that they don't have health insurance. Because if you are permanent resident, you cannot apply for the Husky if you are not 5 years with the resident. You will hear today so many members. You will express their concern and stories that they'll tell you today. That one children can go to the doctor and the other cannot go. It breaks my heart because as a mother, I wonder if my children will go to the same thing, what I will do. Do you know that most of the undocumented go to the emergency room? Not because they want it, it's because they don't have other options. Sometimes it's too late when they go to the emergency doctor and they'll tell a diagnostic or a chronic condition that they didn't they cost their life. The immigrant families, we are vital part of this community of Connecticut. The health of our members matter.
So appreciate your testimony. You're really telling us very, very good information, but you've exceeded your time. Could you please summarize?
Yes. So I understand that it's hard for you to sit here and listen to all this drama and being sharing, but some people will walk out from this room and forget about it. But us as a community undocumented, we cannot escape this pain and we live every day. I ask you appropriation committees to fund Husky, the eligibility for all income qualified residents regardless their immigration status or age. Thank you.
Thank you so much for staying and testifying, and thank you for sharing all your concerns and your stories. I really appreciate it.
Thank
The
you so
next
much.
person- Thank you. Take care now.
Thank you.
Julia Rosenberg is the next one here on the list.
Thank you so much, Representative Johnson, chairs and members of the Appropriations Committee. My name is Dr. Julia Rosenberg. I'm a pediatrician and a lifelong Connecticut resident who works in New Haven. Thank you for the opportunity to testify regarding HB 5048. And thank you for taking the time to listen to testimonies of so many today and your dedication to the health of the Connecticut community. Today, I join the chorus of our neighbors supporting Husky eligibility expansion and requesting that the budget include sufficient funding to expand Husky through at least age 18 to those who are income eligible regardless of immigration status. I also ask that you secure the necessary funds for Husky without cuts, as has been discussed by many here tonight. As a pediatrician, I have a simple mission: to provide compassionate care for all children and families. However, because not all undocumented children are currently eligible for Husky, this is not possible for many in our state. I've had the honor over the past year to deliver some great news to many families with young children that their children are now eligible for healthcare and insurance. But I've also seen disappointment, including families with some children who are eligible and some who aren't. And while I can share the stories for the children I have seen, I continue to worry for the families I do not see. I want to implore you to have this be the last year that our neighbors share heartbreaking stories of missed essential healthcare with real life-threatening consequences. We should be hearing these stories in our pediatricians' offices, not in the Capitol, not on Zoom, and not when it's too late for them to receive the care that's needed. We also know that children's health suffers without insurance coverage. Compared with uninsured peers, insured children do better in school, have more successful careers, have better health as adults, with fewer costly and painful chronic conditions. What's more, there's something known as a welcome mat effect. In our many neighboring states who have rolled out the welcome mat with health coverage now for all children, there's now infrastructure that provides healthcare access for all children, regardless of documentation status. And we see data that there are also benefits for all children, regardless of documentation status. That means all children in those states like our neighbors, Massachusetts, New York, Vermont, Maine, Rhode Island, and now many more, have less foregone care and more preventive visits. I do not want to have to tell another family that their children's recent birthday celebration disqualifies them from receiving essential health care. Childhood does not stop at 16. We support Husky coverage for undocumented individuals through at least 18 to ensure that we keep our state's future and our children healthy and thriving. Covering all children makes sense for individual health, financial health, public health, but most importantly, healthcare is a human right. Thank you for your leadership and for your thoughtful consideration and time.
Thank you for your amazing work and also for staying up this late and providing us with this information. You're much appreciated. Thank you so much.
Thanks for your leadership and service.
Next person is Tracy Madden Hennessy. No? Okay. Moving on to Cynthia Ortiz. Mark Sangria. Yes, is Mark here? I didn't see Mark on the list.
Mark, can you hear us?
Maybe you should unmute. I don't see his name here.
Hello.
Oh, hi, there you are. Very good.
Hi.
Please proceed.
Sorry about that.
No worries.
Hi. Good evening. Senators, representatives, and all the members of the committee. My name is Mark Sanagera. I've been a personal care attendant from Vernon for the past 7 or 8 months. I started doing this work because I love to help people who need help. And as a PCA, I am a consumer with their activities of daily living, like cleaning, running errands, doing laundry, and helping her to get to doctor's appointments. I'm proud of what I do, and I'm here to ask you to fund and pass the PCA contract because it will raise wages from $18.25 to $23 an hour in the next 2 years. Increased wages would help with the ability to afford some of the outside expenses for being a PCA. For instance, I put a lot of miles on my car each day. I spend a lot on gas and have more wear and tear on my car than I ever did. My consumer doesn't drive, so I have to drive sometimes well over 100 miles a day. Retirement benefits would be important to me because I need to be able to start to build a nest egg. As it is, I have to keep working to make ends meet. Funding higher wages would also help my consumer because would be able to get more help with her needs, and workers would stay because they would feel valued and respected for the work they do. Please fund the PCA contract. Thank you for your time. Good evening.
Thank you very much.
Thank you.
For being here, and thank you for sharing your information. The next person on the list is Nancy Rembert. Not there? Oh, she's there.
Hello?
Okay,
Yes.
Okay.
Hi, I'm sorry.
No worries.
Can you hear me?
Okay. Yes, I can hear you. Yes, please go ahead.
Hi, good evening, and good evening to you, and good afternoon. I'm sorry, good evening. My name is Nancy Rember, and I'm a PCA from New Haven. I have been a PCA for the last 2 years. I love being a PCA because I love helping people. I love the fact that I can give people the independence and the comfort in their own homes. As a PCA, I help my consumer with activities in daily living like cleaning, washing, preparing his meals, prompting him to make sure he's independently provides himself for his daily care, which including showering and taking his meds. The service are important because they allow him to live home independently, comfortably, and peacefully. With these services and me providing them, he will end up in a long-term care factory. I love my consumer because he gives me the opportunity to work for him, which allows me to take care of myself. He's very easy to work with, and he appreciates what I do and gives me the most up respect. Unfortunately, because of the low wages and uncomfortable, affordable health, unfortunately, the benefits such as the unaffordable health care, pension, and sick time, I feel that the work that I do is being unvalued, unappreciated, and not respected. I'm a young, independent woman who's educated with a bachelor's degree, and I feel that should be rewarded as such. Most people that is PCAs are really not, or most of them are not educated. And I think we should get the respect that we deserve. Luckily, the state is starting to recognize the work that we do as PCAs. Finally, we have a new PCA agreement. We'll be rising wages from $18.25 up to $23 an hour over the next 2 years. This is important because our wages allow us to provide better care for our consumers and also for myself and my needs. I struggle from paycheck to paycheck, paying bills, rent. Also, it's hard for me to afford groceries and affordable transportation. I'm forced to live in a crime-affected area and jeopardize me as a woman puts my welfare in stake. Fundings and passing this PCA contract and waging and rising my wages allows me to live in a safer community. Please hear us and thank you for your time.
Thank you very much for your testimony this evening, and thank you for taking the time and being up with us this evening.
Thank you.
Thank you so much. The next person is Liz DuPont-Deal. Do you see her on the list? No. Okay. Suzanne Plugowski.
Good evening, Representative Johnson, chairs and members of the Appropriations Committee. Thank you for being here for such a long evening and for all that you do for the people of the state of Connecticut. I'm Suzanne Kulagowski, President and CEO of ARI of Connecticut. We provide services for individuals with intellectual and developmental disabilities in Stamford. We have remained intentionally small, following the dreams of our founders to serve the Stamford community in a family-like setting. We currently serve 46 individuals in our residential program and roughly 90 in our day and vocational programs. Thank you for the opportunity to testify on House Bill 5048, the governor's budget. I'm here to tell you that the governor's budget is inadequate and request that you increase funding for community nonprofits by 5% for a total increase of $186 million. While we appreciate the increases from the legislature over the last few years, much of it has been restricted to wages and benefits, which was greatly needed, especially during the pandemic, but it doesn't help us with any of our other expenses. The other increases have been far short of what we need to provide the high-quality services our consumers deserve. We continue to be hit by extraordinary increases in our costs that outpace the rate of increases the legislature has provided by 32%. And our staffing crisis, add our staffing crisis to the financial crisis, and you have a real catastrophe. The staffing shortages mean that we have been unable to accept new individuals to our day program, and we have cut back on community outings that require higher staffing ratios. I'm sure that you are aware that last week, a study of some of the state's Medicaid rates was released by the executive branch. The study provides devastating proof that Connecticut is spending less than half of what comparable states are spending for behavioral health services. This may have come to a surprise to you, but it certainly was no surprise to providers. I've been in this field for over 40 years, and I can honestly and very sadly say that we have gone backwards. The services we were providing in the 80s were far superior to the services we are providing now. We can't pay for qualified staff, managers, or clinicians. Positions are left vacant for months upon months. When we can't hire staff, we can't provide services, and people sit at home watching TV. This is not a system that the state of Connecticut should be proud of. When I receive calls from parents looking for services for their children who live in other states and are planning moves to Connecticut, I tell them that if they haven't already bought a house or found a job, don't come. They won't get services. We desperately need to improve the services for individuals with disabilities in this state, and we need to do it now. Please support a substantial increase in funding for community nonprofits by $186 million in fiscal year 2025. I thank you for the opportunity to testify this evening, for your time, and for your service to the state of Connecticut. Have a good evening.
You too, and thank you so much for your testimony and telling us all about the impact of the budget. Next on the list is Janae Rodriguez.
Good evening, presidents and members of the Appropriations Committee. My name is Journey Rodriguez. I'm from Danbury, and I'm part of the CT Students for a Dream. Thank you for the opportunity to let me testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025 regarding Human Services Agency's budgets, especially for the Department of Social Services, which administrates Husky, Medicaid, and CHIP. There are important priorities funded in the governor's budget for human services agencies. I'm here to speak in support of Medicaid program and ask for the Appropriations Committee to fund the expansion of the program to fund Husky eligibility for all income qualified CT residents, regardless of your immigration status and up to the age of 18. As a dedicated student and a member leader of CT Students for a Dream, I find significance in contributing to the well-being of those in need. It holds importance to me to actively engage in supporting individuals who require assistance. The lack of insurance has a profound impact on numerous individuals within my community, including my own family. For instance, my mother often holds back from seeking medical checkups when she feels unwell due to the fear of being unable to afford the medical expenses. Consequently, her health has been compromised on several occasions as a result of not receiving timely medical attention. There was an occasion where she had a surgery, and after the surgery, the bill was very high. It was almost $40,000. My parents had to pay the whole bill, leaving them in a lot of debt. The circumstance is fundamentally unfair because everyone deserves the right to access health care, and individuals should not have to give up essential medical care due to financial concerns. This invaluable opportunity empowers tax-paying families to enact meaningful changes to prioritize their physical well-being by ensuring prompt access to health care. Individuals can prevent the spread of illness and safeguard their own health, ultimately benefiting from both themselves and their community. I ask the Appropriation Committee to fund the expansion of the Husky program to all income eligible CT residents regardless of the immigration status and up to the age of 18 this year, and in the future to create a long-term plan to expand to all ages. Health needs does not end when you are 15 years old or 18 years old. Thank you for your valuable time and have a good night.
Thank you so much for your testimony and staying up and sharing your stories with us. We would appreciate it very much. Okay, next person we have on the list is Brenda Moore and Barbara Luna, Margaret Doherty, Karina Banhauer. Karina.
Yes, I'm here. Hi, thank you. Came up quick. Hi, my name is Karina Bandhauer. I am a professor at Western Connecticut State University. I'm a sociologist. I'm also the coordinator of the Undocu Ally Task Force, which is essentially undocumented student services. I'm here to talk to you tonight in full support of HB 5048. In particular, I wanted to call your attention back to speaker number 108, Enmi De Leon. She caught my attention because she was a high school student from Danbury. That's exactly the student that is going to walk through my door in 2 years at Western Connecticut State University. These are the challenges that the CSUs all face. I can't pretend to speak for all CSUs, but I know that we all face the same challenges. Last semester, I taught a course with 23 students, and they were from 19 different countries. This is our reality in the state of Connecticut. And I don't want to instill fear in anyone by saying that number. That's astounding, right? But I want you to embrace this. Our reality is, and the governor knows it, that we have a workforce shortfall. We don't have enough workers in the state. We need these immigrants. We need them in our universities. We need them in the workplace. There is a lot of unemployment, and these are the folks who are coming to our state to fill those roles. They're part of our Connecticut family, and that's just our reality. On top of that, I also specialize in immigration in Latin America, and I wanted to just point out for those in question that immigrants universally pay taxes. Most of them do pay federal and state taxes, despite what people may think. And on top of that, over the years, I've had many students from immigrant families, whether the students were undocumented or not, drop out of school because of family medical emergencies, because they couldn't pay for bills, they couldn't pay for college and pay for health care. On top of that, students at my university and all universities who come from mixed status families, whether or not the student themselves is undocumented, suffer from a much higher rate, 4 to 7 times the normal rate of mental health care issues. So pushing out the date or the age for healthcare qualifications in the state of Connecticut is going to lower the stress level for these students. It's going to encourage our workforce. I just want to really encourage us to think of this as not just a humane thing. My heart is, of course, with the humanity of this, but it's also a fiscal responsibility. When people cannot pay for their health care because they don't have insurance, they go to the emergency room. Then that gets shouldered onto hospitals. That's not fair either. So I just, again, implore you to support HB 5048. I submitted testimony. I'm sure I'm more eloquent in my writing. It's a little late, but I really appreciate your time and thank you for letting me speak.
You did a great job, and I really appreciate your information and your work. And thank you so much for staying up and being with us this evening.
Thank
The
you.
next person is Maria Cortez. Is Maria here? No? Okay. Cal Patel? All right. Norma Martinez Hossain? Okay. Jim Schimmerling? Jim Schimmerling? Okay. Katia Ruista Daly. She's there. Oh, there you
Hello?
are. See you now? Yes, please proceed. Good evening. Thank you for being with us.
Yes, good evening. Thank you. So good evening, chairs and members of the Appropriations Committee. My name is Katia Ruesta Daly, and I am a resident of Vernon, and I'm also a graduate student at the UConn Social Work Program. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, concerning the budget of the Human Services Agency, specifically for the Department of Social Services, which administers Husky. Essential priorities are being funded by the governor's budget for Human Service Agency, and I am here to support funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to the age of 18. I want to share with you all tonight, this evening, a story from when I was in high school back in 2012. At the time, I was 16 years old, and I was undocumented and did not have insurance. I used to play for the volleyball team in my high school, and I was always very cautious about not getting hurt in practice or games due to me not having insurance and me being undocumented. Unfortunately, I was not careful enough one of these evenings while warming up for a game. I sprained my ankle. I kept my injury under grabs, like to myself, and continued playing despite having this swollen ankle for about 2 sets. Only when the pain became unbearable and I began limping is where my coach noticed and took me out of the game. And she pulled me out of the game and questioned as to why I hadn't informed her of my injury earlier. between tears, and I had to confess to her that I was afraid of the consequences of my sprained ankle. At the moment, my concern wasn't only solely for the pain and the swollenness of my ankle, is that it was more worry about the financial strains it would place on my parents. I was very aware that we couldn't afford the expenses of the x-rays or a hospital visit. The coach helped me and provided me with support to ensure that I would get treatment. I saw the school sports therapist the following day and received financial assistance from the high school to cover the costs of crutches and medications and everything that I need to come after to treat my injury. I was relieved that that help was available, but unfortunately, not all students or young people here in Connecticut have access to these resources. This increase in funding for the Medicaid program not only will ensure affordable healthcare access to numerous undocumented youth, but also alleviate the fear that many face when seeking medical treatment. I asked the Appropriations Committee to fund the Husky eligibility for all eligible Connecticut residents, regardless of immigration status, up to the age of 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare does not end at age 15, 16, or 18. Thank you for your time.
Thank you so much for your testimony and your time. Much appreciated. We're going back now to number 192, Susanna Dos Santos. And Susanna, are you there? Well, Susanna appeared, and I was told that she was here. So is she there? Susanna, is she on her way? Where? I don't see her. Okay, go ahead, Susanna. Please proceed. Maybe you need to be unmuted or something. I don't see her on my list on the my screen.
Okay, I just unmuted myself.
Oh, there we go. Now you.
Okay, yeah, I'm here.
Please proceed. Go ahead.
Good evening, State Representative Johnson, Senator Lesser, and Senator Turjak, and members of the Appropriations Committee. My name is Susanna Dos Santos, and I'm a nurse at Secure Care Options 60 West in Rocky Hill, Connecticut. I have worked there for 9 years, and I also work throughout the state for staffing agencies. As an LPN, I provide my residents with medication management, monitoring for any changes in health, end-of-life care and comfort, and I make sure to keep them safe. I also make sure their needs are met, making sure I advocate for them if necessary. I love my job because I get to make a difference in my residents' life, be it just a smile and or showing compassion, sometimes a good laugh. I love listening to my residents' stories, sometimes funny and sometimes sad, and I love being able to provide a good bedside manner. I am here today to ask you to allocate more funding to nursing homes so that we can hire more permanent staff and not depend solely on staffing agencies to make sure our homes have staff coverage. More funding would help me give the best care because we would be able to raise wages and hire more staff, which in turn would make sure my residents' basic needs would be met. They would be kept safe and attended to in a timely manner. All of these improvements would give them a better quality of life. Being at LPN is hard. We work short constantly, and when we work short, residents don't get the care they need. Staff get stressed and burnt out because the workloads are heavy and demanding, and it feels like management doesn't care or make changes when we need them to. When issues are left unresolved, that frustration comes home with you, and it becomes hard to leave it at the door. In addition to that, nurses are carrying a lot of stress on their back, neck, legs, and more. The work is mentally and physically exhausting at times. Not to mention when pay is so low, I have to work 3 jobs and I don't have time to spend with my family. Addressing staffing shortages in nursing homes can save lives. Please fund our nursing homes so that we can provide the care we know our residents deserve. Our residents are in crisis every day. They feel forgotten, and workers like me feel left behind after decades of underfunding this industry. Do the right thing and fund workers in our nursing homes. I would like to share a quote by Dalai Lama. Man surprised me most about humanity because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he is so anxious about the future that he does not enjoy the present. The result being that he does not live in the present or the future. He lives as if he is never going to die and then dies having never really lived. Thank you for your time.
Thank you for that quote of inspiration. Very good. Okay, moving on to number 195, Myra Bakunda. Are you there, Myra? And
She is not accepting the promotion, Madam Chair.
okay, well, we have to accept the promotion, or we can-
Mayra Faconda, por
there
favor,
you are. You did
acepte.
accept the promotion, no?
No, that's translating.
Oh, okay. All right, all right. Moving over to Ann Olson. 217. Is Ann there?
I am. I'm here. Can you hear me?
All right. Yes, I can hear you. All right, please proceed.
I don't know why my camera's not working. That's weird. Oh, there I am. Hi. Thank you so much, Representative Johnson, Senator Lesser, chairs and distinguished members of the Appropriations Committee. I've spoken with you previously. My name is Ann Olson. I'm speaking as a member of the Government Relations Committee with the Connecticut Association for Healthcare at Home. I've been a nurse for 43 years. Crazy to admit that. And I've been in leadership roles in home health for 32 of those years. And I'm really privileged to be here tonight on behalf of our industry to really talk about the unsustainable shortfall with the home health Medicaid reimbursement. My experience.
Oops. Yeah, I think you muted yourself. Oh,
Sorry.
go ahead.
My experience has been at 5 of the largest home health agencies in the state. And each of the agencies I worked with serviced the Medicaid population, really dedicated to quality, comprehensive care to Connecticut's really most vulnerable. I've spoken to this committee, as I said, several times, and unfortunately, the inadequate funding and costly operational burdens that have been placed on agencies have not been addressed and really put patients at risk for access to necessary care at home. I recently joined Yale New Haven Health at Home as executive director, and although I'm not speaking on behalf of Yale New Haven Health System, I'm able to share that the challenging Medicaid situation at Yale has caused financial issues and stability challenges for our agency as well. Many other agencies have had to restrict the number of Medicaid patients they accept, and this in turn has caused Yale New Haven Health Home Care to accept a higher percentage of Medicaid. Currently, our
Oh, you muted yourself again. You're muted.
I don't know how I'm doing that. It's like there's a magic wand here. That's weird. I'm so sorry.
No
Our Medicaid is about 18% of our total census. We had a loss of $1.3 million to care for Medicaid home care population in fiscal year 23. $18,000 had to be written off because social work services are not covered by Medicaid. And I think we can agree that social work is a critical service for Medicaid residents struggling for health, financial, psychosocial, and emotional issues. There are additional uncovered Medicaid home health costs, workforce shortages, escort and care costs for high-risk residents, and regulatory operational burdens with EVV, $10,000 per year conservatively. So we recognize balancing the budget is challenging, but we respectfully request that home care Medicaid reimbursement be addressed to ensure access to necessary care. We're looking for an increase to the current home care Medicaid reimbursement rates. Really would appreciate consideration of a consistent annual provider rate increase to account for COLA and inflation, and establishment of a Medicaid home health social work visit reimbursement, which does not currently exist. I really appreciate the opportunity to speak so late tonight and for your consideration, and happy to talk with any questions. Thank you so much.
Thank you so much. Really appreciate your staying and sharing this information with us. Thank you so much.
Thank you.
Moving on to Melanie Wild Lane. Is Melanie there? No. Melanie's gone. Carlos Luna.
Buenas noches.
Please proceed, Carlos.
¿Me pueden ayudar con el equipo de facilitación, por favor?
Are you unmuted, Carlos?
Carlos, puedes comenzar a hablar, la interpretación ya te está escuchando.
Gracias. Buenas noches, presidentes y miembros del Comité de Acción. Soy estudiante de Danbury, miembro de Constitución. Gracias por la oportunidad de testificar sobre HB 5048, una ley que ajusta el presupuesto estatal para el bienio que termina el 30 de junio del 2025. Con respecto a los presupuestos de la Agencia de Servicios Humanos, específicamente para el Departamento de Servicio Social que administra Husky Medicare y CHIP, hay importantes prioridades que se financian en el presupuesto de la Agencia de Servicios Humanos. Estoy aquí para hablar en apoyo de la financiación de un aumento en la elegibilidad para el programa Husky Medicare y pedirle al Comité de Apropiaciones que financie la elegibilidad de Husky para todos los residentes de Connecticut elegibles por ingresos independientes de su estatus migratorio hasta los 18 años. Soy Carlos Luna y me importa porque una de las experiencias que tuve por falta de seguro médico fue que mi hermana no pudo ir al dentista porque mis padres tienen miedo de lo que pueden gastar y el problema aumenta. Nos ayudaría muchísimo, ya que hay personas que necesitan ir al médico por problemas muy fuertes y sería un alivio para nuestra comunidad. El Comité de Asignaciones que financie la elegibilidad para Husky para todos los residentes de Connecticut elegibles por ingresos, independientemente de su estatus migratorio hasta los 18 años este año, y que en el futuro cree un plan para abrir el acceso a los inmigrantes independientemente de su edad. La necesidad de atención médica no termina a los 15 ni a los 18 años. Gracias por su tiempo.
Chairs and members of the Appropriations Committee, my name is Carlos Luna. I am a student from Danbury and member of Connecticut Students for a Dream. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025, with respect to the budgets of the Human Services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding and increasing eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. and Carlos Luna. And I care because one of the experiences I had because of the lack of health insurance was that my sister cannot go to a dentist because my parents are afraid of what they can spend, and the problem increases. It would help us in a very big way since there are people who need to go to the doctor for very strong problems, and it would be a relief for our community. I asked the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year and in the future, to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 nor at age 18. Thank you for your time.
Thank you so much for your time and have a wonderful evening.
Gracias por tu tiempo, Carlos, y que tengas unas buenas noches.
Next person is Zena Castillo. Okay. Obed Sierra.
Here.
Good evening.
Good evening. Good night, chairs and members of the Appropriate Committee. My name is Obed Sierra, and I'm a Stanford resident. I'm a lead member of Connecticut Students for a Dream, and I'm also part of the Connecticut for All Coalition. Tonight, I'm also here supporting the Husky for Immigrants campaign. Thank you for the opportunity to testify regarding HB 5048. I am testifying in support of funding and expansion in eligibility for the Husky Medicaid program and asking the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to the age of 18. I am testifying in, Stanford has been my home for 12 years now. My parents decided that we were staying to give their 4 sons a chance for a better future. They worked really hard to give us that chance, and their hard work allowed my brothers and I to go on to a higher education and plan for ourselves a better future and continue building onto a better life. There were many moments that we struggled to obtain medical attention or access to healthcare due to the cost and burden that this presented to my parents. Parents across the state shouldn't have to decide between caring for themselves, providing for their family, and getting care for their children. This weight burdens our communities, and I say ours because we are Connecticut residents. In the past year, I've had the opportunity to assist in registering families that were eligible to the Husky program, and the need is there. The need to expand the program is there again. We are here tonight, and we'll be here tomorrow because we are demanding a change in the law and an increase in the budget, because not expanding the access to the program is not costing our communities money. It comes at the expense of our lives, health, stability, and future. These changes are an investment in a healthier Connecticut. Thank you for your time. Have a great night.
Thank you so much for your evening, your testimony rather, and have a good evening. Moving on to David Morgana Jr. Okay. Rhonda Beauvais.
I'd like to address the Subcommittee on Human Services for the Appropriations Subcommittee on House Bill 5048. You have to excuse me, I'm really tired.
No worries, we're all in the same group here.
All right. My name is Rhonda Boisford, and I am the owner of Pleasant View Manor in Watertown, Connecticut. I am a member of the Connecticut Association of Residential Care Homes, and I am here today to support the governor's added funding for residential care homes while urging the legislators to ensure all homes receive an increase in their rates. Specifically, I want to urge you to provide funding to the residential care homes for inflationary increases. Our home cares for 18 residents and all have a psychiatric diagnosis. We provide 3 nutritious meals and 3 snacks each day. We have laundry services, housekeeping, and transportation to appointments. We also include recreation, hairdresser services, and an in-house licensed therapist who comes in weekly. For 10 years, our home dealt with a rate freeze. That challenge was tough and we had to make some painful budget choices. One of the budget choices that was painful for myself was I had to use my credit card, my own personal credit card for making ends meet on several occasions. So the challenge was tough. And when taking care of others, it's important to keep good staff. To reach that goal, we need staff need benefits and yearly raises. It takes special people to work with our residents. Our food costs have grown immensely. Rates are not keeping up with inflation. Recently, we received a visit from the health department that covers our area, only for them to impose new costs. Example, the health department that oversees us recently informed us that our countertops needed replacement and they requested stainless steel with the deadline of April 30th of this year. We provide a critical service for some of the most vulnerable people at a low cost. All our homes in Connecticut must get by with rates that are not keeping up with the costs. Typically, our residents are state funded, making it difficult to cost shift and make up for our low rates. I continue to ask for your support of residential care homes.
Wonderful. Thank you so much for your work and staying here and joining us with our tiredness. Thank you. Thank you. Maritza Contreras, rather. Is she here? Okay. Susan Brosseau. Elizabeth Picasso. All right, Elizabeth, please proceed.
Good evening, everyone, and thank you, Senator Johnson, chairs, and esteemed members of the Appropriations Committee. My name is Elizabeth Picasso, and I'm a policy intern with Reproductive Equity Now, an organization that works in Connecticut and across New England to advocate for equitable access to full spectrum reproductive care for all. I'm also a medical student, a public health student, and a daughter of an immigrant family. Connecticut's General Assembly has made strides in providing affordable health care for young children, pregnant people, and postpartum individuals through Husky, regardless of immigration status. I'm here today to encourage you all to continue to make progress towards health equity across Connecticut by funding Husky eligibility for all income eligible residents, regardless of immigration status, at least up to age 18, and to oppose the governor's proposed budget to reduce Husky income eligibility to protect the health of all residents of Connecticut. As some of you may know, immigration status is a strong predictor of whether someone will access healthcare and use preventative services, which is strongly related with not being able to access insurance. More often than not, many people without documentation will go most of their life in the United States without seeing a physician or other advanced practice provider outside of the emergency room. As Dr. Rosenberg mentioned earlier, her research found that children extended eligibility states were less likely to have unmet medical and dental care and more likely to have preventative visits. Dr. Rosenberg's work highlights the importance of this funding for Husky. Children not receiving medical care or preventative health services is a public health concern and will continue to follow these children for the rest of their lives. Relating specifically to reproductive care, early childbearing is associated with lower rates of high school completion, higher rates of preterm births, and higher rates of low birth weight. Among U.S. citizens, we can already see the disparity between adolescents of high and low socioeconomic statuses, where those of low socioeconomic statuses are less likely to receive an abortion. This is only exacerbated when a child does not have access to health insurance. Expanding Husky to all income eligible residents is the first step in tackling the social determinant of health that has continued health consequences for the residents of Connecticut. We've already seen expansions like this take hold in other states, including California and Illinois. Even though a fourth of all undocumented immigrants in the country reside in California, their enrollment is only 137 million children. And they note that this is also the least expensive group to insure within California because children tend not to have chronic diseases, and this care can prevent future chronic diseases. Funding Husky eligibility for all income eligible residents, regardless of immigration status, up to age 18 is not only common sense legislation for Connecticut, but it is an obligation we have to protect children and see them thrive in the future. This is the first step to ensuring that immigration status is not a social determinant of health in Connecticut. I encourage the Appropriations Committee to also oppose the governor's proposed budget to reduce Husky income eligibility to protect the health of all residents in Connecticut. Thank you so much for your time and have a good evening.
Thank you so much for your testimony and staying with us this evening. Much appreciated. The next person on the list is Chris Butler. Is Chris Butler here? Okay, moving on. Curly Ramu. Cynthia Scully. Elgilcar Paez. Isabella Montero. Zaire Garcia. Brian Hespe.
Madam Chair, we have number 214.
214 is here with us now?
Yes, please.
Okay. 214 is Nishali Alamo.
I'm here.
Hi, how are you?
Hi.
Please proceed.
Thank you for the opportunity to provide testimony today regarding the Human Services Agency's fiscal year 2025 budget. My name is Nashley Alamo, and I am a clinician for the Village for Families and Children, an affiliate site for the Child First program. The Child First program is an evidence-based early childhood mental health in-home program. It helps families and children build nurturing relationships that heal and protect young children from the impact of trauma and chronic stress. With the significant work that Child First does, it is important to note the loss of half of our clinical teams, in addition to a wait list of 67 children, the longest wait list at our site. The development of the Child First model has been informed by scientific research that has shown the critical importance of the psychosocial environment in the formation of the brain structure. By the time a child reaches 3 years of age, 80% of the brain growth is complete, forming the foundation for all later brain development. And so high-risk environments, including child abuse and neglect, maternal depression, domestic violence, substance use, homelessness, and other type of risk often lead to levels of child stress that are toxic to the young developing brain. This adversity leads to long-term damage to brain structures that result in behavioral and emotional problems, decreased learning and memory, and poor health throughout the lifespan for children. So with more staff in the Child First program, we can change the trajectory for young families and children. Here's a story during my time with Child First. I worked with a family in which the child identified as a survivor of homicide victim. He was exposed to gun violence that led to the tragic death of his father. I supported the child in sharing his story through play and helped the family process their grief. After treatment, the child was better able to function in all areas of his life with significantly less behaviors. His development was on point, and the caregiver, which was now the grandmother, was able to help support his experiences, and the family worked through the trauma, which also strengthened their attachment. So given this information, Child First can benefit from additional clinical teams to continue helping families thrive, and continued funding can allow life-changing opportunities for families. Thank you.
Thank you so much for your testimony. Very insightful. Next person on the list, I think, we're at 235 now. Chris Pankratz. We have 237 here. John O'Connor.
Hi.
Oh, Chris, I'm sorry, Chris. Go ahead.
Good evening, chairs and distinguished members of the committee. Thank you for your time and the opportunity to speak this evening. My name is Chris Pankratz. I'm Chief Executive Officer and co-owner of Masters in Home Care. We're a licensed and certified home health care agency specializing in providing skilled medical services in the home for the growing older adult population since 2014. I'm testifying before you today to ask your consideration in two key areas. First, improving the Medicaid reimbursement for skilled medical services provided in the home. And second, for funding to improve the safety of home health care workers providing that care. As many others have testified before me today, caring for the Medicaid population at the existing rate structure is at a tipping point. What's at risk are access issues and a resulting cost shift to other more costly areas of our healthcare delivery system. For agencies to continue to provide services to our clients, Medicaid rates need to keep pace with our inflationary operating costs and account for rising costs of care as well as a workforce shortage. Increases to Medicaid rates should be indexed to the federal CPI to preserve access of these cost-saving services to patients and for the longevity of the program. For a home health care agency, reliance on Medicaid reimbursement, as you've heard, is highly problematic as the cost of wages and operating continue to rise but reimbursement rates have remained static or decreased. As demand continues to grow for our services, providers are forced to seek out other higher sources of reimbursement to remain in business. As a comparison, the current average rates from the Connecticut Medicaid program are an average of 58% less than the corresponding Medicare home health fee-for-service national rates. The result is we're moving towards a model where fewer providers will be able to service this population, and those Medicaid beneficiaries will continue to experience an erosion in service and service availability. Care providers are also in need of funding for enhanced worker safety protections. We need solutions which take into consideration that providing medical services in the home is unique. That environment is not within an agency's control in terms of staff safety. To address this, the following two requirements would have an immediate impact on our ability to better safeguard our caregiving staff. To require greater transparency of our referral information as a home health provider. We need complete picture of the patient, including safety-specific information so we can identify areas of risk and provide the adequate safeguards to a caregiver during a home visit. And second, funding in the form of an additional reimbursement or an add-on rate for situations deemed as high risk by the providers. From a security measure point of view, one size does not fit all, and care providers and staff are in the best position to determine when additional safety measures are needed. And then they need the funding to provide those measures at their discretion. I respectfully request that the committee consider these funding requests for improved safety of our home health care workers and to strengthen the Connecticut Medicaid program for home health services now and in the future. I've also submitted written testimony with some additional details that I hope will be taken into consideration. Thank you for all the work you do for the state of Connecticut and for the opportunity to present this testimony this evening.
Thank you so much for your testimony this evening, and have a great evening. Thank you so much.
Thank you.
And I'm sorry I skipped over Lisa Perry Swain, so please unmute yourself and proceed.
Good evening, members of the Appropriations Committee. Thank you for staying on the call so late. My name is Lisa Perry Swain, and I am the Executive Director of the Connecticut Foundation for Dental Outreach that hosts the CT Mom free dental clinics each year in various portions of the state for the underserved communities. I'm here to support the governor's proposed budget adjustments, but I'm here more specifically to request support for our foundation and our efforts in free dental care for the communities of Connecticut. We are asking the state to consider approval of $500,000 as annual support for the CFDO and our clinics because finding funding for these clinics has become increasingly difficult because of the costs that have increased over the years. The CFDO's reserves for daily operations are being depleted each year because we cannot cover the cost of the clinics through grants and donations. In-kind donations have become scarce, and grant consideration is limited depending on which area we host the clinic in. As previously mentioned by Dr. Levy and Dr. Nash, who are our co-chairs, since 2008, our clinics have treated over 22,000 Connecticut constituents with $14.5 million of oral health education and free dental services. Access to dental care is a real issue in Connecticut, and many citizens go without dental care for various reasons. There are plenty of roadblocks that are causing this. Cost of living, lack of adequate dental insurance, lack of providers, waiting lists for dental appointments, all contribute to oral health disparities, limiting members of communities to get the care they need. Because of this, we provide these clinics and our patients consider us their dental home and keep coming year after year because they need this work desperately. We all know the direct link between oral health and overall health, and untreated dental disease complicates systemic issues, and it can be progressive and life-threatening, causing a lot of people to go to the emergency rooms. And we know how much that costs each year. The state absorbs a lot of that cost because a lot of those people who are going to the emergency rooms have Medicare and Medicare plans or lack of insurance. And studies have shown that a lot of these patients are having that cost absorbed by the state. We're talking close to $80 million a year. These same studies that a lot of the other Mission of Mercies around the state have done are also showing that having these Mission of Mercies have decreased the ED visits surrounding the clinics. With that said, dental infections are not the only thing we treat. We also help patients gain their confidence by providing replacement teeth, relieving them of pain that hinder their ability to live a normal life, helping them to eat, find jobs, and maintain good oral health. Our clinics are truly a life-changing experience for everyone, and we really hope that we can continue these. We are respectfully asking the state to support and consider our request to cover the $500,000 that it costs to host the CT Mom clinics. And we also invite you to join us at our next clinic in Waterbury at Wilby High School on November 9th through 10th, so you can see firsthand what we provide the communities of Connecticut. I thank you very much for your time and the opportunity to speak today on behalf of the CFDO and the great citizens of Connecticut.
Thank you so much for your testimony, and you should send us a follow-up email on your event in Waterbury. Thank you so much.
You're welcome. Have a great night.
You too. Thank you. Next is Martha Howard. Are you there, Martha?
Yes.
Dr.
Hi.
Howard, welcome.
Good evening. I'd like to thank the Honorable Co-Chairs Senator Austin and Representative Walker, Ranking Member Senator Bertham and Representative Nuccio, and members of the Appropriations Committee for the opportunity to speak about HB 5048. My name is Martha Howard, and I'm a board-certified ophthalmologist specializing in pediatric ophthalmology and strabismus. So that means I'm a physician and surgeon caring for children with eye disorders and for adults with strabismus, those whose eyes are not straight. Currently, I'm the president of the Connecticut Society of Eye Physicians. I'm also the director of the Pediatric Ophthalmology Division at the Yale Medical School with 2 colleagues in our division. As you know, about 40% of families with children in Connecticut are on Medicaid. As a group, we care for vision-threatening problems in which the vision does not develop properly without expert care. We also treat adults with debilitating double vision. By treating children at an early age, we can improve their vision and in turn improve their visual function to give these children the opportunity to obtain their full potential without any vision-related limitations. This is why we love taking care of children. The current barriers to access specialist care are only growing, and we fear the potential exists for great harm to result from children not receiving appropriate and necessary care. Untreated or undertreated vision loss in children results in burdens to the state throughout that child's life. What we have run into is an access problem for our patients. There are currently only 6 pediatric ophthalmologists in the entire state of Connecticut who take new Medicaid patients. Only one is in private practice, and you will hear her testimony shortly. The others are hospital-based employees. Our patients are referred from all corners of the state, requiring parents or guardians to take time off from work, children to miss full days of school, and it is onerous and expensive for these families. The reason so few pediatric ophthalmologists see Medicaid patients in Connecticut is the insurance reimbursement rates, since the payment for an exam does not cover the cost of seeing the child in private practice. As a reminder, the last increase in Medicaid rates was in 2007. This is a challenging problem, one that needs your support. From my reading of the Phase 1 report, studies of Medicaid rates of reimbursement, Connecticut rates are much lower than our neighbors. However, given that so few providers seeing all Medicaid patients, comparing Connecticut to other states is not helpful in solving access issues. If Medicaid rates were increased to the level of Medicare rates, the patient access problem would improve since all practices in Connecticut accept Medicare patients. The state of Maryland recently passed a law in which Medicaid rates are equal to Medicare rates. I know that all in this committee are committed to improving the quality of care for citizens under your watch, and we look forward to working with you to ensure the best results for your efforts. Thank you for your time.
Thank you so much for staying with us and your testimony this evening. Moving on to John O'Connor. Please proceed.
Good evening, Representative Johnson and all, I'm sure, very tired members of the Appropriations Committee. My name is John O'Connor, and I teach at Central Connecticut State University in New Britain. I'm part of the leadership of CSU-AAUP, a union that represents 3,000 members across the 4 state universities. CSU-AAUP is a supporter of the Husky for Immigrants Coalition, and we are part of the Connecticut for All Coalition. Thank you for the opportunity to testify tonight regarding HB 5048. I'm testifying before this committee to urge you to amend and expand upon the governor's budget. I'm here to speak in support of funding an increase in eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigrant status, up to the age of 18. Any expansion to our state Medicaid program has a positive impact on our communities, and the cost of this program expansion is minimal compared to the long-term health and economic impacts of this policy. In the last 3 years, we have successfully expanded Husky coverage to undocumented children up to the age of 15. These policy changes are already having a positive impact on the state. Health coverage means access to preventative care, leading to a healthier state, lower uncompensated care costs for hospitals, and lower healthcare costs overall for our state. Now we must ensure that more individuals have access to the Husky program. There are 2 main reasons why this issue is important to me. First, for a state as wealthy as ours, everyone should have access to healthcare. Healthcare is a human right, and an accident of birth should not determine who can and who cannot fall ill. Second, as a teacher at CCSU, I have had numerous undocumented students over the years who have struggled with their health, and they have often found themselves excluded from care. As a professor, it always puts me in an awkward position. How can one expect students to do coursework when all their attention and all their focus is on figuring out how to regain their health? Everyone, regardless of their immigration status, deserves health care. Our state has roughly 113,000 undocumented immigrants in Connecticut. More than half of them do not have any form of health care insurance or any health insurance coverage. With undocumented immigrants over the age of 15 excluded from the Medicaid and CHIP programs, the expansion of Husky health benefits to all Connecticut residents is a solution to a terrible injustice. Expanding Husky programs to all is the solution. I've been teaching at CCSU for 20 years, and it's become increasingly clear to me that undocumented immigrant students have a difficult time compared to their peers. They are disadvantaged by their status, some by their socioeconomic circumstances. They are part of our communities, yet they remain outside of those communities. They live in our state, yet they are not part of our state. We should not let borders determine who is healthy or sick. One's place of birth should not determine who wins and who loses in our state. I urge this committee to continue working to expand Husky access to all immigrant people, regardless of age or immigration status, up to 18 years of age. Thank you all.
Thank you so much for your testimony and staying with us this evening. Much appreciated. The next person is Cara Benedictitis. Cara, are you there? There
Yep,
you are.
I'm here. Can you hear me?
Welcome.
Oh.
Thank you so much for being here this evening.
Hi, thank you guys for sticking around. Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Dr. Caroline D. Benedictis, a board-certified ophthalmologist specializing in pediatric eye disease, pediatric eye surgery, and adult eye alignment surgery in Connecticut. I appreciate the opportunity to share this testimony on House Bill 5048 on behalf of the Connecticut Society of Eye Physicians as an executive committee member and the Connecticut State Medical Society. Most importantly, I represent those most affected by low Medicaid rates who often cannot speak for themselves, the children of Connecticut. Every day, I witness firsthand the devastating impact of this issue. And for me, these challenges and stories are more than just a statistic. An estimated 40% of children in Connecticut are enrolled in Medicaid, and sadly, that does not necessarily mean they are getting health care. I am the only pediatric ophthalmologist and pediatric eye surgeon taking Medicaid, serving the Waterbury area where nearly 90% of the population is enrolled in Medicaid. And I'm the only adult strabismus surgeon taking Medicaid for most of the state. I am just unable to see everybody who needs me, quite honestly. The low Medicaid reimbursement rates make it impossible for a private practice doctor like myself to see the number of Medicaid patients that need medical care. Every Medicaid patient or surgery that I perform, Medicaid exam or surgery I perform incurs a significant financial loss. And in private practice, I absorb those costs on my own. I don't have an academic center or a hospital to absorb those costs. I have no choice but to limit the number of Medicaid patients I'm seeing. And quite honestly, I think that one of my fears is that I'm going to have to do away with all Medicaid patients at some point soon. On a daily basis, I see parents travel exorbitant distances, take excessive days off work, taking their children out of school, sometimes repeating this every 3 to 4 months, up to every week for vision-threatening conditions, just so their children can get medical care. I complete mountains of paperwork for patients to their employers so that parents don't get fired for taking time off work, none of which guarantees their income. Families that rely on public transportation face even additional struggles. Children that can't obtain care are taken to the emergency room or urgent cares, and all the parents tell me that they don't want to do that, but they feel they have no other choice. They're desperate. These facilities usually don't have pediatric specialists, and so the children still don't get the care they need and add to additional unnecessary healthcare costs. Delayed or no care causes unnecessary, potentially permanent vision impairment, blindness, or death, as in the case of a 1-year-old I recently diagnosed with eye cancer, where time was of the essence. Quite frankly, if I don't see those patients, a lot of them don't get any eye care at all. The healthcare crisis is significant and worsening, and it's exerting a long-term and far-reaching impact on children, their families, and our state. I've devoted my life to caring for children, and I want to continue to do so. And I am asking the committee to please help us by investing in our future, decreasing the burden of preventable medical disease, and protecting our most vulnerable part of the population. Thank you.
Thank you so much for your testimony and your work. Working with the children is so important. Thank you so much.
Thank you. Have a good night.
You too. Next person on the list is Kevin Johnson.
Mr. Johnson continues to decline the promotion to panelist. Madam Chair.
Okay. The next one is Nicole Lemoyne. Is Nicole there? Okay. Phil Brewer. Valentino Guerrero. Valentino, are you there? Valentina, I'm sorry. Please proceed.
Thank you. Good evening, chairs and members of the Appropriations Committee. My name is Valentina Guerrero, and I'm a law student intern in the Worker and Immigrant Rights Advocacy Clinic at Yale Law School. I submit this testimony on HB 5048 on behalf of our client, the Husky for Immigrants Coalition. When someone falls ill, we should come together to do whatever is necessary to help. We should find a way to make sure that money is the last thing that someone, especially a family with a sick child, needs to worry about while they heal. Last year, the Connecticut General Assembly did a great thing by passing Husky coverage for children up to age 15. Today, we are asking the Appropriations Committee to close the gap from age 15 to 18 to ensure all Medicaid-eligible children in Connecticut are covered. In 2022, legislators found the funds needed to increase coverage from up to age 9 to age 12 in the budget. Any expansion in our state Medicaid program has a positive impact on communities, and the cost of this expansion is minimal compared to the long-term health and economic benefits of such an investment. By allocating these funds, Connecticut would join its peer states in protecting the health of all children, regardless of immigration status. Massachusetts provides primary and preventative care for all children, regardless of status or income. 2025, Colorado will offer state-funded Medicaid-like coverage to all income-eligible children, irrespective of legal status. I also want to note that as of July 2023, at least 5 states in the District of Columbia cover some income-eligible adults, regardless of immigration status. If Connecticut follows its peer states and expands Husky to all, over 21,000 currently uninsured people will gain coverage. All this for only around 3% of the state's annual Medicaid budget. I also respectfully urge the Appropriations Committee to oppose the governor's proposed budget items that would make income eligibility requirements stricter for parents and caregivers who would otherwise receive Husky A and would reverse fully funding the Husky C income eligibility limit. Moving those who lose coverage under Husky A to covered CT is not a viable solution for undocumented individuals. This is because undocumented people are barred from buying coverage on the state exchange, Access Health CT, and are ineligible to receive federal subsidies to help pay for their coverage. Expanding Husky is the best way to achieve health equity in Connecticut. Incremental coverage expansion is progress, but the clock is ticking for the undocumented individuals, children, and families who needed comprehensive health care coverage yesterday. As the committee looks to the various projects it needs to fund, this investment should be top of mind. If any members have questions about my testimony, spoken or written, or would like additional information, please contact our team at the addresses provided in the written testimony. We would be more than happy to discuss any part. Thank you for your time.
Oh, thank you so much for being here this evening, and thank you for your testimony. Next person on the list is Todd Johnson. Are you there, Todd? Okay. Kevin, he's the next person is, so we don't have anybody until 2:49.
2:39, Kevin Johnson.
Oh,
finally accepted the
sorry.
promotion.
All right.
Good evening.
Good evening. There you are.
My name is Kevin Johnson. I'm the legislative liaison at Gaylord Hospital. Thank you for the opportunity to testify today in support of a Medicaid rate increase on behalf of Gaylord Specialty Healthcare. We are requesting an increase in the daily inpatient Medicaid rate for the hospital. This increase will help us better serve one of the most vulnerable populations in our state. Gaylord is a 137-bed, freestanding, nonprofit, long-term acute care hospital, also known as an LTAC. We care for patients who need a longer stay than expected in a short-term acute care hospital, and our patients are either severely ill or have suffered a catastrophic injury. They are often still on telemetry, a ventilator, and in need of IV medications. They also need intensive rehabilitation due to the complexity of their medical issues. Currently, our Medicaid rate is about $950 a day, which is much less than the average cost of care for a patient at Gaylord, which is about $1,700 a day. This limits our ability to provide care for many Medicaid patients from our acute care partners, and we're looking for parity in the healthcare payment system under Medicaid with the other LTAC in the state. Inpatient rehab facilities, which are a lower level of care than us and work with patients that are a lower acuity level than us, are paid a significantly higher daily rate. On average, the Medicaid rate for an inpatient rehab facility is about almost $1,500 a day. That means that a lower level of care that works with patients who are less acutely ill than the ones we serve here at Gaylord are getting almost $550 per day more than we are to care for patients. We're asking for an increase of $200 a day for our Medicaid rate. And although this will not cover the entire cost of care, the lower difference in coverage of cost will allow us to accept more Medicaid patients. It will help patients who are sitting in short-term acute care hospitals unable to get to the best level of care for their illness or injury. Not only are we able to maximize a patient's function and allow them to return to their community and life, we're also able to help reduce rehospitalizations for the highest risk patient population. When patients can't go to one of the 2 long-term acute care hospitals in our state, they wind up being referred to an out-of-state hospital where the cost of which is significantly higher. The cost is higher not only for the state, but for the patient and their families as well. We appreciate your consideration of the request for a $200 a day increase in our Medicaid rate. Our written testimony provides more details on the issues that I raised today. Thank you.
Thank you so much for your testimony. Very much appreciated. Moving on to Nellie Jara. No? Okay. Jennifer Granger.
Good evening. My name is Jennifer Granger. I'm the President and CEO of United Community and Family Services. On behalf of United Community and Family Services, or UCFS Healthcare for short, I want to thank the committee for the opportunity to provide comments regarding the human services provisions in our budget. UCFS Healthcare is a nonprofit organization serving the most vulnerable residents throughout 900 square miles in Eastern Connecticut. We serve 16,500 people through our federally qualified health centers, provide intensive in-home behavioral health services through state contracts, and operate a residential care home for the elderly. UCFS Healthcare exists to provide access to high-quality care for all. With 60% of our health center patients enrolled in Husky, that includes 9,900 Husky patients each year. To achieve this, we respectfully recommend the committee consider increasing our Medicaid rates. Last year, the legislature ordered a Medicaid rate study, and health centers are included in phase 2. However, because we have conducted research on the gaps between rates and allowable costs, as well as the rates in other states, we believe the federally qualified health center portion of the rate study is already complete. This means we can move immediately to adjust rates to ensure the most vulnerable among us can continue to access our services now and into the future. My submitted testimony includes a summary of that rate data. This data shows a large gap between the average Medicaid rate health centers are paid and our costs for those services. At UCFS, that gap is even more profound. We lose $143.50 on every medical visit and $166.87 on every dental visit conducted with a Husky patient. This discrepancy last fiscal year alone resulted in an underpayment of $1.65 million to UCFS. The expectation that nonprofit community health centers like mine and our patients will continue to bear the financial burden of an underfunded Medicaid program needs to be reconsidered, and quickly. Although comparing Medicaid rates across states isn't exact, the stark contrasts are evident. Connecticut's average Medicaid rate is one of the lowest in the country for FQHCs, and the lowest in New England and the lowest in the Northeast. With such a large percentage of our patients on Husky, these low rates have a direct impact on access to care. We cannot hire providers at competitive salaries to treat patients. Existing providers leave for positions in higher paying healthcare systems. Our once thriving 12 operatory dental practice now has but a single dentist and a wait list of 1,200 people. Other Medicaid enrolled providers have asked us to stop referring patients to them, and our community is suffering. I urge this committee not to wait for the study, but instead to raise rates immediately, a cost of $30 million to the state, which would garner federal matching funds, bringing the total to $75 million. Perhaps a phase-in of higher rates could be the solution if necessary. Thank you for your consideration and commitment to the difficult job at hand, and please feel free to reach out with any questions.
Thank you so much for your testimony this evening. Much appreciated.
Thank you.
Moving on to Elizabeth Gonzalez.
Hola, buenas noches.
Buenas noches.
¿Me escuchan?
Y te podemos escuchar, ya puedes comenzar.
Ok. Hola, buenas noches. Mi nombre es Elizabeth González. Soy una de las trabajadoras dueñas de la cooperativa Tortillería Semilla en New Haven, Connecticut. Estoy apoyando el proyecto de la ley HB 5048 para ampliar el acceso para emplear el asesor de Hosky a la comunidad inmigrante. Soy una persona diabética de alto riesgo. He lidiado durante muchos años con el sobrepeso y el hígado graso en fase 4. Principal desafío de cuidar mi salud es que la atención médica es muy costosa. No puedo permitirme pagar todas mis visitas al médico y muchas veces debo de elegir entre poner la comida en mi mesa con mi familia o comprar mis medicamentos o sea, insulina o pastillas para la diabetes. Esto me provoca el estrés que afecta mis niveles de azúcar en la sangre. Precisamente en diciembre del 2023, mis niveles del azúcar subieron a 450, casi entro en un coma diabético. El médico me dijo que si no hubiera ido a ese día al hospital, habría tenido un ataque cardíaco o un coma, perdón, o un coma diabético. El médico me dijo que al no haber ido al hospital hubiera perdido la vida. Algo que, um, algo para mí muy costoso, muy doloroso, pues tengo a mis seres queridos, mis hijos, que es lo más principal que tengo. Y, y no quisiera dejarlos en esta vida o perder la vida sin dejarlos en un futuro mejor. Somos seres humanos y creo que somos seres humanos y necesitamos ser atendidos médicamente. Quiero seguir viviendo más años para mis hijos y creo que todos tenemos el derecho de tener el acceso a la atención médica. Muchas gracias por escuchar, pues, por atender a todas estas personas a las que estamos pidiendo nos escuchen y nos den la oportunidad de tener el seguro médico, puesto que somos seres humanos y es un derecho. Gracias, mi nombre es Elizabeth González.
Good evening, chairs and members of the Appropriations Committee. My name is Elizabeth Gonzalez. I'm sorry. Thank you for the opportunity to testify regarding HB 5048. Hello, my name is Elizabeth Gonzalez. I am one of the owners of the cooperative Tortilleria Semilla in New Haven, Connecticut. I support the bill HB 5048 to expand Husky access for the immigrant community. I am a high-risk diabetic person. I have dealt for many years with overweight and phase 4 fatty liver. The main challenge of taking care of my health is that the care is very expensive. I cannot afford to pay all the visits to the doctor, and often I must choose between putting food on the table for my kids or buying insulin or the diabetic pills. The stress affects my blood sugar levels. In December 2023, my blood sugar levels rose to 450. I almost had a diabetic coma. The doctor said if I wouldn't go that day to the hospital, that I wouldn't have a heart attack and possibly died. And that to me was very painful because I don't want to leave my family behind without a future. We are human beings and we need to be treated. I want to continue living for my kids. We all have the right to access to healthcare. So I am begging you guys to please let this bill go through. Thank you so much.
Thank you so much for your testimony and staying with us this evening. The next.
Muchísimas gracias por el testimonio.
Excellent. Thank you. The next person on the list is Mark Thompson.
Honorable Co-Chair Senator Oster, Co-Chair Representative Walker, and members of the Appropriation Committee. My name is Mark Thompson, and I'm the Executive Director of the Fairfield County Medical Association. FCMA represents over 1,000 physicians in all medical specialties. A report on the Connecticut Medicaid reimbursement rates that was recently released by the Department of Social Services revealed that Connecticut paid less than a peer state benchmark for 85% of services analyzed and less than the Medicare-based benchmark for 94% of the services analyzed. In 2007, Connecticut set the
Ya
Medicaid
llevamos 550 pesos.
In 2007, Connecticut set the Medicaid reimbursement rates for most physician services at 57.5% of the Medicare rate at that time. Other than for primary care and OBGYNs, the rates have not been broadly adjusted in over 17 years. Less than 60% of Medicare was low in 2007, but it is almost incomprehensible the cost of running a medical practice.
You're on mute. Would you unmute yourself, sir? Mr. Thompson? Mr. Thompson, you're muted. Mr. Thompson, you're muted.
I'm
Thank
sorry.
you. No worries. I just wanted to make sure you unmuted yourself. Somehow you've done it again, Mr. Thompson.
I'm not touching a thing. I don't understand what's happening.
Somebody else earlier, so I don't know what's going on, but
Yeah. Okay. I'm very sorry. In 2007, Connecticut set the Medicaid reimbursement rates for most physician services at 57.5% of the Medicare rate at that time.
oh dear, you're really
All right. Representative Johnson, I'm not touching a thing. I'm just speaking. Okay, we'll try this again. Less than 60%.
I wonder if you're leaning forward, it seems like it goes mute when you lean forward for some reason. I don't know what kind of a device you have there, but
The speaker's built into my computer.
somebody else's.
Okay, we'll try this one more time. I'm very sorry. Less than 60% of Medicare was low in 2007, but it's almost incomprehensible considering the cost of running a medical practice today. As a result of the low rates, many physicians in private practice find they are not able to treat as many patients with Medicaid as they would like, which restricts access to care. These patients, when they are able to get an appointment, find they have a long wait time to see the physician. No one should be treated differently because of the type of insurance. And unfortunately, this is what happens with someone who has Medicaid. We appreciate Connecticut will soon start the second part in a two-phase study on Medicaid reimbursement rates, which will be due in early 2025. But we really can't wait until that time. At this point, the rates are so low that many physicians in private practice cannot offer the quantity of healthcare services they would like to Medicaid recipients. The legislature must make an increased investment in their rates to improve access to Medicaid services. Thank you for allowing me to add my voice to the dozens of physicians who have already eloquently spoken on this matter. Thank you.
Thank you so much. Thank you so much for your testimony and being with us this evening. It's much appreciated. Okay, moving on to Tanya Torres. Is Tanya there? Okay. Patricia Rosas. Okay, Patricia, please proceed.
Sí, buenas noches.
Buenas noches.
Miembros del Comité de Apropiaciones. Mi nombre es Patricia Rosas, soy madre y abuela. Vivo aquí en Hartford. Soy miembro de UA, Hartford Deportation Defense y Manos Unidas de New Britain. Gracias por la oportunidad de testificar en favor de HB 5048. Con respecto a los presupuestos de las agencias de servicios humanos, específicamente para el Departamento de Servicios Sociales que administra Husky, Medicaid y CHIP. Hay prioridades importantes que se financian en el presupuesto del gobernador para las agencias de servicios humanos. Estoy aquí para hablar en apoyo de la financiación de un aumento de la elegibilidad para el programa de Medicaid Husky y pedir al Comité de Apropiaciones que financie la expansión del programa. Me importa mucho el seguro médico para inmigrantes. Es urgente. Todos merecemos tener ese cuidado. En 2019 me diagnosticaron cáncer de riñón y por no tener seguro médico pasé muchas dificultades. Hasta el día de hoy todavía las sigo teniendo. Además, fui discriminada por la doctora. Es frustrante ser testigo de cómo la falta de seguro médico afecta a miembros de mi familia y a mi comunidad. Estoy cansada de cuando llegamos buscando atención médica, lo primero que preguntan, ¿tienes seguro médico? Y como no lo tenemos, pues no nos atiendes. No nos atienden, eso es inhumano. Husky para inmigrantes nos ayudaría a estar más tranquilos, sabiendo que cuando necesitemos atención médica, la obtendríamos sin ningún problema. Es lo justo. Aquí vivimos, aquí trabajamos. Por lo tanto, necesitamos y merecemos Husky para todos los inmigrantes aquí en Connecticut. Gracias por su tiempo.
Chairs and members of the Appropriations Committee. My name is Patricia Rosas. I am from Hartford and part of Manos Unidas of United Action, Connecticut. Thank you for the opportunity to testify regarding HB 5048, an act adjusting the state budget for the biennium ending June 30th, 2025. With respect to the budgets of the human services agencies, specifically for the Department of Social Services, which administers Husky, Medicaid, and CHIP. There are important priorities being funded in the governor's budget for human services agencies. I am here to speak in support of funding and increasing eligibility for the Husky Medicaid program and ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status up to age 18. I am Patricia Rosas. I am a mother and a grandmother, and I care immensely about medical insurance for immigrants. It's urgent. Everyone deserves health care. In 2019, I was diagnosed with cancer in my kidneys, and I experienced many hardships because I did not have medical insurance. I was denied by the doctor, and I'm still going through many hardships. It's frustrating to witness how the lack of health care affects people in my family and in my community. We're simply denied care. It would help to be more relaxed knowing that when we need medical attention, we will get it without any issues. It's only fair. This is where we live. This is where we work. I ask the Appropriations Committee to fund Husky eligibility for all income eligible Connecticut residents, regardless of immigration status, up to age 18 this year, and in the future to create a long-term plan towards opening access to all immigrants, regardless of age. Healthcare needs do not end at age 15 nor at age 18. Thank you for your time. I'm Patricia Rosas.
Thank you so much for your testimony.
Gracias por tu testimonio.
Gracias a usted. Buenas noches.
Buenas noches. Next is Suzanne Lagarde.
Yes, good afternoon, good afternoon, good evening. Can you hear me? Can you hear me?
Yes, I can. Please proceed.
Thank you so much. Thank you, Representative Johnson, Senator Lesser. Thank you for the opportunity to provide comments. It's well known that Medicaid is adversely impacting access to care for Medicaid recipients because of grossly inadequate rates. At this late hour, I'm not going to reiterate what you've heard repeatedly throughout the day, but rather I'm going to refer you to the written testimony of myself and many of my health center colleagues. I want to turn quickly to the topic of e-consults. As a physician of many years, I've been advocating tirelessly for Connecticut Medicaid to adopt this tool, thus far unsuccessfully. I'm hoping the legislators can help me. I truly do not understand the problem because there's tons of data, from other states and CMS that confirms that widespread adoption of e-consults is a true trifecta. It's a trifecta, one, because it vastly improves access to specialty care for Medicaid patients. Two, it increases specialty provider satisfaction. And three, and I'm sure important to all of you, it saves the state millions of dollars. I want to repeat that. Adoption of a statewide e-consult program will save the state millions. In brief, many referrals to specialists can be made quickly and resolved through a communication between a primary care provider and a specialist. The PCP sends a secure email to the specialist along with relevant with upload of relevant testing. Within 48 hours, the specialist responds with recommendations. In a minority of patients, fewer than 20%, the specialist recommends that the patient be seen face-to-face. In all other instances, the feedback from the specialist to the PCP is sufficient to resolve the problem. This model has been implemented broadly in systems such as LA County in California, Cook County in Illinois. 6 years ago, when Dr. Zavosky was the Medicaid medical director, he provided us with 6 months of Connecticut Medicaid claims data for only 8 adult specialties: cardiology, orthopedics. I've included that data in my written testimony, but suffice it to say that with even very conservative estimates, the claims data, this was Connecticut data provided by Medicaid for analysis, revealed major savings to the state. The ROI was around $3 million. That was for 6 months, not a year, and for only 8 adult specialties. But what is critical for this to succeed is the state must establish a system of reimbursement that will appeal to specialists. For this program to work, there has to be adequate reimbursement. But even with adequate reimbursement, the ROI to the state is in the millions. Finally, let me just tell you about our experience here in New Haven. At our health center, we are extremely fortunate to have an e-consult program supported by the specialists at Yale University School of Medicine, free of charge. I don't know how long it's going to last because it is free, but it is wonderful. In calendar year 23, through this program, our health center alone completed 573 e-consults on Medicaid patients. A conservative estimate is because of this program, we saved the state nearly $600,000. As I said initially, it's a win-win-win. Patients get access. Providers are very satisfied with this because they get to see patients who really need their services and that cannot be dealt with in a primary care setting. And there's a huge ROI to the state. It's the ultimate trifecta. I've placed a detailed summary of e-consults along with a few basic calculations in my submitted testimony. And I truly welcome the opportunity to discuss this further with any and all legislators. And finally, thank you so much for what you do and being up at this ungodly hour. I truly appreciate it. Thank you.
Thank you so much. I think some of your recommendations probably should go to the Public Health Committee with respect to systemic change.
Well, I appreciate that, Senator Representative Johnson, but for this to work, there has to be Medicaid reimbursement to the specialist.
But I'm just saying you're suggesting a systemic change as well. Thank you.
Okay.
Moving along. Miguel Quispe. Okay. Ranuel Blyden. Is Renel there? Oh, okay. I don't see him on my computer. If you want mute yourself, Renel, then we can probably proceed.
Hello?
Oh, there you are.
Can you speak me? Can you hear me?
I can. Yes, we can now. Thank you so much. Please
Come up.
proceed.
Good evening, or where we at in the morning?
Yeah, we're
representatives of the Appropriation Committee. I'm a PCA from Tatville. I've been working in this field for around 3 years now. Our consumer Ben, he needs care. And initially, he's a paraplegic where he can't move anything. So I went down there on behalf of my sister a couple of times before I worked there, and he kept asking me to, do little stuff around the house. And he knew that I was on Social Security because I had an incident. I'm a double brain aneurysm survivor. So I was on Social Security, so on my own income wasn't getting me my bill. My ends weren't meeting. Is what I'm trying to say. So he understood my plight, and I helped him out. So he helped me out by saying, "Oh, you want to work for me?" So I ended up working for him and having a job, and you know, by me working for him, end up becoming a friend. And when I'm a friend with somebody, they eventually turn into family. You know, like that's how I am. I love hard. So you know, in him is where he can't he wants to be normal. So you know what I'm saying, that's you know what I'm saying, I try to make everything as close to normal as I can to him, and so he likes to go out, you know what I'm saying, see the world. So the best thing, you know what I'm saying, if the funding can go for any med cabs, or you know what I'm saying, some to get out the house, you know what I'm saying, see the world more, that'd be, you know what I'm saying, good for him.
Okay, very, very good.
And I know that down the road that I would probably want to have some time off. I don't have time off yet from the job, and also down the road retirement, you know,
Sure.
would be good.
All very important things for
Yeah.
I personally, and these are things that everybody needs some of those things. So I thank you very much for staying up and talking to us about your
No
situation
problem.
and your recommendations for, you know, some changes in how things are structured. And I hope you have a great night or morning.
You as well. Appreciate your time.
Okay, take care.
Good night.
Next person on the list is Sandra Roberts. Is Sandra Roberts here? Nellie Jara. Lynn Rickey. Okay. Kim Duran. Is Kim here? Okay, please, Kim, welcome, and please proceed.
Good evening, members of the Appropriations Committee. My name is Kim Durand. I'm a home health clinical manager with J. Kimball Home Care in Putnam, Connecticut. I have 30 plus years experience working in home health, and I thank you for the opportunity this evening to talk about these issues. As an RN who cares about the people and their health, I'm happy to see that our state has expanded and worked on expanding our Medicaid program. However, my concern is that our people are still running into barriers in receiving care. As providers are unable to afford to care for large numbers of people with this insurance. These are usually individuals who need most of the care, and this is including care that is not covered by their Medicare programs. Lack of resources due to unsustainable payment rates tends to give these individuals and families no other choices but to look at other options such as long-term nursing home care. Even though our state has wonderful programs such as the Connecticut Home Care Program for Elders, providers are unable to financially withstand the inadequate reimbursement. Here in the quiet corner, our resources are less abundant than our more urban counterparts. Most agencies have critical staffing issues, and referrals are often declined due to poor staffing. And this includes my agency. Why is that? Home health is unable to compete with the salaries paid for nurses and other clinical staff in the surrounding facilities and larger urban facilities. We also see our non-medical caregivers seeking employment in other industries where they receive better salary other than being paid as they are important members of our healthcare team. How can we ask home health care and home care agencies to take patients where reimbursement negatively impacts their bottom line? Or take people that have complex medical, social, emotional, or even end-of-life needs when we don't have the resources to care for them? Having fair Medicaid rates would improve the acceptance of referrals. The other issue is medical social workers, or MSWs. It is a disservice to those covered by Medicaid to not have this service as part of their coverage. Our MSWs have training and skill to help with the social and emotional factors that affect these people's well-being and health. They help guide people to resources which make a difference in keeping the individuals in the community. And many agencies like mine provide these services for Medicaid recipients as write-off services just so that we can achieve the goals of the plan of care. This is a hefty burden for agencies to accept when we already suffer from the effect of inadequate Medicaid rates. I'm asking the committee to make the following necessary investments for our people. Implement consistent annual provider Medicaid home health and home care rates consistent with the federal CPI. Restore the medication administration rate from the levels of 2016. Look at giving us a home health social work rate to address and support the social determinants of health, and to provide funding to recruit and retrain staff and provide education. I urge you to invest in the much needed services.
Excuse me, could you please summarize?
Yes, I'm just about done. If we don't have changes in the Medicare rates, we won't be able to keep our people at home. I thank you very much for your time, and thank you for staying up with us this evening.
Oh, thank you so much. Really appreciate it. And have a great evening, or have a great morning.
Madam
You
Chair,
too.
Lynn has accepted the promotion.
Okay, who accepted the promotion, please? Okay, thank you. Lynn, Ricky, please proceed.
Good morning, Representative Johnson, Terziak, and Senator Lesser. Thank you all so much for your very long day today and your commitment to this process. Really appreciate it. My name is Lynn Ricky, and I am President and CEO at Hospital for Special Care, a long-term acute care hospital, chronic disease hospital in Connecticut. We are the largest provider of Medicaid services to the very vulnerable folks that we serve. In fact, 82% of our population are Medicaid patients. We serve children through adults, and I think all of you are aware of and have been very supportive of our program, and we're very grateful for that. At this early hour in the morning, I wanted to really just summarize. I did provide written testimony, but I wanted to talk about three specific areas of concern for us. We're very grateful for the past support that we have received from this committee, and we have been able to continue the very important mission that we are committed to and stand behind for our patients. We serve 70 ventilator patients a day. Many of those ventilator patients are babies. We take care of very small children, as small as 5 pounds, in fact, and those children need very close and constant observation. The vent add-on rate that we were given last year, we're very grateful for that continuation of that rate, does not include the observation of babies who have critical airways. These children have about a 2-minute reserve should something happen to them, and we need to very closely monitor them. That means that these children need 24-hour a day, one-to-one monitoring when they're not on their ventilator. These children require tremendous resources and of our time and need that in order to be safe. We are looking for support for critical airway monitoring for these children, in addition to the monitoring that we receive for vent patients, or the same as the monitoring that we receive. The other population that the state has been a great partner for us and invested in are children with autism. That's another singular program that the hospital has and has been involved in since 2012 in partnership really with the state in serving these individuals. This program has been expanded to include a partial hospital program, and that is largely now Medicaid, as many of our programs are, again, because we are a single provider who is committed to this population. That population is now involves very small children who were added just this past year. All of those children are currently Medicaid recipients. Again, because it's a single service. So we are looking for an additional rate for this partial hospital program to cover the necessary resources for us to provide that service. Lastly, again, 82% of our population is Medicaid. That's the largest single Medicaid population of any hospital in Connecticut. And again, we're very proud of being able to provide that service. Many of those patients are very critically ill by nature because of the population that we serve. Many of them come to our chronic disease hospital, but often have to go back out to acute care based on the nature of their illness. When those patients go out to acute care, we are not paid for their services. Obviously, they're not with us, but we hold their bed. And we are not included in the bed hold that is afforded to SNFs or skilled nursing facilities. And we are asking to be included in that bed hold so that we can keep that bed for these patients to return to from the acute care hospital when they're ready. So that summarizes our ask for this year. Again, we really appreciate your partnership and especially your time and your commitment to this process. Thanks so much. And I hope you all have a restful night.
Thank you. Thank you very much. Okay. We're moving right along here. Wakana Hirota? Nope. Okay. Daniel Winkler? Julia Garcia? Erin Saylor?
It's me.
Hey.
Hey.
Good to see you.
Good morning, Representative Johnson, Senator Lesser, and the members of the Appropriation Committee. My name is Erin Saylor, and I am the Chief Operating Officer at Child and Family Agency of Southeastern Connecticut. Thank you so much for the opportunity and to testify today in support of the urgent crisis centers and your commitment to this process. As a licensed clinical social worker with over 20 years of experience working in the mental health field, I have witnessed the growing need for accessible and effective mental health care. And I've already seen the impact that the Urgent Crisis Center is having on our community in New London County. While we appreciate the governor's budgetary proposal to begin to create permanent funding structure outside of ARPA dollars for the Urgent Crisis Center, the funding proposed falls far short of sustaining this new and pivotal service. The existing behavioral health Medicaid reimbursement rates are alarmingly low, especially as the primary funding source proposed by the governor's budget, posing a serious threat to the UCC's sustainability. Despite our commitment and belief in this vital service, the lack of reliable financial commitment by the state jeopardizes our ability to continue offering this critical mental health service to children experiencing an urgent mental health crisis beyond June 30th, when the current funding ends. A recent Medicaid rate study has shed light on the severity of this issue. The study indicates Connecticut Behavioral Health Services would require a 126.3% increase from the current expenditures to reach the 5 benchmark states' behavioral health rates. This substantial gap underscores the prematurity to rely on these rates as the primary source of income for providers and the urgency to address the funding shortfall. It is crucial for policymakers to recognize the direct impact of inadequate grant funding and reimbursement rates on the sustainability of mental health services, especially the Urgent Crisis Center. The UCC model includes a multidisciplinary team consisting of master's level clinicians, registered nurses, community navigators, and psychiatry providers, which results in a holistic, comprehensive, and healing experience for the client, but is also a very expensive model to operate. Without prompt intervention and commitment to full funding, the Urgent Crisis Center will not continue, leaving vulnerable children and their families without adequate mental health care. Again, the 3 community-based providers will need full funding and grant dollars of at least $12.5 million in fiscal year 25 DCF budget to sustain this service at the required staffing model. While this is a large financial commitment to the state, our children have waited long enough to have their mental health needs become a priority. I urge this committee to prioritize and allocate full grant funding for the 3 community-based UCC providers and establish an adequate Medicaid rate using the Medicaid rate study as a guide. By doing so, we can ensure the continued viability of the Urgent Crisis Center and its mission to expand the safety net and continuum of care for children and their families. Again, thank you so much for the opportunity to testify. I appreciate your service and staying on for so long with all of us.
Well, thank you so much for your testimony and staying up with us too. Thank you. Have a great evening.
You too.
The next person is Marsha Hamilton.
Tamarsha has not accepted the promotion.
Okay. And Kamara Crook.
Nope.
Is Tamara there? Well, if that's the case, if Tamara's not there,
We have the
The-
iPhone.
is there an iPhone here? We have an iPhone number. Do you know who
No,
the
we don't
iPhone?
know. We don't know who iPhone is. so
Okay,
if you can
iPhone.
identify-
We need to identify you if you would like to speak. I don't think the iPhone is there. Okay, I think this concludes the hearing for this evening. Thanks to everybody who's still listening. Have a